Good morning. You are watching News Now from Fox, and my name is Rain Augustine. First and foremost, we want to give a sincere thank you to all of the men and women of service on this Veterans Day. Let's take a look at Madison Memorial Square Park right now. Memorials like this are in place all over the country as Americans have observed this holiday every November 11th since 1919, a year after fighting ended for World War I. Now, originally the holiday was known as Armistice Day. The holiday was later expanded after World War II to celebrate all U.S. veterans. The National Veterans Day observance at Arlington Park Cemetery will go on as usual this year, but with fewer people in attendance, of course, due to COVID-19. And also the U.S. Department of Veterans Affairs will live stream the ceremony on its Facebook page, so you all can watch that starting at 11 a.m. Eastern. Also, the National Museum of American Indian in Washington will unveil the new National Native American Veterans Memorial that will also be live streamed on their Facebook page, and it's scheduled to begin at 5. The holiday was later expanded after World War II to celebrate all. Now, every year, Americans gather to show gratitude for the men and women of service. We're going to check in with our sister station in Los Angeles for tips on how to help veterans transition from their time in the service into civilian life. Let's take a look at that.
Remember and thank the men and women who literally signed up to fight for us. The celebrations we hold on those two holidays, they're wonderful. But 365 days a year, many of those very veterans who we thank on those 2 days face personal battles. Long after battles they volunteered to fight are over. We see it in PTSD, we see it in addiction, we see it on our streets in homelessness. The best estimates are that 40,000 American veterans are homeless right now, and more than 10,000 of them are right here on the streets in California. Michael Loazo served 4 years with the Marines and then spent 2 years living on the streets. He joins us along with Christopher Crowley, whose organization New Directions for Veterans, sorry, I'm having trouble talking today, has been working with Michael since earlier this year to get him healthy, to get him happy, to get him a permanent place to live. And both of these fantastic gentlemen join me today. And I think, Michael, I'm going to start with you because I think we should do a check-in with you. How you doing, brother? How are you?
I'm doing pretty good, Michaela, considering what was going on in the past couple of years. From being an alcoholic, living on the streets, going through personal mental issues, to now, in about a month or so, having my own place to live, being a year sober. I'm doing great.
I wish you could see the smile on my face when I hear that report from you, because it's big. Look, I want to ask you something real. When you left the Marines, you had an expectation, I'm assuming, of what your life was going to be like, right? And then there's the reality of what your life was like. Talk to me about that difference.
Getting out of the Marine Corps and going into a regular civilian role, trying to get back into society after living such a rigorous society in the Marine Corps is really, really unexpected. It's hard. It's for a lot of veterans that I know, it was something that they couldn't really plan out as much as they wanted to. And we have a saying in the Marine Corps, and excuse my language on this one, piss poor planning or prior planning prevents piss poor performance. And so we try to plan everything in advance, and that doesn't work going from the military to civilian life. So it's really hard when we get out of here. And for myself, it's a little bit harder because I come from also foster care.
Oh,
so I don't have that plan B. I can't go back to my parents and say, hey, I need a place to crash for a night or a week or whatever have you. So I have to do even more so to plan and try to prevent ending up back on the streets again.
Well, and that's where Sorry to interrupt you, baby, but I want to make sure I talk to Christopher about this, because your story intersects with Christopher's. You know, Christopher, listening to Michael talk about this, he's as hard as it is to hear that reality from Michael, he's not alone. That story is repeated in different variations throughout the homeless veterans population in our state. Oh, can Christopher not hear us?
I heard you, but I didn't hear the very end. But I think I got enough to answer your question. And I think you're right. We hear the story, Michael's story, quite a bit with a lot of the veterans that we serve. You know, they come out of the military and they're not sure where to go next. There's no indication of what the resources are available for some of the veterans, right? Especially those that are struggling or don't have a family member to go back to. And we're here to help get them off the street and into programs, services, and immediate housing. To get those programs and services, and then much like Michael's case, you know, stays in our program 9 months to a year, and then we help find either permanent supportive housing, which comes with a case manager who visits on a daily basis and helps out with the veterans, or they move into their own apartment anywhere in any neighborhood here in Greater Los Angeles, and they start to thrive again, and it really makes them feel good about themselves. It sends a message to their brethren that they can pull themselves up from their bootstraps and do the same thing. Right.
No, that we know that that's an important thing, that the modeling for the other vets that are struggling. Christopher, you know, I think this is a real problem for us. You know, for the next 2 days, we'll be hearing people say to people like Michael, thank you for your service, thank you for your service, and that is important to do, and we welcome that. But then the other days, the under 363 days of the year, where's the disconnect? Where is the disconnect? That's where you guys are trying to bridge the gap.
Exactly. I think we're trying to bridge the gap. You know, everybody, they live their own life. They're very busy. They go around to work and back, and they see the homeless on the street. And, you know, there's mixed messages. You know, some people stop and ask them questions. Why are you homeless? What can I do to help? And others just turn their head, and they don't want them in their neighborhood, and they don't want them on their block, and they don't want them by the freeway by their home. But the reality is that we've got over 60,000 people, veterans and non-veterans, that are homeless, and it's an important function that we need to address. And New Directions for Veterans is addressing this 365 days a year. We've got research teams, 3 teams that are going out to talk with veterans and bring them into our program so that they're off the streets, especially now that winter is coming. You know, COVID was a big issue for us. The VA opened the campus, and a number of people have seen the tents outside the VA campus, and now you see a lot of tents inside, and it's because the VA decided to bring those veterans in and adequately space them for social distancing and give them some of the resources they have to be safer on the campus.
We're glad to hear that. That's an adjustment that needed to be made. Michael, real quick, just one last word from you. What do you want people to know about folks in your position?
That there is help out there. Before I came to this program, I had no idea that it even existed. So first, I'd like to give a shout out to my peer support specialist.
I love that.
Edward Benson. He's the one that told me about this program. He's the one that gave me the push and put me in here. So to all my brothers and sisters out there that are out there right now, maybe not living the life that they thought they would be when they got out of the military, whether it be the Army, Marine Corps, whatever, get yourself a peer support specialist. Get somebody that knows the ins and outs of the benefits that we earn. Fighting for our country, for what we believe in, and get the help that you deserve, that you earn.
You deserve and you earn. Michael, those are the most important words. You did this. We honor you. We stand by you. Christopher, I'm thrilled about what you guys are doing to support people like Michael so that they can live the lives they deserve. Let me point to an event for folks at home, because I know you're probably saying, I'd love to help. Well, if you'd like to do so, they're having an online gala tomorrow. Please check it out. You can get information by going to ndvets.org/events, ndvets.org/events. Michael, Christopher, you both stay well and keep up the great work. So much to be proud of. Thank you.
Thank you so much.
Have a great day.
All right, Maria.
Coronavirus. Earlier on Good Day New York,
a huge thank you to our sister station in Los Angeles on giving us some great tips on how to help veterans transition into civilian life. Switching gears now, COVID-19 has reached a record of 10 million cases in the United States. We're going to check in with our other sister station on just how volunteers are helping fulfill the race towards the vaccine. You're watching NewsNOW from Fox.
And then you get injected with that
coronavirus. earlier on Good Day.
Tomorrow is one of 2 days every year.
Coronavirus. Earlier on Good Day New York, we spoke with a doctor who's also a leading mind when it comes to vaccines.
Yeah, Dr. Paul Offit says that the announcement is great news as coronavirus cases continue to surge in the U.S.
What they're doing is they're taking the gene, the little gene that codes for that protein, that spike protein that sits on the surface of coronavirus. And then you get injected with that gene, and then you make the coronavirus spike protein, and then you make antibodies to the protein. We've never done that before. But it looks like it's going to work. So I think it's not only good news for Pfizer, I think it's good news for all these other companies that are trying a similar approach.
All right, well, joining us right now, a Pfizer vaccine trial volunteer, Andrew Rubin.
We had Andrew on the show back in June. Wanted to check in with him again. Good morning, Andrew.
Morning.
You're still in the trial, right?
I'm still in the trial because they're going to be checking my blood for the next 2 years to see how long this immunity lasts.
So were you given a placebo or did you get the real deal?
No, as you'll recall from a few months back when I was on, I got some symptoms, not of COVID, some flu-like symptoms about 12 hours after I had been given the vaccine. So I knew fairly quickly that it wasn't the placebo.
So what do you think? Do you think it works? I mean, and how would you know?
So listen, we now know it works, and remember, no one signs up for a phase 1 trial hoping they're going to get vaccinated. You sign up for a phase 1 trial to see if it's safe and contribute to the science. The fact that we now know it works as well as it does is a bonus for the 20 people who got this dose, this vaccine back in May as part of phase 1. But none of us knew at the time, that it was going to work or what was going to happen to us. I don't think any of us signed up knowing that we were going to get deathly ill, but we didn't know it was going to work, and we certainly didn't know what the journey was going to be like. When they had released the initial findings a few months ago and showed a positive response, I became optimistic that we were onto something and Pfizer was onto something, and this had the potential to work. But certainly yesterday's news with 90% efficacy is an extraordinary result to a relatively new science.
Well, tell us about your journey getting the vaccines. What did it feel like? How did your body react?
So, when people get vaccines of any kind, sometimes you get a little achy or you may develop a slight fever. I mean, how many of us have friends who get flu shots and say, oh, I got the flu the next day? You didn't really get the flu. Your body was building an immune response to that. And remember, I'm not a doctor, but I know this stuff. So and everybody's body reacts differently. So in my case, on the first dose, remember this is a 2-dose vaccine. It goes for 21 days apart. The first dose, I was a little slight minor fever for 24 hours. The second dose, 21 days.
Trial, right?
I'm still in the trial because they're going to be checking my blood for the next 2 years to see how long this immunity lasts.
So were you given a placebo or did you get the real deal?
No, as you'll recall from a few months back when I was on, I got some symptoms, not of COVID, some flu-like symptoms about 12 hours after I had been given the vaccine. So I knew fairly quickly that it wasn't the placebo.
So what do you think? Do you think it works? I mean, and how would you know?
So listen, we now know it works, and remember, no one signs up for a phase 1 trial hoping they're going to get vaccinated. You sign up for a phase 1 trial to see if it's safe and contribute to the science. The fact that we now know it works as well as it does is a bonus for the 20 people who got this dose, this vaccine back in May as part of phase 1. But none of us knew at the time, that it was going to work or what was going to happen to us. I don't think any of us signed up knowing that we were going to get deathly ill, but we didn't know it was going to work, and we certainly didn't know what the journey was going to be like. When they had released the initial findings a few months ago and showed a positive response, I became optimistic that we were onto something and Pfizer was onto something, and this had the potential to work. But certainly yesterday's news with 90% efficacy is an extraordinary result to a relatively new science.
Well, tell us about your journey getting the vaccines. What did it feel like? How did your body react?
So, when people get vaccines of any kind, sometimes you get a little achy or you may develop a slight fever. I mean, how many of us have friends who get flu shots and say, oh, I got the flu the next day? You didn't really get the flu. Your body was building an immune response to that. And remember, I'm not a doctor, but I know this stuff. So and everybody's body reacts differently. So in my case, on the first dose, remember this is a 2-dose vaccine. It goes for 21 days apart. The first dose, I was a little slight minor fever for 24 hours. The second dose, 21 days later for 36 hours. But nothing debilitating, nothing scary, nothing that I would say should turn anybody off from wanting to get this vaccine. I have had numerous physicals unrelated to the study since May. I had my annual physical, I had a cardiology exam, and I've had bloods drawn. And I'm happy to report there's absolutely nothing wrong with me because there are a lot of people who are afraid of these vaccines. I'm living proof that the side effects, once you get through the first dose, and not everybody's going to even have side effects, but for those who do, once you get through that, so far, so good.
When we were speaking with this doctor a little earlier, we were talking about whether or not the vaccine actually prevents you from getting coronavirus altogether or whether it just lessens the degree to which you get it. So I'm just wondering, did they talk to you about that? And also, did they still recommend that you wear a mask?
So they don't talk to me about anything. My knowledge is exactly what you're reading. I happen to know that I was in the study group that got the vaccine, that they tell you, and I know I got the dose level. Remember, there are different doses of the vaccine in the study, in the phase 1 study. I know I got the same dose that is now part of the vaccine that's going to be rolled out. But beyond that, I don't know anything other than what they've reported. So what I now know is what you know. 90% efficacy means essentially I can't contract it. It doesn't mean it's 100%, but at 90%, that's pretty strong. But between all of us here, I still wear a mask. I've been traveling for business again. I act as everyone else does and should. I wear a mask. I wash my hands frequently. It's nice to know now, as of yesterday, in the back of my mind that I'm not going to get it, but I'm still behaving that way. And by the way, it sets a good example for everybody. I think that until everybody's vaccinated, we all need to be careful about how we interact in the public.
I know you work at NYU Langone and you're operating as a private citizen doing this. Have you participated before in one of these clinical trials, and why did you do it this time?
No, I didn't. I did this time because, as we all know, this has been an unprecedented event in our society, one that hopefully we'll never experience again. And I'm not a doctor, but I work with our 3,300 physicians and our staff, clinical staff, who really were on the front line of this pandemic. And volunteering for phase 1 was really something I felt was important to give back. I was comfortable in my office working safely. They were on the front lines, putting their lives at risk. And for me, this was something I wanted just to do, to give back.
That's amazing, Andrew. Do we know how long this vaccine will last? I mean, is it 6 months? Is it a year? Is it forever?
You know what? You and I will check in again over time when we have more information. All I can tell you, one, we don't know. Nobody knows. What we know now is that it's still working. What we also know is that they'll be following me for the next couple of years. So I will be able to report back to you at some point and tell you if I'm still immune.
And do you know anything about a distribution plan? I mean, have they talked to NYU Langone about possibly doing something?
Yeah, I mean, I know a little bit about this from my work. It's a very complicated vaccine to distribute because it has to be stored at very cold temperatures. So it will only be able to, at least in the beginning, each state will distribute their allotment. So each governor will get to decide how it's distributed and who it gets distributed to. In New York State, I believe that it'll be distributed through hospitals or facilities that have the ability to do mass distribution to the public and also be able to store the vaccine because the storage requirements are quite intense.
Gotcha.
Well, we're glad to know that
But you
everything
won't
is.
be walking into CVS to get one.
Oh, all right.
At least not in the beginning. Not in the
Good to
beginning.
know, Andrew. And thank you so much for sharing your experiences with us here on Good Day.
Yeah.
Anytime.
Good to see you. Thank you.
Take care,
All right.
guys.
Stay well. Fascinating, right?
Very.
We've talked briefly about vaccines. There have been a lot of progression forward this week, specifically coming from Pfizer. Can you break down exactly what's going on?
Yeah, so I think the big headline is that the Pfizer phase 3 clinical trial interim data look showed that there was more than a 90% efficacy in preventing COVID-19 in individuals who got the vaccine versus those who got the placebo.
So they're saying it's 90% effective. How effective is that? It's still not 100%. There's still that 10%. So how realistic is it that we're going to see this vaccine soon?
So to put this in perspective, it's actually great news because the bar for COVID-19 FDA sort of like guidance was 50% efficacy. So 90% is like you study for the test, you didn't get a C and just pass, you actually got an A+. So I think it is good news. And to put it in perspective again, too, the flu vaccine is only between 40 to 60% efficacious. So 90% and above, super good.
For people out there who are nervous about getting vaccines, what is your word to them?
So my word is that our FDA currently it has put in a lot of safety guardrails about this vaccine and vaccine development around COVID in general. For example, they want at least 2 months of people, observation of people who've gotten the vaccine before even giving the paperwork to the FDA for emergency use authorization. Additionally, they want at least 2 years of active observation of these first 40,000 folks or so from this particular trial who've gotten the vaccine. And that's true for every other trial. The other issues for folks to know about is that these are not live viruses. There are some vaccines that are live or live attenuated or killed. This has nothing to do with that. These are just little bits of protein on the surface of the virus that our body will react to, make antibodies. So when the real deal thing comes along, you neutralize it in its steps.
So realistically, how soon could we be seeing this vaccine on the market and people able to take it?
So I would say they would probably submit the paperwork after Thanksgiving. Probably wouldn't see it for the first phase of healthcare workers, maybe January. Probably for the general population, summer or fall of 2021. So not tomorrow, unfortunately. But definitely on the horizon. The additional information is that this is just the first of several vaccine trials that will probably come in the market. So the additional vaccine companies and candidates would add additional doses to the Pfizer product. So it may be sooner than fall if everybody gets their data ready and shows promising results.
And let's talk realistically about distribution. This vaccine has to be kept in certain temperatures. It's going to be somewhat difficult to kind of regulate across the board for all of the states. So what do you see as being the distribution method from state to state?
So currently it's left up to the state to take care of its own affairs, but I'm hoping that with the new administration starting in January, that there will be a national strategy and a national distribution plan, because again, the sum of the parts of the US is better than the individual, states in this perspective, because this is a national issue. The virus doesn't care what state you live in. But currently as it stands, you're right, Daytona, they have to be super cold freezers, like -80. And to put that in perspective, our freezer at home is like -4. So you're talking about ultra cold temperatures that our Walgreens or CVS won't have. Additionally, you need to have enough syringes, dry ice for when you take the vaccine out, and most importantly, information system that will keep track of Californians. So like if you were in San Francisco, you got the vaccine, but you're visiting your family in LA and you decided to stay there a little bit longer, some system has to track where you are to know when you should get the vaccine and keep track of that.
So you're actually out in California, and Governor Newsom this week has spoken about how California will be on the front lines of distributing this vaccine. What have you heard on your end from doctors out there? Do you think California is going to be that first state that really steps forward with this?
I think California is ready. We have a very large population. So far, we have a very good network of communication. So if there's going to be a test state for the rollout of the vaccine, it's got to be California. Of course, I'm biased. I feel really lucky to be here during COVID, but again, I'm hoping that we'll be one of the exemplar states that can show how distribution of a complex cold chain can work.
Now, not only are you in California, but you're also at UCSF. And funny enough, this new coronavirus task force that Joe Biden has rolled out includes a few of your colleagues. Can you speak to that?
Yeah, so 3 of my UCSF colleagues are on the task force. I feel really privileged to be at that institution and to know them to some degree. David Kessler was one of our former deans of the School of Medicine. He's a pediatrician. He was a former commissioner of the FDA, so he knows both governmental and on the ground taking care of the patients, as well as policy. Eric Gooseby was one of the architects or helped move HIV medicines to the rest of the world, particularly in Africa. So he has that global look as well as on the ground experience. And Robert Rodriguez, emergency room physician, whose work has really been around disparities and making sure everyone has access, regardless of who you are. So again, speaking to the breadth of experience from taking care of patients to minority populations to a global overlook, I think not just the UCSF folks, but the panel in general is very balanced. Men, women, lots of race, ethnicity, variation, and diversity that makes me feel very happy.
Well, your outlook for 2021 as far as the pandemic goes, what would you say? What would you describe that year as?
Cautious optimism. A lot of cases right now in the country. California is ticking up. Southern California, in particular, in the north, Santa Clara County. So I think, I'm worried that the cat is already out of the bag, but guarded optimism. I feel like we can at least prevent additional deaths in the country with a national strategy and an alignment of science with politics.
All right. As always, thank you, Dr. Chin Hong, out there in California. We appreciate you.
Thanks so much, Daytona.
Now, as the race for a vaccine continues, many Americans admit that they are a bit hesitant about taking something that is so new. So a huge thank you to NewsNOW from Fox's Daytona Everett for speaking with that infectious disease expert on just what people can expect if they do choose to take the vaccine. Now, switching gears a bit, in Iowa, more than 100 long-term care facilities are seeing a COVID-19 outbreak. So we're going to take you all to Iowa for the latest updates. You're watching NewsNOW from Fox.
And in some cases, staff absences due to virus-related reasons. As the governor mentioned, this represents about 6% of our schools, with 446 public districts and non-public schools in 1,300 buildings. Schools do not have to wait until they reach both student absenteeism of 10% and a county positivity rate of above 15% to apply for a waiver. These guidelines are to assist districts when they are determining when they might want to use remote instruction, but they are only guidelines. The county positivity rate is just one factor that school districts and non-public schools should take into account, and it may not be indicative of the positivity rate among their students and staff. Each request to use remote instruction is reviewed on a case-by-case basis with our public health colleagues, and we have approved waiver requests that did not meet these specific thresholds. Our schools have put a lot of work into health and safety measures and mitigation strategies that have helped them manage conditions in their school environment. Because each situation is unique, school districts and non-public schools have a lot of flexibility to manage conditions in their schools and can always submit a waiver request at any time. Iowa's Return to Learn plans offer flexibility to operate during COVID in ways that do not require approval from the Department of Education and can be adjusted based on input from local school boards and feedback from students and families. Schools can immediately transition to remote learning for up to 48 hours while waiting for a waiver decision. Because the 50% in-person instruction requirement is based on a 2-week period, schools typically providing full-time instruction can also move to remote learning for up to 5 days without needing approval. Schools can also move 1 or more grade levels or sections of a building to remote instruction without department approval. Schools can make these local decisions based on local conditions and only need to request a waiver if they feel that closing an entire building or the district is the right decision for their community.
Thanks, Ann. And I want to commend Iowa schools for doing everything that they can to keep student and staff safe while making sure that learning continues. 3 of Iowa's counties with the highest positivity rate have experienced recent outbreaks in our state correctional facilities located there. The highest rate is 43% in Jones County, where there are currently 490 cases of COVID-19 among inmates at the Anamosa State Penitentiary. 484 are projected to move into recovered status this week of the 490. 254 inmate cases at the North Central Correctional Facility in Rockwell City has pushed the positivity rate in Calhoun County to 35%. Again, a majority of those, I think, are moving to recovered, projected to this week. And in Page County, where the positivity rate is 33%, the Clarinda Correctional Facility have had 440 inmate positives at that facility. I did have the opportunity yesterday to sit down with Director Skinner, who briefed me on the situation and has informed me that the second round of testing in these facilities are taking place today and tomorrow with the inmates that had tested negative. And as I indicated in the comments earlier, most of the individuals are moving to recovered status this week. Yesterday, 1,131 Iowans were hospitalized due to COVID-19. 89% were adults age 50 or older. Patients hospitalized where it is specifically due to COVID-19 account for about 15.2% of the census, and patients who test for COVID, but it's not the primary case, so all COVID patients, it accounts for about 21% of the census across the state. But the overall increased patient volume is stressing our healthcare system, and it is putting capacity at risk. Surge plans are in place, and while beds still are available for patient care, staffing them is becoming increasingly challenging as some healthcare workers may be sick or in quarantine or caring for other family members. The situation has the potential to impact any Iowan who may need care for any reason, whether for COVID-19 or for some other serious medical condition. And we don't want anyone to be turned away from our hospitals. As I said last week, these trends cannot continue, and it's critical that all Iowans do everything within their power to stop the spread of the virus now. Like so many states, we've reached a point of serious community spread, and we can no longer pinpoint any one age group or type of activity that's driving it. The virus is spreading easily between people as they gather together in groups or go about their normal activities, especially when preventative health measures like masking and social distancing aren't being followed. Because of the high level of community spread at this time, we're vulnerable to the virus even in casual gatherings with friends, neighbors, and extended family members. I know, again, as I said last week, we're all experiencing pandemic fatigue, but we just can't let our guard down just because we're getting together with people that we know or doing things that are most familiar to us. Even then, we're still putting ourselves and others at risk. The things that seem the least threatening are some of the highest risk activities right now, like wedding receptions, youth sports, even having some neighbors over to watch a football game. If we want to protect our healthcare workers, keep our businesses open, and our kids in school, and our hospitals open, now is the time for every Iowan to carefully consider what more that you can do to prevent being exposed to the virus and further spreading it. Since the beginning of the pandemic, I've said that I dial mitigation measures back up when conditions warrant, and that time is now. Today, I've signed a new proclamation that continues the public health emergency for another 30 days. And the proclamation imposes a number of additional public health measures to reduce the spread of COVID-19. Effective at midnight, any social, community, recreational, leisure, or sporting gatherings with more than 25 people indoors or 100 people outdoors will be prohibited unless all people over the age of 2 wear masks. Groups of individuals who attend these events together are limited to 8 people unless the group is from the same household, and all groups must still maintain social distancing from other groups at the event. Additionally, at indoor youth and high school sporting or recreational activities, only 2 spectators per youth athlete or participant are permitted to attend. The new 8-person group limitation also applies now at bars and restaurants, where distancing of 6 feet between groups will continue to be enforced, and patrons must be seated to consume food or drinks. Masks are now required to be worn by employees and customers at businesses that provide personal services, including salons, barbershops, massage therapy, tattooing, and tanning. Bowling alleys, pool and bingo halls, arcades, indoor playgrounds, and children's play centers are now required to ensure groups are limited to 8, unless, of course, they're from the same household, and all groups, again, must maintain 6 feet of distance while in the establishment. Reducing the spread of COVID-19 in the workplace is also critical. And while many employers have extended work from home status for their employees, I'm also ordering that all employers again evaluate whether more individuals can work remotely and enable them to do so to the extent possible. Finally, the proclamation strongly encourages all Iowans to consider how their actions impact the spread of the virus in their communities. I know that getting life back to normal is what Iowans want, and we've managed to get things back to normal already, even if they look and feel a little different yet. You can still eat in a restaurant, you can still go to a movie and work out at a gym, and in many states you can't do that. Iowa is open for business, and we intend to keep it that way. That's why it's time for these additional mitigation measures. But it will take all of us doing everything we can to stop the spread of the virus and keep it at a manageable level that we can live with. If we don't, we lose the very things that we've worked so hard to maintain. So I'm asking you to think about how you can make a difference, and it may mean making some really hard decisions. Please consider avoiding events where public health measures may not be followed, especially if you're someone who's more at risk for serious illness from COVID-19 because of age or other health conditions. High-risk events where the virus has been spread to large groups of people, again, it includes wedding receptions, funerals, bridal and baby showers, birthday parties, and even holiday parties. If you attend one of these types of events, consider quarantining afterwards to monitor for any symptoms that could develop. And if that happens, you need to get tested and stay home until you get your test results back. And if you're a healthcare worker, a teacher, or other type of essential worker, please be vigilant about protecting your health in everything that you do, both at work and especially when you're outside of work. There are also everyday changes we can implement within our own lives and families that will make a difference. Minimize your time away from home as much as you can. If you have guests in your home, limit the numbers so that everyone can maintain social distancing. Postpone celebrations or vacations until a safer time. The decisions, again, each of us make over the next few weeks may impact someone's life. It's up to all of us to determine if our actions will protect someone or put them at risk. This is the time when personal responsibility also means personal sacrifice, and we can do this. It's worth it. You are critical to keeping our state moving forward. So before I close too, I want to remind Iowans that the Test Iowa sites will be closed for Veterans Day tomorrow. I know there's high demand for testing at this time and that appointments are filling quickly. But I want to remind Iowans again that there are many, many options for testing, including a doctor, clinic, pharmacies, stroke detection clinics have sites available. So if a Test Iowa site near you is full, please seek out another option so that you know if you have the virus as soon as possible. And if you do, again, follow your isolation as directed by public health. And with that, we'll go ahead and open it up for questions.
Governor, in the past, you've said when you've been asked about a statewide mandate, you said there's no way to enforce that. How will you enforce this 25-person requirement for masks?
So it will continue like everything within the health declaration. If it's not enforced, it's a simple misdemeanor. And again, we've asked our police department, our officials to help us enforce that. But that includes educating, informing, and as a last result, issuing a misdemeanor. So actually, so they'll continue the same practices that we've had all along. And in addition to that, the DIA, the Department of Inspections and Appeals and Alcoholic Beverage Division will also be responsible, like they have all along, for enforcing the regulations at our restaurants and our bars.
Why couldn't they have done that on a statewide basis?
Well, we're targeting, I'm asking for personal responsibility. The mandates that we put in place right now are targeted to where we're seeing potential spread. So we believe that that's the right action to take at this time.
Governor, you noted that in Iowa, there's still a lot more activities that people can do than they can in other states.
Yep.
However, Iowa's per capita spread is much higher than it is in a lot of other states. How do you square those two things, and why not take
Well, we're testing a lot of individuals, so we're watching it. We're working with our hospitals on a daily basis, and so I've said at this point we're putting in additional mitigation efforts. They are targeted to where we're seeing the spread take place, and that is with smaller gatherings. It's with people are just they're just becoming very relaxed because we've been dealing with it for so long, and so they're not taking the precautions maybe as like they were before, and so you start to let down your guard when you're bringing friends and family together. And so we're limiting the number of indoor activities to 25 people, outdoor activities to 100. And if you want to go beyond that, then everyone in the facility needs to be wearing a mask, 2 years and older. We need to still practice social distancing. That's important to continue to do that. And we're going to continue to reevaluate on a daily basis. So this is where we're starting those additional mitigation efforts where we're mandating the mask is in effect until November 3rd. And as I said, we'll continue to evaluate every day and see if there are additional measures that we need to take. We can't continue to see the number of individuals hospitalized. It is about workforce and it's about capacity. And we need to make sure that we're doing everything we can as a state and as an Iowan to make sure that we're doing the simple things that we've talked about from the very beginning, and that's staying home when you're sick, washing your hands often, wear a facial covering if you can't social distance, and limit your trips. And if we all do that and really buckle down, hopefully we'll start to see we'll see the positivity rate go down, and we'll start to see our hospitalizations go down too. Again, we're working very closely with all of our hospitals. I said what the percentage is of the census that's due to COVID and then primarily COVID, but we have seen those tick up over the next week, over the last week. And so we want to see those go back down, and we want to continue to work with the hospitals. They have surge plans in place, and they're managing and adjusting, but we're putting an extreme amount of pressure on them, and we can eliminate and reduce some of that by really taking very simple steps that can have a big impact.
Governor, why 25 people and 100 people? I mean, you mentioned that small gatherings are driving the spread. The
Yeah.
White House Coronavirus Task Force in its reports this week, in recent weeks, have warned that gatherings outside of your household are really driving up the spread. 25 people is still a lot.
Yeah.
I mean, we're coming close to Thanksgiving here.
Well, we're still
What is the
asking people
message
to
there?
be
I mean,
responsible.
why not fewer people?
Yeah, well, it's a good place to start, and we'll take a look at it going forward. We took a look at a lot of different numbers and where we felt that we could be impactful. But in addition to that, Caroline, we're asking people to be responsible. So think about who you have over. Think about individuals that are vulnerable in your family. Think about, how your actions have an impact on hospitals and businesses and schools. And so right now, we have said that for indoor activities, 25 and over, you have to wear a mask and you have to social distance. I would say practice those 25 and under, but anything over that, there is a requirement to have a mask, social distance if you're 2 years and older. Outdoors activities, it's 100 and over. Again, they can be outside. They are to social distance. That it's not a mask versus social distancing. It is both. And we can have a larger venue than that if they adhere to the requirements of wearing a mask and social distancing. Again, with youth activities and high school sports, we want those kids to still have the opportunity to participate because we think that it's good for them. But, those are pretty tight quarters when parents and grandparents and family members come. And so therefore, we're going to allow them to go ahead and participate in sports, but we're going to limit the spectators to 2, and you still need to social distance. And so we'll see what happens. We're going to continue to look at the numbers, and we meet daily with public health and the team in my office, and we're assessing where we're at, and if if we have to do more, then we'll move forward with that. This is a place to start, and it's progress from where we were.
If I could
Was
just
there a
follow up
specific-
really quick.
Well, I'm going to get to somebody that hasn't asked a question yet, and then we'll circle back.
Governor, Test Iowa is getting some criticism because of the lack of appointments this week. There was talk about doing some more metro sites. Is that something you can talk about? Will there be more facilities where people can go?
Yeah. So actually with Test Iowa, I'm going to just give a little bit of a history and talk about what we're doing. It's incredible, the capacity that we've built into that. So right now, we started with Test Iowa, and our goal was to do 3,000 a day, and we've doubled that. We have the capacity right now to do 6,000 a day through the State Hygienic Lab with the Test Iowa lab, which is downstairs. Yesterday, they hit an all-time high, and they ran through the lab 6,203, and that is just the Test Iowa sites. So we continue to increase the number. They brought the numbers down a little bit because of the holiday, and we didn't have the lab, and we don't want people waiting on results. So we wanted to make sure that we would meet that expectation. I had some information here. I can't seem to find it. But overall, I'll give you an example, too, of just the sheer volume that we're testing when you take a look at everything, not just Test Iowa and clinics, but all of our capacity to test in the state of Iowa. From November 1st to the 7th, we tested 160,146 Iowans, which equates to about 23,000 Iowans a day. So we continue to look for opportunities to build that out. And then, okay, so our current capacity with the kind of the rollback with the holiday was 2,470. Yesterday, Todd, we built into some capacity to that. So we have the capacity now of doing 3,040. And that went into effect yesterday, so we bumped them up. And then we are winterizing, so we're making some adjustments there. But with the way that they've set it up inside, we still believe we'll be able to meet the capacity that the State Hygienic Lab has. So just remember, though, but if you can't get a test through Test Iowa, there are multiple other sites, your doctor, your clinics, your pharmacies, the stroke detection clinic centers. I mean, there are the antigen test. You can buy a test at Costco. I mean, there are a lot of options out there, and we'll continue to build that out. So Iowans, I think we've tested 1 in 3. Our numbers, when we look at every every type of test that we're utilizing. We are way at the top in compared to other states.
Governor, is this a de facto mask mandate for schools?
Oh, well, we kind of, I mean, so we're trying to incentivize it, Kay, so I think we already sort of did that for kids, because when I was talking to superintendents, we were asking what are some of the issues, what's working, what's not, and what I was hearing as we talked to superintendents across the state is if they weren't wearing mask at that point and a child tested positive or a teacher, then they would have to quarantine the entire classroom. And what they were seeing out of the numbers that were quarantined, they weren't having any positive cases come out of that. Now, a lot of them were already wearing masks, but the numbers really showed that there wasn't a lot of transmission between the kids, and those kids being quarantined, the continual disruption of being out of school and back in school was causing problems for them and just administrating all of it. And so we worked with Dr. Padati and other states, and that's when we said that if everybody is wearing a mask in the classroom, then you don't have to quarantine. Now, if you don't abide by that, then the old procedure stays in place. So it was an incentive to say if you don't like the disruption and it's hard for families. And what I heard from parents and what I've continually heard from parents is they're okay with the mask. They want the kids in school. They think it's really important for the kids to be in school. So we're trying to figure out ways that we can do that. As far as the sports, it's just one more, that's a way for us to continue to let them participate. But to just say, I can't have a gym packed with people and not take a chance on them not wearing a mask or not social distancing. So the way that we can address that right now is to limit those numbers to 2 spectators, and then we'll take a look at it. I don't know if I'm answering your question.
The question is, if you look in a school hallway, that's quote unquote a room perhaps.
Yeah.
You have more than 25 students in there if the school district doesn't currently have a mask
No, it doesn't
mandate.
apply. These are for, okay, I misunderstood what you said. These are for social, this is for social gatherings, and so that the school would be outside of that.
The 25 number.
Yeah,
Okay.
yeah, I'm sorry, I misunderstood your question. So it's for social, community, recreational, leisure, or sporting events. So that's completely separate, so I'm sorry.
Does that include like a Thanksgiving holiday celebration, like that?
Yeah.
Okay.
Yeah.
May I ask you a question?
Yeah, yeah.
So I've talked to public health professionals in the counties, county
Yeah.
level administrators in the last few days.
Yeah.
And they tell me that it's not really just COVID fatigue, but it's people don't believe masks work. People don't believe COVID is that serious of an illness because they've known a lot of people that have got it and just
Yeah.
simply gotten better.
Yeah.
So there's a lack of belief of the seriousness of the level of this illness in our society. So I'm wondering what you do it just seems like a public service campaign is not going to change hearts and minds on that point. I commend you for the actions today, but if people aren't willing to really believe this is that bad, what do we do?
But some of that goes into pandemic fatigue. Some of that goes into a lot of individuals, people, to your point, that have had it and recovered. Our president did that. So I'm here to tell Iowans, I need your help. If you want to keep our businesses open, if you want to keep our kids in school, if you want to make sure that we have hospitals and long-term care facilities, and we have clinics that can treat not only COVID patients, but that they can treat other individuals that have serious health conditions that need to go to the hospital, then we all have to buckle down and take this serious. It spreads. It's very contagious. And so we need to all do our part. And I hope Iowans take that heed, because I have tried to be very mindful of not only protecting lives, but livelihoods by trying to work with our small businesses. I talk to them all the time as I travel the state, and some of them have indicated they don't know if they can survive another shutdown. So my message to them when they say that is to help us keep it open. Help us help us by doing your part. Talk to your family members. Talk about what we all can do to help us bring down the numbers and really help bend the curve so that we can protect all of the instances that I just listed, our hospitals, our schools, and our businesses. We can do it. And then, David, we are doing a significant PSA campaign. I'm really excited about the individuals that I've had to come in and be a part of that. It's, we've got just a lot of different personalities that people respect, admire, and identify with, and I think that will help also. We're doing print in local papers. That's how a lot of our rural communities get the information information, and we're doing radio. So I'll be doing radio, we'll be doing television, and we'll be doing print to really just do everything we can to say, help us get this thing under control. And let's really buckle down and let's see where that takes us. And hopefully we'll start to see the kind of bend and the containment that we're hoping we will. And if not, we'll have to sit down with the team and we'll have to evaluate what we need to do next.
Governor, what are PPE and staffing levels looking like specifically at hospitals across the state? Unity Point in Des Moines over the weekend saw a 25% increase in COVID cases and are starting to have staffing concerns. So what are they looking like statewide here in Des Moines? And also, will the state be offering any additional support to these systems?
So, I mean, we're monitoring that on a daily basis and working with them. We ask if PPE is an issue right now. They're not telling us that it is. It is truly workforce. So even with surge plans that we have in place, if you don't have the workforce to maintain the individuals or the level of acuity, then, you know.
Se torna más seco. Para ayudar a salvaguardar la salud y el bienestar de nuestro personal, estudiantes y comunidades escolares, y tras consultar con el Departamento de Salud Pública de Filadelfia, el Departamento de Educación y el Departamento de Salud de Pensilvania, hemos decidido seguir implementando al 100% la opción de aprendizaje virtual en este momento. Esto significa que nuestro plan para comenzar la transición a un modelo de aprendizaje híbrido el 30 de noviembre se pondrá en espera y todos los estudiantes continuarán participando en el aprendizaje digital hasta nuevo aviso. Por lo tanto, nuestra transición al aprendizaje híbrido se llevará a cabo solo cuando la orientación y los datos que recibamos del Departamento de Salud Pública de Filadelfia, del PDE y el PDH indiquen que podemos hacerlo de manera segura. Hemos recibido una gran cantidad de comentarios que respaldan nuestra transición al aprendizaje híbrido y sé que esta decisión de permanecer 100% virtualmente puede ser una noticia decepcionante para algunos estudiantes y sus familias. Para aquellas familias que querían reanudar el aprendizaje en persona, su selección para elegir el aprendizaje híbrido será respetada cuando se considere seguro para todos hacer esta transición. A medida que continuamos con el aprendizaje al 100% digital, seguiremos comprometidos a apoyar las necesidades de nuestros estudiantes y sus familias. Eso significa que continuaremos ofreciendo soporte técnico y Chromebooks a aquellos estudiantes que aún puedan necesitar dispositivos para participar del aprendizaje digital. También queremos recordarles a todas las familias que aún no tienen acceso a un servicio de Internet confiable que pueden obtener servicio gratuito a través de la iniciativa PHL Connected. Puede llamar al 211 para obtener mayor información. El distrito escolar también continuará proporcionando comidas a aquellos estudiantes que las necesiten, ofreciendo 5 desayunos y almuerzos cada semana en las escuelas de toda la ciudad. Las familias pueden visitar filasd.org para encontrar el sitio de distribución de comidas más cercano a su hogar. Y nosotros continuaremos ofreciendo el apoyo socioemocional diseñado para ayudar a nuestros estudiantes y a sus familias durante estos tiempos sin precedentes a través de nuestra iniciativa Healing Together. Además,
it spreads. It's very contagious. And so we need to all do our part. And I hope Iowans take that heed, because I have tried to be very mindful of not only protecting lives, but livelihoods by trying to work with our small businesses. I talk to them all the time as I travel the state, and some of them have indicated they don't know if they can survive another shutdown. So my message to them when they say that is to help us keep it open. Help us help us by doing your part. Talk to your family members. Talk about what we all can do to help us bring down the numbers and really help bend the curve so that we can protect all of the instances that I just listed, our hospitals, our schools, and our businesses. We can do it. And then, David, we are doing a significant PSA campaign. I'm really excited about the individuals that I've had to come in and be a part of that. It's, we've got just a lot of different personalities that people respect, admire, and identify with, and I think that will help also. We're doing print in local papers. That's how a lot of our rural communities get the information, and we're doing radio. So I'll be doing radio, we'll be doing television, and we'll be doing print to really just do everything we can to say, help us get this thing under control. And let's really buckle down and let's see where that takes us. And hopefully we'll start to see the kind of bend and the containment that we're hoping we will. And if not, we'll have to sit down with the team and we'll have to evaluate what we need to do next.
Governor, what are PPE and staffing levels looking like specifically at hospitals across the state? Unity Point in Des Moines over the weekend saw a 25% increase in COVID cases and are starting to have staffing concerns. So what are they looking like statewide here in Des Moines? And also, will the state be offering any additional support to these systems?
So, I mean, we're monitoring that on a daily basis and working with them. We ask if PPE is an issue right now. They're not telling us that it is. It is truly workforce. So even with surge plans that we have in place, if you don't have the workforce to maintain the individuals or the level of acuity, then, you know, it doesn't matter. And so that's one of the reasons that we helped allocate the $25 million, I think it was, to help with some of the incentives for the workforce that have just really been the unsung heroes from day one, and to help our hospitals retain and recruit and get the workforce that they need to manage the numbers that we're seeing. And if we need to do more, we'll take a look at that moving forward. They were all very, very grateful for that allocation of CARES dollars to help not only, you know, thank our workforce that have been working on the line from the very beginning, but to also, again, look at opportunity to bring additional workforce in, and then to be competitive, because every state across this country, and especially in the Midwest, are experiencing the same kind of numbers that we are, and they're experiencing healthcare workforce shortages. So, I don't know, Kelly, is there anything that you think that we need to add to that you want to add?
I think the only other thing I add is that we are having a number of different conversations with companies that find and locate healthcare professionals, and really thinking through the other operational levers we can pull to make sure we can find them, get them in quickly, not ever compromising quality, but really just leveraging that availability, and constantly getting back out there to talk to people on the ground about what that barrier is, what's the real constraint in real time. We have nurses, and I leverage our DHS experience on running facilities that pick up extra shifts. So how do we both maintain that safety and know where they are in case there's an outbreak in the facility, they're picking up an extra shift, but kind of how do we spread that resource at the community level?
We're going to take 2 more questions. One more from this room.
I have a follow-up.
Governor?
I have a quick follow-up, if I might.
Yep.
The quick follow-up is, I want to make sure I understand the mask issue that you raised. Is it all 99 counties or just the worst?
No, it's all 99 counties, but
Okay.
it's targeted to those
Okay.
indoor, outdoor,
Okay.
youth.
And will this pertain to the legislature in January at all?
No.
Okay.
They'll have to make their own decision.
Governor, the new proclamation doesn't have any capacity limits on bars or restaurants. You shut down bars in August because you acknowledged they were super spreader events. I'm wondering, when we have a surplus in the state budget of $300 million, our cash reserves are full, our emergency funds are full, why not temporarily close those to slow down the spread and you know, give the small businesses help from the funds that either CARES Act or state dollars to keep them afloat? What is that at all consideration?
Well, first of all, you have to remember that while we don't have a capacity, they still have to social distance. So that basically means they have to have 6 feet between each table. In addition to that, they have to be seated. This is new restrictions. They have to be seated at the table when they're, you know, at all times, except for go to the restroom or for limited activities. And when they do that, they have to practice other measures. In addition to that, we've limited the number of groups. So it can only be 8 at a table unless it's a household, and then it can go, you know, above that. We didn't want to separate families because they're living together. So they really are already still, and we've added some additional to that. And like I said earlier, we'll take a look at it. But what we're seeing, if we need to make additional adjustments, we will. But I remember you asking me a question not too long ago. Governor, what are you going to do about these small businesses that are finding their livelihoods being shut down when I was shutting down the bars? What about the impact that it has on those businesses? And they're reaching out to me and saying, this is my livelihood. I've worked, you know, my whole life to buy this business. Do you remember asking me that question? So I have to balance all of that. I have to balance the health and safety of Iowans, and I have to balance the livelihoods, and I have to take a look at other aspects as well that we always lose in the context of talking about COVID-19, and that is the increase in substance abuse, the increase in suicides, the increase in mental health issues. They are exponentially increasing because of the isolation and what we're dealing with COVID-19. And so we have to always be mindful of that. And that's going to be a lingering effect of COVID-19 that we're going to have to be mindful of as we move into this next legislative session. And we should never lose sight of that, ever.
Governor Joe Biden is likely to do a federal mask mandate. He's not just announced there. I know you said that you did not want to, but I'm curious, how soon the president-elect think of issuing one, and do you believe he is the president-elect?
You kind of sound like you're underwater, but right now, we'll wait until all that takes place. Right now, we're putting mitigations efforts in place that we believe will be impactful. And again, if we need to do additional steps, to take additional steps, we will at that time. So thank you.
All right, everybody, good morning, and thank you so much for watching News Now from Fox. My name is Pilar Arias. I'm going to come on here in just a second. Excuse me, I'm going to come on here in just a second to say hello to you all, since I just started being in charge of the stream or hosting News Now from Fox. So again, everyone, hello, my name is Pilar Arias. Happy Wednesday. Thanks for joining us. It is 11/11, November 11th. We are honoring and observing veterans across the country. If you are currently serving or have served, thank you so much for your service. My father is a Vietnam veteran himself, so I've definitely heard a lot of stories about serving in the Army and military experiences. So again, I want to thank you all across the globe. If you have served or are currently serving our country, we certainly value and appreciate you, not just today, but every day, for sure. We're getting some updates from across the country. Matter of fact, right now I want to show you a live picture that we have currently. I'm being told that this is going to be a live update from Georgia, the GOP Senate campaign briefing. This is Marietta. So as soon as that gets underway, we'll bring it to you right here on News Now from Fox. But I'm going to take you out to Austin, Texas here next, where they did a salute to veterans, kind of an observance ceremony. It's only about 5 minutes long, but again, we are honoring all of you who have served or who are currently serving across the country and across the world, because as we know, a lot of our military members don't stay here in the U.S. when they serve the country. So we're going to listen in right now on News Now from Fox. No, they don't. They don't. And so when he made that comment, I didn't care. Remember when we had that meeting with... Again, everybody, that's a Veterans Day observance in Austin, Texas. Today, Americans are gathering to pay a debt of gratitude to the generations who've answered the call to serve in the armed forces of the United States. From Bunker Hill to Bellew Wood, from San Juan to Saipan, from the Coral Reef to Kandahar, nearly 50 million men and women have donned the uniform of the United States, and nearly 20 million veterans still walk among us. Today, a new generation of American heroes and veterans is being forged around the nation and around the world. Believe it or not, this is an opinion piece by Vice President Mike Pence himself that is published on Fox News. So yes, that's what I'm reading right here. Continuing on to read, our veterans really don't consider themselves heroes. Most of them reject the very thought of it. My dad, a combat veteran from the Korean War, used to say with humility that the heroes were the guys who didn't make it home. Again, this is an op-ed piece from Vice President Mike Pence on Fox News. But on Veterans Day, it's our day to set the record straight. Every veteran of the armed forces of the U.S. is a hero to the American people. On this day, it's our duty to tell the story of what they did for us, what they did for our country, and all that they've done to ensure the survival and the success of liberty. Continuing on to read Vice President Mike Pence's opinion piece on Fox News. Reading, quote, as a father of a Marine Corps captain and a father-in-law of a Navy lieutenant who's currently deployed, I couldn't be more proud to be vice president to a president who cares so deeply about the men and women of our armed forces and every veteran in America. Since the first day of our administration, President Trump has fought to ensure that America keeps the solemn promises we've made to all of our nation's heroes. Continuing on to say, 4 years ago, years of budgetary neglect combined with ever-growing foreign commitments were sapping the strength of our men and women in uniform and challenging their morale. Scandal after scandal at the Department of Veterans Affairs, VA, as most are familiar by calling it, revealed a cold indifference to the fate of our veterans. Again, this is an opinion piece from Vice President Mike Pence. Continuing on to read, in his speech to the American Legion on September 2016, when he was a presidential candidate, Donald Trump promised to, quote, rebuild our depleted military and ensure every veteran in America gets timely access to top quality care. Looks like we're going to be getting this event here out of Georgia. You're going to listen in here.
For the better. David and Kelly have proven that what we believe in as Republicans is the best path for America. But as you know, the Democrats want to take us down a destructive path with their radical agenda and ideas, which have proven to fail everywhere they've been tried. If we lose the Senate and Chuck Schumer becomes the majority leader, we won't recognize America. It will be a different country. We are literally fighting for our freedoms, our principles, and our values. That is what is at stake, and that is why we must re-elect David and Kelly to the Senate. And the good news is that they are the perfect team to fight not only for Georgia families, but for families all across this country. So I thank you all. What a great, great crowd. And happy Veterans Day to all of you veterans. We appreciate appreciate your service, and we're determined to keep the country that you fought for. So if you're a veteran, would you just raise your hand so we could give you another round of applause? Wow. Thank you.
Some of you are going to see a very quick commercial break.
Thank you so much for all you've done for us and for our country. And now I have the honor of introducing a man who needs no introduction. Senator Rubio is a champion for the freedoms. He's a champion for the freedoms that we hold dear. And David is so fortunate and proud to be able to work with Senator Rubio in the Senate. Senator Rubio supports free market solutions that allow our small businesses to thrive. He opposes the socialist agenda that Ossoff and Warnock want to impose on the American people. And this year, as our Georgia families worked in difficult times to survive COVID, Senator Rubio, David, and Kelly worked to bring millions of dollars of relief to our state and to save 1.5 million Georgia jobs through the Paycheck Protection Program. Senator Rubio, as you know, all eyes are on Georgia. So we appreciate you being the first to come to our state to send a unifying message that David and Kelly will win. And that we will defend the majority in the Senate. So please give a warm Georgia welcome to a man you already know and obviously love, Senator Marco Rubio.
Thank you. Thank you very much. Thank you. I'm going to take the mask off because I'm not going to be 15 minutes long, but you want me to wear a mask because I work with 99 strange people from all across the country, so, well, 97. There's 2 of them that are not strange at all, and I'm going to talk about them in a moment. But thank you guys for rallying here today and being here today. Obviously, we are now about a week removed from the last election day, and you're thrown into a new one. I will say I'm a little jealous because I got to tell you, this is supposed to be Florida's job to have a tight election that we're still talking about weeks later. So you're stealing our spotlight. And but I think we should begin where Bonnie just mentioned, and that is there is one thing in this deeply divided country that I think all Americans still cheer and appreciate, and that is the men and women who serve and have served us in uniform. And I want to thank you on this Veterans Day. And I want to thank your families, because that is and that's not a throwaway line. I mean, that's not a throwaway line. I want everybody to understand that as I'm speaking to you right now, there's a young man or a young woman whose family love them and they love our country, who are somewhere in this world in harm's way, not in literally in harm's way, and risk their lives for us every single day so that we could have the freedom to be here at home arguing about the things that we like to argue about. And so I deeply appreciate it. Bonnie, you did a great job. As I told her back there, I mean, we're glad you're here. We think you're a great voice. And David Perdue, who's not here because he's working so hard, David is a unique member of the Senate. This is a guy, first of all, he's an electrical engineer, right? Isn't that what it was, electrical engineer? I don't know anything about engineering, so right away, or I don't know if it was electrical. He's in engineering, okay? I'm just not good at any of that stuff. But then he became so successful in business and helped build some of the best brands that we recognize in America today. And you may say, well, that's great in business, what does it have to do with politics? Well, so much of what we make decisions about are the economy. And to have someone that understands what goes through the minds and what influences the decisions that people that create jobs make has been invaluable for our conference. When we were working on the small business package, I relied on him quite a bit and went back and talked to him about the impact of this and the impact of that and what it would mean and what it would do. His insights were extraordinary. So that is the reason why it's so important that he be reelected. And I want to thank all of you for being here today and working so hard on his behalf. And the same can be said for Kelly. Kelly comes from a very similar background in terms of everything she's brought to the Senate and everything that she's been able to offer us there. Senator Loeffler's been fantastic in all of these things that she has brought forward. She was also, I have the text messages, I almost pulled them up and read them to you, that she was sending to me late at night talking when we were working and negotiating PPP, and a lot of those ideas made it there. And I can tell you for a fact that those contributions that she made to that debate are the reason why there are small businesses in this state and across this country that are open, and jobs that were not lost because that program passed and the president signed it and the contributions she made. That is the reason why we need someone like her to continue in the Senate. She's also shown, and one more thing, she's shown extraordinary fortitude in the face of all sorts of efforts to silence her, to criticize her, to shame her. That's the things they do in American politics. I'm going to talk about that in just a moment. And I think we need that kind of fortitude in America today, and we need that kind of fortitude in the United States Senate. And I'm very proud to be here on her behalf. I got to tell you guys, I mean, I have one observation that's just aside. You guys met in the first grade. All right. I was in this first grade for 3 years. I don't remember anybody from first grade. So I just wanted to make that point. Best 3 years of my life. And now, that's the reason why you need to vote for these folks in normal times. It's rare to get people like this to run for office and serve. But I want to talk to you about the other reality. And that is that rarely does a state, rarely do a people get the opportunity that you've been handed. And that is to determine in a non-presidential race the very direction of the country. Now, I want you to know.
All right, everybody, we're going to switch gears. We will be returning to Georgia in not too long, and that's because there's going to be a Secretary of State election update there. We're for sure going to listen in, but of course today is Veterans Day. So where we're going to head on over to next before returning to Georgia in just a little bit, we are honoring Long Island hero Marine killed in action and fellow Marines and veterans in remembrance ceremony on Veterans Day. So this is the village of Freeport. Mayor Kennedy will be joined by the U.S. Marines, local vet leaders, and officials to honor the Long Island native Sergeant Robert Hendricks, who was killed in battle on April 6, 2019, while on active duty in Afghanistan. Sergeant Hendricks' mother, Ms. Felicia Arculio, will be joined by loved ones at the remembrance event for the local hero and a special Veterans Day ceremony. This is courtesy of Fox 5 New York. We're going to listen in live now.
Is of the night I closed on my house. That evening, I needed someone quick to come over and fix the window that had literally just fallen off of the house that I just bought. Right away, Sergeant Hendricks responded and tells me that he is on his way. He gets to the house and in pure Marine Corps fashion, without wasting any time, puts the window back in place. That memory exemplifies Robert's qualities outside of the uniform. It shows his compassion, loyalty, and heart. We still all talk about Sergeant Hendricks. We tell stories about him and work out in his honor. We name drinks after his team, the Creeper, and then toast in their names. His memory continues to live on and will continue long after we have all left the halls of 225. Someone once said, as you know so well, the passage of time never really heals the tragic memory of such a great loss. But we carry on because we have to, because our loved ones would want us to, and because there is still light to guide us in the world from the love they gave us. And so we carry on, and we remember Sergeant Hendricks as his mother would want us to, as tough, hardworking, and determined, with his heart being his greatest attribute. That was Sergeant Hendricks, a real American hero and a proud United States Marine. God bless Sergeant Robert H. Hendricks, Staff Sergeant Benjamin Hines, and Staff Sergeant Christopher Slutman, and may they rest in peace.
Thank you, Staff Sergeant. And at this time, I'd like to invite Major Murphy Bright to the podium.
Good morning. Thank you. On behalf of all of 225 Marines here, we thank you again. And let me reiterate to all the veterans in the House this morning, I thank you for your service and it's an honor to be among you all. Again, I am Major Murphy Bright. I had the honor and privilege of being Robbie's platoon commander, company commander, and then going downrange with him to Afghanistan. Let me tell you this, as an officer, Robbie was a dream that everyone in my position would dream for or wish for. He was a go-to Marine, as Staff Sergeant Fuertes said, on all levels, not just in the platoon, the company, but also the battalion. There was a reason that he got chosen at his rank to go to Afghanistan. It's because he was one of the top performers in the entire battalion of almost 700 Marines and sailors. I'd like to tell a story that I think really will hit home about his character. Before we went to Afghanistan, we had the privilege of 2-week leave block where we got to go to Europe. God knows why they let a bunch of Marines run around Europe without any supervision, but we got lucky. We were all in London, and we walked into a bar, my wife and I, and we, by coincidence, saw Robbie there, in the corner with some fellow Marines, and surrounded by very pretty-looking ladies. He was doing diplomacy at its finest, because I think there was an international coalition of Europeans, Americans, South Americans, you name it. He was putting that advisory MOS to work that night. Now, as the night went on, we were all having a couple adult beverages and having a good time. But Robbie was always in control. And again, he noticed that a couple of the other Marines that he was there with maybe had one too many. So instead of continuing that night and going out with any of those individuals that he was doing diplomacy with, he decided to take his fellow Marine back home to the hotel. And that speaks to that Marine's character, on duty and off duty. Again, I can't stress, and I get a little emotional here because I've never had a Marine like him, and I probably never will. It was a true honor and privilege to serve alongside of him, and as Staff Sergeant Fuertes said, it had nothing to do with rank and superiority. Yes, I was his boss, but I considered him more as a friend and a brother. So again, thank you again for being here. Felicia, we love you. We will always be here for you, and we're family to the end of time. Again, God bless America. Happy birthday, Marines, and thank you all the veterans in attendance.
Thank you, Major Bright. And at this time, I would like our Commander, Ed Martin, if he would please present this bouquet to Gold Star Mom, Felicia Arculio, from the post in gratitude for your loss.
Such a heartfelt moment there, everyone, in Freeport, New York. I did want to let you know some of you are going to see a very quick commercial break, and then when we return, we will be watching the Georgia election update with the Secretary of State, most likely.
Back up to the podium, and he's going to lead us in the benediction. Please stand and uncover.
Thank you, Ed. Lord, we bow our heads in thankfulness for the victories you have granted us, to us and those peoples who have united with us to stamp out the evils of aggression, intolerance, and greed. We ask you to bring the blessings of understanding to the families and friends, here and in other lands, of those who have given their lives, that all may be free. Grant, O God, that those closest to the fallen may consider the pain of their losses in the ennobling light of sacrifice for civilization, a sacrifice for a better world for this generation and those yet unborn. Grant us too, O God, the courage to so live with the family of nations around the world that the end of strife will be the beginning of enduring peace. May we be granted your continued blessing for the unity and strength that makes victories possible in war, that we may win greater victories in peace.
All right, everyone, we're seeing a little bit of movement there from the photographer in Freeport, New York, likely getting the footage needed for the later coverage on in the day of this very heartfelt ceremony. I'm going to take you out live now to the state of Georgia. We are just moments away from an update from the Secretary of State. I'm actually headed on over to our sister station, Fox 5 Atlanta's website to get the latest information before we hear directly from the Secretary of State. While we are on standby waiting for this update, should be just moments away. So thanks for your patience and understanding as usual. All right, so Fox 5 Atlanta is reporting that the Georgia Secretary of State finds no sign of widespread fraud in the election. So since before Election Day, the Fox 5 I-team has been singularly focused on investigating the integrity of the election and the accuracy of the vote count. The team has spent the last week investigating reports of problems and have found only a small number of errors. Their findings come as Republican U.S. Senators Kelly Loeffler and David Perdue call on Republican Secretary of State Brad Raffensperger to step down, saying he did not deliver an honest or transparent election. And today, the head of President Trump's recount team in Georgia, Republican Representative Doug Collins, called for Raffensperger to conduct a hand count of all the ballots cast in the election. That's more than 5 million votes cast. Senior I-team reporter Dale Russell sat down with Raffensperger as he defended the integrity of the election and the job that he did. This is from that interview. Russell, has there been any systemic voter fraud in the state of Georgia? Let's listen in live, everybody. I think this is getting underway.
Okay. Well, good morning, everyone. Today is November 11th. Before I get started in talking about what we're here today, I'd like to just give a heartfelt prayer of thanksgiving to all of those that gave their lives for this country, all those people that continue to serve. This is a special day. This is a hallowed day. Growing up, my dad served in World War II in the Navy, and people were called to serve. And then we had Korea, Vietnam, and the people serving today. And so we can never forget, and we can never give them enough thanks for what they've done for this nation. And one of the things that they fought for is for our right, our freedom, to have free and fair elections. So that is, at the end of the day, what we really need to be mindful of, particularly in our office, as we work finishing up and closing out the election that we just had. I also want to give a heartfelt thanks to the men and women who are standing with me here today. These are election directors from across Georgia. They represent large counties, small counties, diverse counties, and just from all over the state of Georgia. They and their staff are the ones that do the hard work on the ground of making sure that all legal votes will be counted. Their job is hard. They executed their responsibilities, and they did their job. This is a process. It is a process defined by law. These men and women in my office will continue to follow the law and count every legal vote. As it stands today, 97 counties have sent their final numbers in. The current margin stands at 14,100 111 between the President and Senator Biden, Vice President Biden. My office will continue to investigate each and every instance of illegal voting, double voting, felon voting, people voting out of state. If you report it, we will investigate it. Every legal vote will count. We will continue to follow and enforce the law. Now let's look at the next steps. We are currently looking at having a statewide runoff on December 1 and another on January 5th. This is an untenable situation for these men and women to try and run both of these elections. With that, under my powers under the health emergency, I am moving the date of the December 1st election to coincide with the federal runoff on January 5th. This will protect the integrity of both elections and make for better election administration. It has the added benefit of saving taxpayers millions of dollars. The reason we have so many of these on rollover lists voters is a direct function of COVID. This is the reality. The next step in the current election process is getting the final county certifications in. We'll then move to the risk limiting audit, or RLA. At 1 p.m. today, I will make the official designation of which race will be the subject of the RLA. At that time, I will designate that the RLA will be the presidential race. With the margin being so close, it will require a full by-hand recount in each county. This will help build confidence. It will be an audit, a recount, and a recanvass all at once. It will be a heavy lift, but we will work with the counties to get this done in time for our state certification. Many of these workers will be working plenty of overtime. We have all worked hard to bring fair and accurate counts to assure that the will of the voters is reflected in the final count and that every voter will have confidence in the outcome whether their candidate won or lost. Thank you for coming today. Do we have any questions? Well, because we now have that verifiable paper ballot, for the first time in 18 years, we're going to have something to count instead of just pressing a button and getting the same answer. So we'll be counting every single piece of paper, every single ballot, every single lawfully cast legal ballot. That will be the names that are on the ballot, whoever they voted for president, the English written word. Yes, we will. As I said, people will be working lots of overtime next coming week. Lots of people will be really pleased with those paychecks if they're getting overtime. That'll be coming out of, we'll determine at some point. Adding additional workers, we will probably have to augment that, and we'll be looking at that, and that'll be the election directors at each county will be able, they'll actually handle their own additional, or their own county recount or risk limiting audit county by county.
Is this how this audit was designed to work? I thought originally it was supposed to be looking at a small segment of the votes.
Yeah. Well, that's what's really interesting when you start really digging into probability theorem. When you have 5 million votes and the margin is so close, 14,000, if we pulled out 10,000 votes, all of a sudden it could say, well, this is the person that won. We pull out 100,000, it says this person won. We pull out 1 million, this person won. And that's why mathematically you actually have to do a full hand-by-hand recount of all because the margin is so close. Right now it's 14,101. So it's really just the mathematics, the statistics, the probability theorems that we use for the risk limiting that are taking us to that extent. So if it was another race or you didn't have that such a close thing, then you could do that and it would just be a sample size. But you can't do that when it's that close. This race has national significance, national importance. We get that. We understand that. We do. We follow the process, and we understand the significance of this for not just Georgia, but for every single American. At the end of the day, when we do a hand count, then we can answer the question exactly what was the final margin in this race. Yes, ma'am. Absolutely. Well, we've been open and transparent. In fact, we've had multiple meetings like this, meeting with the press. Gabriel Sterling, our implementation manager, has come out to talk to you, really digging into the weeds. If you have any information about illegal voting or voter fraud, bring that to our attention. We will investigate every case that we hear. I'm hearing that that just came out this morning. We'll look at those records and we'll start digging into that. It really is what the numbers take us to, and we're following the process that would drive us to that, that's in current state law. You're asking me to make predictions, and what we're going to deal is in facts. And so I'll report the facts, and then I'll get up my calculator and I'll get that back to you. I can't do that off the cuff. Thank you. That's a good question, but after it is certified, the candidate that is within 0.5%, I believe, would still be entitled to a recount, but that would be a scan recount just because of that is what is in state law. Yes, sir. We're going to continue to work with the counties on all that, but that's their deadline, and that is the process that we have in place. And we've had great cooperation and dedication from the county election officials. That's why we have so many here. We have professionals out there, and at the end of the day, I know that I haven't asked them, but I know that there's some folks back here that maybe vote this way and other folks that vote that way, and some go this way, that way on different elections. At the end of the day, though, they're following a process. And then what they want is they never want you to be able to question their integrity. And that's what we want for everyone to understand, that we're following a process. Integrity still matters. We'll continue with every county that we have, and if there's some that are still buttoning it up, then we'll roll to that. Hopefully that's the smaller counties. It'll take every bit of the time that we have left, for sure. It's a big lift. We certify. Our date is November 20th. Statistically, because of where we are there, we have a team of people, national experts that have worked on risk limiting audits in several other states. They're part of our team. This is not just a decision we made unilaterally. We reached out to these experts. We've been working with them for several months, and we just follow the science of a risk limiting audit. We follow the numbers, and that's where it leads us to count every single ballot by hand. No, they're still required, and we want them here by Friday at the latest. We have 97 counties already. I'll talk to legal about that, but we want to start this really before the week is up, because we understand there's an awful lot to do. Yes, sir.
This is a little repetitive. Could you elaborate again on the timeline of the audit and what is going to be counted exactly?
The ballot that you had, whether it was an absentee ballot, if you sent that in, or if it was voted by in person like I did, we'll look at that ballot, and someone's going to look at who did you want, and they're just going to go through that, and you'll have two people that are doing all the counting. They'll put them out and just in stacks and make sure that the stack has, let's say, 1,000 ballots, and then you look at the end, you had 501 for this person, 499 for that one. You just keep on rolling through, and that's how it's going to be all the way through, and you're going to tally it all up. It's a big process. It'll be a methodical process, and it'll be an accurate process. And I'm sure that there'll be plenty of oversight. We want to make sure that both parties have the opportunity to observe this, because we understand the stakes are high. I don't really know, and we do what we do in Georgia. We follow our laws. And every state is 50 states, 50 different election laws.
What do you do if these hand counts don't match the computer counts? Do you count again?
No, that would then become the risk limit audit and becomes a full recount, and that is what we're going to be certifying on November 20th. So thank you very much. That'll be what we certify, because that'll be the last count, and that'll be the most accurate count. That'll be the paper ballot count. Well, it is actually an audit. It's all in one. It's an audit, a recanvass, and a recount all in one, because it'll be just really a process that gets it all. Yeah. Well, what many people aren't aware of is that where we are in the process right now in our counting, we're in the same place that Florida is, North Carolina, and Texas. The thing is, in those races, it's not real close. In our case, there's 14,101 votes right now that separate the top versus number 2. And so therefore, all eyes have focused on that, and that's really why you're seeing that. But the other states are still out there tabulating their absentee ballots. Thank you for bringing that up. That's still going on. The 5th district is not affected by what we're doing here. Well, number one, I am not the Postmaster General. We have no control over the Federal Postal Service. So when people mail their ballots back, it's then under federal government control and the federal, post office, postal service. Once it gets to the counties, then that's when the counties, have handled that. Through this process, we believe that, and we know that the machines are correct, and what you're going to find, we believe, in the count. As it relates to dead people and other, forms of illegal voting, that's why we've asked for, if you know of a case of illegal voting or suspected illegal voting, bring that to us. Anecdotes and stories doesn't work. We need something that we can actually investigate. I'm actually very grateful that Attorney General Barr, I respect that man. This is his second round as being Attorney General of the United States of America, and he is a calm, very thorough attorney, and he's directed his U.S. attorneys to look for things. And the one thing that the federal government does have is resources that we don't have. And so if they can find something that we can't, that can help to bring to bear, we want to make sure that the only people that vote are legal voters. Yeah, that we're counting what the paper ballots are, and those will be ongoing investigations. No, we can pick whatever one we pick, but we understand the national significance of this session right now. Next time it may be some other statewide race. In fact, as we roll this out, you have to understand, many states that are doing risk limiting audit, it took them 5 to 7 years to get this going. When Colorado did it, that was a long, multi-year process. We've passed House Bill HB 316 in 2019. We stood up, in spite of COVID, a risk limiting audit this year, and so in 9 months, 11 months, we're going to do the first statewide election with a risk limiting audit. So this is record time that we've done this. We're actually eventually going to be doing risk limiting audits for a host of elections to give you, the voter, confidence that when you've cast your ballot, it was accurately counted, that you have the confidence, and you can leave at the end of the day knowing the system got it right. And then when we do that, we think it really is good for all of the Georgia.
Are you doing this full recount because the Trump campaign asked you to?
No, we're doing this because it is really what makes the most sense. With the national significance of this race and the closeness of this race, we have to run a statewide audit. This is the race that makes the most sense. Logically, as I worked with our team, this is really what made the most sense, and we'll be following the process on that. Yeah, Yeah, it is. We understand that typically the counties fund their own elections, and this is part of one of the things that they buy into. And right now, everyone's in austerity cuts, so that's the issue. But that's where we are, and I don't have an answer specific on that. I have my domain as Secretary of State, and I can only have my authority that I have within office, and we don't. That is something that would really be what the General Assembly perhaps could do to help the counties. At the present time, that would be what it would be.
Secretary, in your media releases to all of us, you bill yourself as a national Georgia as a national leader in elections. Has anything changed in that, or do you still consider yourself a national leader?
Yeah, I think Georgia's done a great job. If you look what we've accomplished in this past year, we stood up a new voting system, new voting machines in less than 6 months. And that was really because we had an activist federal judge that said you can't use the old DRE machines. And so we had to do that for the first primary that we had coming up. All of a sudden we got hit with COVID that started hitting in February, and then March the General Assembly had to take a hiatus around March 15th. And so then we had to do a 360 or a 180 on what are we going to do here so that we can run elections that are safe for voters, and what does that look like? And then coming out of that, we stood up an absentee ballot portal, so that we could have safe, secure requests for absentee ballots that required voters to tell us your name, day, month, and year, so we could identify you, and then also your Department of Driver's, service, your driver's license number, so we make sure it truly is the voter that's requesting this absentee ballot for additional security. And then we added ballot tracks. Then we added the wait time. And then we had very successful early day voting. We had a few lines the first couple of days, and then we had record 2.8 million voters plus voted in early voting. And we had very short lines for that. State Farm stood up, but across the state, every one of these election directors had great success. Then on the day of election, we had an average wait time in the afternoon was about 2 minutes. At one point, I screenshot it, put it out there on Facebook. We had wait times. The longest wait time was 40 minutes. It dropped down to 20 minutes, and before it was 10 minutes. So tremendous, results. And so I think that we've led in so many different areas, and we've proven that every vote counts and integrity matters. At the end of the day, that's good. Well, and we just have to continue that process. But we have our, our charge. November 20th is our day. And the one thing that we've learned in the construction industry, I've been in this thing really, hit my first construction job site when I was about 6 years old, sitting in my dad's pickup truck. And so I say all that. I grew up with the idea of deadlines. And in our business, it is all about deadlines. And every day it's about hitting deadlines. And our election directors, they know all about deadlines because we have this date for this date for that, registration, this early vote, day of election. And then all of a sudden you have a runoff. And then you roll into next year, we're going to have city and municipal elections. And then we're going to roll into the next year. So this whole operation is deadline driven.
I'm just trying to understand how hundreds of human beings working long hours are going to be more accurate than a computer.
Well, that's why there'll be plenty of eyeballs on them to verify that every vote is accurately counted. And that's the way the process works because of the large number of votes and the closeness of the vote. It's the only way to do that. We've talked to our risk limiting experts in our office and also national experts in that. We're following the process. Thank you very much for coming out. We'll have another announcement later today. Thank you.
A recount, everyone, has been ordered in the state of Georgia. The Secretary of State there saying that about 14,000 votes are all that separates President Donald Trump and Joe Biden from essentially winning the state of Georgia there. But a recount is going to be underway, a by-hand recount, matter of fact. So it's likely going to take them quite some time there in the state of Georgia. They say they're going to determine which votes are valid and obviously weed out the ones that aren't. But our sister station Fox 5 in Atlanta is reporting that their investigative team, or I-Team for short, has been on this story and they did not find any widespread voter fraud. We're just moments away from passing it off to Mike Page in Phoenix, Arizona. My name is Pilar Arias. I've been hanging out with you all for the last hour. I'm going to take you all on a quick commercial break. Well, some of you at least. And then for the rest of you, we're going to head on over to Arlington, Virginia. Virginia, where the National Veterans Day observance is about to happen with President Donald Trump, the First Lady, the Second Lady, and Vice President Mike Pence. So that's just moments away. Again, you are watching News Now from Fox. My name is Pilar Arias. Before we head on over to Arlington really quickly, I want to take you out to the big board, Dow Jones Industrial, and that's because we've been keeping a close eye on this lately. You can see it's currently down about 8 points, so a little bit of fluctuation there, and we're going to continue to monitor stocks and the economy for you, all things COVID-19, election related, as well as Veterans Day observances across the country. But the military members are in place here, and things are going to get underway at the Tomb of the Unknown Soldier, again in Arlington, Virginia. This ceremony is about 2 minutes away from getting started.
All right, everybody, welcome here to News Now from Fox. Thank you to our coverage there in Florida as we continue to wait here for President Trump and the ceremony to begin at the Tomb of the Unknown Soldier at the Arlington National Cemetery's most iconic memorial. Stands atop a hill overlooking Washington, D.C. The neoclassical white marble depicts 3 carved Greek figures representing peace, victory, and valor. Inscribed on the back of the tomb are the words, "Here rest in honor, glory, an American soldier known but to God." The tomb stands above the grave of the unknown soldier of World War I. To the west are the crypts for the unknown soldier from World War II and the Korean War. A white marble slab flush with the plaza marks each crypt here. And you could see the wreath is ready there for the president. Soon the president will enter here and then enter with the vice president as well, and the ceremony will get underway. On March 4th, 1921, Congress approved the burial of an unidentified American soldier from World War I in the plaza of Arlington National Cemetery's new Memorial Amphitheater. The journey of the World War I unknown to Arlington began in France in September of 1921 when 4 American bodies were exhumed from unmarked battle graves. U.S. Army Sergeant Edward Younger, a World War I veteran who was wounded in combat and received the Distinguished Service Medal, selected the unknown soldier from among 4 identical caskets at City Hall in France there. Amid pomp and circumstance, the chosen casket was then transported to Washington, D.C. aboard the Navy cruiser USS Olympia. Those remaining in France were interred in the American cemetery there, one of several dozen foreign cemeteries operated by the American Battle Monuments Commission. The World War I unknown arrived in Washington on November 9th, 1921 and lay in state at the Capitol Rotunda for 2 days. Some 90,000 visitors lined up to pay their respects on Armistice Day, November 11th, 1921. Body bearers from the Army, Navy, and Marine Corps transported the casket for a large ceremonial procession to Arlington National Cemetery. At the Memorial Amphitheater, President Warren Harding officiated at a ceremony attended by over 5,000 people. The U.S. Marine Corps band played the national anthem, followed by the Army Chief of Marine Corps, as well as the chaplain's invocation in 2 minutes of silence. President Harding then addressed the crowd and placed the Medal of Honor and Distinguished Service Cross on the casket. Foreign dignitaries attended more medals. The ceremony then moved to the east front of the amphitheater, where a battery cannon fired 3 salvos. The casket was lowered into the crypt. A bugler sounded taps, followed by the battery firing of a 21-gun salute. The unknown soldier was home, and that was history right there. And every year on Memorial Day and Veterans Day, and really every day, we do honor the tomb of the unknown soldier. We are being told in about 2 minutes President Trump and the Vice President will be arriving here, so we are going to listen in to the full ceremony right here on News Now from Fox. We won't be going anywhere. We won't be deviating any of our coverage, because this is such a just a beautiful moment always, as it is every year, for the honoring of this unknown soldier. While we do wait for the president there, the unknowns of World War II and Korea, a little history here. War in Korea from 1950 to 1953 delayed plans to inter an unknown soldier from World War II at Arlington National Cemetery until 1958. President Dwight D. Eisenhower had signed a bill in August of 1956 to select and pay tribute to the unknowns of World War II and Korea, but the selection process for the World War II unknown proved more difficult than the World War I process, since Americans had fought on 3 continents. The Army ultimately exhumed 18 bodies from North Africa, Europe, and the Philippines and Hawaii. 2 unknowns were chosen representing the European and Pacific theaters of the conflict. They were placed in identical caskets aboard the USS Canberra, a guided missile cruiser off the Virginia Capes. Navy hospitalman First Class William R. Charit, then the Navy's only active duty Medal of Honor recipient, selected the unknown soldier of World War II. The remaining casket received a solemn burial at sea. The Korean War had its own share of unknown soldiers. North Korean forces killed and captured a number of American soldiers during the initial offensive in June of 1950, and when the Chinese entered the war that fall, they overran a number of temporary cemeteries. Army officials chose 1 unknown casket from 4 exhumed from the National Memorial Cemetery of the Pacific in Hawaii. On May 28, 1958, caskets bearing the unknowns of World War II and Korea arrived in Washington, where they lay in state at the Capitol Rotunda until May 30th, 1958. The caskets were rotated such that each unknown serviceman rested on the Lincoln cavalcade, a raised platform that held raised President Clinton's casket in April of 1865. On May 30th, then the official date of Memorial Day, transported the unknowns to Arlington, where they were interred in the plaza besides their World War I comrade. President Eisenhower awarded each the Medal of Honor. Little history there with the unknown of Vietnam. The United States' involvement in the Vietnam War deeply divided the nation. Leaders anguished over how to commemorate the conflict. In 1978, President Jimmy Carter dedicated a plaque at Memorial Amphitheater which commemorated those missing in action from the Vietnam War. There were few unknown burials in Vietnam, however, due to advances in technology that facilitated the identification of remains. Nonetheless, President Ronald Reagan and much of the American public wanted to honor Vietnam veterans by interring an unknown soldier at Arlington and pushed for a selection to be made. On May 17, 1984, U.S. Marine Corps Sergeant Major Alan J. Kellogg, Jr., a Medal of Honor recipient, chose an unknown from the Vietnam War during a ceremony at Pearl Harbor, Hawaii. As with the unknowns from previous conflicts, the casket first lay in state at the Capitol Rotunda and was transported to Arlington. On Memorial Day, May 28, 1984, President Reagan presided over the interment ceremony and presented the Vietnam unknown with the Medal of Honor. In his eulogy, Reagan assured the audience that the government would continue looking for the war's missing in action. For almost 14 years, the Vietnam unknown laid in rest at the tomb, while Department of Defense scientists and family members of the war, few remaining unknowns worked to identify him. The remains were exhumed on May 14, 1998, to undergo DNA testing. Scientists identified the remains as those of Air Force First Lieutenant Michael Joseph Blasey, who had been shot down and killed in Vietnam on May 11, 1972. According to the wishes of the family, Blasey was reinterred at Jefferson Barracks National Cemetery in St. Louis, Missouri. We continue to wait right now for the President of the United States, President Trump. That is just moments away right here on NewsNOW from Fox.
The President of the President of the United States, the Honorable Donald J. Trump, has arrived and is being greeted by the Honorable Robert L. Wilkie, Jr., Secretary of Veterans Affairs, Ms. Karen Durham Aguilera, Executive Director, Army National Cemeteries Program, Donald and Margaret Overton of the Blind Veterans Association, and Major General Omar J. Jones IV, Commanding General of the United States Army Military District of Washington. Honor, go. Where's he go? Attention! North, right shoulder, arm. Ceremonial. Stand back. At ease. College ready, taut. the Armed Forces Honor Guard and the United States Army Band are formed and awaiting the President to move to the Tomb of the Unknown Soldier to place the wreath.
Present all. Attention! Treason! Off! Order! Right shoulder! Off!
And it's hard not to get choked up there every time that you hear taps being played on this Veterans Day, honoring all those who have served and currently serving, as President Trump visiting the tomb of the unknown soldier there in Arlington, Virginia. Hi, everyone. Welcome to News Now from Fox as we continue to roll on here on News Now from Fox, bringing you always the very latest. While that was happening, Joe Biden was out in Philadelphia at a tomb honoring the members there from the Korea conflict. Let's show you that right here on News Now from Fox.
Right! Hey!
As Trooper Albert L., PFC, 82nd Airborne, to lead us in our opening prayer.
Okay, the audio was very choppy right there, but that was Joe Biden there honoring in Philadelphia, really at the same time that President Trump was doing his ceremony. So we wanted to bring that to you as Joe Biden there and Jill Biden paying their respects on this Veterans Day here. We continue to roll on right here. We're going to take a quick 2-minute break for some of you. When you come back, we're going to take you out to Illinois, where Veterans Day celebrations are happening right there. Live look at the White House on this special Veterans Day.
Finally get to move in, as veterans get to see their family members and celebrate birthdays and anniversaries and all the things we're going to be able to do when we get this virus under control. And I know that we are in good hands here in the state of Illinois with Governor Pritzker, who's leading that effort to keep our fellow neighbors and friends safe. And of course, I just have to say, what a great day it is to be a Veterans Day, to be able to get to do this. Tomorrow is the 16th anniversary of my Alive Day, and I couldn't think of a better birthday present than to get to be here at this ribbon cutting. So thank you all, everyone who poured your heart and soul and love into this building, and I can't wait to be here when the veterans are here and hear their stories about their service and their love for one another, and to watch their family members be able to embrace and care for them, and all the staff who will be working here, because there are no better staff than the civil servants, than the staff who work in the IDVA and who work to support our veterans at every level, from the secretaries all the way through to the frontline clinicians, to the director, to everyone at IDVA. They truly believe in the mission of caring for our veterans. So thank you, everyone. Thank you for letting me be here. Be well and God bless.
Thank you very much, Senator Duckworth. I'd like to next recognize the chairwoman of the Illinois Capital Development Board, Eileen Rhodes.
Good morning. On behalf of the board and staff of the Capital Development Board, I'm so pleased to be here today. Before acknowledging all the people and work that went into this incredible project, I'd like to deliver my personal thank you to Governor Pritzker. When I first met candidate Pritzker, he promised to uplift the state of Illinois for the benefit of all of its citizens. He committed to working people and business owners that he and his agencies would do everything possible to ensure that the state's economic assets would be equitably dispersed to all the citizens. Even as we face incredible challenges these days, I am personally gratified that Governor Pritzker and his administration continue to make good on that promise. When I was asked to chair the Capital Development Board, it was with the understanding that the work and rewards of an extremely ambitious and long overdue capital bill would be fairly distributed. State facilities are being renovated now, modernized, and built in all corners of Illinois by design and construction teams that represent diversity and equity. I am grateful that Governor Pritzker is looking out for all of his constituents and honored to be of service to his vision. Which brings us to today. As you've heard, we're celebrating the completion of a $118 million, 187,000 square foot facility for veterans. This project represents a partnership between CDB, the U.S. and Illinois Departments of Veteran Affairs, and the Illinois Department of Public Health, among others. This 5-story facility in Chicago is the first veterans home to be built in 20 years. The state-of-the-art structure includes 200 private bedrooms and bathrooms. We're pleased that it is the first to incorporate the best practices of the federal government's community living center model, meaning that it manages to accomplish small house design at an institutional level. Consistent with the state's commitment to sustainability, the building will receive a LEED Silver designation. The building was constructed with Chicagoland area contractors and Illinois union labor. The architect was HED Design of Chicago, the construction manager was Turner Construction, and the prime contractors were IHC Construction, Elite Electric, Amber Mechanical, Great Lakes Plumbing, C.R. Leonard Plumbing, and Automatic Fire Systems. We'd especially obviously like to acknowledge and thank our partners at the Department of Veterans Affairs, led by Director Chapalavia and Gwen Deal. Although my term began towards the conclusion of this project, I can personally attest to the hard work and tenacity of Director Jim Underwood and the CDB team. Emily Zagonjanin, Dan Bielski, and Andrea Brower worked around the clock to bring this complicated project to completion. And of course, I cannot say enough about Ron Wright, CDB's construction administrator, who was personally involved in every detail of this project, expressing his commitment to deliver the best building possible for Illinois veterans. The CDB set ambitious diversity goals for this project. We spent $7.9 million with minority-owned businesses and $2.7 million with women-owned businesses. It's also incredibly important to note that this was the first CDB project that had goals for veteran-owned businesses. By the end of this project, we had spent $4.4 million with veteran-owned businesses. This project has met its fair share of challenges. Construction began in 2014, but when the budget failed to pass, construction was halted. Although the budget impasse persisted, the project was able to recommence in 2016. And then in March of 2017, major delays occurred again when structural issues were discovered that required significant redesign and alterations to the construction. By April 2018, the project was able to begin again. With all hands on deck and extraordinary coordination of multiple trades, we planned for an April 2020 completion. And then COVID-19 hit. This project team, however, remained committed to the project completion. In fact, the construction was accelerated to be available for COVID-19 isolation beds if necessary. The CDB project team, Turner, DVA folks, and on-site medical professionals ensured that all on-site workers were safe. They were able to stay masked and distanced, and the place was regularly sanitized. The staff worked in shifts so that work could
All right, so that feed is unfortunately breaking up here for us right here on News Now from Fox, always bringing you the very latest that's happening across the board right here on this Veterans Day. So we will keep an eye on that and try to play it back for you a little bit later here once we get a better feed in there. Live look right now at the Dow. See how that is performing there. Now up 72 points there in the green on this Veterans Day here. So we are continuing to always bring you the very latest right here on News Now from Fox. Right now, we will go to Dr. Mike in Philadelphia for an update on COVID-19 from across the country.
Dr. Mike Srigliano with Penn Medicine joining us out of Philadelphia. Good to see you, Dr. Mike.
Always a pleasure, Thomas.
You know, looking at the numbers once again, it's clear we're not headed in the right direction here. Do you see another lockdown or a total lockdown on the table?
I'll tell you, Thomas, I think by numbers, I'm worried, but I don't see another lockdown coming. It just can't happen. I think it's going to be a very careful process in terms of what changes and what doesn't. If you look at Governor Murphy in New Jersey, he set limits on the amount of hours that a restaurant can stay open. The theory there is that if someone is at a restaurant after 10 p.m., they might tend to have maybe more drinks, let their guard down, get more likely to have problems, and maybe let their guard down. So for that reason, I think it's going to be a very careful and methodical approach to this rather than just shutting everything down. Now, if we get to the point where it is widespread, and remember, Thomas, in 1918, the second wave was much more deadly than the first wave. And so time will tell. But I got to tell you, as someone in the front lines, it's a little bit frightening. And I haven't been frightened in a while. Things were going better. We were getting kind of used to the whole concept. But this week, I must say, I've had one death in my practice, as well as a significant uptick in the number of patients with COVID-19.
Yeah, I think it is concerning. I mean, I think that's why we're seeing more and more of these restrictions. Do you think it's time to rethink sending children back into the classroom full time, Dr. Mike?
Well, I have one child who is like me, a little bit on the nervous side. He elected to stay virtual the whole time. My daughter, however, is in a hybrid model. As we've seen in several school districts, like in Philadelphia, they've decided they're not going to come back. They're going to stay virtual. If the numbers keep going the way they are, I cannot see how any school district can remain even in a hybrid situation. It's very risky business.
The CDC, and we talk about the holidays here and trying to see family members. I know they just posted its most specific guidance yet on Thanksgiving. What are we learning?
Well, the Centers for Disease Control has listed high-risk activities, lower-risk activities. And when it comes down to it, if you look at all the recommendations and you distill it down, one, you want to limit the number of people that are together. You want to make sure and try to have everyone outdoors rather than indoors. You don't want to share food. Much of these recommendations are similar to recommendations that we talked about when it was the summertime and picnics were going on. You want to make sure if you have someone at high risk, you don't want to have them exposed to family members. And one of the things that really troubles me and worries me are college kids coming home from college. They've traveled in many cases and they have been out in the world. You bring them home and they're going to want to see their friends locally, and they are bringing the outside world in. And if you have a loved one, grandmom, or someone who is at high risk, you have to be very, very careful about that. That's basically what the guidelines are saying. Outdoor dining, make sure that you are outside as much as possible. Hopefully the weather will cooperate. But look, folks, this is not going to be like any Thanksgiving that I've ever experienced in my lifetime. No one has gone through this. It's not going to be the way it normally is.
And this goes with a renewed warning from doctors across the country that their patients simply aren't shaking their symptoms as quickly, that many are experiencing these symptoms months after infection.
Well, we call them long haulers. That's the term that many people use. And what we're seeing is that even after you get through the initial insult of this viral infection, it can have long-lasting effects. It can cause brain fog. It can cause depression. It can cause significant problems with the body in terms of cough. What I'm doing with my own patients after they have been diagnosed with COVID-19, I follow them very carefully. I make sure that they have frequent follow-ups. If they have a continued cough, I check pulmonary function tests. Those are tests to make sure that they are not developing some kind of lung disease from fibrosis, from inflammation. I'm also making sure that their EKG, their heart tests are okay, because we know that this virus attacks the heart in some cases. And I'm making sure that there are no signs of depression, because clinical depression and brain infection is part of this. So we have to watch them very, very carefully.
Is this why we're seeing 1 in 11 COVID patients being readmitted to the hospital, according to a new CDC study?
Well, I think in people, and this study, by the way, looked at people being readmitted. The average time for readmission was 8 days. And these were mainly older folks and people with underlying conditions. And so, look, we want to get people out of the hospital, especially if we start seeing a surge. In my own hospital, we have started reconverting units back to COVID units because of the uptick in patients. Now we have the problem that we were at almost full capacity with regular patients, because remember, for a couple of months there, we weren't doing any routine surgeries, heart bypass, stuff like that was put on hold. Now we have the added burden of all of those patients, but also this rising number. So readmissions are going to be something that inpatient doctors and healthcare administrators are going to have to really think about, because this number, 1 in 11, is not something to take lightly. It's a significant number.
Yeah, and going back to the patients who aren't shaking these symptoms after months after initial infection, you don't necessarily see this with influenza. What is this virus doing to the body compared to the flu? Do we know?
This is a whole new ballgame. This is a virus that we have not seen. That's why originally it was called the novel coronavirus, novel meaning new. And so this is a new entity. And we don't know, frankly. We know for a fact that viruses can cause damage to the heart. Other viruses, I remember when I was a resident dealing with patients that needed heart transplants because they had a viral cardiomyopathy. That means that the virus, and it wasn't COVID back then, it was other viruses that damaged the heart to the point where they needed a heart transplant. So viruses can play havoc with the body, and time will tell. We will have to see the long-term ramifications of this. Remember, back in 1918, we didn't have the record keeping. We didn't have computer technology. So we don't know basically what happened then. It may have been the same way, although it was a different virus. Time will tell, Thomas.
Yeah, and we're learning so much more as time goes on. The Journal of Physics of Fluids shows the droplets, we often talk about the droplets, can travel and linger beyond 6 feet, Dr. Mike.
Well, this has been a point of contention for months and months. Is it reasonable to say 6 feet? Is it reasonable to say that wearing a mask reduces the spread? These are things that people have debated. So let's go over them. Number one, wearing a mask is essential. And the studies show and science shows that it is critical to reducing the amount of travel of both droplets and aerosolized viral particles. Number one. Number two, we know for a fact, and many scientists back this up, that the virus and viral particles can be aerosolized and travel great distances. So this new information is not all that new. Thirdly, there was recently a study that if someone coughs and you are shorter than the person that coughs, you are at higher risk because of the trajectory of those droplets. Gravity makes those droplets, the bigger ones, tend to go down. And so if you're shorter and someone coughs, you're at higher risk. These are all the physics aspects of droplet technology. Fascinating stuff, but frightening. And so you must wear a mask. That's the bottom line.
On that note, our daily reminder, Dr. Mike, on staying safe.
Thomas, we're not going in a good place. We are seeing an uptick in numbers. I'm seeing it in my own practice. And we have been very good in this tri-state area where I work with numbers being quite low. What's happening, I think, is that people are getting tired and colder weather, people are getting indoors, and people are letting their guard down. This is an endurance race. We must stay the course, wear a mask, good hands hygiene, and social distance. And with Thanksgiving coming, we must be very, very careful.
Yeah, got to stay.
And our thanks there to Dr. Mike in Fox 29 Philadelphia providing us that coverage. Next, Fox 2 Detroit special, The Doctor is in.
Visitor restrictions as COVID-19 spikes back here in Michigan and really across the U.S. Every day we're seeing the number of positive cases go up. So what does that mean? This morning, the doctor's in. We're speaking with Dr. Justin Skrinsky, internal medicine specialist at Beaumont Health. Doctor, thanks for being with us.
Good morning. My pleasure to be here.
Let's first talk about what you're seeing right there at Beaumont. And you work out of Beaumont Royal Oak, right, doctor?
Yeah, that's correct. And we've seen our cases steadily increase over the past, I'd say about 2 months or so. So if you go back to maybe end of August, early September, that's the lowest we saw our cases since the summer. And then pretty much since then, you can draw a straight line up, and that's where we are today.
Okay, so we are also, though, seeing, it seems like doctors like you are able to treat COVID patients better because it seems like the cases are less serious. Is that true?
Yeah, so that's actually something we've been discussing a lot. So if you look at the data, hospitalized patients are doing much, much better than they did before, which is clearly excellent news. It's the same disease, so people are still getting sick, but we have a lot of, we have a couple medications which seem to be having a very good effect. Also, in terms of the experience we've had over the past several months, even the non-medical things that we do in terms of positioning our patients, how we oxygenate them, there's a lot of strategies that we have that we're intervening early, they're giving us better outcomes, but people are still getting as sick.
So, doctor, some of the conversations you hear at kitchen tables, and I'm sure you've heard this too, is people saying it seems like this virus has mutated where it's not as severe as it once was back in March. It's a less severe version of COVID-19. You're saying that that may not be true.
As far as we can tell, it seems to be the same virus. And actually, that's a conversation that we've had here at the hospital. We have pretty frequent meetings where we all touch base and we discuss the latest news and developments. But as far as we understand, it's the same virus. And again, if left unchecked, it's just as serious as it was, let's say, back in March and April. People are having better outcomes, though. Again, hopefully it's because of things that we're doing and advances that we've made. But again, if you were just to leave this unchecked, I think you'd see the same deadly results that you saw months ago.
Are you still intubating patients using ventilators, or have we really gotten away from that?
If they need it, and fortunately that has decreased dramatically as well. Again, I'd like to credit some of the early interventions that we're able to do. So again, we're seeing patients who become very ill, they get that sort of inflammatory picture that we've talked about, that viral pneumonia, and they are kind of getting up to that edge. But fortunately, we're not seeing a lot of them fall over to the point that they do need intubation.
Doctor, what's working as far as treatment goes when you do see somebody who needs to be hospitalized, and who does need to be hospitalized? What kind of patients are you seeing?
Right, and again, very similar to what we saw back in the spring. So it's still the respiratory issues that are getting people. So that viral pneumonia. So you've got your patients that come in, severe shortness of breath, low oxygen. Those are still the things that are really hazardous and potentially lethal to people. The couple medications that we use most frequently, steroids, I'm sure a lot of people have heard about that. Dexamethasone is the one we use very commonly. That's got a lot of data behind it right now. The other medication that we use as well is called remdesivir. That's an antiviral medication. And again, there's studies that show that one's beneficial too. But those are the two medications we're using. Other than that, though, we're much better in terms of mobilizing people, positioning them. People have heard about proning, where we have our patients on their stomach. That seems to help with oxygen as well. So there's a lot of sort of non-medical things that we've learned as well to do with our patients to keep their oxygen levels up.
How do you feel going into the cold and flu season, Doctor? Are you feeling optimistic? Are you worried?
Well, it's going to be a challenge. And fortunately, the same measures in the population help to prevent coronavirus. So things like masks, distancing, which are still very essential, even more so now that people are going to be inside over the colder months and getting to the holidays. Fortunately, those measures also help to prevent other communicable diseases like influenza, colds, things like that. So if people are very good about the coronavirus measures, hopefully that'll also take the edge off the flu season this year.
All right, Doctor, let's bring in Jay and Amy, who have questions for you as well. Jay?
There we are. Okay. Doc, my question is just about numbers. As I look into this website, our Michigan website here, over 223,000 cases, 162,000 of the cases since this all started, people under the age of 70. And then you look at the deaths, and one death is a death too many, 7,724. 6,700 of those deaths are people over 60. As a guy with parents in their 70s, you really, really worry about people over the age of 60, and especially when you got over 5,000 of those people over the age of 70. What is it that our older family and friends here in Michigan need to know about this differently than a lot of the younger people are getting this, and that's it, and they're done. But our older population is really struggling with it.
I think that's a great question. It gets to a lot of issues going on right now. So again, just as you mentioned, that's an at-risk population. So our older patients, our patients with chronic illness, those are the patients that are still very much at risk. And in terms of what I see in the hospital, obviously that's a pretty small sample size. But as you mentioned, the data that we see statewide, it's showing that it's our older patients who are most at risk. We got to be really careful moving forward because our younger people can be asymptomatic or they can have very mild symptoms. So you think about instances like Thanksgiving or Christmas, where you have people coming back from school, you have younger people that are going to be in contact with older family members. It's very possible for somebody who's either has very mild symptoms or no symptoms to transmit it to someone who could potentially have a lethal disease. Yeah. In the community, we still see that breakdown where it seems like, again, it is the older people that are getting sick. A lot of the numbers that we have right now, so you see those huge positive test numbers that we're having in the state, that's because a lot of these people are in the younger groups. So we have these ballooning numbers, but in terms of the hospitalizations, again, we are seeing those increase, but that is in our older population.
Right.
All right, Doctor, we're almost out of time, but I do have a question. A shocking report came out, well, shocking to me with the numbers about mental illness after having COVID-19. It's a rather large percentage of people and other physical issues as well. Even if you don't have really bad symptoms, that's a major concern.
That's a very major concern. And I'm sure you've heard the term long hauler, but it's people with COVID who have these lingering symptoms. And as you mentioned, that's a huge one. Depression, and not even just necessarily the cause directly from the virus, but just the circumstances. If you are hospitalized, it's a very isolating experience. If you're sick, it's a very frightening experience. Yeah, depression, we see fatigue, we see shortness of breath, weakness. Those things can be lingering symptoms for months. And again, we think about these waves of illness. One of these waves might indeed be sort of these chronic illnesses caused by COVID infections.
All right, Doctor, thank you so much. We're going to continue this conversation. Yes, the doctor is in this morning. Michigan continuing to see a growing number of COVID-19 cases over the past few weeks, especially concerning as it gets colder outside. We begin to go inside more, and we've got the holiday season ahead of us. So let's get some questions answered. The doctor's in this morning. Dr. Justin Skrinsky, internal medicine specialist at Beaumont Health. Doctor, thanks for hanging out with us this morning.
My pleasure to join you.
The first, I just want to start with a viewer question, and then I do want to talk to you about vaccines and some other business. But Heather writes, I was exposed to someone with COVID 4 days ago. If I test negative today, am I clear, or could I test positive later on? And first, doctor, I would also like you to explain what being exposed means.
Right. So being exposed means being in proximity, unprotected proximity to somebody with COVID for a total of 15 minutes or more. And again, that's if you're in close proximity within 6 feet, no barriers such as masks and so forth. Again, that definition of exposure gets kind of fuzzy because, people who have contact with other people, but let's say you're inside, let's say you're close together, let's say it's prolonged, but people are wearing masks. Again, there are mitigating circumstances, but again, if you look at kind of what the CDC is going to tell you, it's that close proximity for 15 minutes or more. So to answer the viewer's question, if you test negative, the CDC is still recommending, if you have had this confirmed exposure, to still self-quarantine for the 14 days, even if you do test negative. Now, in terms of can you test positive later, kind of depends on the test that you get. So depending on the type of swab that you get, sometimes there are false negatives, depending on how it's done even. And that's why we're recommending to err on the side of caution and to still exercise the 14 days.
Doctor, 14 days seems extreme to me, and I only say that I want everyone to be safe, but it seems as we're trying to navigate this pandemic and we're also trying to live our lives.
All right, we will get back to more of that special in just a little bit here on News Now from Fox, but we want to reset you here coming up at the top of the hour, almost noon out on the East Coast. Everyone, live look here at the White House as we continue to roll on right here on News Now from Fox. And News Now from Fox continues. Live look at the White House here on this Veterans Day. I'm your host, Mike Page. Thank you so much for joining us here today, and happy Veterans Day to everyone that continues to serve our country and that has served our country. We honor you always, every day, and especially on this day. Thank you so much for your service here as we bring you the very latest right here on News Now from Fox. We are going to take you out just moments ago. Start you off with the coverage here of President Trump honoring at the tomb of the unknown soldier in Arlington, Virginia. Take a look at the ceremony.
Order! Right shoulder! Off! Present! Present! Off! Order! Right shoulder off!
Always a moment there when they play taps at the tomb of the unknown soldier there. President Trump once again honoring the tomb there of the unknown soldier there in Arlington, Virginia, as we started you off with this coverage today on Veterans Day. And now we continue to bring you the top stories of the news today. And we're going to go now switch gears a little bit to election 2020, because earlier today in Georgia, big breaking news occurred right there where the Secretary of State came out and says we are going to go to a hand recount for the presidential race. And here is what he had to say about that. That was big news coming out there of Georgia there in the Peach State. Now here is the Secretary of State.
About what we're here today, I'd like to just give a heartfelt prayer of thanksgiving to all of those that gave their lives for this country, all those people that continue to serve. This is a special day. This is a hallowed day. Growing up, my dad served in World War II in the Navy, and people were called to serve. And then we had Korea, Vietnam, and the people serving today. And so we can never forget, and we can never give them enough thanks for what they've done for this nation. And one of the things that they fought for is for our right, our freedom, to have free and fair elections. So that is, at the end of the day, what we really need to be mindful of, particularly in our office, as we work finishing up and closing out the election that we just had. I also want to give a heartfelt thanks to the men and women who are standing with me here today. These are election directors from across Georgia. They represent large counties, small counties, diverse counties, and just from all over the state of Georgia. They and their staff are the ones that do the hard work on the ground of making sure that all legal votes will be counted. Their job is hard. They executed their responsibilities, and they did their job. This is a process. It is a process defined by law. These men and women in my office will continue to follow the law and count every legal vote. As it stands today, 97 counties have sent their final numbers in. The current margin stands at 14,111 between the President and Senator Biden, Vice President Biden. My office will continue to investigate each and every instance of illegal voting. Double voting, felon voting, people voting out of state. If you report it, we will investigate it. Every legal vote will count. We will continue to follow and enforce the law. Now let's look at the next steps. We are currently looking at having a statewide runoff on December 1 and another on January 5th. This is an untenable situation for these men and women to try and run both of these elections. With that, under my powers under the health emergency, I am moving the date of the December 1st election to coincide with the federal runoff on January 5th. This will protect the integrity of both elections and make for better election administration. It has the added benefit of saving taxpayers millions of dollars. The reason we have so many of these on rollover list voters is a direct function of COVID. This is the reality. The next step in the current election process is getting the final county certifications in. We'll then move to the risk limiting audit, or RLA. At 1 p.m. today, I will make the official designation of which race will be the subject of the RLA. At that time, I will designate that the RLA will be the presidential race. With the margin being so close, it will require a full by-hand recount in each county. This will help build confidence. It will be an audit, a recount, and a recanvass all at once. It will be a heavy lift, but we will work with the counties to get this done in time for our state certification. Many of these workers will be working plenty of overtime. We have all worked hard to bring fair and accurate counts to assure that the will of the voters is reflected in the final count, and that every voter will have confidence in the outcome whether their candidate won or lost. Thank you for coming today. Do we have any questions?
So, can you describe what a hand recount will do for the nearly 5 million votes that have been cast in this election?
Well, because we now have that verifiable paper ballot, for the first time in 18 years, we're going to have something to count instead of just pressing a button and getting the same answer. So we'll be counting every single piece of paper, every single ballot, every single lawfully cast legal ballot.
And will that be the QR code or?
That will be the names that are on the ballot, whoever they voted for president, the English written word.
Will you be able to get that done in time for certification?
Yes, we will. As I said, people will be working lots of overtime next coming week. Lots of people will be really pleased with those paychecks if they're getting overtime.
Secretary, for the recount, do you have an estimate on how many election workers it will take to do that? Is there also an estimated cost? Does that come out of county, state, or federal funds?
That will be coming out of, we'll determine at some point. Adding additional workers, we will probably have to augment that, and we'll be looking at that, and that'll be the election directors at each county will be able, they'll actually handle their own additional, or their own county recount or risk limiting audit county by county.
Mr. Secretary, is this how this audit was designed to work? I thought originally it was supposed to be looking at a small segment of the votes to get the larger picture.
Well, that's what's really interesting when you start really digging into probability theorem. When you have 5 million votes and the margin is so close, 14,000, if we pulled out 10,000 votes, all of a sudden it could say, well, this is the person that won. We pull out 100,000, it says this person won. We pull out 1 million, this person won. And that's why mathematically you actually have to do a full hand-by-hand recount of all because the margin is so close. Right now it's 14,101. So it's really just the mathematics, the statistics, the probability theorems that we use for the risk limiting that are taking us to that extent. So if it was another race or you didn't have that such a close thing, then you could do that and it would just be a sample size. But you can't do that when it's that close. This race has national significance, national importance. We get that. We understand that. We do. We follow the process, and we understand the significance of this for not just Georgia, but for every single American. At the end of the day, when we do a hand count, then we can answer the question exactly what was the final margin in this race. Yes, ma'am.
The president just released a list of Georgians who have passed away who supposedly voted in this election. Is that something you look into?
Well, absolutely. Well, we've been open and transparent. In fact, we've had multiple meetings like this, meeting with the press. Gabriel Sterling, our implementation manager, has come out to talk to you, really digging into the weeds. If you have any information about illegal voting or voter fraud, bring that to our attention. We will investigate every case that we hear.
Have you found anything with that particular allegation so far?
I'm hearing that that just came out this morning. We'll look at those records and we'll start digging into that.
Won't a hand recount be less accurate than a computer recount? I mean, humans make mistakes, and are you concerned about accuracy of a hand recount?
It really is what the numbers take us to, and we're following the process that would drive us to that, that's in current state law.
And is it reasonable to believe that the results will change much? 14,000 votes. Is there any chance that the outcome or the results of the presidential election would change as a result? Is it possible that 14,000 votes could flip?
You're asking me to make predictions, and what we're going to deal is in facts. And so I'll report the facts.
We're talking about probabilities. What is the probability?
I'll get up my calculator and I'll get that back to you. I can't do that off the cuff.
Can the Trump campaign still ask for a recount once this is done and you folks have certified like the system used to, or is this count as their one
recount, if you would?
That's a good question, but after it is certified, the candidate that is within 0.5%, I believe, would still be entitled to a recount, but that would be a scanned recount, just because of that is what is in state law. Yes, sir. We're going to continue to work with the counties on all that, but that's their deadline, and that is the process that we have in place. And we've had great cooperation and dedication from the county election officials. That's why we have so many here. We have professionals out there, and at the end of the day, I know that I haven't asked them, but I know that there's some folks back here that maybe vote this way and other folks that vote that way, and some go this way, that way on different elections. At the end of the day, though, they're following a process. And then what they want is they never want you to be able to question their integrity. And that's what we want for everyone to understand, that we're following a process. Integrity still matters. We'll continue with every county that we have, and if there's some that are still buttoning it up, then we'll roll to that. Hopefully that's the smaller counties.
Is there a new sort of estimate of how long this will take?
It'll take every bit of the time that we have left, for sure. It's a big lift.
So by that you mean this,
we certify, our date is November 20th.
You've been saying for more than a year that we should absolutely trust the QR code, so why is a hand recount necessary right now?
Statistically, because of where we are there, we have a team of people, national experts that have worked on risk limiting audits in several other states. They're part of our team. This is not just a decision we made unilaterally. We reached out to these experts. We've been working with them for several months, and we just follow the science of a risk limiting audit. We follow the numbers, and that's where it leads us to count every single ballot by hand.
Does this mean that county certification deadlines are no longer in effect or extended to November 20th?
No, they're still required. We want them here by Friday at the latest. We have 97 counties already.
Can the recount begin before counties certify? If you have to wait till every county certifies and then the recount begins, what's the timeline?
I'll talk to legal about that, but we want to start this really before the week is up, because we understand there's an awful lot to do. Yes, sir.
Yeah, this is a little repetitive, but could you elaborate again on the timeline of the audit and what is going to be counted exactly?
The ballot that you had, whether it was an absentee ballot if you sent that in, or if it was voted by in person like I did, we'll look at that ballot, and someone's going to look at who did you want, and they're just going to go through that, and you'll have two people that are doing all the counting. They'll put them out and just in stacks and make sure that the stack has, let's say, 1,000 ballots, and then you look at the end, you had 501 for this person, 499 for that one. You just keep on rolling through, and that's how it's going to be all the way through, and you're going to tally it all up. It's a big process. It'll be a methodical process, and it'll be an accurate process. And I'm sure that there'll be plenty of oversight. We want to make sure that both parties have the opportunity to observe this, because we understand the stakes are high.
That's for every
other
vote?
state instituted an RLA on a presidential race specifically?
I don't really know, and we do what we do in Georgia. We follow our laws. And every state is 50 states, 50 different election laws.
What do you do if these hand counts don't match the computer counts? Do you count again?
No, that would then become the risk limit audit, and it becomes a full recount, and that is what we're going to be certifying on November 20th. So thank you very much. That'll be what we certify, because that'll be the last count. That'll be the most accurate count. That'll be the paper ballot count.
So this bypasses the audit, I guess, in theory, of grabbing 10,000.
Well, it is actually an audit. It's all in one. It's an audit, recanvass, and a recount all in one, because it'll be just really a process that gets it all.
Secretary, before the election, your office said over and over again, the mail-in ballots, it's going to take longer. It's going to take longer to certify these and go through all these. Now this is being kind of used in claims that the election was inaccurate. It took so long. What do you have to say about that?
Well, what many people aren't aware of is that where we are in the process right now in our counting, we're in the same place that Florida is, North Carolina, and Texas. The thing is, in those races, it's not real close. In our case, there's 14,101 votes right now that separate the top versus number two. And so therefore, all eyes are focused on that, and that's really why you're seeing that. But the other states are still out there tabulating their absentee ballots. Thank you for bringing that up.
What happens to John Lewis's election to fill his seat if...
That's still going on.
But even though someone will have been sworn in for that seat, Akima Williams have already been sworn in by the time the special election now takes place.
The 5th District is not affected by what we're doing here.
Secretary, as you know, the Republican Party is saying that a lot of Republican voters and Trump supporters in particular
Well, number one, I am not the Postmaster General. We have no control over the Federal Postal Service. So when people mail their ballots back, it's then under federal government control and the federal, post office, postal service. Once it gets to the counties, then that's when the counties, have handled that. Through this process, we believe that, and we know that the machines are correct in what you're going to find, we believe, in the count. As it relates to dead people and other, forms of illegal voting, that's why we've asked for, if you know of a case of illegal voting or suspected illegal voting, bring that to us. Anecdotes and stories doesn't work. We need something that we can actually investigate. I'm actually very grateful that Attorney General Barr, I respect that man. This is his second round as being Attorney General of the United States of America. And he is a calm, very thorough attorney, and he's directed his U.S. attorneys to look for things. And the one thing that the federal government does have is resources that we don't have. And so if they can find something that we can't, that can help to bring to bear, we want to make sure that the only people that vote are legal voters.
But that's not part of this process that
Yeah, that we're counting what the paper ballots are, and those will be ongoing investigations.
Does this hand recount set a precedent for every close race going forward in Georgia?
No, we can pick whatever one we put, but we understand the national significance of this session right now. Next time it may be some other statewide race. In fact, as we roll this out, you have to understand, many states that are doing risk limiting to almond, it took them 5 to 7 years to get this going. When Colorado did it, that was a long, multi-year process. We've passed House Bill HB 316 in 2019. We stood up, in spite of COVID, a risk limiting audit this year. And so in 9 months, 11 months, we're going to do the first statewide election with a risk limiting audit. So this is record time that we've done this. We're actually eventually going to be doing risk limiting audits for a host of elections to give you, the voter, confidence that when you've cast your ballot, it was accurately counted, that you have the confidence, and you can leave at the end of the day knowing the system, got it right. And then when we do that, we think it really is good for all of Georgia.
Are you doing this full recount because the Trump campaign asked you to?
No, we're doing this because it is really what makes the most sense. With the national significance of this race and the closeness of this race, we have to run a statewide audit. This is the race that makes the most sense. Logically, as I worked with our team, this is really what made the most sense, and we'll be following the process on that.
Secretary, just to follow up, I understand you don't have a total cost that this is going to be, but can you at least say who's going to foot the bill here? Is it the state, is it the counties? You said there'll be a lot of overtime, so it sounds expensive.
Yeah, it is. We understand that. Typically, the counties fund their own elections, and this is part of one of the things that they buy into. And right now, everyone's in austerity cuts, so that's the issue. But that's where we are, and I don't have an answer specific on that. I have my domain as Secretary of State, and I can only have my authority that I have within office, and we don't. That is something that would really be what the General Assembly perhaps could do to help the counties.
So just so I describe it correctly, it sounds like the counties will foot the bill, but there's an opportunity possibly for...
At the present time, that would be what it would be.
Secretary, in your media releases to all of us, you bill yourself as Georgia as a national leader in elections. Has anything changed in that, or do you still consider yourself a national leader?
Yeah, I think Georgia's done a great job. If you look what we've accomplished in this past year, we stood up a new voting system, new voting machines in less than 6 months. And that was really because we had an activist federal judge that said you can't use the old DRE machines. And so we had to do that for the first primary that we had coming up. All of a sudden we got hit with COVID that started hitting in February, and then March the General Assembly had to take a hiatus around March 15th. And so then we had to do a 360 or a 180 on what are we going to do here so that we can run elections that are safe, for voters. And what does that look like? And then coming out of that, we stood up an absentee ballot portal, so that we could have safe, secure requests for absentee ballots that required voters to tell us your name, day, month, and year, so we can identify you, and then also your Department of Driver's, service, your driver's license number, so we make sure it truly is the voter that's requesting this absentee ballot for additional security. And then we added ballot tracks. Then we added the wait time. Then we had very successful early day voting. We had a few lines the first couple of days, and then we had record 2.8 million voters plus voted in early voting. And we had very short lines for that. State Farm stood up, but across the state, every one of these election directors had great success. Then on the day of election, we had average wait time in the afternoon was about 2 minutes. At one point, I screenshot, put it out there on Facebook. We had wait times. The longest wait time was 40 minutes. It dropped down to 20 minutes, and before it was 10 minutes. So tremendous, results. And so I think that we've led in so many different areas, and we've proven that every vote counts and integrity matters. At the end of the day, that's good.
What happens if the recount isn't done by November 20th?
Well, then we'll just have to continue that process. But we have our, our charge. The November 20th is our day. And the one thing that we've learned in the construction industry, I've been in this thing really, hit my first construction job site when I was about 6 years old, sitting in my dad's pickup truck. And so I say all that.
All right, so that was a big update there in Georgia as Secretary of State there, Raffensperger, who has come under an avalanche of pressure from Republicans to take some kind of action given the tight statewide margin, said he will implement this risk-limiting audit to cover the presidential race. The RLA is expected to be done by November 20th when the state must certify its election results. And we heard there from the Secretary of State that they will have overtime workers trying to get that done by that November 20th date there. So that will be a hand recount there in Georgia as we continue really to see what will happen when all the states do certify there coming up on the deadline there of December 14th. Hi, everyone. Mike Bashir as we continue to roll out right here for you on News Now from Fox. Happy Veterans Day to all as we continue to bring you the very latest right here on News Now from Fox. We're going to take a short break for some of you, just 2 minutes, but when we come back, we are going to take you out to Illinois. A live look right there at Chicago, where Illinois leaders joining for a ribbon-cutting ceremony for the new Chicago Veterans Home on this Veterans Day. We'll bring you out there. Stay right here with us. More News Now continuing.
From our service organizations, first, it is my honor to introduce the leadership of the veteran service organizations that have joined us today. Reverend Donald Meeks, the chaplain of VFW of Illinois. Commander Lori Emmer, VFW, Department of Illinois. Commander Roy Weber, the American Legion, Department of Illinois. And Senior Vice Commander Tim Alexander, Disabled American Veterans of Illinois. I'd also like to welcome our elected officials that have joined us today. Governor J.B. Pritzker, U.S. Senator Tammy Duckworth, Congressman Mike Quigley, Illinois Senator Rob Martwick, Illinois Representative Lindsay LaPointe, and Chicago Alderman Nick Sopazzo. Did I get that right? Sposato. Sposato. I'm sorry. It's your name, and it's my responsibility to get it right, and I apologize for that, sir. And Cook County Commissioner Pete Silvestri. I get that one? All right. We also want to acknowledge former Illinois Governor Pat Quinn, who is here with us today. Governor, thank you for all you have done on behalf of Illinois veterans. It's been truly appreciated, and their families. Now, if you'll please rise if you can for the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I would now like to invite Reverend Donald Meeks to offer today's invocation.
Shall we bow our heads in the presence of Almighty God? Eternal Father, we want to thank you for allowing us to be here for such a time as this. Even in the midst of a coronavirus, God, you're yet providing blessings upon your people and our fellow veterans. As we enter into these ceremonies, we pray that your presence will be here with us as you continue to lead us and guide us in all of our ways. We pray that you will bless each and every presenter, our elected officials, those that are a part of the Illinois Veterans Administration. We're thankful for all those who are present to bear witness the ribbon cutting ceremony for this great facility that you have provided. We pray, God, that your presence, your spirit will dwell within the walls, every floor, every room. Let something unusual be felt in this place as we dedicate it today in your honor as well as in your name. Bless all the veterans, those who have served and those who are currently served. Bless those who are currently missing in action, and even those that are being held as prisoners of war. We don't want to leave no stone unturned, O God, but we want to give your name all the glory and the praise, for we yet have a future hope, and our hope is in you. In all these things we ask in the precious name of thy Son. Shall we all say, amen.
Thank you very much, Reverend Meeks. This time you can all be seated. It is now my pleasure to introduce the Governor of the State of Illinois, J.B. Pritzker.
Well, thank you very much, Acting Assistant Director Vaughn, and thank you and to Director Chapalavia for ushering this facility to its completion safely and efficiently in the middle of a pandemic. Your entire team, notably Gwen Deal as our Department of Veterans Affairs Home Coordinator, and Len Winicky, who came out of semi-retirement to oversee the Chicago project through its completion, put their whole hearts into this project. Very important to so many of us, and they really made it a home for our Illinois heroes. To all the elected officials and community members here with us today, it's my great privilege to join all of you on this very special occasion, this special day that we reserve to show our nation's gratitude and reverence for our servicemen and women. So many people, many of whom could not join us today, made this project possible, and I want to recognize just a few of them. Of course, we need to start with the vision of the then IDVA director, now Senator Tammy Duckworth, who back in 2008 saw the importance of having a veterans home, one which would serve our state's largest population center, and then launched this effort that we finished today. And I want to acknowledge and thank especially our former governor, Pat Quinn, whose administration first gave life to this project. Pat Quinn has demonstrated over many, many years in public life how much he cares for our servicemen and women, that he shows up for them every single time, and I admire that about you, Governor, and thank you very much for all that you do. I also want to thank Eileen Rhodes, the chairwoman of the Illinois Capital Development Board, as well as the entire CDB board for their oversight and engagement, as well as longtime dedicated employee Ron Wright, the construction administrator for this project, who oversaw so many tasks, big and small, from licensure to zoning, that were necessary to make this project a reality. From the Army to the Air Force to the Navy to the Marines to the Coast Guard to the National Guard, we know how important our servicemen and women are to the security and well-being of our nation. And it's my mission that Illinois will provide every possible support for our military men and women, their families, and all of our veterans, those who have made sacrifice after sacrifice so that all of us can live free. As the proud son and grandson of naval officers, I have a very personal commitment to Illinois' nearly 650,000 veterans. That's why one of my first acts as governor back in January was to order a full review, that was January of 2019, to order a full review of the health, safety, and security of veterans' homes across our state, making sure that our heroes are being well cared for. And because I had become concerned over the years about the disinvestment brought about by my predecessor's administration, it was all too clear things needed to change in this state. Shortly thereafter, I began the planning process to build another state-of-the-art facility for our nation's heroes to replace the aging one in Quincy, Illinois, that had been plagued with infectious disease that ultimately tragically took the lives of some of the residents there. And of course, I undertook the restart of this project that we celebrate today, establishing the first Illinois Veterans Home directly serving the Chicagoland area. Finally. As you can see, it's a work of art, and it really is. I have to say, just driving up here today, having seen this facility in its various phases, in the worst of it, with snow on the inside, and all of us deeply concerned about whether we would have to knock down whatever had been built and just start over again. It is really incredible. The high-quality labor union members who did this work, the other construction workers, and the IDVA who found a way to safely and efficiently keep this project moving forward. I just want to say a deep thank you to all of you, something that I think is felt by people all across this state today. And this home, following a resident-centered model of care, really feels like a home. This is a place with local art and community kitchens and gardens, a place that really respects and honors the humanity of the heroic residents that it serves. That work of focusing on upgrading our state's support for veterans doesn't end here. In addition to upgrading the retirement facilities for veterans, my administration has also expanded our veterans services, thanks in part to the leader of our Department of Veterans Affairs, Linda Chapelavia. Last year, working with the General Assembly on both sides of the aisle, we expedited professional licensing for service members and their spouses, reducing the barriers for military families, allowing them to more easily get a job when they move to Illinois. We've made it easier for recently discharged veterans who are re-entering the civilian workforce to get credits and certification, so military medics can become EMTs or certified nurse assistants without having to relearn what they already know. And I also created a task force to review the injuries that currently go unrecognized at the federal level so that we can identify ways to give those who suffered those injuries the health insurance coverage and treatments that they deserve here in Illinois. Illinois has gone beyond the federal GI Bill to a place where only a handful of states have gone, offering free tuition at every educational level for veterans, meaning a substantial number of veterans in Illinois are now able to obtain graduate degrees. And I signed a law last year expanding access to the MIA POW scholarship program, making it easier for the family members of those who made great sacrifice to access higher education in our state. To be clear, our obligations to our service members are not just about providing health care and housing and human services and jobs, although those are critically important. We must live up to the example and the legacy that our veterans have offered us. To believe enough in the people and places and values here in Illinois that we never stop fighting to build a state and a nation worthy of their sacrifice. So God bless our veterans, those who once served and those who still do. And on this day of all days, may we all take a moment to find a way to thank a veteran for their service and their commitment to America's greatness. Thank you, and with that, I'd like to turn it back over to Acting Assistant Director Vaughn.
Thank you, Governor. Now it is my honor to introduce my former director and current U.S. Senator, Tammy Duckworth.
I'm good. Thank you, Anthony. In addition to being the wonderful employee and staff member at IDVA, Anthony has also spent over 30 years in the military and is a retired Master Sergeant. And we call the nickname for our Master Sergeants in the Army is Master Blaster because they get stuff done. And the word that's used is not usually stuff, but they get things done. And so he is indeed in the right place for this. Governor Quinn. Governor Quinn has been a true champion for our veterans in this state, and I will tell you that I met him. Actually, I wasn't awake yet. He met my husband Brian first, and when I woke up from that coma that they had me in, 11 days after I was shut down, my husband said, "Yeah, the Lieutenant Governor has been calling me, and he sent us money." And his championing of the Illinois Military Families Assistance Fund has helped countless military families in this state survive tragic circumstances. And so thank you, Governor, for everything that you've done. And then when I got to serve in his administration, and I said, Governor, we really need a veterans home. Our veterans and their family members in Illinois, in Chicago, have to travel to Manteno or out to Quincy. See, this place, you're seeing brick and mortar and stone and aluminum and all of these things, but this place is love. This place is love. This place is love for one veteran for another. It is love of this state for her servicemen and women, the love that Governor Quinn has shown throughout his entire career for our military men and women and their families. It is the love that a Master Blaster has for all of the troops under him to make sure that they are well cared for and watched out for. It is the love that veterans have for one another with the VSOs. The American Legion, the VFW, the DAV, you all were there when I was sworn in, when I first showed up at IDVA and said, we need a veterans home because the waiting list is 2,000 veterans long. And by the way, why are we making family members travel all the way an hour and a half, 2 hours, 3 hours to go see their loved ones? Because we were separating our veterans from those that they love. Well, this is a place that brings that love back because now our families in Chicago can see their veterans here much more easily, much more cheaply, much more frequently. And then I have to say, Gwen walked numerous empty fields and empty lots and went to so many meetings and arguments at Hines and all sorts of places, begging and pleading for a piece of land that we could build this veterans home on. And she never, ever, ever quit. And she was the true technician behind the scenes making this happen. Thank you, Gwen. This is full of your love for our veterans as well. And then when we decided we were going to do this, I had the fun time of going to Governor Quinn and asking him for $30 million. And he said, Tammy, we're going to do it. We're going to figure out a way. And he was the first governor to put that aside in his capital budget. And then, of course, we had a governor who didn't do anything and, in fact, tried to steal that money from our veterans until we got Governor Pritzker. At a time when the state was in dire straits, we got Governor Pritzker, who came in with his love of veterans, with his love of the state, with his understanding and expertise on how to make things happen. And for him during that time to put that money back into the fund, to reallocate that, is quite amazing indeed. And to make this happen. Thank you, Mr. Governor. This truly is a reflection of your love for our vets. And in that back corner, there's Linda Chapalavia, who's our current IDVA director and my girlfriend. But before that, she was in the state legislature, Representative Linda Chapalavia. It was she who I went to when I had veterans issues. It was she who spearheaded any attempt I had on veterans issues in Springfield, really working with legislators on both sides of the aisle to make sure that we got both Democratic and Republican support for Governor Quinn putting the $30 million into this budget. There's so much love in this building. It is the love and the dedication and the effort and the late nights and the many gray hairs that so many people pulled and put into this building. So when you look through here, just think of the love that is in here and the love that will continue to be here as veterans finally get to move in, as veterans get to see their family members and celebrate birthdays and anniversaries and all the things we're going to be able to do when we get this virus under control. And I know that we are in good hands here in the state of Illinois with Governor Pritzker, who's leading that effort to keep our fellow neighbors and friends safe. And of course, I just have to say, what a great day it is to be a Veterans Day, to be able to get to do this. Tomorrow is the 16th anniversary of my Alive Day. And I couldn't think of a better birthday present than to get to be here at this ribbon cutting. So thank you all, everyone who poured your heart and soul and love into this building. And I can't wait to be here when the veterans are here and hear their stories about their service and their love for one another, and to watch their family members be able to embrace and care for them, and all the staff who will be working here, because there are no better staff than the civil servants, than the staff who work in the IDVA and who work to support our veterans at every level, from the secretaries all the way through to the frontline clinicians, to the director, to everyone at IDVA. They truly believe in the mission of caring for our veterans. So thank you, everyone. Thank you for letting me be here. Be well and God bless.
Thank you very much, Senator Duckworth. I'd like to next recognize the chairwoman of the Illinois Capital Development Board, Eileen Rhodes.
Good morning. On behalf of the board and staff of the Capital Development Board, I'm so pleased to be here today. Before acknowledging all the people and work that went into this incredible project, I'd like to deliver my personal thank you to Governor Pritzker. When I first met candidate Pritzker, he promised to uplift the state of Illinois for the benefit of all of its citizens. He committed to working people and business owners that he and his agencies would do everything possible to ensure that the state's economic assets would be equitably dispersed to all the citizens. Even as we face incredible challenges these days, I am personally gratified that Governor Pritzker and his administration continue to make good on that promise. When I was asked to chair the Capital Development Board, it was with the understanding that the work and rewards of an extremely ambitious and long overdue capital bill would be fairly distributed. State facilities are being renovated now, modernized, and built in all corners of Illinois by design and construction teams that represent diversity and equity. I am grateful that Governor Pritzker is looking out for all of his constituents and honored to be of service to his vision. Which brings us to today. As you've heard, we're celebrating the completion of a $118 million, 187,000 square foot facility for veterans. This project represents a partnership between CDB, the U.S. and Illinois Departments of Veteran Affairs, and the Illinois Department of Public Health, among others. This 5-story facility in Chicago is the first veterans home to be built in 20 years. The state-of-the-art structure includes 200 private bedrooms and bathrooms. We're pleased that it is the first to incorporate the best practices of the federal government's community living center model, meaning that it manages to accomplish small house design at an institutional level. Consistent with the state's commitment to sustainability, the building will receive a LEED Silver designation. The building was constructed with Chicagoland area contractors and Illinois union labor. The architect was HED Design of Chicago, the construction manager was Turner Construction, and the prime contractors were IHC Construction, Elite Electric, Amber Mechanical, Great Lakes Plumbing, C.R. Leonard Plumbing, and Automatic Fire Systems. We'd especially obviously like to acknowledge and thank our partners at the Department of Veterans Affairs, led by Director Chapalavia and Gwen Deal. Although my term began towards the conclusion of this project, I can personally attest to the hard work and tenacity of Director Jim Underwood and the CDB team. Emily Zagonjanin, Dan Bielski, and Andrea Brower worked around the clock to bring this complicated project to completion. And of course, I cannot say enough about Ron Wright, CDB's construction administrator, who was personally involved in every detail of this project, expressing his commitment to deliver the best building possible for Illinois veterans. The CDB set ambitious diversity goals for this project. We spent $7.9 million with minority-owned businesses and $2.7 million with women-owned businesses. It's also incredibly important to note that this was the first CDB project that had goals for veteran-owned businesses. By the end of this project, we had spent $4.4 million with veteran-owned businesses. This project has met its fair share of challenges. Construction began in 2014, but when the budget failed to pass, construction was halted. Although the budget impasse persisted, the project was able to recommence in 2016. And then in March of 2017, major delays occurred again when structural issues were discovered that required significant redesign and alterations to the construction. By April 2018, the project was able to begin again. With all hands on deck and extraordinary coordination of multiple trades, we planned for an April 2020 completion. And then COVID-19 hit. This project team, however, remained committed to the project completion. In fact, the construction was accelerated to be available for COVID-19 isolation beds if necessary. The CDB project team, Turner, DVA folks, and on-site medical professionals ensured that all on-site workers were safe. They were able to stay masked and distanced, and the place was regularly sanitized. The staff worked in shifts so that work could occur around the clock, and some people even slept on site. Due to these and other beyond-the-call efforts, we achieved substantial completion in April of this year and expect to have residents in occupancy when all the audits have been completed. This ceremony today, on Veterans Day, represents the coming together of dozens of agencies, hundreds of people, and millions of dollars. This amazing dedication at all levels of the job, from the VA officials to CDB staff to contractors and union workers, exemplifies the dedication this entire state has towards the veterans that will stay here. To all the veterans who will eventually call this facility home, we thank you for your service on behalf of Illinois and the United States of America.
Forgot my glasses. I can't see a damn thing.
Thank you, Chairman Rhodes. And now I'm proud to introduce my current director of the Illinois Department of Veterans Affairs, Linda Chapalavia.
Good morning. As mentioned, thank you, Governor, for being here today. My name is Linda Chapalavia, and I'm the director of the Illinois Department of Veterans Affairs. As a proud Army veteran and a Goodwill ambassador for 650,000 veterans in the state of Illinois and their families, I want to thank you for joining us today. It's an honor to acknowledge today our nation's heroes that are still with us. So each and every one of you have served. Thank you so much and deeply from the bottom of my heart for your service, especially you, Gwen. I am thrilled to finally be cutting the ribbon on the Illinois Veteran Chicago home. Thank you to each of you who have made this beautiful home a reality for our Illinois veterans and their families. On this day, when we honor those who have bravely sacrificed.
All right, folks, so that was the ceremony in Illinois. I do want to take you out live right now to Simi Valley, California, where we're taking a live look here at the Reagan Library Veterans Day event that is happening right now. Let's listen in to a little bit of the sights and sounds that we are seeing from the airplanes high above. All right, we can't hear much there because we are hearing the podium where that ceremony will be taking place at the top of the hour. Always a great sight to see. Look at that formation that we are seeing right now for the Veterans Day celebration there at the Reagan National Library in Simi Valley. So happy that you can join us here on News Now from Fox as we continue to always bring you the very latest right here to honor the men and women who serve in the United States Armed Forces. The Ronald Reagan Presidential Library will be hosting its annual Veterans Day event. This program, which honors all branches of the military, begins at 10 a.m. Pacific and includes an honor guard, live music, and remarks by keynote speaker Congressman and former U.S. Navy SEAL Dan Crenshaw and Congressman Mike Garcia, representative for California's 25th District, home to the Reagan Library and former U.S. Navy fighter pilot. From an early age, Dan knew that he wanted to serve his country with the most elite fighting force in history, the U.S. Navy SEALs. Following graduation, he immediately reported to SEAL training in California. After graduating SEAL training, Dan deployed to Fallujah, Iraq, to join SEAL Team 3, his first of 5 deployments overseas. On Dan's third deployment in 2012, his life changed forever after being struck by an IED blast during a mission in the Afghanistan province, leaving him without his right eye. Dan refused to quit and went on to deploy twice more, first back to the Middle East in 2014 and then to South Korea in 2016. He was medically retired in September of 2016 as a lieutenant commander after serving 10 years in the SEAL teams. He left service with 2 Bronze Stars, one with Valor, the Purple Heart, and the Navy Medal with Valor, among others. In November of 2018, Dan was elected to represent the people of Texas's 2nd Congressional District. Dan believes in service before self and understands that there is no higher calling than service to the American people. Although he can no longer fight on the battlefield, the integrity, leadership, vision, and tenacity he learned in the SEAL team are present every day in his fight for common sense solutions there in Congress. So we will continue to watch this coming up here in the next hour right now as their musical performance is underway right now. The flyover is happening now, and then the program begins at 10 a.m. Pacific sharp, so about 5 minutes away. And then at 10:45 there is going to be a documentary film screening of History Speaks from the Reagan Foundation that will be showing a World War II documentary screening History Speaks, Diary of a Generation. That's also going to be streamed on the Reagan Library's YouTube channel right there. So we'll keep an eye on this as that gets going here in just a little bit here on News Now from Fox. Live look right now in Clark County, Nevada. Looks like we'll be getting another election update here in just moments as well. So we'll be keeping an eye on that right here. But we should also let you know that within this hour, President Trump did win Alaska. Also, the Alaska Republican Senator Dan Sullivan wins re-election, giving the Republicans 50 seats in the Senate right now, as the Alaska Republican Senator Dan Sullivan won re-election over the Democratic challenger Al Gross, putting Republicans at 50 seats in the U.S. Senate compared to Democrats' 48, according to a projection there from Fox News right now. The results came just 8 days after the election day. Sullivan was ahead. So right now, to get the majority there, Republicans just have to win 1 seat there in Georgia coming up in January to hold on to the majority. So we'll keep an eye on that. We got you covered right here on News Now from Fox. When we come back, we'll take you back out to Simi Valley, California there, where there's Veterans Day celebration will be starting up. Thank you to all our viewers here worldwide on News Now from Fox. Taking a live look there at Simi Valley Reagan Library Veterans Day event about to kick off right there, and take a look at this flyover. Great flyover right now. Always love to see that any day of the year, but especially on this Veterans Day. And News Now from Fox does continue. Welcome everyone here to News Now as we are taking a live look at the Reagan Library Veterans Day event about to kick off right there. Just showing you a great flyover in Simi Valley, California. Always great to see right there. And it looks like the event is going to be starting. It is 10 a.m. Pacific right out there. Let's bring it to you right here on News Now from Fox.
As I'm sure you all are aware, the Reagan Library, unfortunately, had to close its doors to the public earlier this year due to the coronavirus pandemic. No news to you. To this day, we're still not sure when we will be allowed to reopen the Reagan Library. But that said, it was still critically important for the library to seek Ventura County's approval to host today's in-person ceremony to honor our nation's veterans and our military, as nothing mattered more to President Reagan than supporting our nation's heroes. While we succeeded in convincing the state of California that Veterans Day simply had to be honored here today, for health and safety reasons, the size of our audience had to be limited to no more than 100 people. That's okay. Had the state limited today's gathering to only 5 or 10, we'd still find ourselves here this morning. And I know that our special guests who traveled all the way from Texas to be here with us would still have made the effort, given the importance of honoring the men and women in our hearts and in our minds today. For those joining us virtually, hello. Those online this morning, and there are thousands more who are joining us alongside each of you online. Thank you for spending your time with us this morning. Before we begin, if you would, please join me in thanking Royal High School's Wind Ensemble and the Santa Susana Advanced Women's Choir and Abbey Road A Cappella Group for such a great socially distanced beginning to this morning's program. If you would, please stand, and I mean stand, not kneel, before the American flag, recite the Pledge of Allegiance, and hear our national anthem. The Ronald Reagan Marine Corps League Detachment number 597 will parade the colors. Parade the colors. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Oh, say can
the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rockets' red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say does that star-spangled banner yet wave o'er the land of the free, and the hope of the brave, home of the brave.
Retire the colors. Thank you. Please be seated. Before we go further, there are a few people I'd like to recognize who are special guests with us this morning who have helped make our Veterans Day ceremony here at the Reagan Library possible for many years. A special thank you to Lisa Pate and Bevan Abbey for providing today's terrific musical performances. Thank you. All of the active duty military from Naval Base Ventura County, thank you for being here today as well. The mayor of Simi Valley, Keith Mashburn. I know, there you are. Thank you. Great to see you, Keith. Simi Valley Council members Mike Judge and Ruth Luevanos. Former Congressman Elton Gallegly and his wife Janice. Elton, Janice. Congressman Mike Garcia's wife, Rebecca. Rebecca, thanks for coming. I'd also like to thank Congressman Crenshaw's wife, Tara, for being with us today, especially because it's her birthday, so happy birthday to you, Tara. For those of you watching this ceremony from home who saw the terrific slideshow before today's program of our nation's heroes, we hope you enjoyed them, courtesy of our social media followers who sent in the many pictures of their loved ones who served our nation in uniform. And of course, a special thank you to all of our veterans in the audience today. We thank you for your honor, your bravery, and your dedication to our country and our freedoms. We salute all of you. Recognizing the importance of Veterans Day, President Reagan said, and I quote, "The willingness of our citizens to give freely and unselfishly of themselves, even their lives, in defense of our democratic principles, gives this great nation continued strength and vitality. From Valley Forge to Vietnam, through war and peace, valiant Americans have answered the call to duty with honor and dignity. Americans throughout this great land set aside Veterans Day for special remembrance of the men and women who have served to protect our freedom. The sound of bugles playing taps will pierce the air at countless ceremonies across the country and at our bases overseas in tribute to those who gave their lives in order to safeguard human liberty. On this special day, our hearts and thoughts are also turning to those who were disabled while serving their country. Their sacrifices and hardships endure, and daily earn anew the honor and compassion of a grateful nation. With a spirit of pride and gratitude, we honor all of our veterans. In honor of these men and women, those who are currently fighting, those who are missing, those who have perished, and those who are veterans, may I please ask for a moment of silence. Thank you. And on to today's program. In May of this year, Mike Garcia was sworn in as the representative of California's 25th Congressional District, which is home to the Reagan Library. We could not have been more pleased with that election because, like Ronald Reagan, central casting could not have found a more dedicated patriot to represent our district. This highly decorated United States naval officer and leader served his country with distinction and became known as one of the most talented fighter pilots in the United States Navy. We are delighted to have Mike with us today. Congressman?
Well, thank you, John. This is truly an honor to be here on the grounds of the Reagan Library. This is effectively my Graceland, if you will. And I come to you today not only as a representative of this district, but as also a proud and humble combat veteran. And it's great to be here with my friend Dan Crenshaw, who's also a fellow warrior, a patriot, and also a citizen legislator now with me in the halls of Congress. So Dan, thank you for making this trip out here and joining us on this special occasion. Today of all days, it's imperative that we come together as a nation to remember those who have served, to pay respect and honor their families, to those who have served, sacrificed, and loved on this country, and more importantly, to help us all heal little by little in the wake of our wars. We are blessed to live in this, the greatest nation on the planet. Our debt to our fighting men and women goes back over 200 years when hardworking American patriots came together to fight for their freedoms, and more importantly, fight for our freedoms. For 244 years, the United States of America has grown and prospered. We have led the world in the pursuit of happiness and establishing liberty not only on our territories, but around the globe. We have saved Europe from tyranny twice, defended democracies during the Cold War, and have combated terrorism over the last 20 years in defense of our homeland. And most recently, we have eradicated the physical caliphate from the monstrous ISIS threat. We have done so only because our brave men and women, the best of us, have been willing to stand on that wall and protect our nation, even if it meant losing their own lives. We must hold their memories and their service in our souls and keep their sacrifices in our hearts so that the fruits live on from this day to the end of days for all future generations of Americans. But today is not a day of mourning, but rather one to honor the men and women who have fought for us with valor. They may not have perished, but they have all lost something, and we have all lost someone. And as I look around today, I see the strength of this beautiful nation. I see the free-flowing love that we have for each other as Americans and the resulting power that brings us. The power of patriotism flows in our veins, and it's a shared blessing between countrymen. And it's the ultimate deterrent against those who threaten us. It really is Reagan's peace through strength, derived by the people and on the back of our troops. And unfortunately, in these divided times, there are those who have lost hope. There are those who question the resolve of this country, question the purpose of this country. They question whether or not there are any real heroes left. And to those folks who question us, I say to them, look no further than the men and women in uniform today who have solemnly sworn to carry on our legacy and secure our future. And while our nation is currently laden by the drag of internal strife. These men and women are the watchmen protecting us from the bears just outside of our tent, both within our borders and overseas. These bears, those who threaten us, are well served to not ever underestimate the resolve and lethality of our military service members. Fearing our enemies is natural, but we must collectively have the courage to overcome our fears and overcome our enemies. We overcome through courage, and we overcome through action. Whether it's a hostile military or a terrorist threat, or today a virus that we can't see, we must not forget that we are Americans, and we don't lose. We may bleed, we may suffer tragic losses, and we may mourn as a nation the deaths of our sons and daughters as our precious soldiers serve overseas and sometimes don't come back. But as long as we gather every year like we are here today, and as long as we muster the courage to move forward through the fear, we will always be reminded that we fight together as Americans. I'm reminded of a famous quote by John Stuart Mills where he eloquently states that war is an ugly thing, but it's not the ugliest of things. The decayed and degraded state of moral and patriotic feeling that thinks that nothing is worth war, that nothing is worth fighting for, is much worse. The person who has nothing for which he is willing to fight, nothing which is more important than his own personal safety, is a miserable creature and has no chance of being free unless being made so and kept so by the exertions of better men than himself. Today we honor those better men and women who have allowed us to remain free. We as Americans, we don't wish or seek war. We are a peaceful people. But if you as our enemy challenge us or fail to work with us to resolve differences through diplomatic channels, I can promise you that you will recognize the full force of our military strength. And when our military is called upon, you will face the harsh reality of someone else tucking your kids in at night. We do not want war, but we will end them, and we will win them. Let me conclude with this. Our country must fight harder to protect and give our veterans the services that they desperately deserve. My goal as your congressman is to have the VA provide the resources and programs not only to the veterans but also to their families. You should not have to call your member of Congress to get help with the Veterans Administration. We will fix that, and I'm 100% committed to doing so. May we all embrace the brave warriors that have sacrificed so much so that we can remain free. And may we as a nation never forget the meaning of the color red on our glorious flag, a reminder of the courage and the blood and lives lost in defense of this beautiful nation. Let us pay full respects to our flag, and let us not ever forget the heroes who served, understanding that they may sometime come home draped underneath that flag if needed. I want to thank the Reagan Library, the Foundation, John, for allowing me to be a part of this very special occasion. This is a dream come true for me to be able to speak on the lawn of our Graceland. May God bless the United States of America, and may God bless her warriors. Thank you very much. Thank you.
Thank you so much, Congressman Garcia. Great to have you here today. Our keynote speaker today is a true patriot in every sense of the word. He served on the battlefield to defend our country's freedom, and he serves in the United States Congress today to fight for those he represents from the great state of Texas. Our speaker knew from an early age that he wanted to serve as a United States Navy SEAL. Following graduation, he reported for SEALs training in Coronado, which, incidentally, is where he met his wife, Tara. After graduating from SEAL training, he deployed to Fallujah, Iraq, for the first of 5 deployments overseas. On his 3rd deployment in 2012, his life changed forever. 6 months into his tour, he was wounded by an IED blast in Afghanistan. His right eye was destroyed in the blast, and his left eye was badly damaged. In fact, doctors believe he might never see again. But after several difficult surgeries, he regained his sight in his left eye. A miracle, according to his surgeons. The hero sitting with us today refused to quit the military and went on to deploy twice more, once to the Middle East and once to South Korea. In 2016, he was medically retired as lieutenant commander after serving for 10 years. He left service with 2 Bronze Stars, 1 with Valor, the Purple Heart, the Navy Commendation Medal with Valor, among others. In November 2018, he was elected to represent the people of Texas's 2nd Congressional District as he sits on the Homeland Security and Budget Committees. His life has been defined by service before self. He knows there is no higher calling than service to the American people. It is beyond an honor to have him here with us today. Ladies and gentlemen, Lieutenant Commander and Congressman Dan Crenshaw.
Thank you all so much for that warm welcome. Thank you, Mike, for being here. I appreciate the hospitality in your amazing district. John, thank you for letting me be here and speak to this amazing group. Thank you to my wife. I want to say that, we're thanking veterans today. We're honoring veterans, but veterans' families really go through more hardship than you can imagine. My wife would certainly remind me of that. And they're the real heroes. They sit back while we're on deployment doing what we love, but not knowing what kind of danger we might be in, what kind of sacrifices might await us. So thank you all for being here. And of course, thank you to the wonderful men and women who work at the Reagan Library for their dedication, their hard work, and their hospitality. It's been absolutely incredible, and it's such an honor to be with you all on Veterans Day. It's an important day for the obvious reason, right? To honor our vets. Honor their sacrifice of their families, to tell them that we not only thank them for their service, but that we will never forget. But see, that's just the start. It seems to me we have grown accustomed to the ritual of thanking our veterans, and this is a good thing, no doubt. But I worry that we have also grown forgetful about the principles those same veterans stand for. I think on this Veterans Day, it might be worth remembering what it is veterans fight for in the first place. And of course, it's this. It's all of this. It's all of you. And not just the beautiful hills you see here. America is much more than her physical landscapes, as majestic as they are. It's the American spirit, this great American experiment. America is the greatest idea in human history. A republic constructed upon the principle that government exists to protect your God-given rights. America is your freedom to speak freely, your freedom to pursue your happiness, your freedom to take risk, unburdened by the whims of a select elite few in government bureaucracy. Preserving the legacy that is the American spirit is no easy task. Though we pretend it is self-sustaining, in fact, it is not. President Reagan famously warned us that freedom is never more than one generation away from extinction. I think there are many who rightfully fear that that moment is closer than we might have imagined. It's surprisingly easy these days to lose gratitude for the miracle that America is. Easier for many to embrace self-pity, resentment, and envy of another. It's always easier to demand more of others than it is yourself. Easier to feel like a victim instead of a victor. Accountability and personal responsibility are hard things, after all. Maybe it's here that veterans have something to teach us. So on this Veterans Day, I'll give you 5 lessons that we can learn from our veterans. These are 5 lessons in fortitude. Number 1, seek perspective. When I was hit by an IED in 2012 in Afghanistan, I was left blind for weeks. I was unsure if I'd ever see again. My doctors certainly did not think I would see again. This was perhaps the hardest physical trauma I'd ever dealt with. But it wasn't the hardest thing anyone had dealt with. Many of my teammates had paid a far greater price. Many Gold Star wives, my dear friends, were still without their soulmates. I laid there and I thought of my own mother, a young woman in her 30s with 2 small children who battled cancer for 5 long years before she lost that battle when I was 10. She didn't partake in self-pity. She dealt with her suffering with grace, humor, and grit. See, there's a hard truth that we must live by. Whatever you're going through, you've probably been through something harder, so you can deal with this too. And if this is indeed the hardest moment of your life, then consider this truth. Someone else has dealt with something harder, and they dealt with it better than you are dealing with it now. This is perspective in the most fundamental sense. And this seems like an especially important lesson in the year 2020. Times are hard for many this year, no doubt about it. But if we are being honest, this is not our country's darkest times, far from it. It behooves us to put our hardships in perspective. From perspective comes gratitude, and from gratitude comes hope, and from hope comes perseverance. We are a people that does not wallow in despair, but overcomes. And we do so because there is no other choice. Lesson number 2, do something hard. Modern society has fooled people into thinking the purpose of life is to end all suffering. Make all hardships go away. Seek comfort and pleasure as if these things are the ultimate goal, as if living your best life is nothing more than indulging in the pleasures of modern times. Many in our country have come to believe that what doesn't kill you makes you weaker. There is a belief that all opposing opinions are harmful to one's health, that safe spaces must be sought out to protect you from harm. But this is not true. The best things in life must be worked for. They must be sacrificed for. The truth is that suffering must not be avoided, but embraced. It is unavoidable, after all, because we live in the real world, not the world we wish were real. Veterans, and the vast majority of Americans, for that matter, know there are no safe spaces in the real world. We know that true purpose, true happiness, is achieved through hardship. We know that in order to live your purpose, you must challenge yourself willingly. For the hardships that are imposed upon you, well, you must embrace the suck, as we say in the SEAL teams. You embrace it because you have no choice. You tell yourself a story of overcoming your hardships, not falling victim to it. There's value in our suffering. You punish yourself in the gym because it makes you stronger. You put in extra hours at work because it makes you more competitive. You train longer, you wake up earlier, and try to be kinder to those you might despise. These things are good because they are hard. You overcome your pain because to do so builds character. It builds fortitude. So do something hard. Lesson number 3, no plan B. In BUDS, the 6-month basic training that SEALs go through to prove themselves worthy, the only men that make it are those who never gave themselves a choice. This is a deeper concept than just not quitting. It is living according to the purpose, according to the mission that you set out for yourself. Those who ring the bell 3 times to signal that they have dropped out of training, they gave themselves a choice. They allowed themselves to have a plan B. Now, I don't mean plan B as a contingency. Everyone has a backup plan, or at least you should. If you want to be an artist, but you can't paint, and you change career paths as a result, I don't think that makes you a quitter. Quitting is something that happens deep within, when you know you gave up on the best version of yourself. It happens when you don't live according to the purpose, according to the mission that you knew that you could. Purpose is your plan A. It's giving 110%. Plan B is cutting corners. Plan B is doing just enough to get by. Plan B lands you in mediocrity, but living Plan A elevates you above your current self. The comforts of modern society allow many of us to make those excuses, to live a lesser version of our best self. We must avoid this temptation and live with no Plan B. Lesson number 4. The right sense of shame. In the SEAL teams, we often say, don't be that guy. This means exactly what it sounds like. Don't be the guy who forgets the right piece of gear on a mission. Don't be the guy who is late to muster. Don't be the weakest link. Others' lives are depending on it, so it's a pretty important principle to live by. Shame is good. Shame is accountability. Shame means you actually feel bad about your shortcomings instead of lazily accepting them. Too often these days we become obsessed with living our own truth. Our institutions, instead of forming our future generations into tough, courageous Americans, have instead sought to coddle our youth, tell them they are never wrong, never in need of self-improvement. Self-esteem becomes a goal in itself without consideration for virtue or moral strength. But here's the hard truth. None of us are fine the way we are. And that's okay. We all have work to do. But that work will never get done. We will never hold ourselves accountable. We will never know what to strive for if we do not feel a sense of shame when we have done wrong. Lesson number 5, a sense of duty. The whole point of feeling shame is not just to make you feel bad. It is to pave the way for doing what is right, to live with duty. In the military, the concept of duty is so deeply ingrained that it becomes self-evident. One does the right thing because it is the right thing. End of story. To do otherwise is to betray your flag and your teammates. Sure, there are orders, rules in place to direct one's actions. No one is perfect, after all. But for the most part, this sense of duty must be self-actualizing. You have a duty to ensure your gear is squared away, your batteries charged, your magazines loaded. You will not be the weakest link. This has practical value, but also deeper moral value. To be a dutiful citizen is no different. At least it shouldn't be. We should strive to do the simplest of things right. Be on time, work hard, do what it takes. Help our neighbors before demanding that government does it for us. This has always been a key pillar of American exceptionalism. Pope John Paul II, St. John Paul II, for you Catholics in the audience, said that freedom consists not in doing what we like, but in having the right to do what we ought. Fundamentally, what does this mean? It means that our country, our great republic, is centered around this concept of a dutiful citizen. Freedom is not unbridled hedonism. It is ordered liberty. Only a moral, dutiful people can be trusted with freedoms. Otherwise, we are nothing but a society in turmoil and chaos. Laws can be enforced after they are broken, but it takes a good and moral people to avoid breaking them in the first place. And a proper sense of duty comes from a proper sense of moral truth. In the House of Representatives, the words "In God we trust" are inscribed above the chair of the Speaker of the House. Our laws, our country's founding, were based in absolute truth, derived from God. This anchors us, and it's more important than I think people realize. We avoid duty, we avoid truth at our own peril. Our society, our country cannot survive an increasing number of citizens that wish only to survive off the work and ingenuity of others. We have a duty to be stronger citizens if our great American experiment is to survive. And veterans have long sought to protect these values, to impart these lessons, because American values aren't necessarily self-sustaining. Personal responsibility, mental fortitude, moral truth, gratitude for our nation, liberty to pursue our happiness, these things must be taught and passed down. Our institutions must rediscover their purpose in molding our future generations instead of simply reflecting the emotional whims of a restless youth. We can only embark upon such a journey if we rediscover some gratitude for the foundations that make our country the miracle that indeed it is. This place, this idea, is built upon the greatest ideas that humankind ever had. From Jerusalem we learned moral truth. From Athens we discovered philosophy and reason. From Rome the rule of law and the structures of a republic. And from London the first elements of the free market, common law, and the revelation from the Magna Carta that even kings must be subject to laws. And we wrote these ideas down in Philadelphia. This grand experiment has created more good and more prosperity than any other in human history. Our story is unparalleled. It is one of true exceptionalism. It is why Reagan called us the last best hope on earth and paved the way for us to live up to that hope, to persevere. And I think we can. I think we must. I think the next century will be America's best and brightest if we only believe it is our duty to live up to our greatest ideals. God bless you. God bless our veterans, and God bless our great country. Thank you so much.
It was the very moving and inspirational speech there by Representative Dan Crenshaw, Republican out of Texas. We're going to take a quick break right here on News Now from Fox. Stay right here with us.
Thank you so much, Congressman. Well, now it's time for my favorite part of the program, where we recognize all of you who are here today representing the different branches of our military. Our orchestra will be performing a service medley. When you hear your branch's song, please stand so we can salute you. In addition, if you are a family member here representing a member of the military, please stand in their place when their branch's song is played so we can remember everyone who has participated or sacrificed in protecting our country's freedom.
First to fight for the right and to build the nation's might. And
all right, so that was the beautiful celebration there, Simi Valley, California, at the Reagan Library Veterans Day event. We're going to move on here on News Now from Fox, always showing you the very latest that's happening across the board right now and showing you the big board here. Dow Jones up 90 points there in the green. We will continue to always bring you the very latest right here on News Now from Fox. We're going to go a little bit deviate now and go out to COVID-19 related stories. Hi everyone, Mike Pace here as we continue to roll on right here on News Now from Fox, always bringing you the events that are happening in the now right here on News Now from Fox. We're showing you a little bit of Veterans Days events from across the country. Now we're going to show you some COVID-19 related stories. Take you out to Fox 2 Detroit, our sister station there, showcasing The Doctor Is In, asking your questions regarding this pandemic that we are all part of.
3 Beaumont hospitals are reinstating visitor restrictions as COVID-19 spikes back here in Michigan and really across the U.S. Every day we're seeing the number of positive cases go up. So what does that mean? This morning, The Doctor's In. We're speaking with Dr. Justin Skrinsky, internal medicine specialist at Beaumont Health. Doctor, thanks for being with us.
Good morning. My pleasure to be here.
Let's first talk about what you're seeing right there at Beaumont. And you work out of Beaumont Royal Oak, right, Doctor?
Yeah, that's correct. And we've seen our cases steadily increase over the past, I'd say about 2 months or so. So if you go back to maybe end of August, early September, that's the lowest we saw our cases since the summer. And then pretty much since then, you can draw a straight line up, and that's where we are today.
Okay, so we are also, though, seeing, it seems like doctors like you are able to treat COVID patients better because it seems like the cases are less serious. Is that true?
Yeah, so that's actually something we've been discussing a lot. So if you look at the data, hospitalized patients are doing much, much better than they did before, which is clearly excellent news. It's the same disease, so people are still getting sick, but we have a lot of, we have a couple medications which seem to be having a very good effect. Also, in terms of the experience we've had over the past several months, even the non-medical things that we do in terms of positioning our patients, how we oxygenate them, there's a lot of strategies that we have that we're intervening early. They're giving us better outcomes, but people are still getting as sick.
So, doctor, some of the conversations you hear at kitchen tables, and I'm sure you've heard this too, is people saying it seems like this virus has mutated where it's not as severe as it once was back in March. It's a less severe version of COVID-19. You're saying that that may not be true.
As far as we can tell, it seems to be the same virus. And actually, that's a conversation that we've had here at the hospital. We have pretty frequent meetings where we all touch base and we discuss the latest news and developments. But as far as we understand, it's the same virus. And again, if left unchecked, it's just as serious as it was, let's say, back in March and April. People are having better outcomes, though. Again, hopefully it's because of things that we're doing and advances that we've made. But again, if you were just to leave this unchecked, I think you'd see the same deadly results that you saw months ago.
Are you still intubating patients using ventilators, or have we really gotten away from that?
If they need it, and fortunately that has decreased dramatically as well. Again, I'd like to credit some of the early interventions that we're able to do. So again, we're seeing patients who become very ill. They get that sort of inflammatory picture that we've talked about, that viral pneumonia, and they are kind of getting up to that edge. But fortunately, we're not seeing a lot of them fall over to the point that they do need intubation.
Doctor, what's working as far as treatment goes when you do see somebody who needs to be hospitalized? And who does need to be hospitalized? What kind of patients are you seeing?
Right, and again, very similar to what we saw back in the spring. So it's still the respiratory issues that are getting people. So that viral pneumonia. So you've got your patients that come in, severe shortness of breath, low oxygen. Those are still the things that are really hazardous and potentially lethal to people. The couple medications that we use most frequently, steroids, I'm sure a lot of people have heard about that. Dexamethasone is the one we use very commonly. That's got a lot of data behind it right now. The other medication that we use as well is called remdesivir. That's an antiviral medication. And again, there's studies that show that one's beneficial too. But those are the two medications we're using. Other than that, though, we're much better in terms of mobilizing people, positioning them. People have heard about proning, where we have our patients on their stomach. That seems to help with oxygen as well. So there's a lot of sort of non-medical things that we've learned as well to do with our patients to keep their oxygen levels up.
How do you feel going into the cold and flu season, doctor? Are you feeling optimistic? Are you worried?
Well, it's going to be a challenge. And fortunately, the same measures in the population help to prevent coronavirus. So things like masks, distancing, which are still very essential, even more so now that people are going to be inside over the colder months and getting to the holidays. Fortunately, those measures also help to prevent other communicable diseases like influenza, colds, things like that. So if people are very good about the coronavirus measures, hopefully that'll also take the edge off the flu season this year.
All right, doctor, let's bring in Jay and Amy who have questions for you as well. Jay?
There we are. Okay. Doc, my question is just about numbers. As I look into this website, our Michigan website here, over 223,000 cases, 162,000 of the cases since this all started, people under the age of 70. And then you look at the deaths, and one death is a death too many, 7,724. 6,700 of those deaths are people over 60. As a guy with parents in their 70s, you really, really worry about people over the age of 60, and especially when you got over 5,000 of those people over the age of 70. What is it that our older family and friends here in Michigan need to know about this differently than a lot of the younger people are getting this, and that's it, and they're done. But our older population is really struggling with it.
I think that's a great question. It gets to a lot of issues going on right now. So again, just as you mentioned, that's an at-risk population. So our older patients, our patients with chronic illness, those are the patients that are still very much at risk. And in terms of what I see in the hospital, obviously that's a pretty small sample size. But as you mentioned, the data that we see statewide, it's showing that it's our older patients who are most at risk. We got to be really careful moving forward because our younger people can be asymptomatic or they can have very mild symptoms. So you think about instances like Thanksgiving or Christmas, where you have people coming back from school, you have younger people that are going to be in contact with older family members. It's very possible for somebody who's either has very mild symptoms or no symptoms to transmit it to someone who could potentially have a lethal disease. Yeah. In the community, we still see that breakdown where it seems like, again, it is the older people that are getting sick. a lot of the numbers that we have right now, so you see those huge positive test numbers that we're having in the state, that's because a lot of these people are in the younger groups. So we have these ballooning numbers, but in terms of the hospitalizations, again, we are seeing those increase, but that is in our older population.
Right.
All right, Doctor, we're almost out of time, but I do have a question. A shocking report came out, well, shocking to me with the numbers about mental illness after having COVID-19. It's a rather large percentage of people and other physical issues as well. Even if you don't have really bad symptoms, that's a major concern.
That's a very major concern. And I'm sure you've heard the term long hauler, but it's people with COVID who have these lingering symptoms. And as you mentioned, that's a huge one. Depression, and not even just necessarily the cause directly from the virus, but just the circumstances. If you are hospitalized, it's a very isolating experience. If you're sick, it's a very frightening experience. Yeah, depression, we see fatigue, we see shortness of breath, weakness. Those things can be lingering symptoms for months. And again, we think about these waves of illness. One of these waves might indeed be sort of these chronic illnesses caused by COVID infections.
All right, Doctor, thank you so much. We're going to continue this conversation. Yes, the doctor is in this morning. Michigan continuing to see a growing number of COVID-19 cases over the past few weeks, especially concerning as it gets colder outside. We begin to go inside more, and we've got the holiday season ahead of us. So let's get some questions answered. The doctor's in this morning. Dr. Justin Skrinsky, internal medicine specialist at Beaumont Health. Doctor, thanks for hanging out with us this morning.
My pleasure to join you.
The first, I just want to start with a viewer question, and then I do want to talk to you about vaccines and some other business. But Heather writes, I was exposed to someone with COVID 4 days ago. If I test negative today, am I clear, or could I test positive later on? And first, doctor, I would also like you to explain what being exposed means.
Right. So being exposed means being in proximity, unprotected proximity to somebody with COVID for a total of 15 minutes or more. And again, that's if you're in close proximity within 6 feet, no barriers such as masks and so forth. Again, that definition of exposure gets kind of fuzzy because, people who have contact with other people, but let's say you're inside, let's say you're close together, let's say it's prolonged, but people are wearing masks. Again, there are mitigating circumstances, but again, if you look at kind of what the CDC is going to tell you, it's that close proximity for 15 minutes or more. So to answer the viewer's question, if you test negative, the CDC is still recommending, if you have had this confirmed exposure, to still self-quarantine for the 14 days, even if you do test negative. Now, in terms of can you test positive later, kind of depends on the test that you get. So depending on the type of swab that you get, sometimes there are false negatives, depending on how it's done even. And that's why we're recommending to err on the side of caution and to still exercise the 14 days.
Doctor, 14 days seems extreme to me, and I only say that I want everyone to be safe, but it seems as we're trying to navigate this pandemic and we're also trying to live our lives, why do we have to quarantine for 14 days?
It is a long time. And again, we have to recommend what's sort of medically best. And that doesn't speak to what's practically best, doesn't speak to what's easiest. And again, sometimes it's a big ask. So the reason why it's 14 days is, and again, looking at the data the CDC is giving us. So after symptom onset, if you're looking at somebody and you're doing swabs, not the normal swabs that used to diagnose it, but would call viral culture. So basically, can you actually grow live contagious virus out of somebody? These are not the normal tests that you get, let's say, if you just go and get tested to see if you have COVID. It's not telling you if the virus is actually contagious. What we're finding is that after 14 days, over 90%, so this means like 95% of people no longer have any live virus. So at that point, given those percentages, we feel comfortable saying that the vast majority of people are no longer contagious, and that's the rationale for the 14 days.
Dave says, we're all wearing masks, but the pandemic is growing. So can you explain that, doctor? The more mask wearing you see, the more the numbers are going up.
Right, and unfortunately, that's in some of the sectors where we see the virus really growing, are sectors where you have a lot of people in close proximity who perhaps aren't wearing masks as well. we're deeply grateful for all the things that people have been doing, the mask wearing, the distancing, a lot of sacrifices that the community has been making. And believe me, on our end, we're very deeply grateful. But if you look at the really ballooning numbers that we have right now, one of the big sectors is younger people. And younger people are not going to get as sick from the virus, which is why you see, again, we're having, 5,000 to 6,000 new cases a day. People are saying, well, we're having more new cases than we did back in April. So where are the sick people? One of the reasons is that it's a much younger population that's getting sick now. So they're not going to necessarily need hospitalization. But you think about social situations, you think about college campuses, you think about schools, that sort of thing, even sports. You're going to get a lot of people in close proximity to each other. And unfortunately, not the age group that's necessarily going to be the best about mask wearing.
I have a question about vitamin D, Doctor. Can you talk about that? How does low vitamin D impact a person's recovery? Do you know anything about the research into this vitamin D connection?
Yeah, so there's some equivocal research right now. I can tell you that in terms of the inpatient treatment that we're doing here at Beaumont, vitamin D is not part of that. Obviously, we try and optimize that regardless, but it's still sort of an area that needs more exploration.
Let me ask you about vaccines real quick, and then I'm going to bring Derek in with his question, Doctor. I know you guys are testing out a vaccine at Beaumont. Also, this Pfizer news, it got a lot of attention, a lot of excitement. Where do we stand when it comes to vaccines?
Yes, the Pfizer announcement was very heartening. They were saying that they have something like a 90% effectiveness rate. And again, that's comparing people who got this experimental Pfizer vaccine, which is in the final phase of clinical trials, compared to those who got just placebo. So those who got the virus, it seemed, again, to have a 90% effectiveness rating in terms of preventing COVID. So very, very heartening news. Again, these are still in the final phases. So it's not to say that this thing is by any means ready to ship. It's one more tool that we have, just like masks are a tool, just like distancing is a tool. So no silver bullet for this thing. But if we had a vaccine, and especially if we can show that it's safe, we can show that it works, and we can do enough education that people feel comfortable taking it, then that would go a long way.
Doctor, I'm going to ask you one more question, and then, Derek's here too. For Thanksgiving, what are you doing? What are you recommending?
Yeah. That's a really tricky one. Personally, it's just gonna be probably me and just my immediate family. It's a very difficult situation. Obviously, we have to recommend that everybody err on the side of maximal caution. As doctors, as healthcare workers, that's what we have to tell you guys to do. I leave it to everybody to exercise their best discretion, but especially if you have older people, if you have at-risk people with chronic illnesses in the home, just think really, really hard about trying to keep those individuals safe.
Derek?
Yeah, I got a quick question, Doc, about contact tracing. So say, hypothetically, your wife is exposed to it at work. She gets sent home for 14 days. Does the whole house have to quarantine for 14 days, or does it just last for that person that was exposed?
Yeah, those situations get a bit sticky. So right now, it would be the individual who had the potential direct exposure. Now, again, if that person ended up testing positive, for instance, then now you have to consider everyone in the household to be exposed.
Yeah, it's a bit of a puzzle that we're solving, right, Doctor? Well, Dr. Justin Skrinsky, we appreciate you and all of the hard work that you're doing and all the information. It is so valuable to us. So thank you.
My pleasure. Thank you for having me.
A live look right now at the Dow here, up 65 points there in the green. Some of you are going to take a short 2-minute break. Stay right with us here on News Now from Fox.
Dr. Mike Srigliano with Penn Medicine joining us out of Philadelphia. Good to see you, Dr. Mike.
Always a pleasure, Thomas.
Looking at the numbers once again, it's clear we're not headed in the right direction here. Do you see another lockdown or a total lockdown on the table?
I'll tell you, Thomas, I think by numbers, I'm worried, but I don't see another lockdown coming. It just can't happen. I think it's going to be a very careful process in terms of what changes and what doesn't. If you look at Governor Murphy in New Jersey, he set limits on the amount of hours that a restaurant can stay open. The theory there is that if someone is at a restaurant after 10 p.m., they might tend to have maybe more drinks, let their guard down, get more likely to have problems, and maybe let their guard down. So for that reason, I think it's going to be a very careful and methodical approach to this rather than just shutting everything down. Now, if we get to the point where it is widespread, and remember, Thomas, in 1918, the second wave was much more deadly than the first wave. And so time will tell, but I got to tell you, as someone in the front lines, it's a little bit frightening. And I haven't been frightened in a while. Things were going better. We were getting kind of used to the whole concept. But this week, I must say, I've had one death in my practice, as well as a significant uptick in the number of patients with COVID-19.
Yeah, I think it is concerning. I mean, I think that's why we're seeing more and more of these restrictions. Do you think it's time to rethink sending children back into the classroom full-time, Dr. Mike?
Well, I have one child who is like me, a little bit on the nervous side. He elected to stay virtual the whole time. My daughter, however, is in a hybrid model. As we've seen in several school districts, like in Philadelphia, they've decided they're not going to come back. They're going to stay virtual. If the numbers keep going the way they are, I cannot see how any school district can remain even in a hybrid situation. It's very risky business.
The CDC, and we talk about the holidays here and trying to see family members. I know they just posted its most specific guidance yet on Thanksgiving. What are we learning?
Well, the Centers for Disease Control has listed high-risk activities, lower-risk activities. And when it comes down to it, if you look at all the recommendations and you distill it down, one, you want to limit the number of people that are together. You want to make sure and try to have everyone outdoors rather than indoors. You don't want to share food. Much of these recommendations are similar to recommendations that we talked about when it was the summertime and picnics were going on. You want to make sure if you have someone at high risk, you don't want to have them exposed to family members. And one of the things that really troubles me and worries me are college kids coming home from college. They've traveled in many cases and they have been out in the world. You bring them home and they're going to want to see their friends locally, and they are bringing the outside world in. And if you have a loved one, grandmom, or someone who is at high risk, you have to be very, very careful about that. That's basically what the guidelines are saying. Outdoor dining, make sure that you are outside as much as possible. Hopefully the weather will cooperate. But look, folks, this is not going to be like any Thanksgiving that I've ever experienced in my lifetime. No one has gone through this. It's not going to be the way it normally is.
And this goes with a renewed warning from doctors across the country that their patients simply aren't shaking their symptoms as quickly, that many are experiencing these symptoms months after infection.
Well, we call them long haulers. That's the term that many people use. And
all right, we are going to break out of that right now. Take you out to the Los Angeles area. We do have a police chase underway right now. We are going to listen to our sister station, Fox 11 in Los Angeles, as this pursuit is live right now there in California. For those of you on Fox 10 Extra, head on over to NewsNowFox.com so you'll see it all right here.
With the registration. So they've been chasing this vehicle since Joshua Tree. It was on the 60, it was on the 10, then on the 605. We were talking about, when we were talking to you originally, just before we could get on the air, that was going to be the El Monte area. Right now, Pico Rivera. We're going to be approaching the Beverly Boulevard. That's probably going to be the next off-ramp. Now, why they keep chasing them, you know, that's the big question. If it's just a registration issue, why are they staying with it? A lot of times with the pursuit policies that we know about and law enforcement and the things that have been going on, they basically will just be like, well, we got the registration, we know this vehicle, we'll just take care of it later on. But this one, a little bit different. They've been staying with it, like you said, from Joshua Tree. Speeds and the driving conditions on the freeway light. The way this driver's been driving this SUV, just to probably, you know, it's one of those ones you kind of want to poke fun at it. Let's just say California driving normal. He's probably about 75 miles an hour at max, 60. Then he drops down. Hasn't been changing lanes aggressively. Just kind of been hanging out in the number 1 and or the HOV lane. That might be another one of his infractions there if he's in there by himself. California Highway Patrol. They've got the helicopter over it. They've got multiple vehicles behind it. One of the one of the California Highway Patrol vehicles from Joshua Tree staying with it. We've talked about that in the past. They'll hand it off to the divisions that they're driving through, but apparently one of them from all the way out in Joshua Tree still here with it. Marla, this pursuit continues. We're watching this SUV make its way southbound, 605 freeway, well established in the Pico Rivera area now.
Okay, so this pursuit was initiated by Morongo CHP. This is what we're learning in Joshua Tree, as Stu's been mentioning. You can see that there are those tinted windows. We don't at this point know how many people are inside. And yes, that is the interesting thing here. CHP just tried to pull over this Lincoln Navigator for simply not having a registration, which doesn't seem to be too big of a deal. But of course, they didn't stop. And then that's when this pursuit really got underway in Joshua Tree. Been going on for some time now, as we are well beyond that area through Baldwin Park, southbound 605. You can see at least one black and white there. What does it look like, the trail behind this suspect, Stu?
We'll get Vinny to pull out just a little bit more. We'll get a good look at that Lincoln Navigator, old school Lincoln Navigator. That's not a new one. That's probably, I would guess now. I mean, some of the car guys will probably be getting a hold of me on social media here very shortly, but I would put that in probably about the 2000, maybe 2002. So it's an older vehicle. It doesn't look abused in any way, in shape or form. It looks like it's in pretty good shape. The reason why I bring that up is usually when we get these older vehicles, gas mileage, we can talk about that. It has been going on since the Morongo area, and then also how these vehicles are maintained. In this case, it seems like it's running well. Hopefully, we don't know full tank of gas or half a tank, but at this point, the California Highway Patrol, they're behind it. There's a number of vehicles, and I believe the one that when Vinny gets a little bit wider, there's an all-white one back there somewhere, and that's going to be the California Highway Patrol vehicle, I believe, that came from all the way out from the Morongo area. Wow. Now it has dropped way back. So at any rate, so you got about 4 or 5 vehicles right there, all California Highway Patrol. They're using their new Chargers as the pursuit vehicles. We didn't see any of the Explorers. So, and again, the only reason I bring that up is I'm sure we're going to start talking about if he gets off the roads or she gets off the freeways and onto roads. What are we going to do? Can we pit this thing? Is it a big vehicle? Does it have the stability control? All those questions. A vehicle like that, they can still pit it. That's kind of a misnomer when they talk about the size of the vehicles and their cars. Unless it's a mobile home or something, but even a mobile home, they can still do that pit maneuver. Might be a little bit more difficult. In this case, that SUV, we'll see what they do. Right now, 605 freeway southbound, we're coming up on that. I should have been prepared for that. I believe we're coming up onto the 5 freeway. That's it right there. But we're continuing on, getting a little bit of traffic, and if he stays on the 605, the traffic kind of builds for a little bit and then seems to open up. But looks like we're going to be confirmed 605 southbound as we're going to be leaving the Pico Rivera area heading into Downey, Norwalk.
Okay, so just a quick search on Google Maps, just to put this into perspective, from Joshua Tree to just the Baldwin Park area, that's more than 100 miles. So to think that simply because this person doesn't have registration, they failed to pull over as they were supposed to do. CHP, the Morongo CHP initiated this pursuit in Joshua Tree, and here we are more than 100 miles later. So just listening to the scanners and then seeing this live picture, Stu, you talk about the fact that it's this driver, the suspect, not going too much over the speed limit, if at all, which is good. So my point is, at least we aren't seeing the erratic driving.
No erratic driving, and wow, huge points, Marla. That's awesome that you went ahead and Googled that to find out the mileage right there. That's pretty cool. And you got to figure that, just do the math. If he's going about 70 miles an hour, this pursuit's been going on for over an hour. So you'd think that that driver has had plenty of time to calm down, maybe gather their thoughts, or trying to reason what is going on here, and is it worth the running from the law enforcement, or just pulling over? You'd think if it's just just an infraction or something like that, yeah, they might impound the vehicle, but they're going to impound it anyway. And now you're going to be way far away from where you started, unless they're running to where they live. Right now, though, you can see them changing some lanes. 605 freeway, we're well past the 5. So getting into the Norwalk area right now, California Highway Patrol still behind it. Anybody that might not be familiar with the 605 is going to take us down possibly into the tip of Orange County, Long Beach area, and he has a couple of other freeways of choices, but basically we've seen him, this is the first time we've seen him go south. Everything since the beginning has basically just been westbound. When he got on the 605 south, that was the first time we saw him going south. So right now you can see him still picking up a little bit of speed. I hear them talking, and they're throwing around the 70 numbers, and then I'm looking at, you see it now, maybe those were older numbers. He's really starting to pick up some speed down there. You know, reckless driving might definitely start getting into it. We definitely saw it click into the triple digits, 100 miles an hour. California Highway Patrol was calling it about 70, 75, but you can just see how he's passing all those other vehicles. I'm going to go with the Skyfox speedometer and say he's probably bumping that 100-mile-an-hour mark.
Yeah, we're seeing that firsthand, and yep, it just hit the 100 miles per hour. So I just had sort of echoed what you had said about not really driving too erratically, and then here we go. So yeah, definitely picking up speed. Southbound 605, well over 100 miles so far covered in this pursuit. CHP initiated this in the Joshua Tree area. Where are we now in the southbound 605, Stu, as this driver of this Lincoln Navigator, this suspect wanted for no registration, not pulling over? Where are we now specifically southbound 605?
Southbound 605, we're just approaching the 91. That's going to put us Bellflower, Artesia area, right about in there. I was taking a look there. It looks like we are going to be transitioning right there, so we are going to be getting onto the 91. So we'll take a look and see which way he's going to go. It looks like we're going to be favoring the westbound lane. So, and that is where he's been going for the most part. He's been, like I said, it's been everything west, west, west. Maybe he just wants to see the beach one more time before he gets into custody. Trying to blend in with some traffic right there, but it's not really going to work. Trust me. But basically doing what he's been doing, or she. The suspect's been doing the entire time, hanging out in that the center lanes. He's been basically getting as close to that center divider as they can. Number one lane or carpool. Now we're going to be westbound on the Artesia Freeway, otherwise known as the 91, Bellflower area, and the pursuit continues. California Highway Patrol chasing that vehicle. The one thing I got to point out is when he was doing some of those higher speeds and transitioning, I kind of saw the car bouncing just a little bit. That kind of just leads me to believe that, like we said, it's an older vehicle, maybe not in as good shape as I had hoped when the pursuit first started. And the only reason I bring that up is because if he gets off the road or he starts making hard turns, you want to see that vehicle working as well as possible. And if it's bouncing around like that, that means it's probably not in good shape, and that's going to create issues, especially on hard turns, and you just don't want to see anybody get hurt.
Right, and as you were estimating, you were thinking that this is an older model Lincoln Navigator, silver here, pulling up against the other innocent driver back in the HOV lane. And I did see that too, as well, Stu, almost like the hydraulics, right? It was bouncing up and down pretty good, and you wonder if it's because of the roadway or the fact that it's old or the fact that it's driving well above the speed limit at this point.
It's probably a little of all of those. I'm being serious, Marla. But right now, he's basically, the higher speeds, don't know why this is all of a sudden. Possibly maybe starting to run out of fuel, maybe just getting a little bit more desperate or closer to this person's destination. Right now, I can tell you that we're making our way into North Long Beach. We're going to have another freeway. But west has always been kind of the direction this vehicle's been wanting to go. So we're going to be westbound on the 91. 91 freeway. North Long Beach area is where we're at right now. 71 is going to be coming up, but my guess is probably just going to stay on the 91. We've seen these in the past. Maybe this, oh, well, there you go. As soon as you say you think he's going to be doing something, looks like, oh, almost thought he was going to be exiting right there. But we're in the far right lane, so we're going to keep an eye on it, see if he tries to get off the freeway. Maybe this was a destination. Maybe he's trying to bring that vehicle to some location.
Right. We still don't know. So for confirmation on location, we see it right there thanks to our extreme nav technology. This is the Artesia Freeway, westbound 91. It transitioned off of the southbound 605 earlier. That's when we picked up this pursuit just about 10-15 minutes ago. But for those just joining us right now on Fox 11, keep in mind that this pursuit started more than 100 miles ago in the Joshua Tree area, initiated by Morongo CHP. CHP is still the agency trying to get this suspect to pull over in this Lincoln Navigator Silver there, now currently in the Long Beach Lakewood area. Speeds in the 90s. We've seen this person clock 100 miles per hour. There you go. We just saw that happen right then and there. This is the interesting part, simply because no registration. And there you have the start of the pursuit when they failed to pull over. Stu?
I know, I'm just looking at the numbers, and up in the hundreds with that big vehicle. Like you said, it started out in the Morongo area. Now we're getting some information that perhaps this vehicle, we don't have it confirmed, perhaps is registered out here in the Wilmington area. So this might be a destination type of pursuit. This person trying to get back to the neighborhood or back to home, maybe to drop off the car, whatever it may be. But definitely we're understanding that it is registered in the Morongo area. It's registered in the Wilmington area. Started out in Morongo. Maybe it was just somebody out there enjoying that. Looks like we're going to be taking an off-ramp here. Looks like it was somebody enjoying the, maybe out there at the casino, and something happened, and now trying to get this vehicle back home. It looks like we're going to be getting off on Santa Fe or Santa Fe Artesia. Some hard turns. That's a big old truck, and that's what we were talking about. Making a hard turn right there, coming back around. Now we have traffic. Oh, I don't like this kind of stuff. And I don't know if he had a green light or not, probably not, but at least it was a right turn. And making his way now southbound on Santa Fe. And this kind of will take us down, if he stays on this, will take us down into the Wilmington area. But starting to drive a lot more reckless out there, running through those red lights. And there's a lot of commercial vehicles out here. Very dangerous situation. I can't stress this enough.
Right, so now we, for the first time, are seeing this pursuit suspect on surface streets, Santa Fe Avenue. Thanks to Extreme Nav, we can see that. But oh my goodness, Stu, speeds in the 80s on these surface streets. And that's an interesting point, as this is very scary to watch, that we are learning that the registration may be out of Wilmington. This started in the Morongo Joshua Tree area. And so, as you say, this might be a destination for this suspect.
Yes, and again, we're just kind of, just really just spitballing out here. We know we got the information about the registration. We know the direction that vehicle is going. They backed off, Vinny. And so Vinny was wondering if the police were still chasing them, and they have backed off. I don't know if they're handing it off to another agency, and or if the I'm just looking at it. There's a wide intersection. Oh, and he's really banking it hard right there. This is basically got onto South Alameda. I was wondering if he was going to do that. That's more of a straight shot instead of Santa Fe. But what I was trying to point out is I'm going to try to make sure that the helicopter's still following it. And of course, they might be in a tracking mode, and we understand that too. California Highway Patrol, highways right in the name of it. Once it gets off here on surface streets, they're going to back off. Even though right now, Alameda in this portion of Southern California is basically just a type of freeway that it's basically just used for trucking. And straight shots. But we're going to be coming up on the 405 freeway, 100 miles an hour, passing big rigs down there. So it just chills your blood.
It absolutely does. So Alameda Street blowing by all of these trucks. You say this is more a thoroughfare for the trucks out there, the trucking industry. Are we in the Compton area now?
We would be just touching the Carson area, more of Carson, and we are definitely getting into the Wilmington area. I mean, this basically is a straight shot into Wilmington. I'm still trying to just work. I'm listening on the scanner and looking out the window, and maybe if Fulvio can hear me, I'm wondering if the police helicopter is still following it as well. The California Highway Patrol. They actually switched out at one point, so they had a helicopter with full fuel. But definitely keeping an eye on it right there. 80 miles an hour. Thank goodness the traffic is light. Hopefully he doesn't run any red lights, especially at that speed. Older SUV, Lincoln Navigator, just very, very dangerous. And getting the next major is going to be Sepulveda Boulevard, which is Sepulveda Willow, depending upon what side you're on. And then, of course, it's going to be PCH. But then we're going to be in the Wilmington area. Vinny's doing some great camera work there, trying to get a look inside the car.
Right.
It does appear that it is just the driver in there, and still we don't know, guy, gal, but all we do know is driving extremely fast and taking some really big chances out here this afternoon.
Certainly, and right, we can just see that it doesn't look like anyone's in the passenger seat, but then again, we're dealing with these tinted windows, so it's really hard to even speculate. There certainly could be more than one person in there. We don't know really anything about this suspect. If this person is armed, of course, law enforcement always goes into these pursuits assuming that the person is armed and dangerous. This is certainly a dangerous pursuit that we had picked up in the Baldwin Park area, southbound 605. Now we're working our way into the Compton area, South Alameda Street, just blowing by all of the street traffic there. A lot of trucks, as you say. There's another one. Speeds above 100 miles per hour. You mentioned tracking mode. So for people just joining us who may not know what that means between a pursuit and tracking mode, we haven't gotten confirmation, but law enforcement will decide to pull back when it's just too dangerous. As we're approaching an intersection here, I'm going to see what happens. Okay. So law enforcement, Stu, will decide to pull back and therefore go into what they call tracking mode because just the risk of public safety is just too much.
Definitely. Public safety, safety of the suspect. Yes, that's true. And, of course, officers as well. They do have the helicopter above. It is still tracking this and giving out information. When this comes to an end, I wouldn't be surprised if, or it might already have officers at that location that this vehicle is registered to. I'm just kind of keeping an eye on it. I believe that we're staying on Alameda, and but we're staying on the portion that's not the 47. So the road's going to get a little bit more rough, and then it is definitely taking us into the Wilmington area, starting to make a turn right there. So definitely, this is kind of going to take us out of an industrial area and into a residential area eventually. We're going to keep an eye on it, but look, the streets getting a lot tighter and much smaller, and if this person keeps up with those high speeds, I'm just hoping, continually hoping, that nobody gets hurt. And that's it. Just nobody gets hurt.
Right.
Right now, this person really just running from themselves. They don't have to be driving this fast. They can just stay at regular speeds, drive at traffic, just follow the traffic rules. But continuing on down there, and now we're like I said, this is well. Hang on. Looks like a dead end. So perhaps this person doesn't know this area as well as we thought, backing up there because they saw it was a dead end.
Yeah, I was thinking, you know, by and large, this person must have a destination in mind with the sharp right turns and lefts in this particular industrial area, but maybe not, since they just took that wrong turn and it was going to be a dead end. So now they are backtracking. This is East 1st Street and Murdoch Avenue, still in the Compton area, industrial area here. Well, this is interesting, Stu, because now we're creeping along at 30 miles an hour.
Well, you know, it's good. It is really good. You know, I always make jokes that maybe they're listening to us. Hopefully they are, and they just kind of realize that, you know, it's not good. It's always going to end with handcuffs, one way or another. You're going to wind up in handcuffs. Just hopefully nobody gets hurt. And if you start driving at least California, like a Californian, then at least there's a less chance that somebody's going to get hurt. There's no law enforcement behind him. That doesn't mean law enforcement isn't nearby. Every time he runs a red light like that, you just got to worry about somebody that might be coming the other direction that just doesn't know that this is going on, and who would suspect it? And now there's no lights and sirens. You can see Anaheim Street is a road that we're on. Anaheim, at least a little bit of a bigger road down here in the Wilmington area. Making our way out of it's a lot of industrial out here, but there are more homes as we make our way a little bit more to the west. Again, hopefully this is a destination type of thing, and he's not trying to make his way over to the 110 freeway to get it back onto a freeway. Right now, though, just a lot of traffic out there, a little aggressive driving. And of course, when he's running those red lights, running those stop signs, you just don't want to see anybody get hurt.
Right.
Can't say it enough.
Absolutely. So right here, East Anaheim Street and Eubank Avenue, and you just wonder the mentality of the law enforcement at this point, because it was just a couple of minutes ago that this suspect was driving upwards of 100 miles per hour on these surface streets. Now starting to pick up a little bit of speed, but still in the reasonable range, if I can say that, in the 40s and 50s. Less dangerous looking here. Are we seeing the black and white still behind the suspect?
Well, the California Highway Patrol basically backed off completely. Now, does LAPD Harbor Division know about this? I'm sure they know about this, and they've been made aware of it. Now the question is are there officers nearby or even at this suspect's, at the address that this vehicle is registered to? That's the question. Also,
Stu,
are they going to engage? Go ahead.
Pardon me, I just want to interrupt you with this new information we're just getting. Per CHP, there are reports that there are 2 children inside this Lincoln Navigator, which is a worst case scenario, right?
Yeah. And then you just got to start thinking with those high speeds and that person driving, why would you do that? Especially, you've got children inside that vehicle. Why would you take those chances at all? It's bad enough that you would take the chances with somebody else's lives, but if you have children that clearly are yours, you clearly must know these children. Why would you do something like that? He's down. Go down. There he is, right there. And he's continuing on. Clearly, you can see that we're still on Anaheim Street. And Marla, now this just changes everything. Having children in there, and then with that information, LAPD knows about this pursuit. They might be just getting their ducks in a row, as it would be, to re-engage or coming up with a plan to bring this to an end with the least amount of danger to anybody involved.
Absolutely. It does change the whole landscape of this pursuit. Seeing that vehicle go beyond 100 miles per hour and knowing now from CHP that there are 2 children inside. So at least 3 people occupying this silver Lincoln Navigator. Are we coming up to a stop? Yep, stoplight here. So forced to stop. Well, not necessarily, right?
Why are we doing that? Oh, okay. It's just a gas station. Yeah, just cutting through right there. By the way, that's a legal move, just in case you needed to know. Making a U-turn, that might not be so legal. Making a turn there probably just wants to stay on Anaheim. Just keeping that vehicle moving as he's making his way. That's going to be the 110 freeway right there. So not getting on the freeway as I pause to see if he actually is. It sounds like we're going to set up for a southbound turn right there. So we'll see if there's an on-ramp right there or if this person's still trying to make his way to a location.
Okay.
So back on we're getting onto the 110 freeway. So I just, that kind of eliminates the, lives in the Wilmington area now that we're getting back onto the, CHP just went by there. Maybe this person's maybe that officer, there's the California Highway Patrol helicopter. So now we're back southbound 110 freeway heading towards the San Pedro area.
And driving at a reasonable speed at this point in the 50s and 60s. And obviously, as I say that, picking up speed. Yep. There the suspect goes. So if you're just joining us, 11:22 to be precise, on Veterans Day. We are looking at this CHP pursuit. You can see the helicopter there, the law enforcement helicopter tracking this suspect, in pursuit of this suspect as well. Morongo CHP picking up this pursuit more than 100 miles away in the Morongo area, Joshua Tree area. We picked it up about 30 minutes ago, southbound 605 in the Baldwin Park area. Just to give you a quick summary, we've seen this person now, the suspect drive to make a connection to the westbound 91, eventually got off Santa Fe Avenue, went round and around in those surface streets areas, going beyond 100 miles per hour on the surface streets in the Compton area, and then just made the decision to get back on a freeway. This is the Harbor Freeway, the southbound 110, picking up speed, still in the 70s. And we are learning that there are two children inside this Lincoln Navigator. Now, Stu, it's important to point out to people watching at home, as we're now seeing them really pick up speed here, that the original want was simply that this vehicle didn't have registration. And that's when the pursuit started. They failed to pull over, and here we are more than 100 miles away in the Long Beach area, exiting here. Is that right?
We just exited once again. I'm just trying to get a feel for where we are. There's actually two law enforcement helicopters above this, and it looks like we're going to be getting onto the 47. That's going to be is going to take us across the Vincent Thomas Bridge. And so we're going to keep an eye on it right there. Hopefully this isn't anything other than just a rerouting type of situation. Everybody's been following along with their cards at home, I'm sure, writing down all our notes, because there is a test later. 47 was the freeway they were on, or that throughway that's basically Alameda that they use for the trucking industry out here by the harbor. So back onto the 47. This is going to take us across the Vincent Thomas Bridge and basically back over into that same general area. Two law enforcement helicopters actually above it. No LAPD at this time, but you do have a sheriff's helicopter keeping an eye on it, and of course the California Highway Patrol helicopter that we saw in some of those shots that Vinny gave us earlier on. It's still driving a little faster than they should be, getting across the Vincent Thomas right there. And again, this is a pursuit. Now we're hearing that there's might be some children inside that vehicle. If they are, they're probably in the back seat. Hopefully they are buckled in, and depending on the ages, have car seats. But we do know the driver up in the front alone. Vinny gave us a nice clean shot earlier on. We clearly saw just the driver inside that vehicle. Now going across the bridge, at least driving normal speeds out here. And this will take you back down, but when we get back down on the other side, it's very, very industrial. This is an area of the port where it's basically just freight. A lot of vehicles, just trucks moving freight around. So hopefully there won't be any higher speeds again or any kind of crazy driving, but you just got to wonder, where's this person going? What's the plan? Because we're going to follow along till it comes to an end.
And the suspect may not have a plan, as we've seen. Yeah. My question to you, Stu, is now that we're calling this officially a police following, so explain to us the difference between a pursuit and a following.
Well, the following, it's really interesting, and we have actually seen it work in the past, and I have to really emphasize that this is an idea that basically the law enforcement on the ground will back off. Basically, they'll get all the black and whites, the cars that are chasing the suspect, they basically just back off, and then what happens is the driver, hopefully, will see that there's no tension, there's no pressure for that driver, for that suspect. So they will drive a little bit slower, maybe have this feeling that okay, I'm going to be able to get away with this, and it's a good plan. And then they'll keep an eye on it from the air, and sometimes they even don't do that. There's a Homeland Security, that's also Port Police, that I just passed right there. But it is actually a really good idea, and sometimes they will just get that address. When we've seen that in the past, especially recently, where they'll just realize, like, okay, that is the registered owner. Somehow they know that that is a registered owner, and they'll just let it go. And they'll basically door knock this person, basically show up at their house or take them into custody at a later time, or maybe even when they go to the DMV to try to get their license, they'll say, law enforcement wants to talk to you. So those tactics really do work, and you can kind of see it right now that there are no black and whites behind them, and the car driving 70 miles an hour. But I believe that, I can't guarantee it, but I would almost think that the speeds down there might be 65, definitely 55 because of the big rigs.
Well, not going too much beyond that, which is good, in the 60s right now in the 50s. So this is the Vincent Thomas Bridge, the suspect here. And I think the game really changes knowing that, well, it does not, I think. It absolutely changes everything knowing that there are potentially 2 kids inside this Lincoln Navigator. And so that is a really good reason for law enforcement to back off. It's just out of the sake of safety, right?
Definitely out of safety. That is it always is law enforcement or all the first responders biggest that is what they're all about. Safety of the public, safety of the suspects, safety of other law enforcement officers or first responders. That's what it's always all about. Vinny getting the wide shot right there showing that we're going over the new bridge out here. I don't know if they've actually, the Gerald Desmond Bridge, that's General Gerald Desmond, and you can see that right there. So basically making our way out of the port area into the Long Beach area. That's going to be the next stop. I can't see Long Beach PD getting involved in this or basically having a different tactic than what California Highway Patrol has right now. It's just really strange to watch this just kind of unfold, knowing that there may be children back there. If there aren't, even then, why is this person just continue just to drive around randomly? No law enforcement behind them. I'm sure maybe they know, maybe they're on the phone, they're getting messages like, hey, all the media is still following you. But if that's the case, somebody should be telling this person, look, just pull over. Right. Just pull over, just get out, just bring this to an end before somebody gets hurt.
Well, and the other point is the opposite point of what I just made. Knowing that there are 2 kids, it's even more important that we get this suspect to stop, to do so safely, of course, and get those kids to safety as well. And we don't know the relation. This could be, obviously, this could be one of the things. It could be a domestic situation. That is an option, also speculation at this point. But we are hearing that there are, from CHP, that there are 2 children inside this Lincoln Navigator that is currently wanted in this police following. We were on the air earlier as it was officially a pursuit. It's now a following as law enforcement has decided just to back off ever so slightly here.
Well, I can tell you now we're northbound 710 freeway. Speeds, you can see them a little bit slower. A lot of traffic out there. California Highway Patrol helicopter still above it. Sheriff's Department still in the area, keeping an eye on it. Law enforcement on the ground aware of the situation. If this vehicle gets off the freeway and then basically gets back, I got to work with Vinny for a second right now. Hang on, he's
no
staying
problem.
on the freeway.
No problem.
California, there's some black and whites coming up behind him. He's going to get back. They're going to start chasing him here in a second.
Oh, okay.
And I'm trying to see. Okay, he's way up the freeway, passing a green, look for the green semi. Keep going. Oh, you're too far. Slow down. I'm sorry.
That's okay. So southbound, pardon me, this is the northbound 710?
Northbound 710, northbound 710. Number 2 lane, Vinny, number 2 lane. And he's got to be right with us right now.
All right, so Vinnie Mac working the camera there, trying to get eyes yet again on the pursuit vehicle, which is a silver Lincoln Navigator, an older model.
Okay, yellow dump truck. Go wide. Okay, you're too far. Back. Stop. A little to the right. Look for the yellow dump truck. Okay, he's ahead of the yellow dump truck. Keep going. You can't miss him. Keep going. Nope. Go. Yeah, right there. That's him. There he is. Right there.
Yep.
Corner of the screen.
We got eyes on him again. All right.
Sorry, and I'm sure my social media is going to explode about me barking out orders. I'm sorry if Vinny's actually in the back saying he's appreciating all the help.
Yeah, absolutely. We appreciate it too.
There we go. So anyway, back on the freeway, northbound 710, and you can see speeds about normal. But we also, because of all of that, thank goodness, we actually saw that law enforcement definitely in the area, California Highway Patrol, getting their ducks back in a row. They might really initiate this as a pursuit again, meaning lights and sirens. The only plus for that really would be right now for all the people on the ground, at least they would hear the lights and the sirens at least, and have an idea that something is coming their way. As far as the kids inside the vehicle, I wish we could get solid confirmation about that. I'm still very hopeful that it is just the driver. Why would anybody take those type of chances with their children or any children inside that vehicle? Looks like he's getting over to the far over to the right, so that means possibly an off ramp. We'll keep an eye on it. We'll give you this off ramp in just a second if he does get on an off ramp or a freeway.
Okay, so in the Long Beach Lakewood area, this is the northbound 710. This Lincoln Navigator here, we're seeing if it's looks like taking the off ramp, right?
It is going to be a transition road, probably to the 405 freeway. I can't guarantee it as of yet, or maybe not. We'll keep an eye on it right there. It looks like underneath the bridge, just go wide, see where he pops out on the other side. There he goes. It looks like he's staying. 405 transition, right side of the screen. There he is. So that's the 405 transition. It looks like 405 northbound, which is going to be a first. And we'll keep an eye on where he's going, but staying, the speeds at least have slowed down there. But earlier on, we saw him taking those sharp turns at well over freeway speeds. A bigger vehicle like that, you just worry. And right now, it's going to be northbound on the 405 freeway. So we're going to be leaving the Lakewood area here and making our way out towards the airport. I mean, the airport's quite a distance up, but that's our general direction.
It's not that far away, right? So northbound 405 from the Long Beach Lakewood area. So we picked this up on the southbound 605. The suspect then went to the westbound 91, got off on surface streets in the Compton area, then picked up the southbound 110, then went over the Vincent Thomas Bridge, that's the California 47, onto the surface streets, northbound 710, and now here we are, the northbound 405 with speeds picking up. Still nothing too egregious, but we have seen that. As I say that, we're seeing them pop into the 80-mile-an-hour range. But we have seen this driver both on the freeway and on surface streets exceeding 100 miles per hour. There have been a couple of close calls, Vinny, but fortunately we have not seen any injuries. There have been no accidents as far as our cameras have seen, but definitely close calls, certainly on those surface streets.
Oh, definitely some close calls. Running a lot of red lights out there. Basically, almost every intersection that vehicle came to didn't slow. It slowed down a little bit. Let's be real about it. But basically, if it was red, ran right through it. Did actually some maneuvers to get around things. Here we go again, picking up those speeds, really high speeds, changing lanes very quickly. This is definitely, you don't want to see it with just the suspect in there. Now we're hearing children. This is really, really bad. As we can make our way northbound, the law enforcement sometimes will get a pass to cross through the LAX airspace, basically following the freeway. Skyfox, we don't have those type of blessings. We're going to have to actually veer way off. So it's going to be one of those long shots. We're going to keep an eye on it best we can. That all being said, he has a lot of choices, or the suspect has a lot of choices up here. You got the northbound 110 freeway coming up, so perhaps we'll take that freeway going north. But again, the pursuit continuing out here. Carson is the area that we're at. We're going to be on the northbound 405 freeway, coming up onto the 110 right now. California Highway Patrol, they're chasing this vehicle all the way from Morongo for some sort of license plate registration issues on this vehicle. They stayed with it for a long time. We've kept an eye on it. We got information. The car is registered out of Wilmington. We thought that's where they were going. We were in Wilmington. We drove around Wilmington. And then, Marla, you getting the information from our awesome desk people, there might be children inside this car. I didn't hear that, but You know, this is just adds to all the tension. You're just wondering, what is this person doing? The speeds, they're just a little faster than freeway. It does seem like he's kind of leaning over to, well, he's staying in the center. So we'll keep an eye on it, see if he takes the 110. That's going to be the next big decision out here. Of course, there's plenty of off-ramps, but looks like northbound 405 is the general direction. And, you know, we'll see. Maybe he might even do the south of 110. Will it take us back into that San Pedro area? That'll bring us right by Wilmington once again. But it looks like right now, I'm putting money on it, we're going to be staying northbound 405.
Okay, so here we are, northbound 405. For our Fox 11 viewers who may be just joining us, let me welcome you to an early edition of the Fox 11 News at noon. I'm Marla Tejas. Bob DeCastro will be joining us soon. Stu Mandel is up in Sky Fox. We have eyes on this CHP pursuit that you heard Stu just mention. This was picked up in the Morongo area. Specifically, we were hearing CHP Morongo pick this up in Joshua Tree. So if you look at a map, that is more than 100 miles away. We've been on the air with this since about 10:50 this morning, so we are approaching 1 hour of coverage of this pursuit. And as Stu also just said, that the original want when that pursuit was initiated was simply no registration. So CHP initiated that pursuit in the Morongo area, and here we are, northbound 405. We did learn about 20 minutes ago from CHP that they do believe that 2 children are inside this silver Lincoln Navigator, which, Stu, as we keep repeating ourselves, but it's worth repeating, that this makes this pursuit even more dangerous, especially, I should say, when we're working on those surface streets and we're seeing this guy, this suspect, I should say, drive well beyond 100 miles per hour, which is what we saw multiple times.
Well, we've watched this vehicle do some, you know, unusual stunts, but all very dangerous. And to hear that there might be children in the back of that vehicle just makes it just mind-boggling. Why would anybody take those chances alone by yourself? But now you're endangering 2 children, as we understand it. The only thing I can say about that is we don't know their ages. We're hoping that if they need to be, they're in a child seat and everything is secured inside that vehicle. Speeds right now about 80 miles an hour, northbound 405 freeway. We're going to be getting... I'm sorry, we're getting into the Torrance area right now. Okay. The speeds have really kind of just normaled out, and that's a lot of why the California Highway Patrol do the tactics that they do. They will basically just kind of back off. They won't let the driver, the suspect, see the flashing reds and blues and the black and whites right behind him, hopefully to calm that person down. In this case, it might have worked, it might not have worked. We'll see the vehicle slow down and speed up. You just got to wonder, though, this truck probably has got to have had at least a full tank of gas when this whole thing started. Right. We're continuing now northbound on the 405 freeway. Our concern up here in Sky Fox, not that it's the viewers' concern by any means, but is that we're getting very, very close to LAX. Fulvio, our pilot's going to have to do some coordination. They're going to make us basically climb to about 2,000 feet and then cross over LAX, which is at the center. Right. So we're going to be quite a distance away. Vinny will not lose it, I can guarantee it, and we'll keep an eye on this pursuit as it moves along. Hopefully he does not take an off-ramp. Now, as far as law enforcement helicopters goes, the California Highway Patrol, and I don't know if the Sheriff's Department has stayed with it, but as far as they're concerned, they might get a pass depending on traffic, meaning the other aircraft that are landing right now, the commercial jets, or they might actually have to do it with us. It's that type of deal. Right now, he's really hanging on to that right side, so I'm wondering if he's thinking about getting off the freeway right here. Looks like Artesia Boulevard is the next off-ramp, but if he does, or she does, that street seems to be a little bit busier today, so it's going to make for an interesting chase for sure.
All right. Well,
no Artesia.
Okay, so sticking with the northbound 405 in the Torrance area. So we are getting closer to the LAX area, and that's what Stu was just mentioning, that our helicopter will have to maneuver around the coveted airspace there. Of course, we will continue to watch this police following. So if you are looking at your television screen right now, we are labeling this a police following, officially not a pursuit. That means that law enforcement has decided to back off simply because it was just getting too dangerous, especially knowing that there could be 2 children inside this wanted Lincoln Navigator. So that is why it is being called a police following. That doesn't mean that they just went home. CHP just went back and they forgot about the suspect. Not at all. They are absolutely, CHP continues to monitor, and there's actually a black and white ahead. That's interesting. The CHP continues to monitor this suspect, and when they decide that it is safe to re-engage, they will, to bring this to an end as quickly and safely as possible. And Stu, obviously, we're seeing an exit here from the 405.
Yeah, we're getting off here just inside of Lawndale. I've got some cousins in Lawndale. We're getting off here at Inglewood Boulevard. They actually stopped for the stoplight, which is just such a relief. Maybe this driver is starting to at least calm down, as it would be, maybe thinking like, okay, maybe law enforcement is not right behind us right now, waiting for the light right there. I know Bobby's joining us. I kind of want to take, I like a new fresh take on it, Marla. It's awesome, the information you came up with, but Bobby's there. I'm just kind of wondering, what is your take just watching this before you got here?
Yeah, just joining your coverage here, Stu. Thank you very much. Marla's going to be joining me here in the studio here shortly. Going on now for over an hour. If you think about this, it started in the Joshua Tree area. That amazes me that this is a pursuit that started so far away from here, a great distance, over a 2-hour drive to Joshua Tree just to get there. So police have been on this for quite some time. And the other thing that really gets me here is the fact that there could be 2 children inside this SUV. That is the most important part of this, of course, because you really are concerned about the safety of what could be children inside a vehicle, especially if that vehicle is traveling at great speeds, over 100 miles per hour through these freeways, and also going through these surface streets and breaking all of these rules. Makes you wonder why the CHP or officers might want to take a little bit of a step back to allow this driver to perhaps go to where the driver may want to go and then engage the driver when it's safer to do so. But obviously, the biggest concern in all of this is going to be, Stu, for those the possibility that there could be 2 children inside this vehicle.
Sorry, Bobby, we're working right now. I'm not sure if that is the actual vehicle right there. I'm just kind of wondering that we saw this, we saw it make its way in and out of there. I don't remember that full roof rack like that, but it does appear to be the same vehicle. I'm not 100% on that at all. Looks like I'm going to wait and see if we get some information on the scanner, if they're calling it back on the northbound 405 freeway. If they did, then that is the vehicle. If they didn't, he's still on Inglewood. Looked like they made a left turn right there, but we're going to keep an eye on this one for sure. Yeah, that's definitely the vehicle.
I know what it's like up there. Bobby. I know what it's like up there, Stu. You're looking at these little pieces. It's almost like watching one of those shell games with the ball underneath the coconut and trying to figure out which one and where it went, and you're keeping your eye closely on that. I know we have these cameras where we can go up close and see these the vehicles, but obviously, if they go under underpasses and the like, then it's really difficult to really keep an eye on them. So good job to the crew there on board Skyfox there to keep an eye on this car. We've been saying that this is now a following just because we don't see that many black and whites in really close proximity to this vehicle. Looks like we're losing some of the video here, but are you still with us, Stu? Do you see the airships in the air? I mean, is CHP or LAPD or any of the other agencies there following this vehicle like we are?
The helicopters are still there. They're definitely California Highway Patrol. Their helicopters still above, keeping an eye on where this vehicle is, and relaying that information back and forth. You're right. There are absolutely no black and whites behind this vehicle. When we say black and whites, we're talking about the police cars. There are no police cars behind this vehicle right now, so there's no lights and sirens. There is no reason for that driver to drive excessively fast, and that is one of the reasons why they use that tactic. They basically say, hey, we're going to back off, and so that driver will feel a little bit more relaxed, might not have that sense of urgency, might not have that panicked adrenaline rush like I'm being chased. and will basically calm down. That tactic has worked in the past. We've seen it work in the past. In this case right now, this is the first time, Bobby, you know what, maybe it's your energy, maybe it's your aura, because this is the first time we've actually seen this vehicle really drive less than the speed limit out here in any situation. So right now, northbound 405 freeway, just about 60 miles an hour. Basically, just as soon as I said that, you can see that vehicle really starting to pick up some speed again. The kids in the back, the kids not in the back, that really just adds to the confusion of the situation. And if there actually are, it just makes you wonder what that driver could possibly be thinking. You know, I always really have an issue, not an issue, but it makes it more difficult to call a pursuit like this or even tell a story when you don't have a fact and we just have a maybe there's kids in the back.
Yeah.
So oddly, go ahead, Bobby.
Oddly, I think that as we've been covering these pursuits over the past several years, Stu, and I know you've covered many more than anyone else has, but because we've been covering these pursuits and people have seen these on TV, the behavior of many of these drivers during these pursuits has changed dramatically. So you almost have these drivers who all of a sudden find themselves in a situation where they're in a pursuit and they know that there's a helicopter above them. They know that they're being followed. We've seen drivers and sometimes passengers in these pursuits behave very erratically, even motioning to the helicopters, motioning to the officers that might follow them. So they are keenly aware that they are being followed by officers. And in this case, you see still more erratic driving here. Perhaps this is a driver that hears the helicopters from overhead. So even though there might not be police units following directly behind this vehicle, the driver still knows and hears the helicopters above.
South 110. Bobby, sorry about that. We're just making a turn now. We're going to be southbound 110 freeway. That was that quick reaction that car made right there, basically just kind of going across the gore point. And now we are going to be southbound on the 110 freeway, taking us back towards Wilmington. And that's the general area where they said that vehicle is registered to. Clearly, we don't have an actual address or anything like that, but we did see the truck driving through the Wilmington area, through the industrial part of it at least. And basically, really, we saw it. That driver did not know where they were going, basically put himself into a dead end and then had to back up. Now, as far as law enforcement and following and all that, right now I can tell you that this person is basically just running from themselves. Do they know the helicopter's following them? Well, I've been asked that a bunch of times in the past, and my answer is always, if you're driving along on the freeway, how many times have you said, oh, I can hear a helicopter? and that's the same thing. You just don't. So unless this driver is actually physically looking out the window, looking at this car, no sunroof, he might not, or she might not really even know that there's any law enforcement at all following them. In this case, though, the way the world is today, if that person has a phone, which I would guess they do, somebody somewhere is saying, hey, Skyfox is following you. And so that might be going on. But other than that, hopefully if that communication, the way I look at it is if that communication is taking place, hopefully there's some logic being thrown in there as well. Like, hey, you know what? You got kids in the back seat. What are you doing? Just pull over. Think about the children. Think about yourself. You just bring this to an end. Who knows? Who knows? That's what we never really do know. All we know is that we're going to follow this till this car stops, and then we'll see what happens after that. Hopefully it won't stop in any kind of violent way, and hopefully that if there are children in the back seat of that vehicle, it just pulls over. And really, my hope is that there aren't any children in there. That it would just, because you just got to think, what is this driver doing, and why take all these chances over a registration? Clearly might have been in the Morongo area. Maybe this is a gambler. Who knows? And it basically is just gambling right now, thinking, you know what? There's always this odds I might get away, even though we've watched, we've seen it. It is very, very unlikely that this driver is going to escape.
A gambler with kids in the car. I mean, but who knows? It's obviously somebody that's despondent in some way, and it's certainly going to change the actions of officers here in terms of they're not going to use a spike strip. They're not going to do any sort of a pit maneuver in a vehicle when they think that there might be children inside. So the best thing in this scenario is to just take a step back and see when this driver finally stops or just runs out of gas.
Runs out of gas, those are usually, unless it turns into some kind of long, drawn-out standoff, runs out of gas are usually some of the best ones, because then nobody gets hurt. That vehicle just gives up before the driver does, and that's usually, we've seen that happen many times in the past. Looks like we're starting to get over again. Looks like we're going to be getting back off the freeway, and oddly enough, we're back in the Wilmington area, and so maybe this vehicle going to make its way over to an area that the driver knows, perhaps even home. But right now we're getting off the freeway. Looks like it's going to be the Pacific Coast Highway, which is also, I think, no, it's not Sepulveda out here, but getting off at Pacific Coast Highway off the 110 freeway, making that turn, heading, that's going to be eastbound, bringing us back into the Wilmington area. So we're going to keep an eye on it, and we'll see. Maybe LAPD is going to get behind it. Maybe. Or maybe this person's just going to stop underneath the bridge there. Or not. There they are. There we go, Bobby. So we're rolling back out onto California Highway Patrol. I see on the PCH, and it looks like we're just going to be... Or is this... Nope. No, I was wondering, thinking we're getting back onto the freeway, but we are not. So maybe this is the area where it's registered to, because this is very residential out here.
Marlo's back with our coverage here, Stu, just to let you know, but we're still following this. Police following is what we're calling it, because police have taken a little bit of a step back because there is belief that there could be two children in this car. It's a pursuit that's gone on for quite some time, a pursuit that started in the Joshua Tree area by the Morongo CHP and then made its way into the Pico Rivera area, then here in the Wilmington, Long Beach, San Pedro area, and now a pursuit that's been on several different freeways all across Southern California, and now on the surface streets here. You could see they're in this neighborhood now.
Now, Stu, I'm just noting the time, and it was about 1 hour ago that we went on the air with this. So now officially we have been covering this on the air for more than an hour, just over an hour, as we approach the 12 o'clock noontime, the official. So yeah, Bob just mentioned this started in Joshua Tree, so certainly this has been going on for well over an hour if we've had it on the air for that long.
Well, definitely well over an hour, so that driver might, might even be starting to get a little fatigued. Driving at those high speeds, a lot of adrenaline, being stressed out, so maybe this is one of the reasons why we're seeing this much slower driving. Also, it does seem like there's some people on the side of the road down there talking, maybe trying to get the driver's attention. There's somebody running across the street. Yeah, we're going to take a look and see if this person gets in or gets those kids out. There we go.
Okay, the doors are opening.
There we go. Oh, they're like teenagers.
Oh.
Are you kidding me? There we go. There's some law enforcement. Go a little wider. Go a little wider. Go a little. There you go.
She's
and that's kind of what I was saying the entire time. As soon as that vehicle comes to a stop, those cars that are not there will suddenly appear, and there they are. That vehicle is basically blocked right now. It looks like some family members came and got kids. These are babies.
Oh,
what is this person doing?
Seat being taken out of the vehicle.
Unbelievable. But now it's a little bit different. Now and this is the thing. There we go. This guy trying to still trying to get away from law enforcement. There we go. That's a genuine person right there. Trying to make a run there, just running along, and we're gonna. My money's on the officer that just threw whatever he threw away. Oh! That's what I get for putting my money on the officer. There we go. Keeps going. I can tell you that there's more law enforcement in cars close by, and Vinny's doing a fantastic job keeping an eye on this guy. He probably should have taken the stairs, but you can just see keeping it going there. 8 miles an hour, 9 miles an hour, making his way into the alleyway. And we'll see where the law enforcement is here in just
we
a
see
moment.
a lot of these cases that in these foot pursuits that if the person ends up just running out of steam themselves and running out of gas and.
Yep, he's up on the stairs. He's up on the stairs.
Up on the stairs.
Nope. No, he's right there. He's coming back the other way. Maybe he's going to go see if that officer's okay. That would be really nice if he did something like that.
It's only a matter of time.
Here he goes. There we go.
I don't think he's going to get
These officers are going. Boom!
Wow.
There we go. Took him. Right there. Oh, and they brought the dog. So anyway, there we go. It's all coming to an end off of Denny Street out here in the Wilmington area. I still can't tell you. All we know is that suspect is in custody. We did see the small children being taken out of the back of that SUV, which just mind-boggling, just mind-boggling.
We're going to have to,
of course,
we're going to have to look back at that video because yes, there were certainly, we had heard reports that there were children in the car. There was a small child that I believe came out of that car. At least someone was holding a small child. Right. They took a carrier, a car seat out of the car
carrier
as well. But we have to see how many kids were actually in there. And no doubt, as you said, that this was registered in the Wilmington area. This person had likely been on the phone with someone that they knew, came to that area. We saw them make a U-turn on that street in Wilmington. The people came out and grabbed the children from the car. The driver gets out and did not want to stop and just did not want to give up and started running. But the good thing is that he did let the family members or relatives or whoever take the kids out of the car before the officers closed in.
You know, I just want to add this one little thing in there because we're going to be wrapping this up, I'm sure. I'm just hoping that that officer, I mean, he was running at a pretty good clip, and he did get caught on something on that tree, and it basically looked like he broke that small tree. So that was a hard fall. So my concern is that that officer is not badly injured. Right there, those are family members that are giving law enforcement a hard time about taking this person into custody. And, you know, it makes you wonder, did they not see this pursuit 100 miles an hour with your children in the back seat of that vehicle? It is just, these type of situations are usually the toughest for law enforcement, and to have the family members right there trying to get to their family member that's going into custody. This is always very volatile, and you got to think too, these law enforcement guys, they're amped up also. They're full of adrenaline. They just were running. That one officer took a hard tumble, and they had to take this person into custody and now control the situation. Very difficult for them indeed, and that one family member just continuing to be defiant and trying to get closer to that to the suspect, who's probably somehow related to that person.
All right, so here we are, the conclusion of this more than hour-long pursuit on a surface street in Wilmington. This all started as Benny Mack pans over to see the vehicle, the Navigator that was involved. There it is, and police officers there on scene going through just to clear it, make sure it's code 4, as they say. This all started in the Joshua Tree area and coming to a conclusion here with no real injuries, thank goodness. To anybody. We hope that that police officer is okay, but coming to an end here on the service street in Wilmington, Stu.
Oh, I'm sorry about that. I'm not sure if we're supposed to do that right now, but I know the noon hour is coming up, and Fox at noon is going to be starting, and we're going to start talking about this pursuit we just saw just now.
Yeah, we're going to start that in just a bit. This is Fox 11 News at noon. We're going to restart here just in a little bit. We want to let you know exactly what's happening here. A breaking news story that we've been following for over an hour now. A police pursuit that started in the Joshua Tree area that started as a pursuit and then ended up being a following.
And we welcome you officially again to the Fox 11 News at noon. I'm Marla Tejas alongside Bob DeCastro in the Fox 11 studio, and Stu Mundell is up in Sky Fox covering the end of this police following.
Well, Marla, Bobby, you know, it was a following. It was definitely a pursuit at some times as well, but it was very reckless, and there were 2 small children in the back of that vehicle, and that driver taking large risks, 100 miles an hour at some point, changing lanes erratically, hard turns back and forth, running red lights, getting extremely close to some very big rigs as he made his way through the Wilmington area. Now, California Highway Patrol, along with other law enforcement agencies, doing an amazing job, basically, you know, basically making those decisions. Do we chase him? Do we back off? When do we show up? When do we give this person room? There's some video from earlier on. This was the chase itself. It was mostly on the freeways. We have to be clear about that. Most of the time it was on the freeway. Started in the Morongo area and then made its way out here in the Los Angeles area. On the freeway, off the freeway, no matter what, this person driving very, very reckless, and then somewhere along the line, our assignment desk telling us there's kids in the back seat. We couldn't confirm it because of the tinted windows, but in the end, there clearly were children inside that car, which made it so dangerous, and you have to wonder what that suspect was thinking. In the end, the vehicle made a U-turn, family members collecting the children out of the back, and then law enforcement engaging in a foot pursuit. One of those officers taking a hard tumble trying to take that suspect down. In the end, though, other officers made their way over to him and got him into cuffs. There you go. There he is live right now. This is on Denny, near the cross of Wilmington, in the Wilmington area. One suspect in custody, nobody hurt. Thank God. And we got to make sure that that officer didn't get hurt when he took that hard tumble, but nobody seriously hurt, at least. And right now, one suspect in custody. Those kids are safe, but what a ride this afternoon for sure.
It looks like family members are very upset right now, and officers trying to keep them a distance while they handcuff and arrest this suspect and take that person into custody, but really fortunate that they were able to get the intelligence that there could have been 2 children inside that car, because it really could have changed the actions of officers as they were pursuing this vehicle. There were no pit maneuvers. There were no attempts really at a spike strip, all that which could have endangered these children even further. And also, as they took a step back and changed this from a pursuit where there were no vehicles following that person, they took a step back and allowed the person to drive and perhaps changed the person's demeanor and the way that the person was driving so that the person wouldn't drive as dangerously or as erratically as it would have had there been police vehicles right on his tail. But an arrest here by police officers after it all comes to an end and a stop in the Wilmington area. The driver stopping, the doors opening, family members or friends or someone taking children, little ones out of the vehicle, and then the person foot bailing and finally gets arrested by officers. So quite a scene there.
And quite a scene seeing that car seat being taken out of the SUV as well. Okay, so we're letting Stu continue to keep an eye on that. Of course, we will have an update for you as necessary during this Fox 11 News at noon, and then also tonight on the Fox 11 News at 5. In the meantime,
all right, we are going to switch out of that and take you out to some other breaking news here on News Now from Fox. We are following a big rig crash coming out of Texas. It looks like Fort Worth, Texas out there. Not a lot of information coming in quite yet, but these aerials are from our sister station, KDFW. Lots of breaking news happening on this Wednesday morning. Not sure about any injuries in this specific situation. Looks like there's big rig turned over on its side, that crane still upright. Some debris on the side of the road right there. We were just watching live coverage from our sister station, KTTV, on that police pursuit. An arrest now has been made out there in Los Angeles. But again, right here, a big rig crash in Fort Worth, Texas. Not a lot of details yet on the specifics of this situation. We'll continue to monitor that. Again, you're watching News Now from Fox. We appreciate you tuning in on this morning. We're going to be bringing you all of today's live events, including any breaking news that happens. We're monitoring all of our live feeds constantly, but I am going to send some of you off to a quick commercial break. We'll see you in 2 minutes. For those of you who are going to be sticking around with us, we're going to go out to Orange County, Florida. Today is Veterans Day, and everyone is honoring the holiday in their own way. In Florida, they are holding a press conference out there. This was just this morning, so we'll listen into that.
Veterans Advisory Council. In light of COVID-19, and while we continue to practice social distancing, we ask that you stay masked while we commemorate this meaningful ceremony. We come together today to honor and remember the courage, dedication, and sacrifice of women and men, living or dead, who loved their country so much that they're willing to give their life for it. Veterans Day, formerly known as Armistice Day, was originally set as a U.S. legal holiday to honor the end of World War I, which officially took place on November the 11th, 1918. In 1954, after being through World War II and the Korean War, the 83rd U.S. Congress, at the urging of the Veterans Service Organization, amended the Act of 1938 by striking out the word armistice and inserting the word veterans. With the approval of this legislation, on 1 June 1954, November 11th became a day to honor Americans, veterans for all wars. For over 245 years, we have called upon the people of America time and time again to defend the blessings of an American democracy. Although the enemies of freedom have often risen from distant shores, the vigilant women and men who wore our nation's uniform have made freedom's fight their own. From Europe to the Pacific, from Korea to Vietnam, from the Persian Gulf to Bosnia, Kosovo, Afghanistan, and Iraq, these Americans, like my sister, Sergeant Michelle Espute, and 10 Mountaineer Specialist Joe Eason, who responded to the call of duty in defending this great nation and all it represents. We salute the U.S. military and the millions of women and men who have served throughout history. Now, please join me as we rise for the presentation of colors by the Orange County Corrections Department and the Fire Rescue Honor Guard, and remain standing for the Pledge of Allegiance, which will be led by Tech Sergeant Nadia Ferguson, U.S. Air Force veteran and Orange County Veteran Service officer, followed by the national anthem, which will be sung by Captain Maxine Reyes, U.S. Air Force veteran and United States Army retired, and lastly, the invocation by the Mayor's Veterans Advisory Council chaplain, Ms. Paulette Julian, U.S. Navy veteran.
Please join me. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Oh, say, can you see by the dawn's early light what so proudly we hailed at the twilight's last gleaming, whose broad stripes and bright stars through the perilous fight o'er the ramparts we watched were so gallantly streaming, and the rocket's red glare, the bombs bursting in air, gave proof through the night that our flag was still there. Oh, say, does that star-spangled banner yet wave o'er the land of the free and the
Let us pray. Dear Heavenly Father, we just thank you, God, for this day, a day that we've never seen before. We come today lifting up the veterans, active, retired, and all of those who have served this great nation. We come to honor them, and we just thank you for this opportunity. Thank you for them that thought it not robbery to give and serve our country, and even still serve at home. We ask you to watch over the service, the ceremony today, and that you just be honored and glorified in it. We lift up our mayors of this great county, of the city, and this great nation. We also lift up the leadership. We thank you and we praise you, and we ask all these blessings in your son's matchless name we pray. Amen.
Forward. Up.
Please be seated, everyone. Thank you, Orange County Corrections Department and the Fire Rescue Honor Guard, which included members Engineer Jorge Hernandez Jr., Engineer Jose Bruno, Firefighter Hermie Quinto, Corporal Eric Armstrong, Master Corrections Officer Chambers, Master Correction Officer Charles Davis, and also thank you, Tech Sergeant Ferguson and Captain Reyes and Chaplain Julian. Again, welcome everyone. We have some special guests joining us today, and I would like to acknowledge them. Please stand or wave as your name is being called. District 4 Commissioner Maribel Gomez Cordell, District 5 Commissioner Emily Bonilla, District 6 Commissioner Victoria P. Siplin. On behalf of District 1 Commissioner Betsy Vanderlei is Diana Deathlefs. And Orlando VA Medical Center Director and CEO Timothy Cook. If there's any other elected officials and or dignitary present, please stand to be recognized. Thank you all so much for being here today. Now I am honored to introduce the Mayor of Orange County, Mayor Jerry L. Demings. Mayor Demings is a native of Orlando. He received his Bachelor of Science degree in Finance from Florida State University and his Master's of Business Administration degree from Orlando College, now Everest University. He served as Orlando's first African-American police chief and first African-American Orange County Director of Public Safety. In 2008, he was elected as the first African-American sheriff and constitutional officer in the history of Orange County and was reelected in 2012 and 2016. On August 28, 2018, Mayor Demings was elected the first African-American mayor of Orange County and was sworn in as mayor in December 4th, 2018. He is the chief executive over 8,000 county employees with a budget of over $4 billion. We appreciate his continuous support of our active duty service members, veterans, and their families. Sir, thank you for being here. The podium is yours.
Good morning to all of you. Thank you for being here. Thank you, Dee, for that wonderful introduction. Welcome to the Orange County's Veterans Day flag-raising ceremony honoring our veterans. I want to thank the Orange County Veterans Advisory Council Chair, Ms. Dayla D. Dispute-Jones, and by the way, she is being inducted into the Veterans Hall of Fame, I believe, this afternoon. So, congratulations. Also, let me recognize Fred Robinson, who is her backup, really, with our Veterans Advisory Council. We appreciate their dedicated service to the veterans here within Orange County. And also, special thanks to the council members who are able to join us here today. Give all of them a round of applause, please, if you will stand. It is an important day for Orange County residents to come together in honor of our veterans who have served or continue to serve in the United States Armed Forces to safeguard our country. No matter what branch, rank, or duty assignment, it is because of your service that we celebrate our freedom. Your service to our country and fellow residents is something we all hold dear and we will never take for granted. There are almost 72,000 veterans in Orange County, but only 18,000 are getting benefits that they deserve. We are trying to work to change that. Unfortunately, many veterans do not know that they are eligible for benefits, and still more are unaware that our county has an office that stands ready to help them. Since 1945, the Orange County Veterans Service Office has been dedicated to helping veterans and their families with their VA benefits. The office is led by U.S. Army retired Command Sergeant Major Tommy Maldonado, along with a caring and committed staff. I'm proud to say that over 700 Orange County employees are either veterans or active military personnel. It was once said by Arthur Ashe, true heroism is remarkably sober, very undramatic. It is not the urge to surpass all others at whatever cost, but the urge to serve others at whatever cost. On behalf of Orange County government, the Board of County Commissioners, and the nearly 1.4 million people that call Orange County home, we are grateful for the service of our veterans. Thank you for your service to our great nation. I would like to present the following resolution in honor of these brave men and women of our armed forces. The resolution reads, whereas on the 11th hour of the 11th day of the 11th month of 1918, the major hostilities of World War I were formally ended with the signing of the armistice by the Allies and Germany. And whereas an act approved by Congress on May 13, 1938, designated the 11th of November each year as a legal holiday, a day to be dedicated to the cause of world peace and to be thereafter celebrated and known as Armistice Day. And whereas after World War II, the 83rd Congress, at the urging of veteran service organizations, amended the Act of 1938 by designating the holiday Veterans Day. And whereas the Congressional Act established a national holiday intended to thank living veterans for their service, acknowledge their contributions to their country, and underscore the fact that all who serve have sacrificed and fulfilled their duty. And whereas the brave members of the United States Armed Forces have answered the call to serve our nation, ready to sacrifice life and health in their country's name, accepting ever greater responsibilities, living up to the highest standards of duty and honor, and serving as an inspiration to all citizens for generations to come. And whereas it is fitting that on Wednesday, November the 11th, 2020, Orange County residents should join together in honor of our veterans. Now, therefore, I, Jerry L. Demings, by virtue of the authority vested in me as Orange County Mayor, do hereby proclaim November the 11th, 2020 as Veterans Day in Orange County. At this time, let me call upon the Orange County Mayor's Veterans Advisory Council Chair, Ms. Dayla D. Espute-Jones, to accept this resolution. this time, I'm going to turn it back over to Dee for the remainder of the program. Thank you for being here.
Mayor Demings, thank you, sir, for your kind remarks, leadership, and your support for our veterans. We truly, truly appreciate you. At this time, I would like to introduce our keynote speaker, Major Alexis Carter. Major Carter is a product of Central Florida, graduating from Seminole County Public Schools, University of Central Florida, and Florida A&M University College of Law. Major Carter began his legal career as an assistant public defender for the 9th Judicial Circuit of Florida, providing criminal defense representation to over 500 clients throughout the Orlando area. In 2010, Major Carter joined active duty service as a commissioned officer in the U.S. Army JAG Advocate General's Corps. In 2017, he returned home to Central Florida to open a criminal and civil law firm. Major Carter continues to demonstrate his commitment to the nation while serving in the rank of major in the U.S. Army Reserves as the Deputy Command JAG Advocate for the 641st Regional Support Group, a subordinate command of the 143rd Sustainment Command Expeditionary. Additionally, Major Carter is an adjunct law professor at the Florida A&M University College of Law, where he teaches trial advocacy to the next generation of future attorneys. Throughout his entire career, Major Carter has demonstrated a balanced commitment to this country and his local community. Sir, welcome. The podium is yours.
Good morning, everyone. You guys seem so solemn. Yeah, it's a great day. Oh, awesome. Indeed, thank you for the introduction. Distinguished guests, thank you for attending. Mayor Demings, thank you for having me in your home. I appreciate it, the love and the welcome. You know, this time of COVID has separated us a lot, but it's great to see a lot of familiar faces here today and a lot of new faces here today. Before I begin, I'd just like to know my audience and who's in the room. So if I call your branch, go ahead and sound off. Any sailors? Airmen? Coast Guardsmen? Marines? Last but not least, soldiers, where you at? And I doubt we have any folks in the Space Force, right? Not yet, not yet. Maybe in another 10, 20 years. We're gathered here today, as Dee said and as Mayor Demings said, at the 11th hour, on the 11th day, and the 11th month. You know, that day, originally called Armistice Day, was the day where we experienced a cessation of hostilities ending the Great War, World War I. Now, a lot of people don't realize this, but the Great War was supposed to be the war to end all wars. And as you know, we've continued to be at war throughout various periods of our nation's history. Today also marks the 75th anniversary of World War II. That was the war and conflict that gave rise to what America has called our greatest generation. They suffered through and worked through and persevered through a Great Depression, and they are the foundation in which many of our values as Americans stem from. Patriotism, hard work, character, morals, standards, conviction, discipline, and selfless service. Now, I'll be remiss if I did not take the opportunity today to talk to you guys about the epitome and example of the warrior's unwavering spirit. That example is from right here in our own backyard. He was born on July 13th, 1970 in Sanford, Florida, and grew up in Oviedo, graduating from Oviedo High School. He came from moderate means, but according to his family, he was surrounded with an abundance of love. After graduating from Oviedo High School, he immediately joined the Army, and according to his sister, took to it like fish out of water, or fish in the water. He bled Army green through and through. The Army matured him, turned that boy into a man, and turned that civilian into a soldier, rising to the rank of Sergeant First Class. I'm talking to you today about Sergeant First Class Alwyn Cash. Now, Alwyn Cash deployed with the 3rd Infantry Division in 2005. His unit was in a Providence just north of Iraq, and his Bradley fighting vehicle, along with his troops, rolled over an IED, causing an explosion. Now, Sergeant First Class Cash immediately survived that explosion. However, he was doused in fuel and noticed that his comrades were trapped inside a burning vehicle. Without any respect or second thought about his own security and personal safety, he went back in repeatedly reaching into that burning Bradley and rescuing his comrades. Just imagine and think about the immense pain he must have been in as his own body started to be engulfed in flames because of the gas fuel. That didn't stop him. He continued to pull his comrades all out of that Bradley until every last one was pulled to safety. Not only that, he refused to be medevaced out of the area until all of his soldiers were medevaced before him. Now, he was burned on over 70% of his body. He was flown out to San Antonio, Texas, where he received treatment for his burns. But unfortunately, he succumbed to those burns and died. Now, initially, Sergeant First Class Cash was recommended and posthumously awarded the Silver Star, our nation's 3rd highest award for valor in combat. Over the years, the veteran community and elected officials led the charge to get Sergeant First Class Cash's award upgraded. And finally, just yesterday, Congress approved the legislation allowing the President to posthumously award Sergeant First Class Cash the Medal of Honor, which is our nation's highest recognition for service. Of the 23 recipients since September 11, 2001, during our war on global terrorism, Sergeant First Class Cash will be the first African-American service member to receive this honor for his service in combat. Now, we can honor Sergeant First Class Cash in many ways by bestowing him and his family with the recognition that he deserves. We can erect monuments in his name. We can do various things. But his unwavering spirit lives in all of you veterans. We talked about the Great War being the war to end all wars. And it doesn't take a historian to know that we've continued to have many since then. And a lot of us, after serving, find ourselves in the position, what's next? Your community needs you. Your family needs you. Your neighbors need you. We're facing some unprecedented times where it's going to take the leadership, the dedication, the discipline for those of us that have worn the uniform to lean forward and to be the model of what it means to be an American, to be a Floridian, to be an Orange County resident. It's going to take time, effort, and dedication, but I'm confident that you all can be at the forefront and embody those characters and those items of leadership that have been bestowed on all of you, regardless of your branch of service. No matter where or when you serve, today is about you. But it's also about what continued service can you bring to your communities. I challenge you all to walk out of this building knowing that the mission is not complete. The mission continues to lean forward and persevere. Obviously, take care of yourselves, take care of your family, but also think about others around you because your community needs it. And I'll just leave you with one last word, one last phrase, that's mission forward. That's the mantra I live by. Like Dee said, I returned home about 3 years ago and kind of found myself in a what now position. Thankfully, I was able to continue my service in the Army Reserves, but I missed being with my brothers and sisters. And I'm thankful for the Orange County Mayor's Advisory Council and other groups that have given me an opportunity to be involved. So I encourage you all, if you're not involved, get involved. And even at the smallest level, whether you're a soccer coach or a mentor or a teacher, you can impact your sphere of influence for the better. Mission forward. Thank you.
Major Carter, on behalf of the mayor and his Veterans Advisory Council, we thank you for your dedication and continued service to this great nation and our community. At this time, we will ask the mayor to take the podium for his veterans presentation. Would all veterans please stand?
To the men and women who have sacrificed, served, and continue to serve the United States Armed Forces, we all say thank you. Your unwavering commitment and dedication to defending this great nation will never be taken for granted. Again, on behalf of the 1.4 million people that call Orange County home, we are honored and grateful to your distinguished service. Thank you. And I'm proud to be your mayor, and I salute all of you. There is a card that we are presenting to all of our veterans here today, and that card has a lapel pin of the United States flag that we are presenting to each of you. Because of social distancing and other concerns, I would love to put it in your hand directly like we have done in the past. But we are presenting those to you on behalf of our Board of County Commission today. May God bless all of you. May God bless these great United States of America.
Thank you, veterans, for your service. Please be seated, everyone. And again, like the mayor said, because of social distancing, as you exit, you may retrieve your card at the end of the ceremony. I will now call upon our council chaplain, Ms. Paulette Julian, to render the benediction.
Let us pray again. Dear Lord, it's been a great day here in Orange County. We just thank you for Major Carter. We thank you for our great mayor. And we thank you for these mighty warriors, these veterans that's here, that's celebrating, that we're honoring today. But we pray for traveling grace and mercy as we leave this place and ask you to stir up the gift that's on the inside of us to continue to serve. We just ask all these blessings in your Son, Jesus' precious name we pray. Amen.
Our ceremony today would not be possible without the dedicated efforts of the mayor, the mayor's Veterans Advisory Council, the mayor's executive staff, and the county Communications Division. Thank you so much for your assistance and dedication to the veterans community and the Orange County on a whole. Great work, team. We would also like to thank the fire department veterans bus that is supposed to be, or not the bus, but the vehicle that's supposed to be outside. Can someone confirm that it is outside?
It is. It's on the side.
Okay. Would love for you to go and visit and take a look at it. Would also like to thank Mission Barbecue for providing lunch today. Thank you so much for your support to the veterans in our community. On behalf of the mayor and his Veterans Advisory Council, we would like to thank all of you for coming today. Please continue to remember those that have served and still serving. God bless you, and God bless America. Thank you all for coming.
You're watching News Now from Fox. It is Veterans Day, and that's pretty much what our coverage has been this morning. I'm Daytona Everett. Thank you so much for joining us. We are going to continue honoring all those veterans out there. We have some segments from our sister stations around the country. WTTG actually is honoring female veterans out there with a Women in Military panel. So we're going to play that out for you here on News Now from Fox. Again, it is Veterans Day. Thank you to all of the veterans out there. We appreciate you so much.
Chief Deputy Donna Lazinski is also
played a key role in the military, and this morning we have a panel of women veterans. They're joining me to share their stories. So with that, we welcome Army veterans Miranda Jones and Robin Johnson, and retired Marine activist and author T. Hannibal. Good morning to all of you ladies. It goes without saying that I say thank you for your service. It's such an understatement for all that you have given to our country. So please know we're honoring you today and are extremely grateful. I want to start with you answering why you guys chose the path of the military. Miranda, you go first.
I was seeking direction and structure, and I thought that while I was searching for myself, I could also give back to our great country and be surrounded by wonderful people, learn a skill, and go on one heck of an adventure.
I'm sure. Robin, what about you?
My grandmother served in the WAC in the Army, and I felt like I wanted to continue that legacy, and now to be part of the 3 million women that have served. I guess I just wanted to break some glass ceilings.
T, what about you?
Well, I'm from the south side of Chicago, so I was a troubled kid, and I definitely needed some direction. So the Marine Corps was where I set my sights on.
For all of you, I'm sure in your life post-military now, there is one lesson that you learned while in that really serves you on a daily basis. What would that be for you, Miranda?
Character is important, and when somebody shows you what their character is, believe them.
Robin?
Well, I would say that being part of something bigger than yourself is so important, and that you should live your life in a manner that honors the men and women who have given you the rights and the freedom that you have.
T?
Always dig deep and find that warrior inside of you, no matter what the naysayers say, no matter what the competition looks like. Make your own route in this world.
I'm guessing that all of you would say you would do it all over again. You would make that same choice. What would you say to a young person, or even someone older that's maybe thinking this is what they should choose, the path that they should choose? Miranda?
If you feel it's a path for you, why not embark on that great adventure? Why say no to it?
Robin?
I would say whatever you choose to do, choose it and just be fierce about it. Don't look back. And then also let your other sisters in arms help you. If that's the path you choose for service, look to your left and right. There are many women that are willing and ready to help you get through it.
T?
I would say as a prior military recruiter, definitely look into all the branches. Don't just get wowed by that one particular branch. Look into all of them, see what jobs they have to offer, and make your world, make it yours.
T, don't think that we didn't notice that picture of you there with President Obama. I know that you were honored by him in the White House back in 2012. And happened to be on Fox's show American Grit, where you co-starred with John Cena. So clearly, you have done great things post-military. But for all you ladies, you're great in your own individual ways. What is the one thing that really means something to you when people say something to you? Is it okay, that we always have all this talk about, is it okay to just say thank you for your service? Like, what's the one thing that really resonates with you, Miranda?
When I feel the camaraderie of when veterans say that to one another, we've been where we've been, and we understand that. And I think that generationally, when you're looking at the various war veterans and how much we support one another, that's just an incredible feeling of gratitude and thanks.
Robin?
I just feel very undeserving and humbled. I feel like I represent all veterans, and it's not a compliment or something to me personally. And to be a part of that's meaningful to me, just to know that that's really for everybody that served.
T?
I would say on behalf of our veterans, we always appreciate a good I thank you for your service, because we thank you guys for your support. So continue to thank us, and we'll continue to be thankful of you guys.
You know what? Many people have expressed, it's a tough time in our country. We're very divided. But I'm guessing that you're still obviously very proud of this place that you call home. What are your thoughts as a veteran on this Veterans Day? Miranda?
We're here for one another, and we are going to continue to support one another regardless of the times. We need to rely on one another and be there for each other.
Miranda?
I would say, no matter what divides us or, what is getting in the way from unity right now, I think we all can agree that freedom has come at a cost. There's a first name, a last name, and a family behind our freedom, and that matters. And so we can all be unified and just respecting that.
T, I'll let you wrap it up.
I would say we may have different beliefs and different morals on certain things, but if we never forget that together, we're what makes this our veteran community. So no matter who you support, what you support, just never forget to support each other, your brother or your sister to your left or right. Because at the end of the day, we're the ones that's in the trenches with each other.
Well, you all are amazing role models. I hope lots of young women, older women, and everybody in between was able to hear all the messages that you put out today. So thank each of you on this Veterans Day. Women have played a key role in the military, and this morning we have a panel of...
All right, you're watching News Now from Fox. I'm Daytona Everett. That was our sister station, WTTG. That's coming out of Atlanta out there. So we appreciate them so much. We're actually going to stick with them right now, but we are going to send some of you off to a 2-minute commercial break. We'll see you then. For those of you who are going to be sticking around right now, here's a live look from the White House. Of course, President Trump spent his day honoring veterans as well at a ceremony in Arlington, Virginia. That was the first time that we had seen the president over the past 2 days. Joe Biden also showing up to a ceremony as well, and I'm sure we're going to end up playing out those events for you on this Veterans Day as well. So we told you that we had another segment for you from WTTG. Again, that's in Washington, D.C. So we apologize for that, correcting that right now. But there was a veteran-owned business that they were able to honor today on this special day for all the veterans out there. So we're going to play that story out for you here on News Now from Fox.
It's another gorgeous fall day on the courts at Lakelands Park Middle School in Gaithersburg. Carl Lee is helping to teach the game of tennis to a group of wounded warriors. Patients in the
Veteran Denise Ormsby owns the Spot on Mill Street in Occoquan, which supports local, veteran, and women-owned businesses in Prince William County. Her family's service goes back hundreds of years, in fact. A huge resume of service in her family, and Denise joins me now to share more about her story. I love that photo of you in uniform. I tweeted that out earlier this morning. I mean, service is in your DNA. Tell us about the Spot on Mill Street and if you're doing anything special today.
Of course, we're always doing something special here for our veterans. We open up with that premise in mind. I think we sent you the pictures of our heroes table. We honor all of our military, family military, first responders, doctors and nurses and stuff that's all going on with this crazy COVID. Yeah,
that's what I was going to ask you. Because, I mean, you were doing this type of giving well before the pandemic hit, and now you've also become this spot of support, especially during COVID. And then I know that on top of that, because I've seen your social media, you've also helped people collect and make service packages for military members overseas as well.
Yeah, we have been working on that. We actually are trying to work with Crown Royal because they're doing veteran packages for military members overseas. So we're putting some things together for them to send to special military members that are in places that may not otherwise get anything for the holidays.
I'd be interested in knowing, you know, I come from a family with a lot of veterans, and I remember when my sister retired, trying to find her way after the military.
I lost you a little bit.
Oh, no. Can you hear me now? You got me now?
I can hear you now.
Okay,
yes.
Great. So I just wanted to touch a little bit about life after the military. I come from a family of veterans as well, and I remember when my sister was going through that transition of trying to figure out what to do, what to follow as far as her passion was concerned, trying to make those decisions. What kind of advice would you offer to the veterans out there that are still trying to find their way?
You know what? Just keep moving forward. You'll eventually find something that you are successful at or something that you are passionate about. And that's kind of what has led me to where I am now. I've always been in some type of service for the community, or, you know, not a necessarily pay it forward type thing, but I've always done things that were important in the community and such, and working with the community. And I just happened to like bartending, and this came open. This kind of was my passion that I felt I went for.
Yeah, so tell me about the spot, because it's not just bartending, right? I'm looking at a delicious burger right now. You've been named in Northern Virginia Magazine 2020 Best of Nova when it comes to food. What else do you offer there at the spot?
You know, my husband likes to tease that we're a bar that serves, you know, breakfast, but we really are. We serve breakfast all day long. Like you said, you've posted some pictures of our food. We source locally. I work with small businesses, and a lot of them are actually veterans as well. We get our bread, our gluten-free breads from an Army veteran. We get our cupcakes and our cheesecakes and all those things from military veterans and their families. A lot of the things that we get, our popcorn is a big hit here.
I love it. That's what I was going to ask is what's the one must-have thing that you should order when you come to the Spot on Mill Street?
The Spot Burger.
The Spot Burger?
Definitely the Spot Burger.
Yeah. Oh, my gosh. And if you also want a dose of laughter, follow you on social media because you have quite the humor. I love it. Denise Ormsby, thank you so much for your service. Thanks for everything you're doing for the community. The owner of Spot on Mill Street in Occoquan. Make sure, everybody, that you stop by and say hi. Thanks so much. All right, that was our sister station, WTTG in Washington, D.C. It's about lunchtime out here, so that story is making me hungry. We are highlighting all of those veterans out there and all these veterans projects that are going on across the country as well. So we've got one more story coming from that same station right there, but this one is about Wounded Warriors tennis. That's exactly what it sounds like. So let's watch that really quickly.
It's another gorgeous fall day on the courts at Lakelands Park Middle School in Gaithersburg. Carl Lee is helping to teach the game of tennis to a group of wounded warriors. Patients in the SRU, or Soldier Recovery Unit, at Walter Reed National Military Medical Center in Bethesda.
This program is helping them transition into civilian life, giving them kind of the physical and mental, I believe, awareness of just being able to get back into society.
After a 34-year career, Colonel Lyle Orada is getting ready to retire from the U.S. Army Reserves. He's a patient at Walter Reed, being treated for pulmonary issues.
Myself, I've never played tennis, and it's like, it's a good opportunity to learn, good opportunity to try, and just enjoy the day or enjoy those few hours where you're trying to put the mental or the physical health, behind you as you go through the recovery process.
Justin Ennis is 22, in the National Guard, hails from Connecticut. He's being treated for mental health issues, has been at Walter Reed for the past 8 months, since the beginning of the pandemic.
It is isolating in terms of, having family over, but you still make the best of it. You see other people here getting treatment, and, you bond over, you compare notes, you look after each other, you take care of each other,
As for the tennis here?
It's a great decompressor. I mean, you could hit the ball as hard as you want, and you do it on your serves, you get that ball in, there's really no stopping that.
Stop and then transfer that weight through, okay?
Dr. Lee is a dentist by training, started this adaptive tennis program for wounded warriors 3 years ago.
You got it. And they can learn that even if we're missing a body part, we're a human being, we can achieve through our actions, and we can do whatever we want to do as long as we put our will and mind to it.
They meet here every Monday from noon to 2 at these public courts in the Kentlands. If the weather's bad and during the winter, they play under the bubble at the Quince Orchard Swim and Tennis Club. It's all for free.
To me, this is the essence of teaching tennis. We're not teaching just a sport, we're teaching an ability to find yourself and find the potential within yourself, whatever it is. And all you have to do is try.
Dr. Lee says the United States Tennis Association, the governing body for the sport, wants to replicate what he's doing here all across the country.
Let's do some doubles.
In Gaithersburg, Bob Barnard, Fox 5 Local News.
Good, all right.
Sweet story right there, talking about Wounded Warriors tennis. You see programs like that across the country. If it's not tennis, sometimes it's basketball, all across the board. So great to see right there. We are honoring all the veterans today here on News Now from Fox. Thank you so much for being with us, and thank you so much for your service out there. If you want to be interacting with us here at News Now from Fox, you can follow our Twitter handle. That's News Now Fox. We are constantly tweeting out all of the updates that we have here from breaking news, but we also want to hear from you, our audience, so it can be a sort of engagement between us here who are sitting on the chair and bringing you the news, but all of you at home who are sitting on your computer or watching your TVs or whatever that might be. We want to be constantly engaged. That's part of this whole thing here at News Now from Fox. So we're going to kind of step away from the Veterans Day content that we have, and we're going to go back to Georgia. That was a press conference earlier this morning coming from the Secretary of State, as this election cycle still hasn't been wrapped up in a bow quite yet. Fox News Decision Desk has, of course, called the race for Joe Biden to be president-elect, but there's still a Senate race that's kind of uncalled right now. So there's going to be a runoff that happens in January. So we'll get some updates as far as who's going to take the Senate then. But we're going to take you out to this update from Georgia to talk about that recount, talk about the process, and talk about what we can be looking forward to in the next month or two. We're going to send some of you off to a 2-minute commercial break, but when you come back, you will see that press conference.
Today is November 11th. Before I get started talking about what we're here today, I'd like to just give a heartfelt prayer of thanksgiving to all of those that gave their lives for this country, all those people that continue to serve. This is a special day. This is a hallowed day. Growing up, My dad served in World War II in the Navy, and people were called to serve. And then we had Korea, Vietnam, and the people serving today. And so we can never forget, and we can never give them enough thanks for what they've done for this nation. And one of the things that they fought for is for our right, our freedom, to have free and fair elections. So that is, at the end of the day, what we really need to be mindful, particularly in our office, as we work finishing up and closing out the election that we just had. I also wanted to give a heartfelt thanks to the men and women who are standing with me here today. These are election directors from across Georgia. They represent large counties, small counties, diverse counties, and just from all over the state of Georgia. They and their staff are the ones that do the hard work on the ground of making sure that all legal votes will be counted. Their job is hard. They executed their responsibilities, and they did their job. This is a process. It is a process defined by law. These men and women in my office will continue to follow the law and count every legal vote. As it stands today, 97 counties have sent their final numbers in. The current margin stands at 14,111 between the President and Senator Biden, Vice President Biden. My office will continue to investigate each and every instance of illegal voting. Double voting, felon voting, people voting out of state. If you report it, we will investigate it. Every legal vote will count. We will continue to follow and enforce the law. Now let's look at the next steps. We are currently looking at having a statewide runoff on December 1 and another on January 5th. This is an untenable situation for these men and women to try and run both of these elections. With that, under my powers under the health emergency, I am moving the date of the December 1st election to coincide with the federal runoff on January 5th. This will protect the integrity of both elections and make for better election administration. It has the added benefit of saving taxpayers millions of dollars. The reason we have so many of these on rollover list voters is a direct function of COVID. This is the reality. The next step in the current election process is getting the final county certifications in. We'll then move to the risk limiting audit, or RLA. At 1 p.m. today, I will make the official designation of which race will be the subject of the RLA. At that time, I will designate that the RLA will be the presidential race. With the margin being so close, it will require a full by-hand recount in each county. This will help build confidence. It will be an audit, a recount, and a recanvass all at once. It will be a heavy lift, but we will work with the counties to get this done in time for our state certification. Many of these workers will be working plenty of overtime. We have all worked hard to bring fair and accurate counts to assure that the will of the voters is reflected in the final count and that every voter will have confidence in the outcome whether their candidate won or lost. Thank you for coming today. Do we have any questions?
So, can you describe what a hand recount will do for the nearly 5 million votes that have been cast in this election?
Well, because we now have that verifiable paper ballot, for the first time in 18 years, we're going to have something to count instead of just pressing a button and getting the same answer. So we'll be counting every single piece of paper, every single ballot, every single lawfully cast legal ballot.
And will that be the QR code or?
That will be the names that are on the ballot, whoever they voted for president, the English written word.
Will you be able to get that done in time for certification?
Yes, we will. As I said, people will be working lots of overtime next coming week. Lots of people will be really pleased with those paychecks if they're getting overtime.
Secretary, for the recount, do you have an estimate on how many election workers it will take to do that? And is there also an estimated cost? Does that come out of county, state, or federal funds?
That will be coming out we'll determine at some point. Adding additional workers, we will probably have to augment that, and we'll be looking at that, and that'll be the election directors at each county will be able. They'll actually handle their own additional or their own county recount or risk limiting audit county by county.
Mr. Secretary, is this how this audit was designed to work? I thought originally it was supposed to be looking at a small segment of the votes,
yeah,
with the larger picture.
Well, that's what's really interesting when you start really digging into probability theorem. When you have 5 million votes and the margin is so close, 14,000. If we pulled out 10,000 votes, all of a sudden it could say, well, this is the person that won. We pull out 100,000, it says this person won. We pull out 1 million, this person won. And that's why mathematically you actually have to do a full hand-by-hand recount of all because the margin is so close. Right now it's 14,101. So it's really just the mathematics, the statistics, the probability theorems that we use for the risk limiting that are taking us to that extent. So if it was another race or you didn't have that such a close thing, then you could do that and it would just be a sample size. But you can't do that when it's that close. This race has national significance, national importance. We get that. We understand that. We do. We follow the process, and we understand the significance of this for not just Georgia, but for every single American. At the end of the day, when we do a hand count, then we can answer the question exactly what was the final margin in this race. Yes, ma'am.
The president just released a list of some Georgians who have passed away who significantly voted in this election. Is that something that they
Well, absolutely. Well, we've been open and transparent. In fact, we've had multiple meetings like this, meeting with the press. Gabriel Sterling, our implementation manager, has come out to talk to you, really digging into the weeds. If you have any information about illegal voting or voter fraud, bring that to our attention. We will investigate every case that we hear.
Have you found anything with that particular allegation so far?
I'm hearing that that just came out this morning. We'll look at those records and we'll start digging into that.
Won't a hand recount be less accurate than a computer recount? I mean, humans make mistakes, and are you concerned about accuracy of a hand recount?
It really is what the numbers take us to, and we're following the process that would drive us to that, that's in current state law.
And is it reasonable to believe that the results will change much? 14,000 votes. Is there any chance that the outcome or the results of the presidential election would change as a result? Is it possible that 14,000 votes could flip?
You asked them to make predictions, and what we're going to deal is in facts. And so I'll report the facts.
We're talking about probabilities. What is the probability?
I'll get up my calculator and I'll get that back to you. I can't do that off the cuff.
Can the Trump campaign still ask for a recount once this is done and you folks have certified like the system used to, or is this count as their one recount, if you will?
That's a good question, but after it is certified, the candidate that is within 0.5%, I believe, would still be entitled to a recount, but that would be a scan recount just because of that is what is in state law. Yes, sir.
What happens if certain counties are unable to or refuse to certify their elections?
We're going to continue to work with the counties on all that, but that's their deadline. And that is the process that we have in place. And we've had great cooperation and dedication from the county election officials. That's why we have so many here. We have professionals out there. And at the end of the day, I know that I haven't asked them, but I know that there's some folks back here that maybe vote this way and other folks that vote that way, and some go this way, that way on different elections. At the end of the day, though, they're following a process. And then what they want is they never want you to be able to question their integrity. And that's what we want for everyone to understand, that we're following a process. Integrity still matters.
So those delays wouldn't impact...
We'll continue with every county that we have, and if there's some that are still buttoning it up, then we'll roll to that. Hopefully that's the smaller counties.
Is there a new sort of estimate of how long this will take?
It'll take every bit of the time that we have left, for sure. It's a big lift.
So by that you mean
we certify. Our date is November 20th.
You've been saying for more than a year that we should absolutely trust the QR codes. So why is a hand recount necessary right now?
Statistically, because of where we are there, we have a team of people, national experts that have worked on risk limiting audits in several other states. They're part of our team. This is not just a decision we made unilaterally. We reached out to these experts. We've been working with them for several months, and we just follow the science of a risk limiting audit. We follow the numbers, and that's where it leads us to count every single ballot by hand.
Does this mean that county certification deadlines are no longer in effect or extended to November 20th?
No, they're still required. We want them here by Friday at the latest. We have 97 counties already.
Can the recount begin before counties certify? If you have to wait till every county certifies and then the recount begins, what's the timeline?
I'll talk to legal about that, but we want to start this really before the week is up because we understand there's an awful lot to do. Yes, sir.
Yeah, this is a little repetitive, but could you elaborate again on the timeline of the audit and what is going to be counted exactly?
The ballot that you had, whether it was an absentee ballot if you sent that in or if it was voted by in person like I did, we'll look at that ballot and someone's going to look at who did you want, and they're just going to go through that, and you'll have two people that are doing all the counting. They'll put them out and just in stacks and make sure that the stack has, let's say, 1,000 ballots, and then you look at the end. You had 501 for this person, 499 for that one. You just keep on rolling through, and that's how it's going to be.
So that was the update from the Georgia Secretary of State earlier this morning, but we're going to keep you in the Peach State. It looks like we have an event coming up here, Election News Conference in Savannah, Georgia. Let's listen right now.
We didn't get it. Yeah, we were told by ABC that this was happening, so.
Yeah, so we will.
Y'all do me a favor if you have cards, give them to
Yeah.
me, and I'll make sure she puts you all in the list. The list that we use, we got from county PIO.
Oh, okay, that'd be great.
We might need to update that information. Are y'all sure you don't want to move everything in some so you're not in the rain? Whatever's fine with y'all is fine with me. But before we get started, to give you an overview of what that press release indicates, basically, we have submitted everything we've got to the state. It's included in the state results. That brings us now to the certification process. It's the same process we go through all the time. We're certifying the election. I want to talk to everybody. I want to make sure the public understands that this is the process we go through. This is just what we do. There is a risk limiting audit that we'll be undertaking too, but then there's a cacophony of other things that's happening to us a little bit. There is a recount. I want to talk to everybody about that. The recount is something that's required by Georgia law. It's nothing extraordinary. It's, we're doing that. And we're going to work with the Secretary of State through all of that. And then there's, now one good thing that happened is that there will be, so the bad news is, depending on how you're looking at it, if you're an election worker, maybe, the bad news is there's three runoffs. The good news is the December 1st runoff, state runoff for state public service commissioner, and the Senate race runoff for January 5th have been combined, so they'll all occur on January 5th. Be less confusing for the voters, and it's going to be much better for the workers. It was going to be very difficult for us to do everything we're doing and putting on 2 runoff elections. So that's all it is here. And then, of course, any questions y'all have. So.
Okay, 1 second. I need to switch batteries real quick.
All right, looks like that shot froze up on us. Looks like it's back up, but it froze there for a second. Let's continue to listen.
Okay, I'm good. Okay, we'll have you just look here in the center.
All right.
So, is this the time for questions, or?
I can start off and give a brief overview, and I guess y'all can take clips of whatever it is that you want to add in. So, the Chatham County Board of Elections has completely counted everything that we have in hand, and we turned everything over to the state yesterday, in fact, and it is already included in the state results. So now we're in the process of certifying those unofficial and incomplete results. And this is the same certification process we go through after every election. It's just that because these elections are so close, that everybody is involved in this process. We do it usually and nobody is interested in what we're doing. But in this time around, everybody is keenly interested in these because the margins in the races are so slim. So we will complete certification by the deadline. The county deadline is this Friday, and then the state certification deadline is next Friday, November 20th. So at the same time, the Secretary of State, we're working with the Secretary of State's office in order to do a risk limiting audit, and we'll be going through and selecting ballots to be recounted by hand. So we'll go through that risk limiting audit procedure, and we'll certify the election, do the risk limiting audit procedure, and there's also a recount that will be going on at the same time. We're going to work with the Secretary of State's office on doing all of those things. We also have 2 runoffs coming up, 3 races, 2 U.S. Senate races January 5th, and then the earlier December runoff has been consolidated. That is for the State Public Service Commissioner. So that's going to be consolidated to that January 5th federal runoff date so that all 3 races will be done at the same time on January 5th.
Can you talk to us a little bit? You mentioned that you guys are obviously doing the certification, the recount, or the audit, as well as the runoffs, preparing for those. Is that all happening simultaneously? Is there a priority level?
Yes.
What does that look like?
Yes, it is kind of all happening at one time. But, you know, what we're finding and what we know from experience is that you've got to just keep your mind on one thing to completion at a time. You don't always have that luxury, but that's what we're doing. You know, right now we're focused on certification. The Secretary of State's office will be talking with all of the counties tomorrow about the risk limiting audit. So we'll undertake that conference call, of course. We'll undertake that as well. We'll get our workers in the warehouse, a small crew, started tomorrow, you know, toward finishing up certification and on that audit work. But, you know, we'll be kind of wading through both of those projects at the same time.
So this certification, I know you guys were originally planning for 4 o'clock tomorrow to officially certify. Is that still on track? Does this announcement today change things, or that timeline?
Well, remember now what we had announced was that we were going to go ahead and certification at 4 o'clock on Thursday, and if we could not get everything done, that it would be Friday. And so I think that it is a very strong possibility that we will have to bump back certification from 4 o'clock tomorrow to Friday afternoon.
Can you talk about the recount? Is that starting as early as tomorrow, or do you have to finish the certification before you can begin the recount?
We're going to wait for guidance from the Secretary of State's office in that regard. I think there may be some ways to do both things, you know, begin both processes at once. But we're going to follow whatever the Secretary of State's guidance is in that regard. I mean, if we're going to start hand recounting ballots for the audit, maybe we should just start with the hand recount of the, you know, a hand recount that's going to be required anyway.
And of course, it took quite some time to get our results to this election. We still haven't certified the race. Do you think a hand recount, or how long do you think a hand recount will take here in Chatham County?
Well, Chatham County is the only county that has had experience under the new system with a hand recount. And so it took us several days to complete a hand recount in that smaller race. It was a primary, and it was only 5,337 total votes. We've got 20 times that number of votes in the presidential race. So we have some experience here in Chatham County about having done it. So I feel better that we will be prepared to do it, but I also feel that it's going to take much more than a few days. You know, so it may take us right up until the state certification deadline. We'll just have to get more crews working on it, and that'll be our first focus, is trying to get more crews.
What happens if you're unable to finish by that state certification? Like, do you have to finish by the state certification, or is there some sort of protocol if someone or if the county is unable to meet that deadline?
We'll have to wait for the Secretary of State's office to give us more guidance on that. Again, you know, the state certification deadline is just next Friday, November 20th, so it doesn't give us a lot of time.
You just mentioned it, but this is 9 days to essentially get what you guys had of a 20 microscopic view of last few months ago.
Right.
I mean, is it realistic to get this done this time with the workers we've got in the structure that's available? I mean, are we looking at the potential of something going crazy beyond this, or?
It may take longer. It may take other counties longer if they don't know what's hitting them. But you know, I'm confident that in Chatham County we've seen it, so we've had a glimpse at it, and we know how much it's going to take. You've all been over at the warehouse and seen how many people we've got working. So we're going to get, hopefully, we're going to get all of those dedicated people back in to work again. And if we can get full ranks, then I think we can knock it out.
What is full ranks? I mean, how many people does it take to do this?
Many teams. I think Mr. Bridges and the Secretary of State, I think everybody's going to be trying to bring as many resources to that as we have. I would say certainly a dozen teams, hopefully more than that.
And something that I've seen ever since the Secretary of State announced this hand recount is there's been some, studies showing that hand recounts are typically less accurate than machine counts and recounts. In your purview, what's your opinion on that statement? Are hand recounts actually less accurate than the machines?
I would say yes. Hand recounts are historically less accurate. There is a trust factor with the machines. I would hope that Chatham County's experience with the runoff earlier in August would give people more confidence in the machines in Georgia. But that machine recount, the machine doesn't get tired and mark something in the wrong spot. So I would say this, that it's likely that the recount will vary from the earlier count. But we're just going to have to be very careful and methodical as we go through in teams. And that's what we did in that earlier case where we worked in teams, and it was monotonous, and but everybody worked through it, just vote by vote.
So why do the hand recount if the machines are known to be more accurate?
Well, there is, I mentioned a distrust of the machines, and so the risk limiting audit requires a hand recount. It requires it by a sample, for example, and I think that's designed to give more confidence to the machine count. So if you can replicate the machine count by counting them by hand, then that's a good thing. Remember that there's a computer code that the computer reads, and then there are words that a hand recount team would read. So they're reading different things, and you'd hope that those different things would both be counted the same. And I'm confident that they will be counted the same. Not to say exactly the same, I'm sure there will be a variance, but I'm confident that it will be a very, very similar result.
And of course, this recount was triggered by the Secretary of State's office, and there's the potential that a recount by a candidate can be triggered after the state certification. Is Chatham County prepared to potentially do two recounts in two different types of ways, with a hand recount and then the machine recount that a candidate can request? Are you guys prepared to do that in such a short time frame?
Yes, Chatham County will do what's required, but I think we need to wait for the Secretary of State's office to give us guidance on how we're going to proceed.
Mr. Blake, can you talk a little bit? I mean, election staff, your guys' workers have been tireless for a long time, literally probably since June.
Right.
Can you talk about the resources and how this all plays into the budget, the picture of what we are doing in this county in terms of how do we pay these people for long overtime hours and the exhaustion that they might be feeling?
Right. I just left some of our workers in here, and they did look tired. I have to say, they did look tired. but they're dedicated, and they will get through it. So I can't thank them enough, and Mr. Bridges and his staff enough for the hard work and determination to plow through. I don't think that anybody in the public can ever really understand how they're able to handle all the curveballs that have been thrown to them in this election cycle. This is certainly another curveball being thrown at them, but I've seen them do it, and I've got confidence in them, great confidence in them.
Hold on, sorry, let me check my notes here. Oh no, let me change it.
Do you know what is the total number of votes that were counted in Chatham County?
Just over 107,000 votes.
Okay.
Is that?
Secretary of State had 130.
That was in. I'm sorry. That was in the.
134,000.
Yeah. Yeah. 134,000. Right.
So that's how many you guys will have to recount.
Yes.
Can you talk to the actual process of a hand recount? What does it actually look like?
Well,
I know that might sound silly, but
no, it's not silly at all. Mr. Bridges had to kind of imagine that and create that because we were the first county in the state of Georgia to undertake a hand recount under the new voting system. And so, that looked like a table, had several at one point. So they were.
Looks like we're losing that feed right there, unfortunately, coming out of the Peach State in Savannah, Georgia, and looks like both of those feeds going down at this moment. So what we'll do right here for you is we're going to take a short break here on News Now from Fox. Some of you will be going to this break. It'll just be about 2 minutes. This is how the Dow ended up for the day, just down about 23 points there in the red, so almost flat. But when we come back, we will be going out to Chicago, where some restaurant owners, they are fighting back. They are saying enough is enough with these COVID-19 restrictions. It's time to get back to work. It's time to get people back in the restaurants at full capacity. They're tired of all of these restrictions on their businesses. You'll hear it right here on News Now from Fox.
This data shows that only 297 employees through their city's contact tracing tested positive for the virus. Going forward, of the city's roughly 18,000 new COVID cases in this period from June to September, only 585 people out of 18,000 reported that they had visited a restaurant within 14 days of feeling sick or contracting the virus. So, what does this data tell us? One, it reaffirms to us the great and careful efforts by our Chicago restaurants since the pandemic in March. They care deeply about their employees, their customers, and everyone throughout the city. The restaurants overwhelmingly have taken great efforts to safeguard their guests and their employees. Most of the restaurants clearly complied with the city's rules, and many of them spent thousands of extra dollars to improve their ventilation systems, improve their cleanliness protocols, and their equipment. And several of the restaurants are here with me today, and they're going to talk about that. Now, what was their reward for their incredible efforts from March through October, and especially when indoor dining began from June through October? Well, unfortunately, as we've seen, the governor, he re-slammed the door on indoor dining throughout Illinois and in Chicago. Where is the governor's specific data about the city of Chicago? We don't have it. The city's got the data. And so what we need to know is that the restaurants, they moved from 25% occupancy from June through September to 40%, and then they were suddenly re-slammed down to 0 indoor dining as of October 30th. The mayor and the aldermen, we'll get to them. So now that we have the city's data, now we have the data from the Department of Public Health, it is time in our city of Chicago to stop restaurants from being the scapegoats, and we believe perhaps falsely scapegoats, for the spread of this virus. There's no question that all the restaurants, our economic development groups throughout the city, we want to defeat the virus, we want everyone to be safe, and we want our economy to be restored. But if the data does not point to and directly connect restaurants and their employees to the spread of the virus, then we've got to reassess what we're doing here in the city of Chicago. So here's what we're asking from the mayor and the aldermen. Number one, we're asking Mayor Lightfoot to call the governor. We're asking the mayor to present the city's data directly to Governor Pritzker. And we're asking them to sit down and talk about the fact that the data does not support the restaurants of Chicago being squarely blamed for the spread of the virus. We're asking the mayor and the governor to sit and talk about how we can safely and appropriately reopen indoor dining in our city of Chicago. If it is necessary, the city of Chicago should consider legal action to assist the restaurants. Now, again, since the pandemic hit, we've all agreed, let's rely on data and science. Now that the data shows that restaurants have not been a statistically significant driver of virus spread in Chicago, according to the city's own data, we need to reassess, we need to understand the data, and we need to understand the massive financial losses to our restaurants and our Chicago economy if we can't restore indoor dining. Let's remember, if other public businesses like salons, like gyms, and even casinos can continue to stay open, restaurants can do the job. Restaurants have done the job. Let's work with them. If we need to reassess safety protocols, let's do it. But you have unwavering commitment from the majority of restaurants in the city to maintain safety. What else are we asking of the mayor and the aldermen today in light of this data? We're asking, in light of their data at the city and the governor's data, the governor and the city have been grouping restaurants and bars together in their data. We think that's unfair, and we think that's not scientifically accurate. Look, restaurants serve food and people under 21, so you can have your kids, your grandparents, and everyone come together for a very appropriate and safe meal. Bars, nobody under 21 can get in there, and it's a very different dynamic than restaurants. So we really need the city and the state to separate out restaurants and bars in their data and definitely in their punishments. We can't group restaurants and bars together in punishment any longer, period. The restaurants, if you look at their operations and food service and the amount of employees and what they're serving, a food commodity mostly with alcohol incidental, perhaps, for people that want that, it's a totally different environment, dynamic than bars. Look, let's separate them out. 3 more points. Today, in lieu of the data and in lieu of the sudden shutdown that occurred on October 30th, as well as the other shutdowns of restaurants in the past, we applaud the mayor for the new grant program that she announced last week. $10 million, 10,000 grant maximums for the restaurants in Chicago. But unfortunately, the mayor announced that this would be a competitive lottery throughout our city. Well, look, the city's got 7,300 restaurants. And so if you have 10 million divided by 10,000, that's only 1,000 grant winners. All right? The city has $2 billion in TIF surplus. We need to increase the funds for the restaurant grant program to at least $75 million. We can't have a lottery. We can't restaurant versus restaurant for the survival of their businesses and jobs. We need to increase the pot of funds to $75 million at least for this new grant program. Final 2 points. In the time that restaurants have been shut down, and if restaurant indoor dining is going to continue to be an issue, we have to exempt restaurants from their rent payments and property tax payments for the rest of the year. Look, again, the data doesn't support that the restaurants have been a virus spreader based on the city's own data. So if their indoor dining operations are going to be closed, we need to look at giving them rent and property tax exemptions at least through the rest of the year. Lastly, the point of it is here. We're here in Fulton Market, right? And this is one of the most historic neighborhoods in Chicago. I've had the honor to work in this neighborhood for 20 years. This building right behind us here used to be a woman-owned, wonderful food distribution business. And now it's a wonderful restaurant with entertainment. The city of Chicago can lead the world in how we defeat the virus and how we keep people safe and how we work with our restaurants. We need a new day. We need a new day of collaboration between our city officials, our city's Department of Business Affairs, and the Health Department, and our wonderful restaurants. So our new committee, our Chicago Restaurants Committee, is asking for weekly Zoom phone calls so restaurants throughout the entire city can participate and we can share the data. Let's share the real data about whether restaurants are tracking and spreading the virus based on the city's own information. Let's share the safety protocols that are working. Let's drill down on whether we need better safety protocols. And let's work together so if we need a new spirit of public safety communication, in other words, reporting offenders, then let's do that as a city and let's work with these restaurants. Public safety is the foundation of economic development. Now, yesterday Alderman Riley talked about people renting hotel rooms and throwing irresponsible parties, and we've seen other perhaps irresponsible parties at people's homes. So now let's collaborate as a city to work with the restaurants to defeat the virus and, if necessary, to report people that are breaking the rules. Let's defeat the virus. Chicago can set the way for the rest of the world. Okay, I'd like to bring in our restaurants one by one. I'm going to quickly wipe down here. If anybody wants to wipe down the podium, they're welcome to do that. We've also got hand sanitizer here as well. I'm going to bring forward first Nancy Bruni, who's with the B Hospitality Group. Thank you, Nancy. Feel free to take your mask off. I'm going to put mine back on right now.
Thank you. Good afternoon, everybody. I represent Fomentos, the Bristol, and Nona's. Two is on West Loop and one is in Bucktown. So for us, we've been suffering. We have spent over $120,000 on air filtration systems, ultraviolet rays, you name it, we got it. So we have been responsible. And now the winter is coming, and we just don't know what to do. The heaters it costs an arm and a leg. So, and we feel like we are getting nothing back from the city. And these grants, $1,000, $10,000 is not gonna cover a penny worth of the $120,000 that we need. So we would just like to know what the city is gonna do for us. They're punishing us, we feel, for no reason at all, especially those of us, I think almost all of us here, we complied with every wishes of the mayor. We just want to know what is next. So that's all. Thank you very much.
Will you spell your name, please?
Bruni, B-R-U-N-I.
And Nancy, will you spell Nancy too, please?
N-A-C-Y.
Okay, Nancy, thank you very much. Okay, we'll now have Dan Conroe of City Winery.
Thank you, Roger. And that is D-A-N, last name Conroe, C-O-N-R-O-E. And I'm the marketing director here at City Winery Chicago. Thank you all for coming today. And I just want to talk about what this experience since March has been like for our business here. Obviously, we were hit hard like the entire industry. And when indoor dining and outdoor dining shut down in March, we closed and unfortunately had to furlough a great deal of our staff. When we learned more about the spread of the virus and cases had decreased significantly, we're able to reopen our outdoor patio behind us in May. And then with the return of indoor dining, we were able to reopen inside with limited capacity, a great deal of spacing between tables, and with additional safety protocols in place, we were open for business both indoor and outdoor. And it remains, and it was very important to us to keep our guests safe. So guests, when they arrived, received a wellness check where we asked a series of questions for contact tracing and took temperatures. We do require masks at all times when guests are moving through the space, when they're speaking with our staff, exiting, using the restrooms, or interacting with other guests as a way that we decrease the chance of spread and protect our staff, which of course is extremely important to us. We also we got for indoor dining, we replaced our air filtration filters with MERV 13 filters, which are more likely to control the virus and prevent spread. And you know, we continue to take every precaution that we can to offer a place where people can gather safely and enjoy food and wine, which allows us to remain open and keep people employed. Throughout the summer, that worked very well for us with the indoor dining and outdoor options for guests to gather. With the close of indoor dining, things have become more difficult for us, obviously, like they have for so many restaurants. And we're blessed to have this outdoor space behind us, which we tented, and this will allow people to come visit us for the next several cold months. But it's with very reduced capacity and reduced revenue potential, which prevents us from being able to bring back more of our staff and operate as we need to sustain the business. And I just also want to make a point that where our business has been hit hard, the entire industry has, and sometimes we don't think about our vendors in the food service industry, our valets, many people beyond just the restaurants and our employees who have been affected by this virus and the shutdowns that have gone along with it. So we want to keep them in mind. We want to make sure that restaurants have support from the city, sustained support, especially in light of the indoor dining shutdown, to get through this. We know it's going to be a difficult winter. We would love to see indoor dining come back as soon as possible, because we do believe that we can do that safely and keep guests safe when they visit us. But again, we need the city's support. We need the city's data and information in order to know how we can be safe, keep our guests safe, and continue operating in a way that will carry us through until we can increase capacity again. Thank you very much. And
why don't you wait to the end?
Okay.
Thanks.
Absolutely.
Okay, good.
Thank you.
You good, Dan?
I am. Thank you.
Okay, good. Thank you. I'm going to bring up Rich next, but I do want to make a quick point. Whoops. Let me get that. Sorry, guys. John, can you help me out here? Okay, I think I got it. The point is this. Again, I've worked in Fulton Market for 20 years and other Chicago neighborhoods for total of 30. What you see behind you at City Winery, the wonderful indoor tents and bubbles that they have, we celebrate that with City Winery. But guess what, people? This is not your typical Chicago restaurant display here. The vast majority of restaurants in our city that are surviving right now, are struggling to survive, they can't put tents outside. They don't have the money. They don't have the space. So we have to rededicate ourselves, city officials, restaurants, economic development supporters, to restoring indoor dining for all restaurants throughout our city. Because again, the vast majority of them are on the edge of going out of business. They can't do outdoor tents. They don't have outdoor space. That's a critical point. I want to bring up Rich Ruffalo with the Forno Rosso Restaurant Group.
Thank you, Roger. I'm here today to inform the public who I believe are misinformed, as Roger kind of touched on a little bit, about what the restaurant industry has done, the steps we've taken in this big fight that we're in right now. We want to educate the public more on how consistently and vigilantly we are as an industry to the public health and well-being of everything. Explain to me how you can walk into any store in the city or the suburbs and touch products that haven't been sanitized or wiped down as religiously as our industry has. And then to think of the possibility of bringing that virus home when you do that. As Roger touched on, the numbers have been unbelievably low in this industry for as many people as we touch and serve and deal with on a daily basis. And I think we've done a great job. We've gone above and beyond. Not many other industries are religiously taking the same safety measures that we are. It's just not happening. Not only has this industry taken every step that has been asked of us, but we have gone above and beyond those safety measures, which should be rewarded and not penalized to the point of non-survival almost. We have created a culture in this industry with our customers over the years of quality in all that we do, including now more than ever safety, which has rewarded us and facilitated us, many of our restaurant group that are here, to open multiple locations or survive on the location that they have. And it's created several industry jobs with the public. We feel attacked and stripped of everything we have earned with no other industry in the world has had to face this onslaught. We deserve better. We have earned that by the hard work and dedication to each and every industry employee. I just feel like there's so much more politically that can be done to help this industry out that isn't being done right now. We feel like we're taking the brunt of all of the bad things that are happening with this virus. But 3 weeks ago, I was able to get on a plane, travel to Arizona to see my daughter, where there wasn't one open seat on the plane at all. And then I was able to fly back where there was 2 open seats on the plane. Everywhere I go in, they're not testing your temperature or asking the questions that we ask at our restaurants in this Fulton market, and I'm sure the entire city, which has been required. We've gone above and beyond, like I said before, and I feel like we should be rewarded more than we are. So thank you for your time today. Appreciate it.
Thank you very much. Did you spell your name for the people?
I did not.
Go ahead, spell it out for them, please.
It's Ruffalo, R-U, 2 F's like Frank, O-L-O, with the Forno Rosso Restaurant Group. Thank you.
Thank you, Rich. Okay, I'd like to bring up now Mike Roper with Hop Leaf Restaurant in Andersonville, one of the neighborhoods I used to work in, and we're really pleased to have Mike down here in Fulton Market. Come on, Mike.
Hello, my name is Michael Roper, M-I-C-H-A-E-L-R-O-P-E-R. I'm from the Hop Leaf. I've been in the business for over 45 years. This is the most challenging time that I've had, trying desperately to keep open, keep my employees working, keep paying taxes, keep paying rent. I feel we have done everything we've been asked to do, and it's the fact that we cannot serve inside is almost like the last nail in the coffin for us. What I would like to see is, first of all, I'd like to see the city and local politicians advocate for us higher up the food chain, and also with our lenders, so that we can get some relief. Obviously, rent relief would be fantastic. It could be a game changer for us. Some of us, like myself, we own our building, so we have a mortgage. We could use a gap year in payments. We would like to be able to renegotiate our loans and mortgages so that we could add a year to the end and get a gap year. That would really, really help us, because in the end, what is really causing places to close is that we have fixed costs, and those fixed costs don't go away because our revenue is declining. Those fixed costs keep going, and they include things like property tax. We either pay it directly as building owners, or we pay it through our rent, because our landlords pass those property taxes to us. We pay licensing fees those licensing fees should be waived for this year. We pay, we're paying, most of us, we're paying off loans. We borrowed money to build our places, to buy equipment, and it's very difficult to continue to pay those fixed costs when your revenue has been slashed. For us, we are lucky. We do have 10 outdoor tables, but winter is coming, and realistically, no matter how many heaters you have or tents you put up, the service that we can provide outdoor it's inferior. We're never going to make the revenue that we made with indoor service. At Hopleaf, we're very fortunate that we have a fair amount of space, so we can very easily keep people, very spaced out. If we had 25% capacity, that's 97 people for us, and we can spread out 97 people so they'll be safe. I have to say our employees have done, such a fantastic job. They're working twice as hard for half as much money. I also want to compliment our customers who have been very, very cooperative. So, we have so many people who are cooperating to try to, kill off this virus, from our staff, from our vendors, from our customers and our neighbors. What we need now is to get the city on our side. We need to get the county on our side, and then, obviously up the food chain in government. We have other expenses that it would help if the city would advocate on our behalf with people like the insurance business. We're paying liability insurance as if we have 269 people inside, and I have no people inside. So there is, obviously a great decrease in liability. So perhaps if the city would advocate on our behalf to the insurance companies, to the banks, to the mortgage companies, all these people that we have to pay money to when we're not taking in much revenue. I'm hoping that the city can use its bully pulpit and its influence to help us out. And then, of course, they can help us out directly with loosening up some of the money from the TIF money, which is over $2 billion, to make a realistic contribution to our survival. And I guess that's all I have to say. I'm very grateful that we have this opportunity to talk directly to the press. Thank you so much.
Okay, thanks, Mike. Did you want to say something, Anthony, at some point? Not right now, but I'm going to bring you in at some point. I just want to make a couple other quick points. Since we, just 3 quick points, and I'll bring Jody up and then Anthony. Point number 1 about the data. The reason we asked for this data is that our association, together with many restaurants, we had a conference call on September 25th with the Illinois Restaurant Association. And we said to the Illinois Restaurant Association, we said, how are you dialoguing with City Hall? How are you helping to negotiate for the restaurants? And Sam Toya on the call said, well, we went in there and we insisted that the restaurants needed 40% occupancy, up from 25%. And we said, Sam, that's helpful. How did you do that? What data did you use to get to that discussion? He said, we didn't have any data. So it dawned on a lot of us that, look, we've all agreed since the pandemic hit to rely on data and science. And if the Illinois Restaurant Association didn't go to the negotiating table with data and science, Chicago needs a new restaurant association. Chicago needs a dedicated restaurant chamber of commerce and association. The Illinois Restaurant Association is statewide, right? That's a lot of area. Our city needs its own restaurant association. And I'm a former board member of a group that was called the Chicagoland Association of Neighborhood Development Organizations. CAN-DO is what it was. And it ran from about 1985 to about 2000. And it was wonderful. It was a citywide association all the neighborhood economic development groups. We need to rebuild a citywide association for the restaurants. If we ever are negotiating with the city, we've got to bring the data. Got to have it in hand. I want to echo what Mike said, really delve into the data point. We're asking the mayor to take her data and sit down with the governor and have a serious discussion about data and science and about how wonderfully our restaurants have cooperated during the COVID crisis. If the governor doesn't have data that trumps the mayor, we need the mayor and the aldermen to stand up for our restaurants. We need that to take place. The last point I'll say is, if you look at this data, there's a little bit of concern about one of the data points. It says right here, from June 1st to September 15th, that the city had 17,963 total cases, right? But they were only able to contact, trace, or interview 9 of those people. And I got the form here, can email. That's 44.6%. 45% of the new cases in Chicago from June 1st to September 15th, only 45% we were able to interview. We need 100%. None of the city employees, well, I'll rephrase that. All of our wonderful city employees have retained their employment since the pandemic hit. We need 100% of contact tracing. So I'm a little concerned about what this data shows us. Again, we're committed to the city's maximum safety and maximum success, but we do need better collaboration with City Hall. Let me bring up Jody Agee with the Jefferson Tap.
Hello, everyone.
Hey, Jody.
Thank you. My name is Jody Agee, Jodi. Last name is Agee. I own Jefferson Tap and Grill. This month is my 19th anniversary, and I've been asked to speak from my heart about the challenges of COVID, and also about the accomplishments that we as restaurants have made, adhering to every new standard that's mandated. Since closing in March, and I'm echoing what everyone else has said, I have personally spent thousands, tens of thousands of dollars out of my savings account, out of my pocket, to disinfect, to provide hand sanitizers, to staff training, for daily and nightly labor for deep cleaning, to sanitize and disinfect my establishment to make it safe for my guests and for my staff. This is it's been my number one goal through the past very difficult months, to keep staff and guests safe and healthy, and we have done a great job. Along with my fellow restaurateurs, we have done a fabulous job, in fact. I can list everything out, but I mean, it's everything. We take temperatures. To enter Jefferson Tap, of course, you have to have a mask on while seated. When if staff approaches, masks must be worn. If you get up from your seat, masks must be worn. This is not, it's like herding cats, you guys. It is not an easy thing to do. People don't love wearing masks, but I think they've really rallied around this, and we've been hugely successful. We've spaced our tables, we've limited dining to 2 hours, and we've also shut down completely inside. And that's kind of like the kiss of death for us. As an independent, I only have one place, and I don't have the funds to go out and buy the beautiful structure like this. To heat it, it's not manageable. Outdoor dining is unmanageable for the cold city months ahead. The Chicago winters are brutal. So I'm looking at probably closing my restaurant if indoor dining isn't restored to at least 25%. I don't think we're asking for too much here, and we definitely need the mayor and the aldermen behind us, supporting us, so that we can provide a great service and keep our employed and keep the city safe. So, thank you.
That's great.
Oh, and I don't know if you saw my mask, but it says "Keep America Safe Again" or "Make America Safe Again." I take that to heart, and I do it 100% at my restaurant every day. Thank you.
Thanks, Jody. Anthony, do you want to say something?
Sure.
Okay, go right ahead. Feel free to take off your mask.
Good afternoon, everyone.
My name is Anthony Waller. I'm the owner of Catering Out the Box, and as a caterer, we're slightly different, but we're in the restaurant industry. And I'm not going to be redundant. I think everything that my colleagues here have stated is all on point. The time, effort, and energy and the heart that we put into this industry, next to the medical industry, I don't think you'll find an industry where one cleans, sanitizes, and is more cognizant of food service safety. Just to give a little history in terms of when one opens a restaurant,
Why don't you move up a little bit to the
whenever you open a restaurant, you have to go through food service inspection. You have to have inspectors come out to make sure that your facility is compliant. You have to make sure that you have a food service sanitation manager on site at all times. And it's been mandated in many cases that all of your employees, even the dishwasher now, have to be SaniServe certified. What does that mean? That means that you have to understand time, temperature, food service safety, and safety being most prevalent. So again, when you walk into a retail establishment and someone has picked up a package and then the next person picks up a package, you've already contaminated that package. Our industry has always been the most prevalent when it comes to making sure that the safety and well-being of our clients and our customers is always at 100%. With that being said, when you look at vendors that are affected by this, again, I'm in a little bit of a different situation being a caterer. But when you have your suppliers, when you have valet services, when you have fixed cost, it's just that, it's fixed cost. It's not going away. And now all of a sudden you have 50% less, 75% less in revenue that you're bringing in. There's only one other direction in which one you're going to go. And unfortunately, that's the closure. We need to have the mayor, we need to have the governor relook as far as at these numbers and understand that the industry, the restaurant industry, is not the cause, obviously, of this pandemic. People, human nature, are still going to gather, so why not have them gather in a controlled environment where you have people that are looking out for their best interest and safety, rather than to be gathering in a situation of 12, 15, 20 people in an uncontrolled environment. Thank you.
Thanks, Anthony.
Thank you,
Okay.
Roger.
Yeah.
Last point for me, which is this. From June 26, roughly, when indoor dining was restored, through September, when the numbers continued to increase a little bit, and then through October, when our restaurants went up to 40%, the mayor's own health commissioner was talking about that the spread of the virus was happening. People were having parties. We saw a college campus spread on college campuses. Yesterday, Alderman Riley talked about people renting hotel rooms and having irresponsible parties. So the ultimate point of this is the businesses of Chicago, the residents of Chicago are ready to work even harder with the mayor and the aldermen to find out where in the world is the spread coming from, and let's defeat it. And if we don't have data that statistically and significantly links our restaurants to the spread, we can't blame them. I will just say, last point, is someone working in economic development with public safety, I think we're at a crisis point in our city and actually in our country where if a speeder goes by right here, people are afraid to call the city. If somebody over here is throwing garbage, or if somebody over here is maybe urinating on a building, people are afraid. We need a new spirit of involvement of the citizens. If there's a hotel party where people are breaking the law and ruin it for everybody with the virus, we got to incentivize. We got to encourage the people of the public, hey, pick up the phone, call the city. Don't be afraid. We can work together to defeat the virus, but we can't put the blame on our restaurants who really don't deserve it based on the data. Okay, any questions? Dan, why don't you come back up here in case there's any questions? And why don't, if anyone would like to ask questions, why don't I start on this end and then we'll work over here. I'm going to put my mask on and I'm going to put my mask on. If you guys want to respond, maybe take it off and talk to people who have questions. Okay, let's start. Any questions over here? Okay, why don't you do me a favor? Why don't you just come up and speak a little louder, and a question for everybody, right? Go ahead. Let's go with Dan. Let's start with Dan and just come along and see what your feedback is. Go ahead, Dan. Why don't you stay right over there and just answer? Oh, okay. Okay, sorry about that.
That's a good question, and we recognize that some of our employees may be immunocompromised or have family members that are. So that's a decision that ultimately they would need to make, and we wouldn't encourage anyone to come back unless they felt comfortable. And part of coming back and onboarding and starting again with City Winery as we ramped up again was really rigorous training on what our protocols were, making them very familiar with what we were doing in order to keep them safe and keep guests safe. And so I think we have not had any incidents of people who went through that process and then said, this is not for me, I prefer not to be here. So I think they responded very well to what we were doing in order to keep them safe and keep our guests safe.
And you got any comments on that?
Sure.
Again, the question is, you heard the question, right? Okay, good.
Our environment is more of a production environment. With that being said, we provide social distancing, and with each one having their own station, it's a lot more comfortable in terms of working in that environment. So the majority of my employees would certainly welcome to come back in that environment.
Go ahead, Rich.
So, like Roger said, our employees are all sanitary certified employees. They want to work. They want to be in this situation because they're prepared for it. At our group, at our restaurant group, we haven't had anyone that has not wanted to work or come into work. They're begging us for more hours. They're begging us to get this opened back up a little bit and get the economy rolling in our industry back to closer to where it is, especially with the holiday season upon us. And they've taken this challenge on, being in this industry, by passing these certifications and going through the necessary process to do that.
Thanks, Rich. Mike?
So back in March 17th, we laid off 65 employees. When we reopened in June, we contacted everybody, and we only hired back 28. And of the 28, none of them are working full-time anymore. So we certainly had the opportunity to, for those employees who did not feel comfortable, perhaps they're living with their grandparent, perhaps they are themselves immunocompromised, to say, no, I don't feel comfortable. And a few did. But everyone who is working because they want to work. And everyone who is working realizes that we're doing an incredible job being safe for them, being safe for our customers. So I don't feel that it is an issue that people are feeling that they have to work when they don't feel safe, or they're frightened to come to work. Those that are working because they want to work. Thanks.
Jody, did you want to add to it?
I don't need to add to it.
Okay.
Thanks.
Did you, anything else from over here?
I'm good.
Anything? Okay, go ahead.
My only question is just for you. Have you formally submitted these demands to the mayor, and have you heard any response from anyone yet?
No, we've waited 40 days for this information. It's been heartbreaking because it's been costly for us to be able to advocate on behalf of restaurants. So we just got the data on Monday. We decided we needed, because the data was so startling, to me it was very shocking. We wanted to present it to the media right away, and we'll email the mayor, and we'll definitely get our ideas to the mayor very soon. And we hope the media will help convey that. Any other questions? Anything else down the road here? Hold on, let's let the truck go by.
When we looked at the data, we had the same issue that you did about it being somewhat incomplete, and because the tracers were unable to reach a a vast number of those who were affected. So how does that affect your view of the data in the first place?
Good question, John. Well, when you look at the data here, they were able to talk to 8,000 people, right? And of that, 585 of those people said they were in a restaurant. So that's extremely low. I think that's about 3% of the people said they went to a restaurant. We don't find that to be statistically significant. Now, if you think that number would be doubled, I mean, it seems like it would keep the same ratio. 3% of the cases apparently had some contact with the restaurant. Okay? Now, that's a good question. I don't know if the 3%, if this is conclusive information or if this is where the CDC says, hey, if your industry reaches some kind of 3% link, that's a problem. But I can tell you this. We have the data. The data doesn't appear to statistically significantly land the virus spread on restaurants. The 3%, none of these statistics were interpreted for us by the city, whether, hey, this was the big red flag that we decided to go with the governor and call for agree with the indoor dining shutdown. So what we need dialogue. We need cooperation. We need the end of the blame game. We need teamwork. But that's a good question. I mean, we just got the data. When we looked at especially 22 restaurants out of 7,300 closed for problems. That to us, my sense was, after talking to a lot of the restaurants, they bent over backwards to comply with the city's rules. So if there were more restaurants non-complying, there would have been a lot more closures. I'm really puzzled as to why the city wouldn't give us the fines data. Tell us. These restaurants have been asking for months. Tell us how we're doing. Tell us. We've been working hard. Tell us how we're doing. So we'd love to get the fines data from the city, how much in fines were issued. But Nancy left, and Nancy made a great point from B Hospitality. If the fines need to be higher, let's talk to the restaurants about that. If the protocols need to be different, let's communicate. Let's communicate. Let's have teamwork. Let's stop punishing restaurants unfairly that the data doesn't support that they're a major spreader of the virus. Does that answer your question, John? I'm doing the best I can, but I appreciate that question. Any other questions?
The question just along those lines, but I wonder if you can respond directly to something that the city wrote to you in your response.
Sure.
They say the Chicago Department of Public Health does not possess the data, nor does it have a way to track definitively whether COVID-19 transmission occurred while at a restaurant. So what does that tell you? They can't even know this data, is what they're saying.
Well,
so I guess, what's your response to that directly, where they're saying we can't even figure this out, we don't even possess this data, and we can't possess it?
I would say this: we need 100%. We need to achieve 100% contact tracing. That's first, and the fact that we're only at 45%, that's a concern. But we've got to get serious about the data. If there's a direct link, if we would have seen, what the data doesn't show is 585 people said they visited a restaurant within 14 days out of the 8,000 people interviewed. Okay, what kind of correlation was that back to the restaurant? Did the restaurant have a customer come back and tell them that there was a problem? So we're not seeing the kind of communication data that's communication with the restaurants to correlate this data. The other answer to your question is, the city can't tell where the virus is spreading. If we can't trace down exactly where this virus is spreading in a public place or in our private places, we're all having a big problem there. This is the 21st century. We can trace the virus. We can defeat the virus. But we need to get up to 100% tracing, and we need to trace back to the restaurant. So I guess that would be the response. Out of these 585 people that said, out of the 8,000 or 17,000 that said they visited a restaurant, did the city call the restaurant? Did they check to see if there was a double? I mean, if someone visited the restaurant, they're going to remember what restaurant they visited. So I'm a little concerned that this data is really lean. There's no narrative. It took us 40 days to get this data. I'm a little concerned about it. But again, to your point, we have got to know how this virus is spreading. We've got to know where it's spreading. And we can't get to a point where we say, well, we have no idea that it's spreading at a restaurant or on a college campus or in a hotel room. Where does that leave our restaurants? So they want to work with the city. They want to, if they need to implement safer protocols, great. If they need higher fines, let's talk about it. If we need to have a better spirit of reporting out offenders, let's do that. Now, we've got to be able to conclude where the virus is spreading. We've got to be able to conclude that. If not, let's go back into our restaurants, see what the protocols are, maybe brush up the protocols. But higher fines, better protocols, ultimately we've got to know where that's coming from. I don't know. Anybody else want to jump at that question? The city's saying that they don't really know for certain if it's coming from your restaurants. Go ahead.
If they can't produce that data, then how are they penalizing us? How are they shutting us down and rewarding us in the winter with a tent? That's what they've done. They've rewarded us with a tent. They've closed our insides down and rewarded us with a tent to put people in, or a bubble or whatever that is. We're allowed to do that. If you can't produce the data, then how are you penalizing us? How come we're not penalizing any other industry? And I don't want them to penalize any other industry. I'm not saying that, but how are you penalizing this industry that strives so hard since this has hit to stay within all the regulations, and we've gone above and beyond that as well?
Anybody else want to field that question?
One more thing that would help with the data is that testing is still not easily got. It's hard to get a test. It is, if we really, really want to defeat this, and we really want to get the data that will help us to defeat it and also to find out where the blame is, we need to have the city provide us with much, much more readily available, free testing for everybody that wants it, anytime. Right now, there's probably long lines. There's probably, you go online to get a test and they say, no, there are no appointments available. And that's something that the city could do. The health department should vastly increase the amount of testing available so that all of our employees can be tested as often as they feel comfortable being tested.
Anybody else want to address the city data issue? I do want to add one more point. Again, this is a lot of information that's coming fast, and we wanted to have this press conference as soon as possible because the winter's here. But look, we know what the city says about our restaurants.
All right, we've been watching for about the last several minutes Chicago restaurant owners and business owners there in the Windy City who are not very happy with the mayor's new restrictions on restaurants due to the coronavirus and the uptick in cases there in Chicago. So we were showing that to you just now. We want to now take it back over to some of the content we have now that today is Veterans Day. We want to wish all of those veterans out there a happy Veterans Day and thank you so much for your service to our country here on NewsNOW from Fox. We want to take it out now to WTTG Fox 5 DC, our sister station in the nation's capital, who profiled a veteran who owns a business there in the District of Columbia. Let's listen to that.
This morning on Veterans Day, we continue to highlight our heroes here in the DMV. Army veteran Denise Ormsby owns the Spot on Mill Street in Occoquan, which supports local, veteran, and women-owned businesses in Prince William County. Her family's service goes back hundreds of years, in fact. A huge resume of service in her family, and Denise joins me now to share more about her story. I love that photo of you in uniform. I tweeted that out earlier this morning. I mean, service is in your DNA. Tell us about the Spot on Mill Street and if you're doing anything special today.
Of course, we're always doing something special here for our veterans. We open up with that premise in mind. I think we sent you the pictures of our heroes table. We honor all of our military, family military, first responders, doctors and nurses and stuff that's all going on with this crazy COVID. Yeah,
that's what I was going to ask you. Because I mean, you were doing this type of giving well before the pandemic hit, and now you've also become this spot of support, especially during COVID. And then I know that on top of that, because I've seen your social media, you've also helped people collect and make service packages for military members overseas as well.
Yeah, we have been working on that. We actually are trying to work with Crown Royal because they're doing veteran packages for military members overseas. So we're putting some things together for them to send to special military members that are in places that may not otherwise get anything for the holidays.
I'd be interested in knowing, you know, I come from a family with a lot of veterans, and I remember when my sister retired, trying to find her way after the military.
I lost you a little bit.
Oh, no. Can you hear me now? You got me now?
I can hear you now.
Okay,
yes.
great. So I just wanted to touch a little bit about life after the military. I come from a family of veterans as well, and I remember when my sister was going through that transition of trying to figure out what to do, what to follow as far as her passion was concerned, trying to make those decisions. What kind of advice would you offer to the veterans out there that are still trying to find their way?
You know what? Just keep moving forward. You'll eventually find something that you are successful at or something that you are passionate about. And that's kind of what has led me to where I am now. I've always been in some type of service for the community, or, you know, not a necessarily pay it forward type thing, but I've always done things that were important in the community and such, and working with the community. And I just happened to like bartending, and this came open. This kind of was my passion that I felt I went for.
Yeah, so tell me about the spot, because it's not just bartending, right? I'm looking at a delicious burger right now. You've been named in Northern Virginia Magazine 2020 Best of Nova when it comes to food. What else do you offer there at the spot?
You know, my husband likes to tease that we're a bar that serves, you know, breakfast, but we really are. We serve breakfast all day long. Like you said, you've posted some pictures of our food. We source locally. I work with small businesses, and a lot of them are actually veterans as well. We get our bread, our gluten-free breads from an Army veteran. We get our cupcakes and our cheesecakes and all those things from military veterans and their families. A lot of the things that we get, our popcorn is a big hit here.
I love it. That's what I was going to ask is what's the one must-have thing that you should order when you come to the spot on Mill Street?
The Spot Burger.
The Spot Burger?
Definitely the Spot Burger.
Yeah. Oh, my gosh. And if you also want a dose of laughter, follow you on social media because you have quite the humor. I love it. Denise Ormsby, thank you so much for your service. Thanks for everything you're doing for the community. The owner of Spot on Mill Street in Occoquan. Make sure, everybody, that you stop by and say hi. Thanks so much.
Thank you, guys.
All right, and like I said, this is Andrew Kraft with the News Now from Fox. We've been following a lot of these veteran stories with veteran angles today because this is Veterans Day, and we want to thank all of those watching who may have served our country for their service. We want to switch gears now and head over, and we're following Tropical Storm Eta. As you can see here, this is the live radar as it moves toward North Florida, and the panhandle there is weakened to a tropical storm, I believe. But we're joined now by Ken Graham of the National Oceanic and Atmospheric Administration. Ken, thanks so much for being with us.
Just too early. They might start going north again.
And Ken, I was wondering, what is the trajectory like going forward with Eta? It's been so unique in that it has kind of made landfall, from what I've been reading, 4 separate times as it's made its way up to North Florida. So what's the trajectory looking like now?
Yeah, right now this will be the 4th landfall we expect tomorrow morning, and you know it's interesting. It's been battling so much dry air in the Gulf of Mexico, so it doesn't look like your typical system. Most of the weather's on that right-hand side, but that's where Florida is. So in those rain bands, you know, you're getting some of that significant wind, tropical storm force winds, and tornadoes. There's actually been tornadoes warnings issued for this. But as far over as the East Coast and even in the Bahamas, you see some of these rain bands. But this is what it looks like for our track. So by tomorrow morning, right on the coast here in Florida, where you're going to see some tropical storm force winds. But look how quickly it moves. By Thursday afternoon, already making its way off the east coast of Florida back into the Atlantic.
And as far as the number of storms we've seen this season, and we've had to go into the Greek alphabet, obviously, with Eta, are we going to be expecting any more storms going into November? We're almost at the end of hurricane season. Is this kind of rare and unprecedented to have this late of a storm still be hitting Florida?
Yeah, it is rare. I mean, this is actually this is a very unusual track for this time of year, especially making its way from Cuba and then back over to the Keys and then back into Florida. 2 landfalls in Florida, but yeah, 29 named storms for this season. That breaks the record from 2005. So yeah, the most named storms we've ever had, and we're not quite done. Hurricane season ends at the end of this month, end of November, and we've got a couple places that we're outlooked. We're watching it real close. So just urging everybody, these busy seasons, just like 2005. Sometimes extend towards, the end of the season and maybe even into December as it did in 2005. So we just can't let our guard down quite yet.
And Ken, just lastly, do you expect this storm Eta to strengthen any more? I know we mentioned that it has weakened considerably, but just making landfall, is that something you're looking out for?
Yeah, we're watching that real close. But the interesting thing about this one is just battling that dry air. I mean, if you really look at the satellite, Andrew, these red areas, that's super dry air. I mean, this is satellite detecting the moisture in the atmosphere, so nothing can really penetrate some of that dry air on the western side. So we're not really looking at it getting any stronger, but at the same time, wow, tornadoes, a rainfall, storm surge, 3 to 5 foot of storm surge is possible this around Tampa Bay. You get into some of those areas, you could see some flooding. So still some impacts, even though we don't see any more strengthening.
All right, Ken Graham there from NOAA. Yeah, we've been following a lot of that heavy rain there in North Florida, especially around the Tampa area, and when it made landfall a couple days ago, also around the Miami area as well. So, Ken, we'll be following this storm here on News Now. I thank you for your time.
Thank you.
And we want to just show you again the radar that we made here on News Now as well, that Ken was also showing you. And this is Tropical Storm Eta. And like Ken was saying, so many storms in this season in 2020. We've had to go to the Greek alphabet. And as you can see, the Tampa area, North Florida, just getting inundated with rains, heavy rains. Bringing substantial flooding there, as Ken said, also a threat of a storm surge. So we'll be tracking this storm as it makes landfall and goes what's looking like through North Florida up until the northern panhandle and out again. So we want to just take you back to some other stories we're following here on News Now. I'm Andrew Kraft. Let's take, how about a quick commercial break for some of you watching. And now let's go out to the nation's capital, where we're looking at some of these scenes. The Capitol Dome there, the White House. Today was the first day in several days we saw the president. On Veterans Day, he made an appearance to commemorate those veterans who've served at the Tomb of the Unknown Soldier at Arlington National Cemetery in the rain, with Vice President Mike Pence, and I believe his Secretary of Veterans Affairs, Bob Wilkie, was there as well, paying their respects at the Tomb of the Unknown Soldier. So that was the first time we've seen the president since his news briefing last Thursday from the briefing room. He took no questions from reporters. You remember the president, it was certified today that he won Alaska. I believe that's 3 electoral votes. Fox News Decision Desk confirmed that the president will take Alaska's electoral votes. We also found out that Dan Sullivan, the incumbent senator there in Alaska, won his re-election race. So the balance of the Senate is now 50 Republicans and 48 Democrats. And we'll be watching on News Now those 2 Georgia Senate runoff races come January, where they're already in campaign mode once again in the state of Georgia, as we learn that Georgia is doing a hand recount, recanvass, and audit there in the state for the electoral votes. So we're going to play out for you another event that we saw from earlier, but we'll be bringing you a lot of live events throughout the late afternoon and into the night here on this Wednesday. And speaking of Georgia, why don't we just play out for you that announcement from earlier from the Secretary of State there in the Peach State, where he announced that recount earlier this morning, I believe on the steps of the state capitol. Let's play that.
prayer of thanksgiving to all of those that gave their lives for this country, all those people that continue to serve. This is a special day. This is a hallowed day. Growing up, my dad served in World War II in the Navy, and people were called to serve. And then we had Korea, Vietnam, and the people serving today. And so we can never forget, and we can never give them enough thanks for what they've done for this nation. And one of the things that they fought for is for our right, our freedom, to have free and fair elections. So that is, at the end of the day, what we really need to be mindful of, particularly in our office, as we work finishing up and closing out the election that we just had. I also wanted to give a heartfelt thanks to the men and women who are standing with me here today. These are election directors from across Georgia. They represent large counties, small counties, diverse counties, and just from all over the state of Georgia. They and their staff are the ones that do the hard work on the ground of making sure that all legal votes will be counted. Their job is hard. They executed their responsibilities, and they did their job. This is a process. It is a process defined by law. These men and women in my office will continue to follow the law and count every legal vote. As it stands today, 97 counties have sent their final numbers in. The current margin stands at 14,111 between the President and Senator Biden, Vice President Biden. My office will continue to investigate each and every instance of illegal voting. Double voting, felon voting, people voting out of state. If you report it, we will investigate it. Every legal vote will count. We will continue to follow and enforce the law. Now let's look at the next steps. We are currently looking at having a statewide runoff on December 1 and another on January 5th. This is an untenable situation for these men and women to try and run both of these elections. With that, under my powers under the health emergency, I am moving the date of the December 1st election to coincide with the federal runoff on January 5th. This will protect the integrity of both elections and make for better election administration. It has the added benefit of saving taxpayers millions of dollars. The reason we have so many of these on rollover list voters is a direct function of COVID. This is the reality. The next step in the current election process is getting the final county certifications in. We'll then move to the risk limiting audit, or RLA. At 1 p.m. today, I will make the official designation of which race will be the subject of the RLA. At that time, I will designate that the RLA will be the presidential race. With the margin being so close, it will require a full by-hand recount in each county. This will help build confidence. It will be an audit, a recount, and a recanvass all at once. It will be a heavy lift, but we will work with the counties to get this done in time for our state certification. Many of these workers will be working plenty of overtime. We have all worked hard to bring fair and accurate counts to assure that the will of the voters is reflected in the final count and that every voter will have confidence in the outcome whether their candidate won or lost. Thank you for coming today. Do we have any questions?
So, can you describe what a hand recount will do for the nearly 5 million votes that have been cast in this election?
Well, because we now have that verifiable paper ballot, for the first time in 18 years, we're going to have something to count instead of just pressing a button and getting the same answer. So we'll be counting every single piece of paper, every single ballot, every single lawfully cast legal ballot.
And will that be the QR code or?
That will be the names that are on the ballot, whoever they voted for president, the English written word.
Will you be able to get that done in time for certification?
Yes, we will. As I said, people will be working lots of overtime next coming week. Lots of people will be really pleased with those paychecks if they're getting overtime.
Secretary, for the recount, do you have an estimate on how many election workers it will take to do that? And is there also an estimated cost? Does that come out of county, state, or federal funds?
That will be coming out of, we'll determine at some point. Adding additional workers, we will probably have to augment that, and we'll be looking at that, and that'll be the election directors at each county will be able, they'll actually handle their own additional, or their own county recount or risk limiting audit county by county.
Mr. Secretary, is this how this audit was designed to work? I thought originally it was supposed to be looking at a small segment of the votes with the larger picture.
Well, that's what's really interesting when you start really digging into probability theorem. When you have 5 million votes and the margin is so close, 14,000, if we pulled out 10,000 votes, all of a sudden it could say, well, this is the person that won. We pull out 100,000, it says this person won. We pull out 1 million, this person won. And that's why mathematically you actually have to do a full hand-by-hand recount of all because the margin is so close. Right now it's 14,101. So it's really just the mathematics, the statistics, the probability theorems that we use for the risk limiting that are taking us to that extent. So if it was another race or you didn't have that such a close thing, then you could do that and it would just be a sample size. But you can't do that when it's that close. This race has national significance, national importance. We get that. We understand that. We do. We follow the process, and we understand the significance of this for not just Georgia, but for every single American. At the end of the day, when we do a hand count, then we can answer the question exactly what was the final margin in this race.
All right, we've been listening there to the Secretary of State in Georgia, Brad Raffensperger, announced to the press that there'll be a hand recount in each county. He was saying that the votes will be certified by the deadline. I believe it's in December at some time. So that was some news out of Georgia today to make sure the vote counts are accurate. But we do have a live event here for you from Ohio, and we want to play that now and go to that. You know, here on News Now, we're all about the live events, but we can show you in real time that are live. So let's go out to Ohio, where Governor Mike DeWine is giving an update on the coronavirus situation there.
We're in the hospital right now with COVID-19. During the spring and summer virus surges, the most COVID patients we ever had in the hospital at one time was a little over 1,100. Last week, we were at almost 2,000 COVID patients in our hospitals. And today, 1 week later, we are now approaching 3,000. We now also have a record number of patients in our intensive care units. A month ago, 240 patients with COVID were in the ICU receiving critical care. Tonight, more than 700 of our fellow Ohioans are in the ICU. We've learned throughout this pandemic that what happens today sometimes won't reveal its full impact for weeks. This is certainly true of hospitalizations, and sadly, it's also true of deaths, leaving us with the stark reality that we simply won't know the ultimate fate of individuals who are diagnosed today with COVID for weeks or even months. Now, despite great work by our medical personnel, improved treatments for COVID, too many of our fellow citizens are still dying. In the first week of October, 86 Ohioans died from COVID-19. With many more Ohioans testing positive for COVID today, we know that number will surely grow. And it already has. During the first week of November, 104 Ohioans died. 104 mothers, fathers, brothers, sisters, sons, and daughters. 104 families left to mourn and grieve a loved one. To those families, please know that Ohio grieves with you. Now let's talk about our nurses, our doctors, and all those who care for COVID-19 patients. God bless them. Our hospitals are functioning right now, as if they were at the peak of the flu season in January. But unlike the flu, when hospital personnel know that cases will begin to drop and come to an end in the late winter and early spring, these new COVID cases are not trending down, and it's taking an enormous human toll on our healthcare workers. In the spring, we wanted to be sure we had enough personal protection equipment. That's what we worried about. We worried about ventilators, hospital space. Today, the question is whether or not we have enough people. Our healthcare workers are quite frankly exhausted. They've been running a marathon for 9 straight months. And with this new wave and the onset of flu season, it's like they're starting the race all over again. If we don't change this, we will not be able to provide appropriate care for all the Ohioans who need it. All the Ohioans who need it for COVID, and for all those Ohioans who require other emergency care, things such as accidents and strokes and heart attacks. Hospitals will again be forced to postpone important but less urgent care. Make no mistake, if nothing changes, this all could happen in just a few short weeks. Today, I was asked by our hospital leaders to confirm that Ohio remains in a state of emergency. I'm telling you tonight, it most certainly does. This state of emergency supports their ongoing efforts to make staffing adjustments in accordance with CDC guidance as they work to care for our rising number of COVID-19 hospital patients. Martin Luther King once said, and I quote, that every crisis has both its dangers and its opportunities. In this most dangerous phase of the pandemic, as Ohioans, we still have opportunities before us. We can control our fate. And the good news is that we don't have to search for the tools to fight back. They are ready at hand. We've used them effectively before, and we must use them effectively again. We got to get back to basics. Wearing a mask, maintaining at least 6 feet of distance from each other, washing our hands frequently, and not having parties and get-togethers in your house, and trying to get adequate fresh air into our homes, particularly as it's getting colder. What each Ohioan does in his or her own life impacts all of us. It impacts every community. It impacts every school, every nursing home, every hospital, every business. And the more people who get the virus, the more likely it will spread to all the places that we desperately want and need to keep open and operating. Just yesterday, I received a letter from a local school superintendent who was concerned about community spread in her community. She said, and I quote, that people don't seem to understand that while COVID exposures are occurring outside of the school setting, they are having a profound effect on our ability to keep our school open. Now, the simple truth is that your local school will not be able to stay open if it can't keep teachers in the classroom and bus drivers in buses. This virus threatens our ability also to keep our grandparents safe in nursing homes, our hospitals functioning, our businesses open, and our citizens working. We must do the basic and necessary things to protect those at the front lines. Our nurses, our doctors, our health personnel who are treating patients, our grocery store workers who are keeping our stores open, our teachers, our bus drivers, our child care workers who are helping our children. Let me tell you about Jen. Jen's a nurse at Ohio Health. During the start of the pandemic, she was on medical leave, courageously fighting breast cancer. Just as soon as she was medically cleared, Jen jumped right back into action and returned to work, first managing patient cases over the phone and now caring directly for her patients. She wears a mask at all times. She stays home while out working in order to stay safe and to protect her elderly parents and her patients. And so as we wait for this vaccine, we have so much to protect. We can't surrender to this virus. We can't let it run wild until enough of us get the vaccine. It's advancing quickly and seeking victims in every community in Ohio. If you don't know any of its victims yet, sadly, I suspect you will. Throughout the pandemic, most people and most businesses in Ohio have done things right by wearing masks and ensuring that safety guidelines were strictly followed. And we're very grateful for that. It's those actions that kept the virus from spreading uncontrollably in the spring and the summer. Today, every Ohioan, though, lives in a county where there is a high incidence of the virus. Most retail businesses have done a good job providing a safe place for their employees to work and for their customers to shop. However, it is clear that there are some businesses where mask wearing is simply lacking. We know that masks work. They are the easiest, most cost-effective way to limit the spread of COVID-19. Every retail employee has the right to work in an environment that is as safe as can be, which means all customers must wear masks. Further, each Ohioan who goes out to shop, wherever they go, they have the right to know that every store they enter, every door they go into to shop will be safe, and the people they encounter in that store will all be wearing a mask. Our mask order was issued on July 23rd, and in fact says just that. Today, we will reissue that order with 3 additional provisions. 1, each business will be required to post a face covering requirement sign at all public entrances to the store. 2, each store will be responsible for ensuring that customers and employees are wearing masks. And 3, we are forming a new retail compliance unit comprised of agents led by the Bureau of Workers' Compensation. They will be inspecting to ensure compliance of that mask order. A first violation of this order will bring about a written warning, but a second violation will bring about closure of the store for up to 24 hours. We must do this. We must do this to protect our frontline workers. And now let me tell you about Ashley. Ashley is a meat and seafood specialist for Kroger in Columbus. She's been with Kroger for 5 years. Ashley has severe asthma. Ashley has a chronic lung condition. She's an only child, only grandchild. And because many of her immediate family members have compromised immune systems, she has not visited her parents and grandparents since March. We need to follow the safety guidelines so that she can stay well and see her family again soon. As we implement the new mask order, it's essential that we also remember the existing orders that are already in place to slow the spread of the virus. In April, we issued an order to limit gatherings of more than 10 people. That limit has been and still is very much in effect. Now, this applies to public events and to private gatherings. Despite this order, we have seen rampant spread of the virus as a result of banquets, wedding receptions, and social gatherings following funerals. We have seen great tragedy great tragedy associated with some of these events. Now, it's not the ceremonies causing the problem. It's the party afterward. So to address this, we'll be issuing a new order in the next few days that will place significant new restrictions on these social activities. Specifically, open congregate areas can no longer be open. The order also requires everyone to be seated, everyone to wear a mask unless they are actively consuming food or drinks. And the order prohibits things such as dancing and games. Now let's turn to our bars, our restaurants, our fitness centers. If the current trend continues and cases keep increasing, we will be forced to close restaurants, bars, and fitness centers. We will look at this 1 week from tomorrow. I'm very well aware of the burden that this will place on employees. I'm well aware of the burden this places on the owners. But these are places, candidly, where it's difficult or impossible to maintain mask wearing, which we know now is the chief way of slowing this virus. Let me turn now to our schools. We must wear our masks to keep our kids in school. Our K through 12 schools are doing a phenomenal job. I thank them. I thank everyone in the schools. I believe that most children are simply better off in school than learning remotely. However, as the increasing surge threatens school districts' ability to keep teachers in the classroom, some schools are starting to shift to virtual learning. We must do everything in our power to slow this virus down so our kids can stay in school. It is up to each and every one of us. What you do in the community, what we all do in the community, impacts whether our kids will be able to stay in school. Because no matter how good the schools are, they cannot overcome widespread COVID in the community. It will get into the schools. Let's turn to our colleges. I want to thank our colleges, our universities, for agreeing to not return to in-person classes after Thanksgiving, but to finish the semester remotely. The vast majority of schools have made this decision. And I also want to thank them for reducing the number of students on campus. That has made a significant difference in helping keep the cases lower and our campuses safer. But unless we dramatically slow the community spread of this virus, our higher educational institutions in Ohio may have to remain virtual when school opens in January. With widespread COVID, they may have no choice. Again, it's up to us. My friends, my fellow Ohioans, I know you're tired. I'm tired of all this COVID. I know you're tired. I know you're weary. I know you want this to be over. But in words often attributed to Winston Churchill during one of the most dangerous and darkest times of World War II, when you're going through hell, keep going. And so tonight, I ask you, keep going. Recommit to your individual efforts to stay safe, because what you do in your private lives affects everyone. Please, please, don't host that birthday party or that baby shower or that kid's sleepover or that get-together to watch the football game. Don't attend the gatherings that you're invited to. Stay home when you can. Work from home if you can. And as we approach the upcoming Thanksgiving Day holiday, please remember that when someone you don't live with, not in your household, enters your bubble, it puts everyone you live with at risk. Even our family and our closest friends can bring COVID into our homes. They don't do it intentionally, but it happens when they don't know that they have the virus. And we just need to avoid any unnecessary and additional risk right now. If you're going to be with people who don't live in your home, if you feel there is something you just have to do, please make sure everyone is at least wearing a mask. It matters. Today is Veterans Day. We honor and remember all our men and women who have served our country. They understand what it means to serve a cause greater than themselves. This pandemic gives each of us the chance to serve a higher cause, a more noble purpose than just ourselves. None of us could easily forgive ourselves if we learned that a loved one got the virus because we had it and we didn't know it. It's just not worth it. It's just not worth the chance. My fellow Ohioans, few times in our lives will we ever be able to do something or refrain from doing something that will or can save a life. This is one of those rare times. Throughout our country's history, each generation has faced unique challenges. In generations gone by, Americans have been asked to lay down their lives that our nation, our country, might live, that we might live in freedom. Today, we all must do something far less dramatic, but very important. Wear a mask. Wear a mask that your friends, neighbors, and family members might live. All of our living generations are facing the same challenge in this country at this moment, at the same time. Ohioans have not faced such a collective challenge in 100 years. And whether you're 5 or 15, 20, 50, 80, whatever your age, you're facing this same challenge and have the same opportunities. On Sunday, Fran and I are blessed with a new baby granddaughter. And a grandson is due any day now. Each one of us has our own reasons why we want to be here when this horrible virus is over. And when we make that decision, when we decide whether or not to put on that mask, we should remember all those things that we really want to live for. All the world's great religions have their own version of what most of us learned as children as the golden rule. Treat others as we wish to be treated. Now, whether you were raised in a religious household or not, and whether you adhere to religious teachings or not, all of our most revered teachings are based really on the principle of believing in and working for something bigger than ourselves. It's a common good. It's the love for our fellow man. It's our obligation to our fellow man. And there's no higher purpose than to work for that common good. Each of us has a moral obligation to do our part. And I believe each one of us will do this. Our beautiful Ohio state seal depicts the sun shining brightly over Mount Logan in Ross County. That rising sun holds the promise that the light is coming, the dawn is near, and we will together get through this because we are Ohioans. Thank you very much. God bless you. I hope you have a good evening.
All right, that was Governor Mike DeWine there in Columbus, Ohio, where he was urging Ohioans to really not hold gatherings in person and not meet with small groups of people, friends, family. He says if you want to watch the football game together, just don't. And he was really urging Ohioans to not gather with these small groups of friends or family, especially just coming up with Thanksgiving holiday, because COVID cases are so high in Ohio. He said almost 3,000 hospital beds are occupied right now because of the rise in cases there in Ohio. So that was Governor Mike DeWine, and urging people to wear masks more than they are. He said there's been a lack of mask wearing, and then he said in the next several days they're going to announce this tier structure of prohibitions and restrictions on those people who choose not to wear masks out in public. He says the first tier will involve a written warning to people, and it could end up with that certain or said business being closed because of the lack of mask wearing in it. So we took that for you live and full, and we want to just keep it here on coronavirus news. We have some great content from our sister stations around the country, the Fox affiliates. So we want to hear from 2 of them in Atlanta and 2 of them in Minneapolis around all things coronavirus as it's happening right now, as people are trying to shop for the holidays, as people are trying to travel with the holidays coming up. But let's listen into this right now.
Safe during the pandemic.
But which ones are really worth listening to, or which ones are we listening to for that matter? As the Fox Medical team's Beth Galvin explains, a recent study shows the source of the message really matters.
UNC Chapel Hill researcher behind this study says she got the idea for it from a postcard she got in the mail back in the springtime with some pandemic safety tips. And it was credited to both the CDC and the White House. And that got her wondering which public health messages are most effective right now based on where they're coming from.
For months, we've been bombarded by health messages to wear a mask, wash our hands, keep our distance, stay home, avoid crowds. But does the source of these messages really matter? UNC School of Medicine's Dr. Marcella Boynton and a team of researchers set out to answer that question.
We actually had a pool of over 2,500 different messages.
Back in June, they asked volunteers to read and rate 5 pandemic safety messages that they had credited to different sources.
For example, you might have rated a message that said, protect the people you love, wear a mask. This message is brought to you by President Donald Trump.
Another message would read,
slow the spread, stay 6 feet apart from others. This message was brought to you by the Centers for Disease Control.
The study participants came from a cross-section of political and social backgrounds, but across the board, Dr. Boynton says they rated the messages credited to health agencies like the CDC or state or local health departments the most effective.
And what we found was for messages that included President Donald Trump as the message source or President Donald Trump and the CDC, those messages were less effective and created more negative reactions to that message than citing the CDC, than citing a local health department or state health department. So there's something about adding President Donald Trump's name to that message that really decreased its effectiveness and increased negative reactions to those messages.
And Dr. Boynton is continuing to study public health messaging during the pandemic, but she says this study clearly shows that people put more weight into advice coming from public health officials than they do politicians. For your Fox Medical team, I'm Beth Galvin.
Well, Thanksgiving is, of course, a huge time for travel, but this year things are a little tricky. Many of us are still trying to decide whether it's safe to hit the road or get on a plane right now. And to help us get a little clarity, Fox Medical team's Beth Galvin joins us live. And Beth, good morning. And it just feels like a lot of people are waiting until we're maybe closer to Thanksgiving to make a call on whether to travel. So is that a smart idea?
Absolutely, Elise. I think we're all just kind of holding our breath because things are transpiring so quickly that, it's hard to know what's going to be happening with this virus next week or the week after that. And what we are seeing right now is a major surge, kind of a third surge in this country in new infections. We're averaging, more than 115,000 new infections across the U.S. every day. And in, some days it's even higher than that, up to 130,000 new infections. So I think deciding about Thanksgiving Thanksgiving and what your plans are going to should involve some flexibility. It should involve some real thought that you're putting into it, and maybe just a wait and see approach. Like, if things are not looking good next week or the week after that, maybe we make the call then about what we're going to do. Elise?
So what are some things specifically that we should consider when we're trying to decide, whether we're going to stay here or whether we're going to travel?
So the Mayo Clinic had 3 good questions that they recommend that you be asking yourself about your Thanksgiving travel. And one is, what's happening where you're going? So what do the viral transmission rates look like where you're going? If you're going to a hot spot where this virus is spreading pretty easily in the community, there's the higher risk that you could be infected. And then another thing that you need to be asking yourself is, are you at higher risk if you do get infected of developing severe illness? I mean, could you be one of those folks who ends up in the hospital? Most people do just fine, but if you're at higher risk and you've got some underlying health conditions, this virus could be harder on you. The other question, do you live with somebody who is considered at higher risk of developing complications from this virus? If you do, you may want to really rethink, if either you or someone in your home is at increased risk, you may want to rethink Thanksgiving and maybe do a smaller celebration and stick close to home. Elise?
So if you're trying to decide whether or not to travel, is driving the best option? And then is it safe to get on a plane right now? Twofold.
So I think driving is going to be your best option if you can possibly drive, because you can control almost, so many factors about driving. So when you're driving, I think you really want to plan ahead. You want to pack your food. You want to pack your drinks so that you can limit the number of stops. When you do stop, you want to be wearing a mask. You want to be using that hand sanitizer or washing your hands and staying apart from other people. If you need to stop for food or gas, I think food, you go through the drive-through rather than going into a store or restaurant to get food. If you need gas, pay at the pump rather than going inside. And then I think when it comes to flying, I think planes in general are very safe because they have put in these very high-tech filter systems to filter the air while you're on the plane. They're, blocking off that center row. They're, making everybody wear a mask on the plane. But there's a lot that you can't control at the airport, Elise, or getting to and from the airport. So those are, factors that you'll have to think about. How do I stay socially distanced? Are people going to be wearing a mask at the airport? What do I do if I've got to wait in line with a lot of other people? Are they socially distancing? And I think you'll find in general, air travel is probably pretty safe when it comes to traveling right now, but you've got to be really cognizant and really vigilant about this virus and knowing there may be people around you who could be infected. Elise?
A lot to consider, and the clock is ticking when it comes to making a decision. Thanksgiving is now right around the corner. All right, Beth, thanks so much for the insight.
Yes, it is.
We appreciate it.
Thank you.
All right, with the holidays rapidly approaching, airlines are bracing for an uptick in traffic.
So for many people, it could be their first trip back on an airplane in months. Joining us live with what you can expect on your next flight is Thrifty Traveler Editor-in-Chief Kyle Potter. Nice to see you, Kyle.
Yeah, you as well.
If you are flying for the first time since the pandemic began, as many people will for the holidays, what should people be aware of and brace themselves for?
I keep coming back to what my friend Gilbert said about flying today, and he said it's kind of like an awkward first date. It's kind of uncomfortable. People don't really know what to do because this is such a strange new world. But a couple of things. The service on planes is generally speaking pretty bare bones, so don't expect to get anything more than a bottle of water and maybe a snack. And now airlines have done such a good job at cutting back how much they're flying to match just how few people are flying in the country today, despite all of the growth, despite the hopes that, more people are going to travel during the holidays, that unless if you're flying with an airline that is blocking middle seats, you should pretty much expect at this point that your flight is going to be full.
Okay, that's something to keep aware of. And there are obviously still airlines that are blocking middle seats, and every airline's kind of doing things a little differently. So what are the big differences in, I'd say, the main 4 or main 5?
Yeah, the biggest thing, as I touched on, is middle seats. So Delta is still blocking middle seats, and they say they'll do it at least through early January. Southwest has said that they are still blocking middle seats, but that will stop at the end of the month here. And then some smaller airlines like JetBlue and Alaska are also blocking middle seats. Meanwhile, American and United are not blocking middle seats and haven't for many months. So that's the big thing to keep in mind. And then again, the service that you get on each airline can vary greatly. The order that you get on the plane when you board, some airlines like Delta are boarding from back to front and in rows of just a few at a time, while others like American, at least in my experience, really haven't changed the boarding order to try to limit how passengers pass each other while getting on and off the plane. So it really just depends, probably more than ever, what airline you fly with now. So it really behooves you to do your research if you're concerned getting on a plane.
Okay, so before you get on the plane, you have to get through the airport. What would you recommend for people? Do you think the TSA PreCheck or Clear is a good idea?
I think so, but those aren't free. A TSA PreCheck membership costs $85 for 5 years. The starting price for Clear starts at $179 for 1 year. So these are not cheap. So I would say, do the math. Think about, not just 2020, but 2021 and far beyond, and ask yourself, what, is it worth, that $85 for me, depending on how I hope to travel for the next 5 years. But, no question, I have both TSA PreCheck and Clear, and, I value both of those probably now more than ever, because it does really speed up that time standing in whatever line may exist at the airport.
So Kyle, I follow you on Twitter, and I know you hopped on a couple of planes maybe a month or two ago for the first time in a while. Obviously, everyone has to wear masks. It's pretty much a mandate for all the airlines and most airports. What is the key to making it as the most comfortable experience as possible? Because let's face it, wearing a mask for many hours is not exactly a pleasant experience.
I think the biggest thing is to pack several masks and pack several different kinds of masks. When I have traveled for work, I've had an N95 mask in my bag as well as a good cloth mask. And, I think that's the biggest thing, especially once you get up in the air. An N95 mask for some people might be a little bit harder to breathe through as the air gets thinner. So you may want to, at least have that backup available. Not just if you want to be more comfortable, but also, things happen, masks break, and you don't want to be mid-flight and have a little tie break off, and all of a sudden you don't have a mask, which is against airline regulations right now. So that's the biggest thing, is just to be prepared and have a backup.
That's a very good idea. Yeah. Carry a couple masks at least when you're traveling. So we know, okay, so some people might make reservations and for whatever reason they have to cancel. Are airlines still as flexible with those cancellations?
Yeah, absolutely. It really depends on when you book your ticket, but what we're really focused on right now is 2021 travel. And right now you can book airline tickets all the way out through November of next year. And every major airline in the United States now says if you buy a ticket before the end of the year, December 31st, we will allow you to change that ticket for free, no questions asked, without paying that normal $200 change fee. Or you can cancel it and get a voucher. So that's huge. That gives everyone who's trying to figure out how to rescue their canceled trips from 2020 and replan something for 2021 some peace of mind that they can book some plane tickets for 2021 and not get stuck holding the bag if it turns out that those plans aren't going to pan out. And there have been some really amazing deals, really that far out into 2021, out into the fall and even kind of early winter travel period. So it is truly one of the best times to start planning future travel.
And as a customer, hopefully they continue that well beyond our current pandemic level. That would be nice moving forward. All right, Kyle Potter, thank you very much. We appreciate it.
Yeah, thanks, guys.
Thank you, Kyle. For all of your latest travel news and deals, you can visit thethriftytraveler.com.
The holiday shopping season already looks different this year. The pandemic, recession, and record unemployment have some feeling more like the Grinch. And joining us live with the 4 things we can do to make the season merrier and brighter, we need that, Justin Halverson from Great Waters Financial. Justin, good morning to you.
Hey, Tom. Good morning to you as well.
First off, what are we seeing when it comes to holiday shopping? What are the trends this year?
I think overall it's kind of expected, right? We're seeing a lot more happening online with the pandemic, as well as with the shift we've been seeing over the years people are moving more and more to online shopping, and we're seeing deals come out even sooner than Black Friday. People are starting to shop earlier. 30% of people have already gotten a jump on their holiday shopping. And the experts tell us that we're going to spend a little less this year. Tom, they say about $50 less per person. The reason being, we may not buy gifts for ourselves this year.
Oh, I would like to say that that's happened in our house. I cannot say
bad idea. Bad idea. I'm just saying that's what the experts are saying.
To help navigate the shopping season, you advise making your list early. So tell us about that.
Yeah, Tom, just like planning for retirement, right? You list out your income, your expenses, your assets, your liabilities. Let's plan for the holidays. They come every single year, and oftentimes we get caught off guard and we're scrambling and we spend too much. So make your list early. List out all the people you're looking to shop for, how much you're looking to spend overall, and then make those things match up. And how much can you spend per person? And you may have to make some cuts. You may have to trim back per person. You may have to cut some people off the list. But Tom, I'd like to just give people permission out there to know that people aren't expecting certain gifts from you. And if they are, that's not the kind of friend or family member you want. And so give because you want to give, because you care, and do it within your budget and your list.
Boy, that's a good way to put it, too. And the one thing I always try to think about, how much do I have to spend? And I do use the credit card, but I always know that I'm going to be able to pay that off at the end of the month. But that's where we can get into trouble, is using credit this time of year.
It sure is, Tom. And I'm not one of the financial professionals that says never use a credit card. I know some people say that. I'm for using it wisely. And it's just like you said, it's use it for convenience, use it for the security, get the points, get the miles, but pay it off at the end of the month. Because if you don't, the interest starts to rack up quickly. And the last thing you want to do is enter the new year trying to pay for last year's holiday shopping. That's just not a good way to enter into 2021.
No question. And then you also say consider alternative gifts that make a positive impact on your finances.
Absolutely. For some of you, you're crafty. You can make things. You can be, you can be good that way. But the one I'm going to give you, it almost makes me feel like the dentist that gives out dental floss and toothbrushes for Halloween a little bit. But the smart gift you could give for the younger people in your life is a 529 plan, a contribution to a 529 plan. It's a way to accumulate money tax-free for educational expenses, and it's getting them a head start on their future as well. We got a great list on our website, greatwatersfinancial.com, of all the good 529 plans available, and we're happy to help as well.
We've had them for both of our girls, and they are paying off big time. All right, Justin, great to chat with you on this Wednesday, and hope the family is well and you are well, and good seeing you. That's Justin Halverson from Great Waters Financial. You bet. For more information, you can head to Justin's website. It's greatwatersfinancial.com. That's greatwatersfinancial.com.
And there was just a collection of some of our great content from our Fox affiliates around the country on all things coronavirus, especially with Thanksgiving coming up, and if you should travel, if you should fly, if you should drive, what to do about holiday shopping, and a lot of great conversations from Atlanta and Minneapolis. But right now, we want to take you out to something we didn't get to show you live, but we have it still for you. This was a gathering of a group of people outside the Wauwatosa, Wisconsin City Hall. And we've been following this story of Officer Joseph Mensah, who has been accused of shooting Alvin Cole, that 17-year-old black teenager. So that was back in October. He has since been suspended from the police force in Wauwatosa, Wisconsin. There were some protests there, I believe, in late October. The shooting happened in October as well. But a grand jury decided not to charge Mensah, and people there in front of the City Hall today are now calling for his removal from the force. So let's listen in. I believe these are some of the family members of Alvin Cole as well.
Is a collaboration of different anti-racism groups in Wauwatosa. We are TOSA Together, Indivisible TOSA, TOSA Moms Tackling Racism, Persisters. And we're all here today because the Police and Fire Commission will be meeting this afternoon for a special meeting discussing the case of Joseph Mensah and whether or not he should be fired. It's most likely going to be a closed session, so we wanted to let you all know what we think about that. First, I'm going to bring up Ann Heidkamp with TOSA Together.
Good afternoon. I'm Ann Heidkamp from TOSA Together. TOSA Together is in full support of the Coalition's call for the Fire and Police Commission to act immediately in accordance with the investigation and report that they requested from Attorney Stephen Biskupic and remove Officer Joseph Mensah from employment with the Wauwatosa Police Department. TOSA Together is a community group that has been working for equity and inclusion in Wauwatosa since 2016. One of our first public actions was responding to the shooting death of Jay Anderson Jr. at the hands of Officer Mensah. This was Officer Mensah's second shooting in 11 months. Officer Mensah's first victim, Antonio Gonzalez, apparently suffered mental health and alcohol problems. All Mr. Anderson was doing was responsibly sleeping off a hangover parked in an empty public parking lot, creating no harm for anyone. We supported the Anderson family in their quest for justice. When the DA decided that he would not charge Officer Mensah and Jay Anderson's death, I was one of several TOSA Together leaders who met with Chief Weber and publicly called for changes in the Wauwatosa Police Department to prevent any such deaths happening again. At that time, we questioned if Officer Mensah had made good judgments about the type and level of force needed in the two situations and whether alternative actions on his part could have prevented the deaths. We expressed fear then that if he remained on the force, he might again move unnecessarily or too quickly to deadly force. At a minimum, we called for retraining and trauma counseling for Officer Mensah. We called for body cameras. We called for the TOSA Police Department to revise its use of force policy and provide officers with training in de-escalation. We called for implicit bias training. We called for police community dialogues. In response, the chief expressed the belief that the Wauwatosa Police Department was doing everything right and that the DA's decision not to charge reinforced that. And so, as we feared, here we are again. Our worst nightmares about Officer Mensah remaining on the force and the lack of changes in the police department came true when it was disclosed that he was the officer who shot Evan Cole to death near Mayfair Mall in February 2020. This is now 3 deaths at the hands of Officer Mensah in questionable circumstances. This might have been avoided if appropriate actions had been taken in 2016 and the ensuing years. The DA made it clear in his decision not to charge Officer Mensah in the Cole death does not mean the death was justified. It does not mean that Officer Mensah made the best decision or that shooting Elvin Cole was the only option available. It does not mean that changes in the police department are not needed. It does mean that if he remains on the force, the citizens of Wauwatosa have reason to fear not only him, but also the department as a whole that defends him and his actions. The Police and Fire Commission's own special investigator, Attorney Biskupic, calls Officer Mensah, quote, an extraordinary, unwarranted, and unnecessary risk to the city and its citizens, emotionally and financially, if he remains on the force. As TOSA Together, we call on the Police and Fire Commission to heed not only Attorney Biskupic's opinions, but also the resolution of the Common Council and calls from TOSA citizens to terminate Officer Mensah's employment with the police department immediately. Further, we call on the Police and Fire Commission to implement changes in the Wauwatosa Police Department regarding training, hiring, data collection, and alternative approaches to dealing with crisis situations, all recommended by TOSA Together and the city's Equity and Inclusion Commission and Ad Hoc Committee. Thank you. And now I'd like to bring up Dory Davenport-Stexton from Tosa Moms Tackling Racism.
Thanks, Ann, and thank you all for being here. Tosa Moms Tackling Racism was founded in June, or maybe it was right after George Floyd's death, on the idea that when George Floyd was dying and called for his mama, every mother was summoned to fight racism in our country. Along with all of the things that Ann just talked about, we want justice for the families of the victims at the hands of Joseph Mensah. We also really want the Wauwatosa Police Department to change. We can do better. We can do so much better, and we must do better so that Wauwatosa can be the community that we all want to live in and to raise our children in. This is what Wauwatosa mothers want. We have over 800 mothers in our group from Wauwatosa, and we all want change now. Thank you. I'd like to introduce Mary Lockwood and Joe.
All right, we've been following these scenes out of Wauwatosa, Wisconsin, and we'll bring you any updates on if the local officials do decide to fire Officer Joseph Mensah in Wauwatosa, Wisconsin later today. I believe they said that was a closed hearing, so we weren't entirely sure if we would have access to any pictures coming out of that meeting there in Wauwatosa. So we'll be on that story. But we wanted to take you out now to something happening in Houston, Texas. This is in Northeast Houston. Oop. Just lost the shot there of a recycling plant on fire. I believe we have it back. So Houston Fire is on the scene of this very, very large fire at this recycling plant. And these are coming to you, and apologize there. It keeps going to blue. That's just the chopper aerials from our sister station, Fox 26. Authorities, though, say this fire broke out at Independent Texas Recyclers shortly before 4 p.m. local time. And we're working on getting you more information. This is a breaking story right now, but emergency crews are working, as you can see there, quite diligently to douse those flames. And as you can see, there's even heavy equipment trying to get recycling out of the way there in the lower right hand of your screen. So we're monitoring this story. This is out of Northeast Houston. And this fire quite literally just broke out. And we hope our chopper aerials come back to the fire. We have another picture as well we want to show you here. And as you can see, they're trying to put this out at the moment. No word yet on if there are any possible injuries at all. And we're seeing now kind of the billowing smoke there over Northeast Houston as the chopper aerials are zooming out just a bit. And it looks like we have this as well too. You can see, I believe this is the same shot. They're going to zoom out now just a bit, but we're trying to get more information on this scene here. It does not look to be really under control just yet. Obviously, it just was alerted to us and to emergency crews that around 4 p.m. local time, this started at this recycling plant at Independent Texas Recyclers. So we hope the chopper is obviously there, just showing you the sunset in Houston, which is also quite picturesque, but we're hoping to get, here we go, some more aerials out of this fire in Houston. Emergency crews are on the scene. And in what appears to be just tons and tons of recycling just on fire. There's no yet a cause as to how this happened. We don't have any information on that. Obviously, fire investigators will be working to determine how this happened and how this started. And as you can see, they are out on the ladder there trying to put this out. Pretty stunning pictures from this Wednesday afternoon in North Houston. No word yet on if anyone really needs to be, evacuated from the area in case these are kind of noxious fumes. We haven't gotten any information on if that's a possibility. We don't really have any information yet either on on the actual number of emergency crews responding. But these are quite devastating images out of Northeast Houston this afternoon. I can't really tell if there's a structure in there, but from what it appears to be, no structural damage to this processing facility. It just happens to be that all of this recycling is on fire at the moment. And we apologize there. It looks like our chopper is having some technical difficulties with their shot there. We are gonna get off of this for now, but we've been showing you it for quite some time. Let's go back though to Wauwatosa.
We got 2 minutes.
All right, and there you just were seeing kind of what I've been alluding to, if there was any possible reaction by neighbors in the area. You see a lot of streets are blocked off by police there. People are trying to get close, it seems, to get a view of this on the streets there in North Houston. So those were new pictures we were seeing. So we'll be following this as it develops and as fire crews work diligently to put this out there in Northeast Houston at this recycling plant. For now, we want to head back over just to these great night shots, night scenes. Here you have the White House, where we saw President Trump and First Lady Melania today at Arlington National Cemetery to commemorate Veterans Day. They appeared with Vice President Mike Pence and the Secretary of Veteran Affairs. Here's the U.S. Capitol Dome. As the president still has yet to acknowledge President-elect Joe Biden, we await any remarks from the president on if that's coming soon in the next few days. But we're going to keep it on a lot of things politics here on News Now. where we're going to be talking to a number of reporters around the country about all these lawsuits that are happening in these battleground states. We heard today in Georgia that the Secretary of State there is going to be announcing, and he announced today, a hand recount, also a recanvass, and a audit. So we're going to go to Fox's multimedia reporter, Jayla Whitfield, who is in Atlanta, and she can break all of that down in that press conference from today. You know, Jayla, what exactly does that mean for the average Georgian and the average American, and how long will this take, this recount in Georgia?
Well, you know, there's over 5 million votes to count by hand, and that's a lot. So that means that this is going to take a while. But before this can even happen, the votes in each county have to be certified. And we have over 159 counties in Georgia. And so far, only about 80 or more have been certified. Well, you know, they're asking the counties to have their certifications in by this Friday. So then the Secretary of State's office can also certify those votes by next week. So hopefully that gets on the roll by the end of November. Maybe we'll know something by then. But it's really all up in the air. But, you know, Georgia is not just in the spotlight for this presidential election, but also because of the Senate race that's going on. There's a runoff election for that on January 5th, and it's going to decide who controls the Senate. You know, they actually started campaigning today. I was at a rally held by the Republican Party. Actually, Senator from Florida came out to host this rally for them. And there was about 150 people there. There was about 50 more people in the line waiting. I saw some masks, but not everyone had on a mask. And there definitely wasn't any social distancing. I don't know if they're worried about the coronavirus right now, but I did hear them saying at this rally that their vote really matters. They need all of those Republicans to get out and vote in this Senate race to make sure they keep the majority.
And Jayla, just lastly, going forward throughout the week, what would you be looking for as far as progress made in a lot of these hand recounts, especially in these counties? There's so many counties.
Yeah, I think my main eye is on making sure all the counties get their votes certified in time. Once that is complete, then we can start looking to the officials to see what the next step is going to be and what their time frame is going to be on this recount. I just know with a recount on more than 5 million votes by hand, I'm sure it's going to take a little while longer than expected.
All right, Jayla Whitfield there for us in Atlanta, Georgia. And we'll be following this as well here on News Now. Thank you for that update. And just to mention as well, Joe Biden's margin of victory there, I believe, is about 14 or 15,000 in the Peach State. So we'll be following that as this recount, I believe it automatically starts today, and electors will then certify the vote from Georgia going forward. So we want to just take you out now to some of these other scenes we're following, probably back to Houston, where you're seeing this large recycling plant fire. And we just lost the shot. We apologize. We have it back. And that's just what happens with some of our chopper aerials. The shot comes in and comes out. But there is a massive emergency response amongst crews and vehicles there that we can finally get a sense of. We didn't really have this vantage point when we showed it to you just before we spoke to Jayla Whitfield. But this is quite the massive fire there in Houston. Just to update some of those who are coming to this just for the first time, authorities are saying that this fire broke out. This is Independent Texas Recyclers, shortly before 4 p.m. I believe that's Central Time. And since we last showed it to you, it kind of looks the same, really. And as you can see as well, the emergency crews on the streets surrounding and the plant itself, that those streets look closed. And you can also kind of see in the previous shots we've been showing you, passersby, bystanders trying to catch a glimpse of it, I guess, with their cell phones, and those who live in the area. So we'll keep following this if we hear any more information or any more developments out of this here in North Houston on this Wednesday afternoon. So as we keep it on these really compelling images right now, they're terrible images out of Houston, we do want to take you back to that press conference that happened a little earlier in Wauwatosa, Wisconsin. A group there is calling for the firing of Officer Joseph Mensah, who was involved in the shooting death of Alvin Cole, the 17-year-old black teenager who was shot by Officer Mensah in October. And they're calling for his firing from the force. He's since been suspended, but no charges have been filed against him. A grand jury declined to charge him with attempted murder in that case. So let's go to that right now out of Wauwatosa, Wisconsin, and we'll be updating you on if the firing has happened amongst local officials there.
And you'll hear over and over again as people speak that we all sort of learned of this together in around the time that George Floyd was killed. We learned that Officer Mensah was the person responsible for the 3 deaths by our department in the past 5 years. Since then, we've written our Police and Fire Commission, we've written our council members, and if you look at the public record, since that time, an overwhelming majority of people have written requesting that this officer be fired. The community recognizes what a liability this is and the huge amount of destruction and harm that this officer has caused. We have the special report that people keep talking about by former Attorney General Stephen Biskupik, which not only states that he is unfit for duty, it also highlights the fact that he violated policies. So we have a report that says he's unfit for service. We have cause saying that we can fire him, and we have a community crying out for this man to be fired. We need Officer Mensah to be fired, and I personally, and as a member of Indivisible TOSA, am calling for the Police and Fire Commission to do their job and to fire Joseph Mensah so that the Gonzalez family, the Anderson family, and the Cole family and our community can heal. Thank you. And now Joseph Kranick with Indivisible TOSA.
Hello, and thank everyone for being here this afternoon. I just would like to reiterate what my colleague Mary of the Racial Justice Team in Indivisible TOSA says in stating that it is absolutely necessary for Joseph Mensah to be fired, and to be fired now. We have seen what he's done over a period of 5 years. He's killed 3 people of color. The numbers about how many police officers will ever draw their gun in anger, 76% never will in the entirety of their careers, and yet this one police officer has done it 3 times in 5 years. That is absolutely unacceptable. Under no definition would this ever be considered good policing. We all see this. We all see what he's done. We all know that the chances of him doing it again, if he's allowed to remain on the police force, are extremely high. He's had 3 chances now to show that he will not police in this fashion, and he's failed all 3. On top of that, I think it has to be hammered home again and again that the Police and Fire Commission in Wauwatosa asked for an independent investigation to be done to check out what he has done over this period of time, and they got it. They got Stephen Biskupik, who is himself a former U.S. attorney and a conservative and a law and order man. And he looked at the facts, and he came to a conclusion that validates what the People's Revolution and the coalition have been saying for months, that he is absolutely not fit to be a police officer. There really isn't anything else left to look at. We've seen the facts of the case, and the end result is clear. He needs to be fired. Justice has been denied to the families of Alvin Cole and Jay Anderson and Antonio Gonzalez for long enough. If we're ever going to move forward to something better, this needs to be done. It won't solve everything, but it's a necessary first step. So we at Indivisible TOSA demand that the Police and Fire Commission in Wauwatosa fire Joseph Mensah and do it immediately. Thank you. And now I would like to introduce Karen Zimmerman, representing Persisters.
Good evening. Persisters is a civic action group founded in Wauwatosa almost 4 years ago by women called by events to become more engaged citizens. We are now more than 600 women strong, growing in other communities. Persisters believe in holding our elected officials and the employees of our city to the highest possible standards. Like other groups in the coalition, we are committed to creating a more diverse, equitable, and just Wauwatosa. Persisters, along with other like-minded community organizations, wish to be part of a positive solution to address the recent turmoil and unrest in our community. To the Police and Fire Commission, Persisters call upon you to fire Joseph Mensah now. It is no longer safe for the city of Wauwatosa to continue to employ Officer Mensah. A special investigator hired by this commission has recommended his firing. We find the analysis in his report very compelling and urge you to heed the risks he identified. We also call upon you to review the best practices in police reform and to advance the best and most appropriate reforms for the Wauwatosa Police Department. Our community won't heal until change happens. Members of the Police and Fire Commission, you have the power to make it happen. Utilize your power to make the necessary changes. And next I would like to introduce Mariah Smith from the People's Revolution.
Hi, my name is Mariah Smith, and I am a representative with the People's Revolution. So my first statement is to the FPC is Joseph Mensah needs to be fired. My second statement is the why. So the way I see it, every job, being a police officer is a job. It comes with job responsibilities, job duties, just like any other job that you have. So let's say you're a mechanic. You're doing oil changes. Every time you do an oil change, you get customer complaints. My wheels are bad. My windows won't roll down. My antifreeze is leaking. That mechanic is gonna eventually lose their job for the simple fact they cannot do the duties that they have to do. So any other job, you'd get fired. Joseph Mensah is not doing what he's supposed to do. The responsibilities of a police officer are supposed to protect and serve us. First and foremost, he's protecting and serving himself. First of all, he's supposed to enforce the law, conduct criminal investigations, file reports, administer first aid. We know he does not do that. Make arrests, maintain knowledge and procedures, laws and ordinances, and operate equipment and vehicles. So those are his job duties. And it's been proven time and time and time and time again, 3 different times specifically, that he is unfit to be a police officer. So why does he still have a job? That's a serious question. Chisholm has already said he's he can't stand. What did he say? He can't. He's not fit to stand trial. Well, not trial. He's not fit to stand as a police officer. He also said that he couldn't say that the shooting of Alvin Cole was justified. So, again, why does he still have a job? I feel like Chisholm is giving this serial killer, he's a serial killer, he's giving him a license to kill. If you're telling him he's not right in what he's doing, but he's not fired, what are you telling him? Keep going, keep doing what you're doing. It's a slap on the wrist. He should not be employed. He should not be employed. He should be convicted. So, us at the People's Revolution, we're standing with the TOSA Coalition. Joseph Mensah needs to be fired. I personally feel like in the words of Maya Angelou, when someone shows you who they are, believe them the first time. Joseph Mensah has now showed us 3 times. We as the people believe him. I'm not sure why the FPC doesn't believe him. My last statement is a plea to the FPC. Fire Joseph Mensah. If you don't, who's to say that there's not going to be another body? Thank you. Oh. I'm going to introduce the beautiful, absolutely amazing Camilla. She is also a part of the People's Revolution. Camilla.
Good afternoon. On February 2nd, 2020, Officer Joseph Mensah ended the life of Alvin Cole in the parking lot of Mayfair Mall. In the 8 months since then, there has been no justice for his actions. Officer Mensah has remained on the Wauwatosa Police Department and is currently suspended with pay. There is no other job where you can kill 3 people and still be employed. Wauwatosa's mayor and FPC are complicit in continuing to pay a murderer. Since June, we, the People's Revolution, have been committed to seeking justice for the 3. Antonio Gonzalez, a Latino man, murdered in his front yard while in a mental crisis. Jay Anderson, murdered in his vehicle in the park while he slept. And Alvin Cole, who I have already mentioned, who was 17 years old. A teenager. Antonio Gonzalez did not deserve to die. He deserved a mental health professional. Someone who is trained to deal with someone in a mental crisis. Instead, he was shot multiple times because of Officer Mensah's lack of training and blatant disregard for human life. Chief Weber in the Wauwatosa Police Department awarded Joseph Mensah a Medal of Valor for the murder of Antonio Gonzalez. Who gets an award for murder? Who gets awarded for killing someone? Nobody else had to lose their life, but because of TOSA's implicit bias and racist ideology, Mensah remained on the force just to commit yet another murder. Jay Anderson Jr. was asleep in his vehicle. I'm sorry, y'all. Jay Anderson Jr. was asleep in his vehicle when he was approached by Officer Mensah. Jay Anderson posed no threat to Joseph Mensah. He was asleep. He posed no threat to the community. He was asleep. What type of threat does a man pose while he's sleeping? But Mensah still murdered him. At this point, what is the purpose of him still being employed? Why is Wauwatosa continuing to pay a murderer who has been deemed unfit for duty with the real threat of a forced shooting? This is what their special investigator concluded. But he still has his job. Wauwatosa needs to put its citizens first and hold their officers accountable for his actions so no one else has to lose their lives. All people have the right to feel safe in this community of Wauwatosa, and that includes black and brown people. The People's Revolution demands the immediate termination of Officer Joseph Mensah's employment with the Wauwatosa Police Department. Because if you don't, he will kill again. And it might be your child, your brother, your sister. There's no reason for Joseph Mensah to still be employed. None. None. You killed 3 people. That's 3 legacies gone. And he's still being paid. So it's time for Wauwatosa to do the right thing by its citizens and also by the people who commute back and forth through Wauwatosa, who work in Wauwatosa, who spend their money in Wauwatosa. We deserve to feel safe. So the People's Revolution is demanding the immediate firing of Joseph Mensah. I'd like to introduce the phenomenal attorney Kimberly Motley. Thank you.
Thank you guys for coming. And thank you all for being here. It's wonderful to have all these groups here, Tosa Moms, Tosa Together, Indivisible Tosa, the People's Revolution. You know, again, we strongly believe that Joseph Mensah, and we have the evidence to show that he should be terminated immediately. As has been mentioned, according to attorney Stephen Biskubich's reports, he has said that Mensah is not credible. He has said that he should be terminated for just cause. We know now that Joseph Mensah has violated Wauwatosa Police Department policies while he's been on suspended paid leave. If the Common Council and the Mayor of Wauwatosa and Chief Weber wanted to terminate Joseph Mensah, they do not have to wait for the hearings. He has violated the policies while he's been on suspended paid leave. And this was noted by Chief Weber when he sat down with Stephen Biskubich and he was interviewed. And that interview we have a transcript of that we're happy to share on September 21st. Chief Weber can be demoted and should be demoted today. Mayor McBride and the Common Council could demote Chief Weber today if they wanted to. And they need to think about their reelection prospects. They need to know that Vice President-elect Kamala Harris has talked about Alvin Cole. This past election in Wauwatosa has shown that this city is a blue city. Mayor McBride can be recalled in April. He is refusing to act. He is hiding behind the law and claiming that he can't fire Chief Weber. If he wants to accept that interpretation, we disagree with that. However, we do know that we can both agree that he can demote Chief Weber today. And he continues to fail to act. To be complicit in the actions of Joseph Mensah, to not do anything today, shows an acceptance for his actions. We also know that today there was a lawsuit that was just filed against the city of Wauwatosa for the targeting of nonviolent peaceful protesters as it relates to the curfew. We know that there were over 60 arrests as it relates to the curfews. And again, all the protesting, all the marches and things like that that have been happening in Wauwatosa is a result of people calling for Officer Joseph Mensah to be fired. Calling for the politicians in this community to do what they are elected to do that they continue to fail to do. The Common Council and the mayor, they don't have to hide behind the Fire and Police Commission. We could take care of this today, right now, if they wanted to. And this will be remembered when people are going up for re-election. This will be remembered when come April, when Mayor McBride can be recalled. So we appreciate the support of everybody. This isn't just about the three families, the Alvin Cole, Jay Anderson, and Tony Gonzalez's families. This is about justice. This is about the type of community that Wauwatosa wants to have moving forward. Do you want to be the community where you now have Vice President-elect Kamala Harris talking about Alvin Cole and what happened to him? Do you want this to be a community where Reverend Jesse Jackson has to send a representative to come up and mediate a conversation, a first conversation between the mayor and the families? Do you want a community where you have a chief for over 30 years who has ruled this community with impunity, who has shown extreme abuses of power with the way people have been treated while they've been protesting this community, the way the families have been treated when they have been nonviolently protesting in this community? Do you want a chief that wants to say that he wants to keep an officer on the force who he has admitted to has violated the policies that he has written himself, and he has no problem with that? So it's time for a new day. Wauwatosa, this is your opportunity to show the world who you are. And for those that choose not to act and not do anything, this will be remembered come election time. So thank you.
Thank you for coming out today. As you can see, we are all here united. We are citizens of Wauwatosa. We are citizens of Milwaukee County. We are all part of this community, and we all want the same thing. So thank you for coming out and listening to us today. We appreciate it. Thank you.
Fire Joseph Mensah!
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 All right, so we do want to take you back out to this breaking news coming out of Houston, Texas. Firefighters are responding to a recycling plant blaze. You can see right there. The flames have gotten larger since we started following this shot. Again, these are aerial shots from our sister station KRIV out in Houston, Texas. Authorities say that the fire broke out at Independent Texas Recyclers shortly before 4 p.m. This is near Bennington in northeast Houston. Still not a lot of information coming out about this particular story, but several crews on the scene. Flames still active tonight with smoke billowing up into the air. Again, this is in northeast Houston at a recycling plant. Here on News Now from Fox, we are going to continue bringing you the latest live coverage of not only this, but we are speaking with reporters on the ground in several states around the country. In the next hour, we will be speaking with one of our reporters in Pennsylvania, where a legal battle continues over the presidential seat. We'll also hear from reporters out in Nevada as well. As we keep our eyes on this shot, we are going to take a quick 2-minute commercial break. We'll see some of you in just a few minutes. For those of you who are just tuning in right now, we are watching a recycling plant set ablaze tonight. No word yet on how the fire sparked or if there have been any injuries reported. Only information we know so far is that emergency crews are on scene of this roaring fire at a recycling plant in northeast Houston. We'll keep this shot up in what we call a double box, meaning that you can watch it on the screen as long as we have the shot, but we're going to switch gears a little bit and go out to a COVID-19 update from Virginia. You're watching News Now from Fox.
Are unfortunately trending upward. Today, the Virginia Department of Health reported 1,435 new cases and 13 newly reported deaths statewide. We're seeing a rise in cases and in percent positivity, which is now 6.2% statewide, and we're also seeing a rise in our hospitalizations. This is very concerning, especially because it is getting colder. The holidays are approaching, and the temptation to gather with other people is high. So let's look at some of our numbers. You can see from this graph that our cases are rising. It tells us that this virus is still alive and well, and it is very, very contagious. Our statewide positivity rate, as you can see from this slide, is 6.2%. We continue to be concerned about Southwest Virginia, which has rising cases, community spread, and fewer hospitals than other regions of our state. The percent positivity there is around 9%, which is higher than the rest of the state. Our team has been in communication with health directors in Southwest Virginia about the spread in that region. We're focusing on a communications campaign to emphasize the importance of doing the things that we know work, avoiding indoor gatherings, washing our hands, and wearing face coverings. Remember, Virginia has a mask mandate in place when you're indoors or out in public. It's also a good idea to wear a mask whenever you're around other people, especially indoors. I know local leaders in Southwest Virginia are working with Ballard Health to reinforce this simple message. We can all protect the health workers around us when we take precautions like wearing a mask. Business, faith, and education leaders in the region sent a letter to their communities with that message last week, and it's important for everyone to hear. While we are concerned about Southwest Virginia, I want to remind Virginians that we're seeing rising cases in other regions and around our nation as well. The central region of Virginia, for example, is seeing a steady increase in case counts. So my message today is for every Virginian, because we are one state, one commonwealth, and no region is an island. We all need to step up our vigilance and our precautions, especially as we head toward the Thanksgiving holiday. It's important to remember some important points. This virus spreads through the air, and it spreads more easily indoors. You should take precautions around anyone who does not live in your own house. Yes, even if they are your family. There's no genetic immunity that prevents you from giving this virus to your mother, to your grandfather, or any other loved ones in the house with you. I'm not saying don't celebrate Thanksgiving, but if you're planning to gather with people outside of your household, think about ways to do it more safely. Consider how the space is ventilated, or think about ways to have gatherings outdoors, especially if the weather is like it is today. Wash your hands. Think about smaller gatherings and wear a mask. I want you all to be safe and to stay healthy and to do what you can to keep your friends and family healthy. As we have said all along, testing is a vital part of how we combat this virus. We have two pieces of testing news to announce today. First, we're announcing contracts with 3 labs to participate in our new One Lab network. One Lab is our coordinated COVID-19 lab testing system. It allows us to increase our testing capacity specifically to support high-priority testing campaigns, such as community testing in surge areas, outbreak investigations, and testing in congregate settings, such as our nursing homes. This network will allow us to add about 7,000 new tests per day by the end of the year. Second, we're in the process of distributing antigen tests. Those are the quick response tests. We purchased 200,000 tests through the Rockefeller Testing Compact, and those are arriving in Virginia and being distributed to our nursing homes and our long-term care facilities. In addition, we're receiving rapid NewsNOW tests from the federal government and have distributed more than 52,000 of those so far. This week, we're distributing hundreds of thousands of tests to the Virginia Hospitals and Healthcare Association, institutions of higher education, and to local health departments. As we focus testing on high-need areas, our health equity team has distributed more than 850,000 masks and nearly 700,000 bottles of hand sanitizer in communities all over Virginia. As you know, our DE&I, our Diversity, Equity, and Inclusion Officer, Dr. Janice Underwood, has been overseeing this particular project, and I thank her for that. And we are also continuing planning for a coronavirus vaccine. Yesterday, we all heard good news from Pfizer that their vaccine appears to be 90% effective. That is very, very encouraging. But we should all remember that this isn't the magic bullet. Any approved vaccination will still take months to distribute. Virginia, like other states, has spent months already preparing plans for how to equitably distribute a vaccination. When a vaccine is ready, one that is safe and effective, we will be ready too in Virginia. Now I'd like to turn to the General Assembly. They adjourned their special session yesterday evening after 84 days. And I'm proud of the good work we did together to address criminal justice reform and adjust our budget for COVID considerations. But I still have some concerns, specifically about restrictions on executive authority to respond to the COVID-19 pandemic. While it is very important to work with the General Assembly, especially the money committees, and we have been doing just that, it is also important that we maintain flexibility. For example, we crafted the Rebuild Virginia project in one way, and then we saw that the needs were greater. So we were able to make changes to the program to help more businesses. In fact, in the 2 weeks since we expanded Rebuild Virginia, we've approved nearly $50 million in grants and still have some 6,000 applications to be processed. We know there is tremendous need for help for our small businesses, and we will continue to work on ways to assist them. In recent weeks, we have distributed federal CARES Act dollars to help Virginians across the Commonwealth. We have allocated $7 million to help our food banks to address food insecurity. 19% of our Virginians are food insecure. Nearly $140 million to help colleges and universities cover COVID preparation costs. $220 million to K through 12, $60 million for utility relief programs, $30 million for workforce training, and $3 million for our free health clinics. Overall, I'm proud of our work on this budget. We went into this special session to craft a budget that would help Virginians get through this pandemic, and we have done just that. This budget will help keep people in their homes with their lights on and their water running. Now I'd like to talk a bit about the elections. We saw roughly 73% of all registered voters turn out to vote either in person, early in person, or by mail. Virginians embraced our new early voting laws. Around 2.8 million Virginians voted early in person or early by mail, a jump from 566,000 who voted early in 2016 when early voting was more restricted. I really want to thank our election officials, both at the state level and in every locality, for a smooth and well-run election, especially given the challenges of this pandemic. I also want to thank all of the poll workers, the people who volunteered their time. Elections are the ultimate exercise in democracy, and we are all grateful to those who make them work. Today, Virginia localities are certifying their election results. Next week, on the 16th, the State Board of Elections will meet to certify those results. This is our system working as it should. In the words of an editorial in the Virginia Pilot this morning, Virginia should be proud to have delivered on the promise of conducting an election with integrity, even in extraordinary conditions. End of quote. Finally, a word about the results of those elections. We expect to have a new president in January. President-elect Joe Biden and I look forward to working with him and Vice President Kamala Harris. I am heartened that President-elect Biden's first action has been to appoint a task force to respond to the coronavirus pandemic. Other governors and I have said for months that a stronger federal response would be helpful to us, and I look forward to seeing that become a reality. In closing, I want to reiterate what I said earlier about our rising caseloads and the upcoming holidays. Virginians, you have done an exceptional job over the past 8 months of responding to this crisis. And think about that, 8 months. And I know you're tired. I'm tired. The new normal is still ahead of us. But I want to say, by and large, people have listened to the public health advice, and we can't stop now. We put on our face coverings in public, and we avoid large crowds. And we need to keep it up. It's more important now than ever. We cannot get complacent or let down our guard for the holidays. I don't want to see our case counts continue to rise, but we want to lower them, and we all must do our part. You know, we are leaders in Virginia, and I'm just like you, I'm proud to be a Virginian. We're number one in a lot of things, and I want to be number one in having the lowest numbers of COVID-19. And if we continue to work together, if we all come together and be part of the solution, we can get our numbers down where they need to be until the hope of that vaccination comes to us. So keep up the good work. I thank you for all you're doing, and I really hope all of you have a safe and peaceful holiday season. I'd like to bring up our Commissioner of Health, who's also been working overtime, Dr. Norm Oliver, to talk more about the health numbers and especially about our vaccination plans, which I think are really exciting. And then we'll be glad to take your questions. So thank you. Dr. Oliver.
As the governor mentioned, our numbers have been increasing for pretty much the last month or so, a little over a month. And that was demonstrated as well yesterday. He reported that we had 1,435 new cases of COVID-19, bringing our total case count up now to 194,912 cases. Our deaths were at 13, and total death count now stands at 3,726. Testing has been doing well. We still are averaging somewhere around 19 to 20,000 tests a day. Yesterday we posted 17,809 PCR tests. The number of antigen tests have been increasing as well. I wanted to underscore what the governor said about the importance of continuing our mask wearing, hand washing, physical distancing as a way to keep a lid on the spread of this virus that causes COVID-19. The news from Pfizer was indeed very encouraging. We will see what happens with the vetting process at the FDA and whether or not they get their EUA. In any case, we can expect to have a vaccine from one of the many that are in play right now by the end of the year. And I want to let you all know that we are ready to get that vaccine and administer it to citizens here in the Commonwealth. A COVID-19 vaccine is especially important because in order to stop a pandemic, we really have to do our best to increase the immunity that exists in the population. And vaccines do that. They boost immunity and helps us to fight the vaccine. Although, as the governor said, it's going to take months for us to vaccinate millions in the Commonwealth. It will take a while to develop that immunity, and during that period of time, a lot of the things that we're doing now, we will continue to have to do. VDH, the Virginia Department of Health, maintains a very robust system of emergency response to things like the flu and novel viruses like the coronavirus. We've done mass vaccination campaigns every year for seasonal flu. We've done that this year. Our flu vaccination rate is up by 30%. Thank you to all of you who've been helping to participate in that. We are ready and organized and prepared to deliver the COVID-19 vaccine as well when it is delivered to us. Our unified command, the whole of government approach that we've taken to responding to the COVID-19 pandemic, established a vaccine unit early on and developed plans. We wrote a plan for how we were going to set up dispensing units for the COVID-19 vaccine and the distribution of that, submitted that plan to the CDC at the beginning of October. It was approved by the CDC. Since then, there's been, of course, a lot of new information coming out of the CDC, out of HHS around the vaccines, and as a result, we've revised and tweaked those plans, and we are ready to work with the CDC and the Department of Defense, who are the two entities that will be leading the vaccine allocation, to receive those vaccines from them and ensure that those vaccines get into the arms of us here in the Commonwealth of Virginia. One note on the safety and efficacy issue. We know and share with the rest of the people in the Commonwealth the importance of ensuring that the vaccine that we distribute and administer is safe and effective. This is our number one priority. We work very closely with the CDC to conduct active surveillance and review of all the trials and the data coming out of those trials about the vaccines. Our vaccine unit has an advisory committee which has a number of healthcare professionals and a subcommittee that's been reviewing all the data around the vaccines and will serve as our own sort of review board to ensure that the vaccines that we receive are safe and effective vaccines to protect us from the pandemic. And with that, Governor, I will hand it back over to you.
Hi, can you talk about the decision to enter into these contracts to boost testing? Is that because we're anticipating cases to go up during the holidays, or what was the need for that? And then Dr. Oliver or anyone, if you could talk about the rise in cases we're seeing in the state, and then also maybe the positivity rate. How should Virginians mold that information? What level of alert should we be in right now?
Great questions, Mel. Let me handle the first one regarding testing. And I know you all have heard us talk about this before. Our first case in Virginia was on March the 7th. And at that time, the few tests that we had available were sent to the CDC in Atlanta, Georgia. The turnaround time was anywhere from a week to 2 weeks. And so we have worked really hard, and I think in our messaging have tried to impress upon Virginians the importance of certainly, number one, a better turnaround time, and also more testing. And so the availability of testing right now, and what we've been using mainly in Virginia, are the PCRs. And we've gotten the turnaround time down to 1 day, sometimes 2, sometimes 3, depending on which labs are doing it. But what's really important, Mel, and I don't think it's in response to what we're seeing or forecasting down the road with the holidays, but it's just overall the need to be able to do more testing, and also to do testing with a more rapid turnaround time. And so we've really put a lot of emphasis into the rapid antigen test, where the turnaround time may be 15, 20 minutes. Part of that process, and I might have missed it if Dr. Oliver said it, but part of that process as we move forward with the antigen test is the training of the individuals to do that. So we're also in the process of that. So whether it be for our hospitals, our healthcare facilities, whether it be for our nursing homes, our higher education schools, to be able to have more of the rapid testing will really make Virginia more nimble in order to deal with the hot spots or the outbreaks through Virginia. So that's really been our focus and our incentive moving forward. Dr. Oliver, did you want to?
Maybe I'll start. Just to add to what the governor had mentioned, the expansion of the public health capability from the ECLS lab here in Richmond and the one in Fairfax was to make sure that we had additional public health testing capacity. In Virginia, the PCR tests, which are in addition to the antigen tests that the governor just mentioned, we did almost 600,000 tests in October, over 18,000 a day. And we saw last week multiple days above 22,000. Most of that, over 90% of that testing, is in where it should be. It's in the clinical areas. It's in our health systems and from doctors' offices. It's coming from pharmacies. It's from federal qualified health centers. But in addition to that, that's driven by people seeking care because they have flu-like symptoms, we also need to be prepared for outbreaks and surges. And that's why it's quite strategic to add to the public health lab in Northern Virginia, the one here in Richmond. We've added the 3 additional partners as part of one lab.
All right, you're watching News Now from Fox. We're going to switch gears a little bit. Let's head out to the White House right there. What a beautiful look. And we have a live report as we promised you. Ballot counting in Pennsylvania continues as President Trump's campaign ramps up its legal battle over election results there. Fox's Katie Byrne is live in Pittsburgh. She brings us the latest now. Katie, how's it going out there?
Hey Daytona, well, it's been a busy day for workers here. They've been going through thousands of ballots as President Trump's campaign is challenging election results in the state. The campaign, though, still hasn't pointed to evidence of widespread voter voter fraud rather, that would change the outcome of this election. So far, there's been litigation over three main things in Pennsylvania. The campaign is arguing some poll observers had to stand too far away. They're questioning the legitimacy of late arriving ballots, and they're saying some counties weren't efficient in alerting voters about mail-in ballots. Officials here in Allegheny County, where Pittsburgh is, though, say there's been no evidence of widespread fraud here. They are looking into one report. Listen.
What this means is if you are a Democrat in Philadelphia, you are allowed to work outside the bounds of the restrictions on fixing defective ballots, sometimes referred to as curing. But if you're in Republican counties in the state of Pennsylvania, you are not allowed to do that because they're strictly following the text of the statute in Pennsylvania.
So you just heard from Matt Morgan, the lawyer for Trump's campaign. That was what he had to say on Monday. And now today, in response to the lawsuits, Pennsylvania's Democratic Governor Tom Wolf says allegations of fraud and illegal activity have been repeatedly debunked and dismissed by the courts. There's a little over 45,000 ballots left to be counted here in Pennsylvania. Biden is leading by about 49,000. And here in Allegheny County, that's where Pittsburgh is, they say they think it might take until Sunday to finish counting, but the state has until November 23rd to certify their vote. Daytona.
Katie, we're hearing of some issues that Pittsburgh is having. Can you break that down for us?
Yeah, we got some more information on this yesterday. So the Board of Elections here in Pittsburgh, Allegheny County, had to have a vote basically about what they were going to do with about 2,000 ballots that were missing a date. So this got some attention because people thought that that date was a postmark, but it wasn't. It was a date that was where the voter may have signed at the bottom of their ballot, their signature. Ultimately, the Board of Elections decided they're going to keep those ballots, so there's about 2,000 of them that they're still going to keep despite the date being missing. Daytona.
All right, thank you so much, Katie. Katie Byrne out there in Pennsylvania. She's been out there all week for us. We appreciate you, Katie.
Thanks for having me.
All right, so there you have it, the latest in Pennsylvania. We're also going to have a live report in Nevada as well, so stay tuned for that. We're going to send some of you off to a 2-minute commercial break. We'll see you in a sec. For those of you who are sticking around with us, we are going to head back to that Virginia update coming from the governor out there about COVID-19 and the rise in cases that they are seeing. Definitely an unfortunate but pretty popular situation for a lot of states right now. You're watching News Now from Fox. Thank you so much for joining us.
Outbreaks through Virginia. So that's really been our focus and our incentive moving forward. Dr. Oliver, did you want to? Maybe I'll start.
Just to add to what the governor had mentioned, the expansion of the public health capability from the VCLS lab here in Richmond and the one in Fairfax was to make sure that we had additional public health testing capacity. In Virginia, the PCR tests, which are in addition to the antigen tests that the governor just mentioned, we did almost 600,000 tests in October, over 18,000 a day. And we saw last week multiple days above 22,000. Most of that, over 90% of that testing is in where it should be. It's in the clinical areas. It's in our health systems and then from doctors' offices. It's coming from pharmacies. It's from federal qualified health centers. But in addition to that, that's driven by people seeking care because they have flu-like symptoms, we also need to be prepared for outbreaks and surges. And that's why it's quite strategic to add to the public health lab in Northern Virginia, the one here in Richmond. We've added the 3 additional partners as part of one lab. Blacksburg, Southwest, Charlottesville, kind of Western Central, and then Centera Healthcare with their lab down in Tidewater. So it is all about the different varieties of labs, lab testing available to take care of the total problem. But that's really exciting because it makes sure that when there's a time of outbreak and there's a time of delayed testing times, that we have that capability for rapid turnaround in the public health to add to the total picture.
Thank you. And Mel, your second question is, I think, maybe addressing how we're mitigating or how we're planning to mitigate the higher numbers that we're seeing in Virginia.
Talk about the level of alarm that the numbers that as you're talking about cases are rising, what does the positivity rate say and how alarmed should Virginians be about those trends?
Well, I would say, they're rising. As you see, a few weeks ago we were below 5% positivity rate. Now we're over 6. We're at 6.2. And you saw the graph just like I did. So the message is that, as I said earlier, Mel, this virus is alive and well. It is very contagious. And so we are looking at ways across Virginia to mitigate the rising numbers, and that's by increasing our testing, as we've already talked about. It's also about communication and working with our elected officials in the regions where the hot spots are. Also working with our faith leaders is very important. So to be able to get the message out that this virus is still there, we can't get complacent. This is not the time to give up. Nobody here is giving up, and we've got to continue the push until that vaccination is available.
Yes, thank you, Governor. You mentioned Southwest Virginia and Ballot Health is continuing to set record numbers of inpatients with COVID-19 week over week. Is there any, I have two questions. The first, is there any consideration or is any capacity that the state could provide any assistance to Ballot in treating the large number of cases that they're now seeing?
Yeah, it's a great question. I may let Dr. Carey address some of it. Just before he comes to the microphone, we have hospital beds. The challenge, and they may be in short supply if the numbers continue to go up, especially ICU beds, but a concern also is our staffing. And we just don't have as many nurses and technicians in the smaller hospitals. So we've got to really prepare for that and communicate with other healthcare systems across Virginia. If you... We won't mention any names.
Thank you, Governor. The question really was around what assistance that we could provide, and I think the real question is, and we faced this with alternative care sites early on, and as our health system leadership let us know, it wasn't beds primarily, it was personnel. And I think the number one thing that we can do is communicate to the population, to all of us here in Virginia, especially in Southwest, how we need to take this very personally, that hand hygiene, wearing of masks, staying home if you're sick, keeping your distance, even through the holidays, especially with the holidays, is the number one thing that we can do to assist the health system today and all the men and women that are caring for the residents of Southwest Virginia and all over Virginia, is to continue this consistent message to make sure that we can control this virus. And that's how we will do it, is by making sure that we do those behaviors that are proven to limit the spread.
Thank you. The second part of my question is, Governor, might you consider imposing any additional restrictions if the numbers that we see in this area continue to rise, or in any other area continue to rise?
Well, a lot of things that we're considering, but we're right now focusing on how to mitigate the increase in numbers by the measures that we've already talked about.
Thank you.
Governor, there are folks who've called about the DMV. Those who are handicapped, so they can't get their decals and signage, if you will. Wondering if you have any resolve on that. Also, people have said that maybe you should consider, if you haven't already, using some of those mobile vehicles to kind of help with that situation. And then on sidebar, are you in communication with law enforcement who may give people breaks, if you will, who have not been able to get into?
Yes, those are all great points. And I don't think there's anybody here from transportation today, but we are aware, Andre, of the lines and the backlogs. And as you have probably seen, we've opened more DMV offices, which I think will help with that. We have worked with our law enforcement agents, and as you know, they're not writing tickets for some of the things that have been challenging for people. And I think the other point you made, to use our mobile DMV units, is something that we'll continue to do. And if we can ramp that up, I suspect that would be helpful as well. But we're aware of the challenges and trying to accommodate everybody's needs as we move forward.
Secondly, a couple times we've talked about correctional facilities
Yes.
and inmates who say they need more PPE and
Yes.
issues around safety there. Got a couple calls wondering if you would have maybe Secretary Moran and maybe you visit some of these facilities, maybe outside in a safe way, to hear directly from the inmates who feel as though they're not being heard. You may be getting mixed messages from inmates versus staff, if you will.
Well, I do visit the correction facilities. Brian, did you want to comment any on that? I mean, we communicate with the chair of our Department of Corrections, and certainly Brian more than me, but those communications are all ongoing. If you want to kind of give a little update on what we're seeing at the corrections units, that's great. Thanks, Brian. Never want to put you on the spot.
Very well. Happy to do it, Governor. Thank you. Andre, thanks for the question with respect to our Department of Corrections facilities. As you know, this has been a deep concern of ours throughout when the first case arose on March 7th. I will say some good news. Some of the numbers continue, though. We have 240 offenders who have active COVID cases. 239 of those offenders at the facilities. One is in the hospital. But 3,812 offenders have recovered. 33 offenders have died. But the good news is that we haven't had anyone since October 2nd. And so, that's well over a month now. We've performed tests. 47,804 tests have been performed. You heard the governor talk about how our testing has increased, and certainly at our correctional facilities, we have maintained a robust testing system. So, in addition to that, the PPE continues to get distributed, both from DOC themselves, who actually manufactures masks and other PPE equipment, and certainly that we provide them any and all that is requested. So, challenging times, but I think DOC, the leadership of Harold Clark and others have really stepped up. I will say with respect to the visits, I think really, in addition to all the other challenges we've had, that is something I really miss. The governor has joined us on many occasions. In fact, there's a Veterans Day luncheon that we typically enjoy this time of year and attend, and at Deerfield Correctional Facilities, and it really is one of the highlights of the year to see and enjoy lunch with them. And so we'll resume those visitations as soon as it is safe. We certainly do not want to impose on our facilities and do anything that would actually create a problem with respect to the spread. But as soon as we have vaccine, I look forward, and I know the governor does as well, in resuming our frequent visitations to these facilities.
Thanks, Brian. Appreciate it.
Bill Atkinson, Progress Index.
Thank you. Governor, following up on David's question about the restrictions, would your administration be looking at how the numbers come out through the holidays to determine if Virginia will go into another lock? And if so, how long do you think it would take the Virginia localities to get out from this one?
I'm sorry, I heard some of what you said and missed other parts.
Okay, I'll repeat it. Following up on what David McGee from the Bristol asked about restrictions, will your administration be looking at how the numbers come out through the holidays, primarily through Thanksgiving and maybe even Christmas, to determine if Virginia will go into another lockdown?
I appreciate the question. I heard you that time. Again, we're looking at ways to mitigate these rising numbers. We look at the numbers every day. We're not just looking at the holidays or whatever. So every day and following the trends. And again, I think one of the responses that we have is to understand why the numbers are rising. And that's why I have reiterated what we know works, but certainly I can tell you this virus it spreads through the air. It is very contagious, and if someone has the virus and doesn't have a mask on and you're in their presence, there's a real good chance that you're going to contract it. So behavior is very important. We know that getting into groups, especially larger groups, and that's why with the holidays coming, we just really implore people to keep their gatherings to a minimum, to keep distancing, all the things that we've been talking about, wearing masks, et cetera. If we do these things, then we know that we can keep the numbers under control.
You know, not to beat a dead horse when it comes to guidance and restrictions with COVID, but when I look at the state metrics, I see that we're seeing, you know, daily new cases rise higher than they ever have in the pandemic. And so I'm wondering, like, what it would take, what metric you would look at that would trigger a new, you know, possible new restrictions. And then, you know, you mentioned that you know what's making COVID rise. So, I mean, can you speak more specifically to why 8 months in we're continuing to see these spikes and lulls in Virginia?
Yeah, a couple of things I would say, Kate, and I appreciate your question. We are seeing higher numbers of new cases, but I would reiterate that we're doing more testing. I mean, you know, early on we were just doing a few tests every day, if that, and now we're doing 20,000 plus tests, and we'll continue to do more. So we'll follow the number of new cases. As you saw, that curve was increasing. But I think as important is following the positivity rate and also the incidence rate. But just speaking to the positivity rate, if you go back and look at the graphs, I mean, we were over 20% at one time in Virginia. Now we're at 6.2. So yes, there are more cases in Virginia because of more testing. The positivity rate, while it's increasing, is still relatively low. And so we monitor all of these things. And again, I would just, again, not to beat a dead horse, to use your words, but we need to continue to be able to figure out why those numbers are rising, and they're rising right now because people are gathering and they're not wearing masks. And if you look at where they're not wearing masks, you see the increased numbers. So it's, I won't call it scientific, but it's pretty straightforward. And so we've got to look at, when we talk about mitigation, really how do we change people's behavior? That's really the challenge. How do we encourage someone to just get up in the morning when they go outside the house to put a mask on? That, in my mind, is not asking a whole lot, but it certainly is for some people. And that's why I mentioned earlier, it starts with leadership, and I'm going to do everything that I can to continue to put that message out. But it's good to see that we're going to get that message coming out of Washington as well, and I think that's going to be very important as we move forward.
I appreciate the fact that you're going to do a marketing campaign in Southwest. However, we have heard this message all along and have been putting the same message out about wearing a mask, staying distant, and the behavior hasn't changed. And so is it time to do something a little bit stronger, such as enforcing the mask mandate with fines? And also, we have situations now with outbreaks in public schools and sports about to start. So, are you going to recommend that schools not participate in winter sports?
Two questions there, and they're both good questions. The first is about enforcement. And we're certainly looking at businesses and making sure that they comply. And we also now have the availability of a civil penalty. As you know, it used to be a criminal charge, and so that will, I think, allow us more options for enforcement. I've said all along, this is not about carrying a stick around. This is about carrots, and I would really encourage Virginians to continue to follow the guidelines. And again, not just for themselves, but as Dr. Carey said, for the people that are working in our hospitals, the frontline workers in our grocery stores. We need to think about all these people, not just ourselves. Regarding sports and obviously schools, we continue to provide all of the information that we can. We have the dashboards for the localities, but I can promise you that Virginia is very diverse and one size doesn't fit all, and that's why we've given the localities the discretion to make decisions on returning to school, and that's the path that we'll continue to follow in that regard. One more question here. Jamie?
Jackie. So close. But
I had the J right.
So. That's fair.
Okay.
But anyway, so you mentioned, your excitement about President-elect Biden, presumably going into office, and you have repeatedly obviously criticized the Trump administration. So I'm wondering what specifically you think that the Biden administration can do differently to help Virginia that the Trump administration has not done.
Yeah, it's a great question. There are a lot of things, and it starts with messaging. and encouraging people to follow these guidelines. It also includes options, and obviously we're going to be communicating, governors, with the national leadership. But it's using things like the Defense Act to if we need more supplies, if we need more swabs, if we need more reagents, if we need more Binax testing, all of those things will be important. But I think a lot of it is, again, I'm repeating myself now, but it's really looking at behavior. And this shouldn't be a Republican versus a Democrat or metropolitan versus rural. It's really all of us. And in our case in Virginia, we're all Virginians. And let's do the right thing, not only for ourselves, not only for our families, but for those around us. So that we'll continue the communications. We've already been in communication with the task force members, and we'll continue to do that moving forward. I thank you all again for tuning in today. And my message as we leave is that nobody's giving up here. We can't give up. And I'm a runner. I'm sure you all have been in, situations where you see the finish line and you just say, I don't know if I'm going to be able to get there. I'm going to stop running, start walking. This is not the time to do that. This is a time to really dig in, to be vigilant, to be hopeful that there is light at the end of the tunnel, that there is a vaccination. And by the way, putting on my doctor hat, and I think Dr. Carey and Dr. Oliver have already discussed this, but we have all been involved in clinical trials, and when there is an effective rate of over 90%, that is really very, very promising. And so I would encourage all of you that we're going to get there. We're going to get there together, and we're going to get there by continuing to follow the guidelines. And we want to get our businesses back open. We want to get our children back in school, but we need to do it safely and responsibly. And we all want that new normal. So thank you all. Be safe. I probably won't talk to you before Thanksgiving, but certainly have a safe and peaceful holiday season, and spend as much time with your friends and family, but do it safely. So thank you all.
Alrighty, that was a COVID-19 update coming out of Virginia, and across the country we're seeing higher and higher case counts of coronavirus ahead of the holiday season, which is something that all of the officials, health officials, are telling people you got to be careful. If you're flying home to see family, maybe you shouldn't be flying home to see family. This is an across the board situation. So we're going to send out some of you to a 2-minute commercial break. We'll see you in a second. For those of you who are sticking around with us, we do have another COVID-19 update. This one coming from Erie County, New York. There's new restrictions in parts of Erie County, so we're going to get the latest on that here on News Now from Fox. I'm Daytona Everett.
Good afternoon, and thank you for joining me today as we update you on COVID-19 here in Erie County. Before we begin, I would like to take a moment to honor every one of our veterans today as we celebrate Veterans Day. Those who have valiantly dedicated their service to our country, to preserve our democracy, to protect the people of the United States of America. To each one of you veterans, we honor you, and happy Veterans Day. Now to COVID-19. We have 99 cases to report as of late last evening, which brings us now to a total of 2,846 cumulative positive cases since March. We have 557 cases that are currently active, certainly the largest number we've ever had active at one time. 2,232 have recovered, and unfortunately 57 deaths have been reported in the NEDS database. Of the cumulative cases in Erie County, 5% are female, 45% male. Regarding race and ethnicity, of our total cumulative cases, 63% are white residents, 14% are African American or Black residents, 8% are Asian, 2% other, and 13% unknown. Regarding Hispanic origin, 5% are Hispanic of any race, 75% are non-Hispanic, and 20% unknown. The breakdown of cumulative cases by age shows that 2% are ages 0 to 4, 1% ages 5 to 9, 8% ages 10 to 18, 16% are ages 19 to 24, 37% are ages 25 to 49, 19% ages 50 to 64, and 16% are ages 65 and older. Between November 2nd and November 8th, we had a total of 381 cases, and that equals 140 cases per 100,000. At this point, 1% approximately of the population of Erie County has contracted the disease. While our cases continue to affect people of every age, race, and gender, and in every area of the county, as you can see on our zone map data, our disease investigators report that the majority of our cases are being traced to adult behavior in the community, basically people gathering. The uptick in cases is definitely concerning, especially with the Thanksgiving holiday approaching, where family and friends will spend hours together eating, laughing, embracing, and celebrating. And it's natural for all of us to feel some sense of COVID-19 fatigue this many months into this pandemic. There are some of us who haven't seen certain loved ones in many months. Some are still waiting to get back to work. Some are tired of the Zoom meetings and virtual schooling and staring at the same faces on a screen at home. Let's face it, every single one of us craves socialization, being near our family and friends. Please take great caution and know any social activity at this point in Erie County is a high-risk behavior. I know that we are all excited and hopeful for what we see potentially on the horizon when they talk about a vaccine, and we should be. But it's important to remember that it will probably be many months before all of us have access to that vaccine. We must not cave into the temptation that could lead to devastating results. We must continue to use the tools that we have at our fingers now to fight this virus. And that includes, of course, we must wear our mask and keep our distance from people who don't live inside our homes. And we must wash our hands frequently. And we must stay home if we're feeling sick in any way. And we must stay away from large gatherings. As Director Lyons said last week, this is not an a la carte menu. All of these things need to be part of your practices to mitigate COVID-19.
All right, we do have some breaking news that we want to bring you right now. President-elect Joe Biden will name Ron Klain, a veteran Democratic operative and a decades-long confidant, to be his White House chief of staff as early as Thursday morning. That's just hours from now. It's about 6 o'clock out here in Phoenix, Arizona. But wanted to bring this to you right now here on News Now from Fox. Of course, Joe Biden has announced several appointments that he will be making if he is in fact named president down the line, as he is president-elect right now, according to our Fox News decision desk. Ron Klain is a lawyer with deep experience on Capitol Hill advising President Barack Obama, and in corporate boardrooms has been seen for months as the likeliest choice to manage Joe Biden's team in the White House. So wanted to cut in and bring that to you live here on News Now from Fox. In just moments, we'll have a live report coming from Nevada, but for now, we will take you back out to that COVID-19 update coming from New York. Again, Joe Biden to name Ron Klain as his White House chief of staff.
And that includes, of course, we must wear our mask and keep our distance from people who don't live inside our homes. And we must wash our hands frequently. And we must stay home if we're feeling sick in any way. And we must stay away from large gatherings. As Director Lyons said last week, this is not an a la carte menu. All of these things need to be part of your practices to mitigate COVID-19. Our COVID-19 case numbers continue to rise, and every morning when I receive these numbers, it does make me gasp. We do have a mask mandate in place from the state, and we are doing everything we can to keep our businesses up and running. And I continue to say our businesses have done a great job enforcing the mask mandate. But again, we need the help of every single citizen, resident of Erie County. For months, we've been able to keep our numbers lower pretty reasonably because so many people have been using the tools that we have. And we know that they work. But we need to double down now. We need to all come together and use those tools. And I will encourage everyone to download the COVID Alert PA app if you have a smartphone. The app notifies users if they have been exposed to COVID-19 without revealing their identity or their location. Pennsylvanians can use this app when traveling in New York, New Jersey, and Delaware, although it is recommended that you not travel at this time. As much as you can, stay close to home. But the more people that download this app, the more effective the app will be. And it can be found in the Google Play Store and the Apple App Store by searching for COVID Alert PA. As we honor our veterans today, reflect on the many sacrifices that they made for us. Wearing a mask, keeping physically distanced from others, is seen by some as a sacrifice, but it certainly pales in comparison to the many sacrifices made by our veterans and by our current active men and women in our armed services. So honor them today and serve your fellow citizens today and every day by following the COVID-19 mitigation guidelines. And now I am grateful that we have our healthcare partners with us today to share updates from each one of our hospitals in Erie County and their systems. And we'll start with Chris Clark, the President and CEO of Allegheny Health Network, St. Vincent's Hospital. Dr. Clark?
Thank you, County Executive Dahlkemper. Hello, everybody. We are managing fine at AHN St. Vincent. We continue to test patients for COVID disease by physician order at one of two locations, the hospital and the West Side Health and Wellness Pavilion in Mill Creek. At the pavilion, we recently transitioned to an indoor structure in the parking lot that is still separate from the building. The new process was put in place in preparation for the upcoming cold weather months and is very safe for our patients and staff. Like the other health systems in Erie, we partnered with a community center to offer additional testing every week on Thursdays. AHN St. Vincent is proud to work with the MLK Center on Chestnut Street to offer this additional access to testing. To date, we have tested over 8,200 patients with a definite increase in the demand for testing in the recent weeks. Our rate of positivity has now increased to over 6%. And we've had over 60 patients test positive just since last Friday. We have hospitalized over 160 patients to date, and we currently have 20 patients in the hospital with COVID, with one on the ventilator. They are admitted to designated COVID units with negative air pressure rooms and are managed completely separate from our non-COVID patients. By far, patients hospitalized are older and have chronic conditions like diabetes, obesity, lung disease, and heart disease. Specifically, about 75% of hospitalized patients at AHN St. Vincent had been older than the age of 60. A majority of patients are discharged home when their status improves, and about 20% are released to nursing homes. St. Vincent has sadly seen 18 patients pass away from COVID in the hospital since this all started. We offer nationally recognized evidence-based treatments for COVID patients, including the convalescent plasma, dexamethasone, and remdesivir. We continue to allow for only one support person visitor per patient for everybody's safety. And our staff uses masks and shields exclusively. Our PPE supplies are good too. We are also preparing to become a distribution location for the COVID vaccination when it is available.
All right, you're watching News Now from Fox. I'm Daytona Everett. We're going to cut in right there because we do have a live report coming out from Clark County, Las Vegas. Fox's Robert Sherman is out there. He's been following that close race out there in Nevada. Robert, what are you seeing now? Are we going to get some final results soon? What's the deal?
Well, that's the plan, Daytona. Tomorrow, the expectation is that all ballots here in Clark County will be submitted, and then Monday is going to be the canvassing date. That is the date in which the votes are certified. In terms of what is still out there right now, Clark County election officials, which is home to over 70% of the state, say that they have processed all of the mail-in ballots at this point. So what they're still waiting on right now to finish up is just a few more ballots that need to be cured. And then there is one large batch of votes that still has to come in, and that is over 60,000 provisional ballots. The breakdown of those is about 21,000 coming from registered Democrats, another 20,000 coming from registered Republicans, and another 19,000 that are nonpartisan. But at this point, election officials say that they see no issue with them meeting either one of those deadlines, whether it's the submission deadline of tomorrow or the certification deadline on Monday. People have been asking a lot about recounts, and one thing that is important to note here is that a recount cannot be requested here in Nevada until the vote is certified. That's Monday. When that happens, then someone can come in and request a recount, and that recount must begin within 5 days of that request date. So we won't know until Monday if there is going to be a recount in this state. As things stand right now, the latest reported numbers show former Vice President Joe Biden with a 30,000 plus, about 36,000 vote advantage here in the state of Nevada. Over the last couple of days, we've seen back and forth allegations on the issue of voter fraud. Just to break those down just a little bit, we have heard from the Trump campaign saying that they have made allegations that there is voter fraud here in the state of Nevada. The Attorney General's office here in Nevada has consistently said from the beginning that they do not see any evidence of widespread voter fraud. That doesn't mean that there aren't any suspicions of voter fraud on the micro level. Take Clark County, for example, here. Election officials have confirmed to us that they have sent information off to the Secretary of State's office regarding 3 separate potential cases of voter fraud here in this county. Again, the narrative coming from the top here of the state's top law enforcement official is that they don't see evidence of widespread voter fraud. That's not what the president is saying, though. He took to Twitter earlier this week, calling the state of Nevada, quote, a cesspool of fake votes. And that continues to be the message from his campaign. So we will wait to see as both of these sides continue to clash and all of this starts to iron itself out.
Robert, that's the latest on the presidential race right there. But let's talk about this Senate race. It just flipped a few days ago. Are you hearing anything on your end about that?
Senate races here in Nevada, the last Senate race here was in 2018, but there are still a couple of other key Senate races that we are following. 2 out of Georgia, which are going to be coming up in January. Both Perdue and Kelly Loeffler are up for re-election there. So a big conversation politically, and everyone here in Nevada recognizes it as well, is that, the state of the election and, the balance of power in the Senate. We're keeping a very close eye on Georgia and how both of those states are going to shape out. In best case scenario, if the Democrats were to take both of those seats, it would be a 50-50 split here in the Senate, which would give assuming that Kamala Harris is sworn in as the Vice President of the United States, the tie-breaking vote. If Republicans can hold just one of them, they will maintain a majority in the Senate out there. So those are the last two Senate races that we're keeping a close eye on.
Georgia, Pennsylvania, and Nevada, we're keeping a close eye on all you guys. Thank you so much.
Thank you. Appreciate it.
All right, so again, you're watching News Now from Fox. We're giving you the latest on the results out there in Nevada. We're giving you the latest on the results out there in Pennsylvania. And of course, keeping a close eye on all of these lawsuits. Georgia is going to be a recount, and Nevada, that's still in the works right there. So we're going to head back to that COVID-19 update coming out of New York, where we're seeing some changes in Erie County. But some of you are going to be going out to a 2-minute commercial break. We'll see you in a sec. For those of you who are sticking around, thank you for staying with us here on News Now from Fox.
Triage line, 814-868-8661. Again, 814-868-8661. This will help limit exposure rather than coming directly into the facility at first. Our nurses will triage and provide the direction and care that you may need. Again, I wish our veterans a very happy Veterans Day and look forward to when we gather for our annual parade and ceremony, which we routinely would host today. And likewise, have those discussions early. I know I have family from out of town, just west of here in Cleveland, and had those discussions this week. And unfortunately, as hard as it may be, to keep people safe, to keep the parents safe, to keep the grandparents safe, we're going to limit any kind of travel and stay home and limit the visitations this year. So please heed that caution and be safe, everyone. Thank you.
Thank you, John. And now I'd like to invite Dr. James Lynn, president of LECOM's Institute for Successful Aging, to speak to us from LECOM. Dr. Lynn?
Good afternoon. Thank you, County Executive Dahlkemper. On behalf of LECOM Health, we want to wish all the veterans a happy Veterans Day. And I'd like to begin by saying that I want to thank all of the LECOM healthcare providers and all the healthcare providers in our community in their dedicated service in this pandemic and this fight. The last 2 weeks have been very challenging times for myself personally. As a geriatrician, I have the responsibility of taking care of at least 20% or more of the post-acute care beds in our community. Our entire health system includes Corey Memorial Hospital, Mill Creek Community Hospital, and all the post-acute care beds. We serve 389 nursing home beds. And as such, my colleagues at Hammett and St. Vincent's have given the statistics in acute care and it's similar numbers in our acute care facilities. I'd like to focus my time in speaking about post-acute care, since that's one of the focus in our health system. Currently, as some of you may know, we made the announcement earlier this week that we're opening up a second COVID unit. So the total capacity for LECOM Health is that we have the ability to take care of 70 COVID positive patients that are either being discharged from acute care hospital and or other healthcare facilities that cannot cohort or isolate or quarantine their COVID positive patients. We currently have a total of 47 COVID positive patients in our COVID unit. And these units are dedicated units, and we have converted our units into negative pressure and separate air handling system with separate entrances and exits. And the patients that are COVID negative in these facilities are completely separate away from the COVID positive units. So in that realm, as all of you know, the most vulnerable for this virus is the geriatric patient that is in the post-acute care facility. Many of you know that LECOM Health is taking the position and have created policies and procedures that are more stringent than even the guidelines out there. We're the first health system in the area to stop visitations prior to the CMS mandates. We continue to practice the most stringent policies and procedures to protect our patients and our staff. And just to illustrate to everybody how interconnected we all are and we all have to play a part in this fight, we can make our policy and procedures as stringent as we can. So for example, We have one entrances to every building that we have. Every entrance has a touchless thermal camera to screen patients or visitors or any personnel coming in, employees and patients, temperature every day. And there's a screening questionnaire that they would have to answer. And right now, since Erie County is in the yellow zone, we have instituted full PPE on all of our post-acute care buildings for all the care staff. And despite this, it's very complex because if you imagine that our patients will require outside services and they have to go out to the community. For example, if a patient needs to go out to dialysis, we need to get EMS to come pick them up. So all the personnel, healthcare partners would all have to play a role in this. In addition, when they go out to the community, and there are certain areas that these patients are going to get exposed to. So if we don't do our part, there's a potential that the patient may get exposed outside the community. And when that patient comes back into the building, it is very, very difficult for us to contain sort of the spread if they become positive, but despite all the stringent protocols. So I'm here to urge the community that, as my colleagues previously mentioned, that is very, very important to play your part. You have a social responsibility to our community as well as our seniors. So please wear your mask, wash your hands, social distance, and we'll all get through this together. I appreciate the time. And once again, I thank the veterans for their service and happy Veterans Day. Thank you.
Thank you, Dr. Lin, and thank you to all of our health partners. We are very, very fortunate in Erie County to have so many wonderful healthcare partners, and I know we in county government, particularly the Department of Health, has had a great partnership with all of you throughout this pandemic. And now we're going to turn to the media, and we'll start today with Erie Times News.
Hi, Kathy. It's David. New York State today implemented some more severe limits on gatherings and other things. Has that been a discussion with state officials? Is that something that's being considered for Erie County in light of the increase in cases?
I haven't had any specific discussions. I haven't heard anything specifically that this state is looking at doing, but I'm sure that it is being looked at the State Department of Health and with the Wolf administration as we see numbers increase not only here in Erie County but across the Commonwealth.
And based on what you learned from the restrictions when we were in the red zone and the yellow zone earlier on, do you think they would be different in terms of more of an emphasis on gatherings and less of an emphasis on having businesses closed?
Well, we do know that the majority of cases are coming from people who are with people they know, whether that be together in someone's home or in some other setting, and it's very, very difficult to be able to curtail that. That really takes people deciding themselves that they're going to not do those kind of activities. You know, we're not seeing the businesses being a hot spot. Now, people may have done something outside of work, and then they go to work, and then the work has to shut down. The schools have to go virtual, whatever it might be. But the actual virus is not spreading quickly through that business. It's spreading on the outside, really during people's personal time. And I don't know how you ever put enough guidelines in that would stop that. And so it really does take people just deciding that we've got to stop doing all of those things for the time being.
Thank you.
Talk Erie, Joel?
Thank you, County Executive. I actually have a question for Dr. Lin from LECOM. Dr. Lin, you mentioned that there are 47 in your post-acute care COVID units. The Pennsylvania State dashboard is showing 28 patients hospitalized, one on a ventilator. Can you explain for our listeners the difference of the kind of care that you guys have at LECOM in those COVID units and what's being presented by the acute care that's being reported to the state, and why wouldn't your numbers be reported to the state?
Sure. So for what post-acute care means is that most of our patients, there's two levels of services. One is long-term care, meaning They have chronic diseases with disabilities that they need 24-hour nursing care, and they live there. Those are long-term care residents. And then there's a different population, what we call subacute or transitional patients that are transitioning from acute care hospital that are medically stable enough to go to a post-acute care unit like a skilled nursing facility. However, they're not quite ready to go home. So during these times, the average length of stay for them in those type of beds are somewhere between the neighborhood of 17 to 20 days. And some of them may require longer. And the goal is they would require physical therapy, occupational therapy, speech therapy, and nursing to care for them until they're strong enough and safe enough for us to discharge them home, to transition them home or to a community setting. That is the definition of a skilled nursing facility in terms of two levels of services that we provide. So the type of patient that we typically receive are individuals that have spent some time in the ICU and or acute care hospital that are so debilitated that they have difficulty moving around or being safely being discharged to home, or they require more help that the patient may not have the help at home. So we have to help them through that time to get them strong enough and make discharge planning safe before they can go back into the community. As far as your question in regards to reporting and so forth, just so everybody knows, in the skilled nursing facility, there is a mandate that we have to test universally. We have to test all the patients and the residents early on as a CMS mandate. And the rule is that as we test, if there is a positive staff, that are, even if they're asymptomatic, the facilities were required to test on a weekly basis until we have zero positive employees and patients for 2 weeks in a row before we can sort of step back. But since now the county is in the yellow zone because of the infection rate, all skilled nursing facility and personal care homes in the county would have to test on a weekly basis. And many of you know LECOM is part of the Regional Response Healthcare Collaborative, and part of that is the state's program for us to do post-acute care COVID-19 mitigation. And part of that is when there is a facility that are in need for testing and or there's an outbreak, it is our team that goes out and respond to the facility, what we call a rapid response team. And when that happens, we support the facility with testing. We support the facility with PPE equipment if they do need that. And all those things are reported to the state, as well as we test them. It goes into the national database, the NED system that goes to the County Department of Health. So in a way, to pick up the positive patients in the facility and or employees, it is being reported through that system.
Thank you.
Thank you. Jet TV.
Hello. Just a quick question on the hospitalizations, as we're kind of on that right now. Is St. Vincent reported the 20 patients with the one on the ventilator. I'm just curious as to how many the other hospitals currently have right now.
Emily, would you like to speak to that?
Sure. Currently, we have 12 patients admitted with COVID.
Do either
So for Mill Creek Hospital, we have 2 patients admitted with COVID.
And at the VA, we don't have any.
I'm sorry, did you say Mill Creek with 2? Kind of broke out a little bit there.
Yes, Mill Creek has 2 COVID and none on ventilators.
Okay, thank you. And then just kind of the other one, Kathy, I guess this one's for you. As for contact tracing, any difficulties with this surge in cases? What are the difficulties with contact tracing right now, if there are any?
There's huge difficulty. I mean, when you think about 99 new cases today, the investigators, who are the individuals who speak directly to the person who's COVID positive to get all the information, make sure that they are isolating and know all the protocol, that's all that anyone's able to do right now. So the contact tracers are working as investigators. Everyone is just trying to contact the positive cases. And then the positive cases are being informed that they should contact their contacts. And we have gotten some help from some of our partners in the state with the Northwest contact tracing effort. But again, nothing like what we've been doing for many months, nothing to the extent as we have been doing, but we're doing all we can do at this point, and that's to contact every single positive case as quickly as we can. I mean, the goal used to be to do it in 12 hours, and it went to 24. Now it's even a little longer, and to let them know that they are positive and they need to contact.
What would be the benchmarks that would require us to?
By the governor, his administration, led by the Pennsylvania Department of Health, and that's who had the shutdowns and determined the parameters around that in the spring. Again, I think we've learned a lot about COVID. We've learned what the more risky behaviors are versus the things that maybe aren't as risky. So we've also learned how to treat it a lot better too. But it's still obviously a very contagious virus, and it can still cause people to become very sick, and obviously causes some people to die. So I don't know what the state is going to determine as they see this rise across the Commonwealth, but I know it is likely being discussed. We'll go back to David. Erie
Okay,
Times.
thanks.
Sure. Erie Times News.
Yes, Kathy. We've been dealing with this as a county for more than 8 months now. There's been some troubling times before, but is this week, with the rise in cases and the concern on as we see hospitalizations increase, is this, in your opinion at least, the most troubling time we've seen since the pandemic started, or was it worse when you add the economic impact of when we were shut down early in this late spring, early summer?
It's hard to say. That was obviously very troubling for many, many reasons. But right now I can tell you the morale, the exhaustion that the health department employees are feeling is very troubling for me as I guess as their ultimate boss. So they're overwhelmed. They're trying their best to try to do what they can to help contain and mitigate the spread of this virus. But I've said this all along, the health department can't do it alone. Even with great partners that we have with our health systems and the testing that they've been doing, and obviously the acute care that they've been providing, none of us can do this alone. It really takes every one of us. It takes every citizen of Erie County to decide, this is so serious that I'm truly going to change my behaviors and help this community get this under control. So for me, I think this is much more concerning, just as these numbers are so large and the spread is so wide, and it is affecting every area of our county as well as this country. So I think this is probably more concerning to me just in terms of personal health and people's personal well-being.
Thank you.
Talk Erie, Joel.
Yes, thank you, County Executive. I have a question for Dr. Clark from AHN. Dr. Clark, can you explain the new CDC guidance regarding mask wearing, talking about now somehow the masks help us, and especially in regards to these surgical masks, how long can you wear a paper mask until it no longer has efficacy?
Okay, so you're certainly referencing, Joel, the fact that when we were first advised to use masks, it was really messaged strongly that it was protecting others in case you were an asymptomatic carrier of COVID. But the fact of the matter is, any barrier of any type could potentially help someone from contracting the virus or anything that's airborne. So what time has probably shown, and what you're referring to, is that there's probably some evidence out there. It might not be great evidence, but in theory and conceptually, any kind of barrier with a mask could help, again, prevent someone from spreading it or from catching it. Then with regards to the actual type of mask, and then calling out surgical masks, which is what we use in healthcare, clearly there's an added benefit with using those. Those have been produced in a way to help filter organisms from getting in.